1. Dyslipidemia, a condition characterized by abnormal levels of lipids in the blood, is often a silent disorder that significantly increases the risk of cardiovascular diseases, including coronary artery disease and stroke, due to the accumulation of plaques in arteries, which can lead to atherosclerosis, permeated by elevated low-density lipoprotein, LDL, decreased high-density lipoprotein, HDL, and elevated triglycerides. 2. The diagnosis of dyslipidemia primarily involves a fasting lipid profile measurement which quantifies the levels of total cholesterol, LDL, HDL, and triglycerides in the blood, providing a comprehensive lipid assessment that aids clinicians in determining the risk of atherosclerotic cardiovascular disease in patients. 3. Statins, inhibitors of the enzyme HMG-CoA reductase, form the cornerstone treatment for dyslipidemia due to their potent LDL-lowering effects, which not only help to decrease the incidence of cardiovascular events but also have additional pleiotropic benefits such as improving endothelial function and reducing vascular inflammation. 4. Familial hypercholesterolemia, an inherited form of dyslipidemia typically caused by mutations in the LDL receptor gene, leads to dramatically elevated levels of cholesterol from birth and is characterized by early development of cardiovascular disease. Hence, early diagnosis and aggressive treatment with lipid-lowering therapies are crucial to improve long-term outcomes. 5. Lifestyle interventions, including dietary modifications such as reducing intake of saturated fats and trans fats, increasing soluble fiber, engaging in regular physical activity, and maintaining a healthy weight, play a fundamental role in managing dyslipidemia and serve as first-line strategies alongside pharmacotherapy. 6. Secondary causes of dyslipidemia, such as hypothyroidism, nephrotic syndrome, chronic kidney disease, type 2 diabetes mellitus, and the use of specific medications like corticosteroids, beta blockers, and antipsychotics, should be excluded during the clinical evaluation of patients, as these conditions or medications may exacerbate lipid abnormalities. 7. Niacin, also known as vitamin B3, can be used therapeutically to increase HDL cholesterol and lower triglycerides and LDL cholesterol levels. However, its use is often limited by side effects such as flushing, pruritus, and potential hepatotoxicity, which necessitates careful monitoring of liver function tests during treatment. 8. The role of omega-3 fatty acids, primarily found in fish oil, in the management of dyslipidemia centers on their ability to lower triglyceride levels, making them a useful adjunct therapy in hypertriglyceridemia, although their effect on LDL and HDL cholesterol is variable and requires further research for confirmation. 9. PCSK9 inhibitors, such as evolocumab and alirocumab, represent a novel class of lipid-lowering agents that work by inhibiting the degradation of LDL receptors, thus increasing hepatic uptake of LDL cholesterol from the blood, and are particularly beneficial for patients who are statin intolerant or have familial hypercholesterolemia requiring additional LDL reduction. 10. Insulin resistance, a key component of metabolic syndrome, contributes significantly to the development of dyslipidemia by altering lipid metabolism, leading to elevated triglycerides, reduced HDL cholesterol, and small dense LDL particles, which collectively promote atherogenesis, underscoring the importance of addressing insulin sensitivity in management strategies. 11. The use of fibric acid derivatives, or fibrates, such as fenofibrate and gemfibrozil, is primarily indicated for the treatment of severe hypertriglyceridemia due to their effectiveness in lowering triglyceride levels and modestly increasing HDL cholesterol, but care must be taken when co-administering them with statins due to the risk of myopathy and severe muscle damage. 12. Dyslipidemia in women, particularly post-menopause, may be affected by changes in hormonal levels, resulting in increased LDL cholesterol and decreased HDL cholesterol, thus necessitating sex-specific considerations in both the assessment and management of lipid disorders to prevent cardiovascular events. Dyslipidemia can lead to non-alcoholic fatty liver disease, NAFLD, which is characterized by fat accumulation in the liver that can progress to non-alcoholic steatohepatitis, NASH, cirrhosis, and potentially liver failure, signifying a compelling reason for clinicians to address dyslipidemia aggressively in patients with or at risk for NAFLD. In patients on statin therapy, routine monitoring of lipid levels and potential side effects is essential, as initial lifestyle and pharmacological interventions may need adjustments based on LDL cholesterol targets, which are personalized according to the patient's baseline cardiovascular risk factors and history of cardiovascular disease. The dyslipidemia-related concept of atherogenic dyslipidemia encompasses a combination of high triglycerides, low HDL cholesterol, and an increased number of small dense LDL particles, which together heighten atherogenic potential and often require a multifaceted therapeutic approach, including advanced lipid profiling for accurate assessment. Apolipoprotein B, ApoB, is an important determinant of atherogenic particle number, offering a more precise understanding of cardiovascular risk in dyslipidemia patients beyond traditional lipid panel measurements, thus becoming a valuable adjunct in lipid management for assessing risk and tailoring treatment strategies. Elevated lipoprotein, A or LP, a genetically determined risk factor for cardiovascular disease, may contribute to residual cardiovascular risk in patients, even with optimized LDL cholesterol levels, justifying the need to consider it during risk evaluations and meditative insights into novel therapies aimed specifically at its reduction. Inherited dyslipidemias, such as polygenic hypercholesterolemia, result from multiple genetic variations affecting lipid metabolism, which cumulatively elevate LDL cholesterol levels, underscoring the complexity of genetic contributions to dyslipidemia and highlighting the potential benefits of genetic screening in families with histories of premature cardiovascular diseases. The relationship between dyslipidemia and inflammation is increasingly recognized, with chronic low-grade inflammatory processes thought to perpetuate lipid abnormalities and enhance the risk of atherosclerotic plaque formation, positing biomarkers like high-sensitivity C-reactive protein as potential targets for comprehensive cardiovascular risk assessments. The JUPITER trial demonstrated that the use of statins in patients with normal LDL cholesterol but elevated inflammatory markers such as high-sensitivity C-reactive protein significantly reduced cardiovascular events, suggesting a broader application of statin therapy beyond traditional criteria, particularly in dyslipidemia characterized by inflammatory states. The management of dyslipidemia in patients with HIV requires special consideration due to the lipid-altering effects of antiretroviral therapy and the inherent risk of cardiovascular disease within this population, necessitating tailored therapeutic approaches to balance viral suppression with optimal lipid and cardiovascular health. Dyslipidemia during pregnancy is not uncommon due to physiological changes in lipid levels but requires careful management, particularly when pre-existing lipid disorders are present, to avert complications like preeclampsia, necessitating risk-benefit analysis before pharmacological interventions, favoring lifestyle modifications for safety. The Diabetes Prevention Program highlights the role of comprehensive lifestyle modifications in preventing the progression of dyslipidemia, illustrating that interventions such as weight loss, dietary changes, and physical activity can significantly reduce fasting glucose and improve lipid profiles, thus reducing subsequent diabetes and cardiovascular disease risk. 24. The prevalence of dyslipidemia is significantly higher in patients with chronic kidney disease due to alterations in lipid metabolism related to reduced kidney function, necessitating nuanced management strategies that address both cardiovascular protection and renal considerations, often necessitating cross-specialty collaboration. 25. Plant stanols and sterols, natural substances found in small amounts in many fruits, vegetables, nuts, seeds, cereals, and legumes, can help lower LDL cholesterol levels by reducing cholesterol absorption in the intestine and are often incorporated in dietary strategies for managing mild dyslipidemia or supplementing pharmacotherapy. 26. Ezetimibe, which functions by inhibiting the absorption of cholesterol in the small intestine, can effectively lower LDL cholesterol levels, especially when used in combination with statins, providing an option for patients who require additional LDL reduction but might be unable to tolerate higher statin doses. 27. Secondary prevention trials such as PROVE-IT-TIMI 22 have reinforced the concept of achieving more aggressive LDL cholesterol targets in patients with established cardiovascular disease, suggesting that the lower, the better paradigm applies to minimize recurrent cardiovascular events in high-risk dyslipidemic patients. 28. Mediterranean-style diets, rich in monounsaturated fats from olive oil, nuts, and fish, have shown promising results in improving lipid profiles and reducing cardiovascular disease risk in patients with dyslipidemia, thus providing a culturally adaptable dietary pattern with a strong evidence base for health promotion. 29. Director of the 7-country study, Insel Keys highlighted the association between dietary fat and cardiovascular disease, laying the groundwork for dietary guidelines that emphasize reduction of saturated fat intake to ameliorate dyslipidemia and decrease the incidence of atherosclerosis-related conditions. 30. Adolescents with obesity are increasingly being identified with dyslipidemia, which necessitates strategies focused on comprehensive lifestyle interventions alongside consideration of pharmacotherapy in select cases, to address both current cardiovascular risk and potential future health implications. 31. Emerging evidence about the lipid triad, high LDL cholesterol, high triglycerides, and low HDL cholesterol, underscores the need for multifactorial approaches in dyslipidemia management to address underlying metabolic abnormalities that may potentiate cardiovascular risk through synergistic pathophysiological mechanisms. 32. Statin-associated muscle symptoms, a common reason for statin discontinuation, require careful clinical evaluation to ensure compliance and persistent lipid-lowering benefits, while considering alternative dosing strategies, adjunctive non-statin therapies, or newer agents like PCSK9 inhibitors as potential substitutions. 3. The association of dyslipidemia with sleep apnea is becoming recognized, with disrupted sleep contributing to systemic inflammation and altered lipid metabolism. Hence, diagnosing and treating sleep apnea might mitigate dyslipidemic profiles and reduce cardiovascular risk in susceptible individuals. 34. Genetic testing in dyslipidemia can identify specific mutations causal of lipid abnormalities, offering pathway-based treatment approaches and enabling personalized risk assessment for offspring in families with hereditary dyslipidemias, with potential implications for proactive interventions in at-risk populations. 35. Patients with type 1 diabetes are not exempt from dyslipidemia, with the risk influenced largely by glycemic control and presence of diabetes-related complications, meriting comprehensive lipid management to thwart accelerated atherosclerosis even in the absence of traditional obesity-linked lipid aberrations. 36. The role of bile acid sequestrants such as cholestyramine, once a mainstay in cholesterol-lowering therapies, still persists today for lipid management, particularly in patients who require non-systemic intervention options or with contraindications to first-line lipid-lowering medications like statins. (37) Gender differences in response to dyslipidemia treatments may exist, with women potentially benefiting more from statin therapy than men in terms of cardiovascular risk reduction, highlighting the need for gender-specific research and personalized treatments to optimally address dyslipidemia-related risks. (38) Dyslipidemia is often part of a cluster of conditions in metabolic syndrome, including hypertension and insulin resistance, which together greatly intensify cardiovascular risk, mandating simultaneous, comprehensive management strategies to effectively modify the cardiovascular landscape in affected individuals. (39) Dyslipidemia in children and adolescents can herald future cardiovascular risks and is often exacerbated by obesity, contributing to early atherosclerotic changes and necessitating early lifestyle interventions and possible pharmacologic treatments to combat long-term cardiovascular health detriments. (40) Recent studies suggest a potential benefit of coenzyme Q10 supplementation in alleviating statin-associated myopathy, positing a role in improving muscle insulation and utilization of energy reserves, although more robust trials are needed to delineate its efficacy and safety in dyslipidemic management. (41) High-sensitivity C-reactive protein, HSCRP, although not a traditional marker of dyslipidemia, serves as an adjunctive biomarker for cardiovascular risk stratification in patients with lipid aberrations, potentially guiding therapeutic intensification where subclinical inflammation coexists. (42) In chronic inflammatory states such as rheumatoid arthritis, dyslipidemia presents unique challenges, as systemic inflammation can alter lipid metabolism, reciprocally increasing cardiovascular risk, therefore necessitating judicious therapeutic approaches that address both lipid abnormalities and underlying inflammation. (43) The lipid study solidified the benefit of statin therapy in secondary prevention by demonstrating substantial reduction in cardiovascular events among those with established coronary heart disease, irrespective of baseline cholesterol levels, affirming statin therapy's critical role in dyslipidemic cardiovascular risk mitigation. (44) The existence of mixed dyslipidemia, characterized by concomitant elevations in LDL and triglycerides and low HDL, demands a detailed lipid management plan that incorporates lifestyle changes, pharmacotherapy, and regular monitoring to thwart its complex contributory role in atherogenesis. (45) Ethnic differences influence dyslipidemia profiles and subsequent cardiovascular risk, necessitating that clinicians consider such disparities when developing and deploying preventive and therapeutic strategies to ensure efficacy that is tailored to diverse population settings. (46) Dyslipidemia management in the elderly is often nuanced by polypharmacy and altered drug metabolism, necessitating a judicious approach to lipid-lowering therapies to balance the benefits of cardiovascular risk reduction with potential adverse effects and drug interactions. (47) The British Heart Foundation emphasizes the importance of a tailored dietary approach, fine-tuning nutritional intake, paying close attention to macronutrient distribution and caloric composition, as first-line therapy in the management of dyslipidemia, emphasizing the utility of food-based interventions in healthcare. (48) Patients hospitalized for acute coronary syndromes can benefit from early initiation of statin therapy, which has been evidenced to rapidly stabilize vulnerable plaques, reduce inflammatory markers, and improve overall survival in the context of aggressive dyslipidemia management. (49) Alcohol consumption has a complex relationship with dyslipidemia, with moderate intake potentially increasing HDL cholesterol, yet excessive consumption poses cardiovascular risks through triglyceride elevation and hepatotoxicity, necessitating context-specific guidance on alcohol intake for lipid management. 50. Although dyslipidemia screening recommendations may vary, they generally advocate for routine lipid profiling beginning in adulthood, or earlier in those with family histories of premature cardiovascular disease, to facilitate timely identification and initiation of appropriate interventions to forestall progression of lipid-related cardiovascular damage. One, Alzheimer's disease, a progressive neurodegenerative disorder, primarily affects the elderly, leading to memory loss and cognitive decline, and is characterized by the accumulation of amyloid beta plaques and tau tangles in the brain, which disrupt neural communication and lead to cell death, distinguishing it from other forms of dementia and necessitating comprehensive clinical evaluation for accurate diagnosis and management involving pharmacological and non-pharmacological strategies. 2. One of the first and most recognizable symptoms of Alzheimer's disease is short-term memory loss, often starting subtly with the affected individual frequently forgetting recent events or newly acquired information, and may eventually lead to more serious cognitive impairments, underscoring the importance of early detection strategies that can help manage symptoms and potentially slow disease progression before significant cognitive decline sets in. 3. Although Alzheimer's disease affects both sexes, women appear to be at a higher risk than men, which might be attributed to differences in life expectancy, hormonal influences, or genetic factors such as the differential impact of APOE4 allele, suggesting the need for gender-tailored approaches in risk assessment, prevention, and therapeutic interventions tailored specifically for women. 4. The diagnosis of Alzheimer's disease is primarily clinical based on detailed patient history, cognitive testing, and neuroimaging techniques such as MRI or PET scans that may reveal characteristic brain changes like hippocampal atrophy and decreased glucose metabolism in specific areas, confirming the presence of the disease and aiding in differentiating it from other cognitive disorders. 5. Alzheimer's disease is thought to have a substantial genetic component, with mutations in genes such as AP, PSEN1, and PSEN2 leading to familial forms of the disease, while the presence of the APOE4 allele increases the risk of sporadic Alzheimer's, highlighting the complex interplay between genetic predisposition and environmental factors in the etiology of the disorder. 6. Interest in biomarkers for Alzheimer's disease is growing, with cerebrospinal fluid (CSF) levels of amyloid beta and tau proteins showing promise in reflecting pathological changes, alongside novel blood tests currently under investigation, which aim to provide less invasive, cost-effective options for early detection, tracking disease progression, and evaluating responses to therapeutic interventions. 7. Neuroinflammation is increasingly recognized as a significant factor in the pathophysiology of Alzheimer's disease, with microglial activation contributing to neuronal damage, supporting the idea that targeting inflammatory pathways could be a potential therapeutic strategy to slow or modify disease progression, which research is actively investigating through varied pharmacological approaches. 8. Cholinesterase inhibitors, such as donepezil, rivastigmine, and galantamine, constitute a primary treatment for mild to moderate Alzheimer's disease by enhancing the levels of acetylcholine in the brain, which helps alleviate symptoms related to neurotransmitter deficiencies, although their effects may be modest and decline as the disease progresses, requiring ongoing evaluation and adjustment of therapeutic strategies. 9. Recent advancements in positron emission tomography (PET) scans utilizing specific tracers like Pittsburgh Compound B (PIB) have allowed for visualization and quantification of amyloid plaques in the living brain, providing a powerful tool not only in improving diagnostic accuracy of Alzheimer's disease but also in the development and assessment of new anti-amyloid therapies. 10. Alzheimer's disease presents with a wide range of symptoms that gradually worsen over time, starting from mild cognitive impairments and advancing to more severe impairments including language difficulties, disorientation, mood swings, behavioral changes, and ultimately the loss of the ability to carry out everyday activities, requiring comprehensive care strategies that address both cognitive and non-cognitive symptoms for effective management. (11) Vascular factors like hypertension, diabetes, and hyperlipidemia are considered potential risk factors for Alzheimer's disease, suggesting that optimal control of these conditions through lifestyle modifications and appropriate pharmacotherapy might reduce the risk of cognitive decline or slow its progression, though more research is needed to confirm these associations. 12. Oxidative stress is thought to play a critical role in the pathogenesis of Alzheimer's disease by damaging cell membranes, proteins, and DNA, thus contributing to neuronal dysfunction and death, and understanding these oxidative mechanisms has spurred research into antioxidants and other compounds that could potentially ameliorate such damage as part of therapeutic efforts. (13) Alzheimer's disease is clinically divided into several stages: preclinical, mild cognitive impairment, MCI, due to Alzheimer's, and dementia due to Alzheimer's disease, with each stage characterized by its own set of cognitive and functional impairments, which inform the prognosis, management decisions, and provide guidance for planning care and support tailored to the needs of patients at each stage. (14) The role of lifestyle factors such as diet, physical activity, and cognitive engagement in possibly lowering the risk of Alzheimer's has garnered attention, with studies suggesting that adherence to a Mediterranean diet, regular exercise, and mental stimulation may contribute to maintaining cognitive health and potentially delay the onset or progression of Alzheimer's disease, although direct causal relationships remain under investigation. 15. Bilingualism has been proposed to offer a protective cognitive reserve that may delay the onset of Alzheimer's disease symptoms, with research suggesting that the lifelong practice of managing two linguistic systems enhances neural networks and cognitive flexibility, potentially serving as a non-pharmacological intervention to reduce the risk of cognitive decline. 16. In patients with advanced Alzheimer's disease, sundowning, a phenomenon where symptoms such as confusion, anxiety, agitation, and disorientation worsen during the late afternoon and evening hours, poses significant challenges for caregivers, highlighting the importance of structured routines, environmental adjustments, and potentially pharmacological interventions in managing this behavioral aspect. 17. Although there is yet no cure for Alzheimer's disease, ongoing research is exploring several novel therapeutic approaches, including monoclonal antibodies targeting amyloid beta and tau proteins, small molecule inhibitors, gene therapy, and neuroprotective strategies, which aim to modify disease progression, improve symptoms, and enhance the quality of life for affected individuals. 18. Environmental factors, such as exposure to heavy metals, pesticides, and air pollution, have been investigated for their potential roles in the pathogenesis of Alzheimer's disease, underscoring the need for further research to understand these influences and develop public health initiatives aimed at reducing potential environmental risks associated with cognitive decline. 19. Frontal lobe dysfunction in Alzheimer's disease can lead to a variety of symptoms including decision-making difficulties, changes in personality, impaired judgment, and social behavior alterations, which complicate the care of affected individuals and necessitate tailored interventions to address these deficits and improve overall functional outcomes. 20. Alzheimer's patients are at a heightened risk of epilepsy, with seizures commonly appearing in the later stages of the disease, likely due to increased neuronal hyperexcitability resulting from neurodegenerative processes, emphasizing the need for awareness among clinicians to ensure timely diagnosis and management of seizures to improve patient safety and quality of life. 21. The use of assistive technology and adaptive strategies, such as memory aids, simplified communication devices, and environmental modifications, plays a crucial role in enhancing the quality of life and independence of individuals with Alzheimer's disease, allowing them to maintain functional abilities longer and providing essential support for caregivers in managing daily challenges. 22. Neuropsychological testing in Alzheimer's disease serves as a vital tool for assessing the breadth and depth of cognitive impairments, differentiating it from other dementias or psychiatric conditions, and establishing baselines for tracking disease progression, guiding treatment decisions, and evaluating the effectiveness of therapeutic interventions over time. 23. The concept of cognitive reserve implies that individuals with higher educational attainment, mentally stimulating occupations, or active engagement in complex environments may exhibit a delay in the onset of Alzheimer's symptoms, as they can better compensate for neurodegenerative changes, underlining the importance of lifelong learning and intellectual engagement in potentially mitigating cognitive decline. 24. The gut-brain axis is an emerging area of research in Alzheimer's disease, with studies investigating how alterations in the gut microbiota may influence neuroinflammation and amyloid plaque formation, suggesting potential new avenues for intervention through diet, probiotics, and microbiome-modulating therapies as part of a comprehensive approach to treatment. 25. Brain-derived neurotrophic factor, BDNF, levels have been implicated in the cognitive decline observed in Alzheimer's disease, with reduced levels associated with weak synaptic plasticity and neuronal survival. This insight supports the exploration of BDNF-enhancing strategies, possibly through pharmacological agents, lifestyle changes, and exercise, to promote cognitive health and slow disease progression. 26. Sleep disturbances, including insomnia and altered sleep-wake cycles, are common in Alzheimer's disease and can exacerbate cognitive symptoms, increase caregiver stress, and affect overall health, making sleep assessment and management an essential component in the comprehensive care and quality of life improvement of individuals with this condition. 27. The potential role of cholesterol metabolism in Alzheimer's disease has drawn interest given its effect on amyloid beta production and clearance, suggesting a possible link between dyslipidemias and increased disease risk, with ongoing studies exploring the impact of statin use and other lipid-modifying therapies as part of a multifaceted approach to disease management and prevention. 28. Advanced neuroimaging techniques, such as diffusion tensor imaging, DTI, and functional MRI, fMRI, provide deeper insights into structural and functional changes within the brains of Alzheimer's patients, allowing for a more detailed understanding of neural connectivity disturbances and the development of biomarkers for early disease detection and monitoring therapy responses. 29. Individuals with Down syndrome have a significantly increased risk of developing Alzheimer's disease, typically at an earlier age, due in part to the presence of an extra copy of chromosome 21, which harbors the gene for amyloid precursor protein, AP, highlighting the importance of targeted surveillance and early intervention strategies in this high-risk population. 30. Systemic inflammation, such as that resulting from chronic infections or autoimmune conditions, has been implicated in the progression of Alzheimer's disease, suggesting that managing systemic inflammatory processes might hold potential as a therapeutic approach to delaying or mitigating neurodegenerative changes associated with this condition. 31. The role of synaptic dysfunction in Alzheimer's disease is pivotal, with the loss of synapses considered a primary driver of cognitive decline, focusing research interest on synaptic repair and protection strategies, including the development of neurotrophic factors and modulators of synaptic plasticity, aiming to restore cognitive functions and halt disease progression. 32. Recent research into Alzheimer's has highlighted the potential of neurotrophins, such as nerve growth factor and brain-derived neurotrophic factor, which support neuronal growth and survival, Targeting these molecules could lead to novel therapeutic interventions aimed at promoting neuroregeneration and functional recovery in patients affected by the disease. 3.3. The use of multi-domain lifestyle interventions, encompassing diet, exercise, cognitive training, and social engagement, as observed in the FINGER study and subsequent trials, shows promise in reducing the risk of cognitive decline and preserving cognitive function in at-risk populations, suggesting the importance of a holistic approach to Alzheimer's disease prevention. 34. Metal homeostasis, particularly the interactions of copper, zinc, and iron, is an area of increasing interest in Alzheimer's research, given the role these metals play in amyloid beta aggregation and tau phosphorylation, raising the prospect of metal-modulating therapies as a means to alter disease course and improve patient outcomes. 35. The presence of neurofibrillary tangles, composed of hyperphosphorylated tau protein, is a hallmark of Alzheimer's disease, disrupting intracellular transport and contributing to neuronal death, with ongoing research exploring tau-directed therapies to prevent tangle formation and spread, thereby offering potential for disease-modifying treatments. 36. Alzheimer's disease is associated with alterations in neurotransmitter systems beyond acetylcholine, including glutamate, gamma-aminobutyric acid, GABA, and serotonin pathways. Understanding these changes informs the development of new pharmacological treatments aiming to restore neurotransmitter balance and alleviate cognitive and behavioral symptoms. 37. While age remains the most significant risk factor for Alzheimer's disease, other modifiable risk factors like physical inactivity, smoking, obesity, and midlife hypertension offer opportunities for preventive interventions, underscoring the importance of public health strategies focusing on lifestyle modification to reduce disease burden and enhance longevity. 38. The proteinopathy hypothesis postulates that misfolded proteins, such as amyloid beta and tau, propagate through neural networks via prion-like mechanisms, contributing to the progression of Alzheimer's disease, driving research into therapies that target these propagation pathways to halt or slow the spread of neuropathological changes across brain regions. 39. Recent trials with monoclonal antibodies like aducanumab have provided insights into the feasibility and challenges of amyloid-targeted therapies, showing potential in reducing amyloid plaque burden. Yet the clinical significance regarding cognitive benefits remains under debate, necessitating continued evaluation in larger and more diverse patient populations. 40. The cholinergic hypothesis of Alzheimer's disease proposes that a deficiency in acetylcholine contributes to cognitive deficits and memory loss, providing the rationale for the development of cholinesterase inhibitors as symptomatic treatments and stimulating ongoing research into novel therapies aiming to enhance cholinergic function in the brain. 41. Depression and anxiety are common comorbidities in Alzheimer's patients, complicating the clinical picture and impacting quality of life. Recognizing and addressing these mood disorders through pharmacological and non-pharmacological means is crucial for comprehensive care and improving patient and caregiver well-being. 42. Autophagy, the cellular process of degrading and recycling damaged components, has been implicated in Alzheimer's disease, with research suggesting disruptions in autophagic flux may lead to the accumulation of misfolded proteins. This highlights the potential for therapies aimed at enhancing autophagy as a strategy to clear amyloid beta and tau aggregates. 43. Understanding the interplay between cerebrovascular changes and Alzheimer's disease has led to the concept of mixed dementia, where vascular pathology coexists with neurodegenerative changes, stressing the need for integrated diagnostic approaches and interventions addressing both vascular health and neurodegeneration for optimal patient outcomes. 44. The phenomenon of anosognosia, or lack of awareness of one's cognitive deficits, is frequently observed in Alzheimer's patients, presenting challenges for diagnosis, management, and patient care, and necessitating the development of supportive strategies that involve caregivers in decision-making and care planning to address safety concerns and enhance quality of life. Amyloid beta oligomers are considered highly neurotoxic entities contributing to synaptic dysfunction and neurodegeneration in Alzheimer's disease, focusing therapeutic research on targeting these soluble assemblies to prevent synaptic impairment and promote cognitive preservation, expanding potential avenues for disease-modifying interventions. 46. Alzheimer's disease-related amyloid angiopathy involves the deposition of amyloid beta in cerebral blood vessels, leading to increased risk of microbleeds and hemorrhagic stroke, highlighting the importance of vascular health monitoring and management of cerebrovascular risk factors as part of comprehensive care strategies for affected individuals. 47. The role of mitochondrial dysfunction in Alzheimer's disease pathogenesis has gained attention, with evidence suggesting that impaired energy dynamics and increased oxidative stress contribute significantly to neuronal death, driving research into mitochondrial targeted therapies aiming to restore energy balance and protect against neurodegeneration. 48. The APOE4 allele is the most common genetic risk factor associated with sporadic Alzheimer's disease, increasing the likelihood of developing the condition and influencing age of onset, but ongoing research is exploring gene editing technologies and other novel strategies that could alter APOE expression or function to modify disease risk. 49. The selection of potential therapeutic targets in Alzheimer's disease often relies on preclinical models, including transgenic animals engineered to develop amyloid plaques and tau tangles, which provide critical insights into disease mechanisms and facilitate the evaluation of disease-modifying treatments, though translating findings from models to human patients remains a challenge. 50. Multimodal intervention trials highlight the potential benefits of combining pharmacological treatments with lifestyle modifications and cognitive training to optimize care for Alzheimer's patients, underscoring the significance of early intervention and individualized care plans that address both the biological and environmental aspects of disease management. 1. Hepatitis C, a viral infection primarily affecting the liver, is caused by the hepatitis C virus, HCV, and can progress silently over decades, leading to chronic liver disease in approximately 50 to 80% of infected individuals due to the virus's ability to evade immune detection and establish a persistent infection. 2. The hepatitis C virus is predominantly transmitted through blood-to-blood contact, with intravenous drug use being the most common route, and despite substantial reductions in transmission rates thanks to blood screening, unsafe medical practices in some parts of the world remain a significant risk factor for new infections. 3. Diagnosis of hepatitis C involves both serological and molecular tests, where an initial enzyme immunoassay detects antibodies to the virus, followed by a confirmatory PCR test to measure the viral load and assess if the infection is active and requires treatment intervention. 4. Chronic hepatitis C infection can lead to complications such as cirrhosis and hepatocellular carcinoma due to ongoing liver inflammation and fibrosis, making regular screening and monitoring essential for those at risk or diagnosed, to ensure timely intervention and reduce the risk of severe liver damage. 5. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering over 90% cure rates with oral medications that target different stages of the viral life cycle, providing shorter, more effective treatment courses with fewer side effects compared to older interferon-based therapies. 6. Hepatitis C exhibits 6 different genotypes, with genotype 1 being the most prevalent worldwide, and identifying the genotype is crucial in the tailoring of antiviral treatment plans that consider genotype-specific efficacy, optimizing therapeutic outcomes for the patient. 7. The liver injury from hepatitis C is characterized by immune-mediated mechanisms where the virus persists within hepatocytes, evading immunity and creating an inflammatory state that drives progressive liver damage and potential fibrosis, ultimately affecting liver function and health. 8. Liver fibrosis staging is essential in managing hepatitis C, where non-invasive tests like elastography can assess liver stiffness, reducing the need for liver biopsies and helping to guide treatment decisions and predict progression to more severe liver disease, such as cirrhosis. 9. Hepatitis C is not only a liver disease but also has systemic implications, with extrahepatic manifestations including type 2 diabetes, glomerulonephritis, and lymphoma, affecting multiple organ systems and significantly impacting the quality of life and prognosis of affected patients. The natural history of chronic hepatitis C infection varies greatly among individuals, with factors such as host genetics, viral genotype, and environmental influences like alcohol consumption playing critical roles in disease progression and liver damage severity over time. 11. Horizontal transmission of hepatitis C can occur through sexual contact, though it is less efficient than other routes, making it essential for patients and partners to take preventative measures, especially those with high-risk behaviors that increase exposure likelihood. 12. Effective public health strategies for hepatitis C control focus on harm reduction methods like needle exchange programs, safe blood supply practices, and awareness campaigns that aim to reduce transmission and promote early detection and treatment in high-risk populations. 13. Hepatitis C infection can lead to an alteration in liver enzyme levels, commonly presenting as elevated aminotransferases on routine laboratory tests, which can trigger further investigation into the viral status when considered in conjunction with appropriate clinical risk factors. 14. The introduction of universal hepatitis C screening guidelines for adults born between 1945 and 1965 significantly enhanced early detection of chronic infections within this cohort, who are believed to be at higher risk due to past healthcare practices that may have exposed them to the virus. 15. While there is currently no vaccine for hepatitis C, ongoing research is focused on developing strategies to induce robust immune responses capable of protective immunity, with the hope of one day preventing HCV infections and reducing the global burden of this liver disease. 16. In patients with chronic hepatitis C, co-infections with other blood-borne viruses, such as HIV or hepatitis B, can exacerbate liver injury, complicating management, and necessitating careful coordination of treatment regimens to address the interplay between these infections. 17. Reinfection with hepatitis C is a concern, particularly in high-risk populations, as past infection or clearance does not confer immunity, underlining the importance of continuous preventive efforts even after successful treatment, to avoid relapse or new infections. 18. Steatosis, or fatty liver, is a common histological feature in chronic hepatitis C, particularly with genotype 3 infections, and contributes to liver injury and progression of fibrosis by increasing hepatic inflammation and oxidative stress within the liver tissue. 19. Autoimmune phenomena are associated with hepatitis C, as the virus can trigger immune dysregulation, leading to conditions such as mixed cryoglobulinemia, which presents with a triad of purpura, arthralgia, and weakness, requiring integrated management strategies. 20. Despite universal precautions, occupational exposure to hepatitis C remains a calculated risk for healthcare workers, especially in situations involving needle stick injuries or direct contact with blood, highlighting the importance of post-exposure protocols and early intervention. #21. FibroScan is a valuable non-invasive diagnostic tool in hepatitis C management, using transient elastography to provide an accurate measure of liver stiffness, facilitating the assessment of fibrosis without the need for invasive biopsies, which can be costly and painful. #22. In hepatitis C patients, alcohol consumption accelerates liver damage, promoting fibrosis and increasing the risk of cirrhosis, making abstinence from alcohol a critical recommendation for lifestyle modification to prevent complications and improve treatment outcomes. #23. Hepatitis C and pregnancy require special attention, as vertical transmission rates during childbirth are approximately 5%, with risk enhanced by high viral loads, necessitating strategies to minimize this transmission risk and ensure prompt evaluation of newborns. #24. Chronic hepatitis C has been linked to neurocognitive dysfunction, affecting memory, concentration, and mood, a condition known as hepatic encephalopathy, which can occur even in the absence of cirrhosis, impacting daily function and quality of life for patients. #25. Combination therapies for hepatitis C that utilize multiple direct-acting antiviral agents are designed to prevent viral resistance by targeting different viral proteins, ensuring a higher barrier to resistance and increasing the likelihood of treatment success. #26. The presence of hepatitis C antibodies in laboratory tests indicates exposure to the virus, but confirmatory RNA testing is required to distinguish between past, resolved infections and active infections that necessitate treatment to prevent liver damage. #27. The discovery of the hepatitis C virus in the late 1980s, a triumph of molecular biology, closed a historical gap in understanding non-A, non-B hepatitis, catalyzing research and development of diagnostics, treatment options, and a clearer understanding of transmission. #28. Chronic hepatitis C impacts glucose metabolism, increasing the risk of insulin resistance and development of type 2 diabetes, which contributes to liver fibrosis and further complicates the management of liver disease in affected individuals. #29. The Common Fibrosis 4 (FIB4) score, calculated from routine lab data such as age, liver enzymes, and platelet count, serves as a useful and widely accessible tool for assessing liver fibrosis in hepatitis C infected individuals, guiding clinical decision-making. #30. Hepatitis C co-infection with HIV poses unique challenges, as both viruses share transmission pathways and exacerbate one another's effects on liver disease progression, requiring a cohesive treatment approach to address both infections effectively. #31. Successful eradication of hepatitis C with antiviral therapy has been shown to reduce the incidence of liver-related complications and improve survival rates, underscoring the importance of achieving a sustained virologic response as the primary goal of treatment. #32. Hepatitis C-associated mixed cryoglobulinemia can manifest as vasculitis, impacting the skin, kidneys, and peripheral nerves, driven by immune complexes and necessitating treatment that addresses both the viral cause and symptomatic relief of vasculitic symptoms. #33. Identifying liver histopathology, such as lymphoid aggregates or bile duct injury alongside steatosis and inflammation, helps refine the diagnosis of hepatitis C and its staging, offering critical insights into the degree of liver damage and guiding therapeutic strategies. #34. Hepatitis C genotype 3 confers an increased risk of hepatic steatosis and faster progression to cirrhosis compared to other genotypes, leading to tailored treatment regimens and vigilant monitoring for this subgroup to prevent rapid liver deterioration. The global distribution of hepatitis C genotypes reflects historical and geographical patterns of human migration and behavior, influencing research strategies that focus on region-specific genotypic prevalence to optimize treatment efficacy and accessibility. The advent of DAAs has changed the landscape of hepatitis C epidemiology, allowing for treatment plans that accommodate diverse populations with varying healthcare access, aiming to eliminate diagnostic and therapeutic disparities and reduce the overall disease burden. In hepatitis C, advanced liver fibrosis correlates with increased risk of hepatocellular carcinoma, warranting surveillance strategies that include regular imaging and laboratory assessments post-therapy to catch any malignancy early and manage it effectively. Host genetic factors, such as polymorphisms in the IL-2AB gene, influence treatment response and spontaneous clearance rates of hepatitis C, providing personalized risk assessment and therapy customization that predict patient-specific therapeutic outcomes. Chronic hepatitis C has complex effects on lipid metabolism, often resulting in dyslipidemia, which may contribute to cardiovascular risk profiles and necessitate a comprehensive approach to managing not only liver health but also associated systemic comorbidities. Hepatitis C-related hepatic inflammation and fibrosis may be modulated by certain cytokines, such as TGF-beta, which promotes fibroblast activation and scar formation in the liver, offering potential targets for antifibrotic therapies under exploration. Socioeconomic factors significantly impact hepatitis C outcomes, as populations with limited healthcare access or education may experience delayed diagnoses and inconsistent treatment adherence, challenging public health efforts to control and eliminate the virus. The hepatitis C virus's ability to mutate rapidly aids its evasion of host immune responses, contributing to chronic infection and highlighting the need for multifaceted therapeutic approaches that target multiple viral elements to achieve sustained clearance. While liver transplantation may be necessary for end-stage liver disease resulting from hepatitis C, recurrence of the virus in the new liver is common without successful viral clearance pre- or post-transplantation, informing the timing and strategies of antiviral regimens. Understanding the natural reservoirs and evolutionary origins of hepatitis C involves studying related hepiciviruses in non-human primates, which may offer insights into viral transmission dynamics and inform future approaches to vaccine development and public health strategies. The role of cellular apoptosis in hepatitis C-related liver injury involves both hepatocyte and immune cell pathways, emphasizing a complex interplay where therapeutic strategies aim to limit cell death and preserve liver health by mitigating ongoing immune-driven damage. Hepatitis C can mediate changes in the gut-liver axis, impacting microbiome balance and cytokine release that contribute to systemic inflammation, necessitating strategies that consider gut health in the holistic management of chronic liver diseases. Advances in biomarkers for hepatitis C have facilitated the classification of liver disease severity and response to treatment, enhancing patient management by allowing more personalized approaches to therapy based on dynamic, accessible, and non-invasive measurements. With hepatitis C eradication being achievable in many patients, follow-up care remains pivotal to ensuring long-term health, as previously infected individuals may still face residual risks of liver disease complications or comorbid conditions that require ongoing monitoring. (49) The psychosocial aspects of living with hepatitis C include stigma and mental health challenges, underscoring the necessity of comprehensive care models that incorporate psychological support alongside medical treatment to support patient resilience and enhance quality of life. (50) The development of pangenotypic antivirals for hepatitis C has brought forth a new era of simplified treatment regimens that transcend genotypic boundaries, offering therapy options with wide-ranging efficacy across all genotypes and reducing the barriers to successful viral eradication. (1) Alzheimer's disease, a progressive neurodegenerative disorder, primarily affects the elderly, leading to memory loss and cognitive decline, and is characterized by the accumulation of amyloid beta plaques and tau tangles in the brain, which disrupt neural communication and lead to cell death, distinguishing it from other forms of dementia and necessitating comprehensive clinical evaluation for accurate diagnosis and management involving pharmacological and non-pharmacological strategies. (2) One of the first and most recognizable symptoms of Alzheimer's disease is short-term memory loss, often starting subtly with the affected individual frequently forgetting recent events or newly acquired information, and may eventually lead to more serious cognitive impairments, underscoring the importance of early detection strategies that can help manage symptoms and potentially slow disease progression before significant cognitive decline sets in. (3) Although Alzheimer's disease affects both sexes, women appear to be at a higher risk than men, which might be attributed to differences in life expectancy, hormonal influences, or genetic factors such as the differential impact of APOE4 allele, suggesting the need for gender-tailored approaches in risk assessment, prevention, and therapeutic interventions tailored specifically for women. (4) The diagnosis of Alzheimer's disease is primarily clinical based on detailed patient history, cognitive testing, and neuroimaging techniques such as MRI or PET scans that may reveal characteristic brain changes like hippocampal atrophy and decreased glucose metabolism in specific areas, confirming the presence of the disease and aiding in differentiating it from other cognitive disorders. (5) Alzheimer's disease is thought to have a substantial genetic component, with mutations in genes such as AP, PSEN1, and PSEN2 leading to familial forms of the disease, while the presence of the APOE4 allele increases the risk of sporadic Alzheimer's, highlighting the complex interplay between genetic predisposition and environmental factors in the etiology of the disorder. (6) Interest in biomarkers for Alzheimer's disease is growing, with cerebrospinal fluid (CSF) levels of amyloid beta and tau proteins showing promise in reflecting pathological changes, alongside novel blood tests currently under investigation, which aim to provide less invasive, cost-effective options for early detection, tracking disease progression, and evaluating responses to therapeutic interventions. (7) Neuroinflammation is increasingly recognized as a significant factor in the pathophysiology of Alzheimer's disease, with microglial activation contributing to neuronal damage, supporting the idea that targeting inflammatory pathways could be a potential therapeutic strategy to slow or modify disease progression, which research is actively investigating through varied pharmacological approaches. (8) Cholinesterase inhibitors, such as donepezil, rivastigmine, and galantamine, constitute a primary treatment for mild to moderate Alzheimer's disease by enhancing the levels of acetylcholine in the brain, which helps alleviate symptoms related to neurotransmitter deficiencies, although their effects may be modest and decline as the disease progresses, requiring ongoing evaluation and adjustment of therapeutic strategies. (9) Recent advancements in positron emission tomography (PET) scans utilizing specific tracers like Pittsburgh compound B, PIB, have allowed for visualization and quantification of amyloid plaques in the living brain, providing a powerful tool not only in improving diagnostic accuracy of Alzheimer's disease but also in the development and assessment of new anti-amyloid therapies. Alzheimer's disease presents with a wide range of symptoms that gradually worsen over time, starting from mild cognitive impairments and advancing to more severe impairments including language difficulties, disorientation, mood swings, behavioral changes, and ultimately the loss of the ability to carry out everyday activities, requiring comprehensive care strategies that address both cognitive and non-cognitive symptoms for effective management. Vascular factors like hypertension, diabetes, and hyperlipidemia are considered potential risk factors for Alzheimer's disease, suggesting that optimal control of these conditions through lifestyle modifications and appropriate pharmacotherapy might reduce the risk of cognitive decline or slow its progression, though more research is needed to confirm these associations. Oxidative stress is thought to play a critical role in the pathogenesis of Alzheimer's disease by damaging cell membranes, proteins, and DNA, thus contributing to neuronal dysfunction and death, and understanding these oxidative mechanisms has spurred research into antioxidants and other compounds that could potentially ameliorate such damage as part of therapeutic efforts. Alzheimer's disease is clinically divided into several stages: preclinical, mild cognitive impairment, MCI, due to Alzheimer's, and dementia due to Alzheimer's disease, with each stage characterized by its own set of cognitive and functional impairments, which inform the prognosis, management decisions, and provide guidance for planning care and support tailored to the needs of patients at each stage. The role of lifestyle factors such as diet, physical activity, and cognitive engagement in possibly lowering the risk of Alzheimer's has garnered attention, with studies suggesting that adherence to a Mediterranean diet, regular exercise, and mental stimulation may contribute to maintaining cognitive health and potentially delay the onset or progression of Alzheimer's disease, although direct causal relationships remain under investigation. Bilingualism has been proposed to offer a protective cognitive reserve that may delay the onset of Alzheimer's disease symptoms, with research suggesting that the lifelong practice of managing two linguistic systems enhances neural networks and cognitive flexibility, potentially serving as a non-pharmacological intervention to reduce the risk of cognitive decline. In patients with advanced Alzheimer's disease, sundowning, a phenomenon where symptoms such as confusion, anxiety, agitation, and disorientation worsen during the late afternoon and evening hours, poses significant challenges for caregivers, highlighting the importance of structured routines, environmental adjustments, and potentially pharmacological interventions in managing this behavioral aspect. Although there is yet no cure for Alzheimer's disease, ongoing research is exploring several novel therapeutic approaches, including monoclonal antibodies targeting amyloid beta and tau proteins, small molecule inhibitors, gene therapy, and neuroprotective strategies, which aim to modify disease progression, improve symptoms, and enhance the quality of life for affected individuals. Environmental factors, such as exposure to heavy metals, pesticides, and air pollution, have been investigated for their potential roles in the pathogenesis of Alzheimer's disease, underscoring the need for further research to understand these influences and develop public health initiatives aimed at reducing potential environmental risks associated with cognitive decline. Frontal lobe dysfunction in Alzheimer's disease can lead to a variety of symptoms including decision-making difficulties, changes in personality, impaired judgment, and social behavior alterations, which complicate the care of affected individuals and necessitate tailored interventions to address these deficits and improve overall functional outcomes. 20. Alzheimer's patients are at a heightened risk of epilepsy, with seizures commonly appearing in the later stages of the disease, likely due to increased neuronal hyperexcitability resulting from neurodegenerative processes, emphasizing the need for awareness among clinicians to ensure timely diagnosis and management of seizures to improve patient safety and quality of life. 21. The use of assistive technology and adaptive strategies, such as memory aids, simplified communication devices, and environmental modifications, plays a crucial role in enhancing the quality of life and independence of individuals with Alzheimer's disease, allowing them to maintain functional abilities longer and providing essential support for caregivers in managing daily challenges. 22. Neuropsychological testing in Alzheimer's disease serves as a vital tool for assessing the breadth and depth of cognitive impairments, differentiating it from other dementias or psychiatric conditions, and establishing baselines for tracking disease progression, guiding treatment decisions, and evaluating the effectiveness of therapeutic interventions over time. 23. The concept of cognitive reserve implies that individuals with higher educational attainment, mentally stimulating occupations, or active engagement in complex environments may exhibit a delay in the onset of Alzheimer's symptoms, as they can better compensate for neurodegenerative changes, underlining the importance of lifelong learning and intellectual engagement in potentially mitigating cognitive decline. 24. The gut-brain axis is an emerging area of research in Alzheimer's disease, with studies investigating how alterations in the gut microbiota may influence neuroinflammation and amyloid plaque formation, suggesting potential new avenues for intervention through diet, probiotics, and microbiome-modulating therapies as part of a comprehensive approach to treatment. 25. Brain-derived neurotrophic factor, BDNF, levels have been implicated in the cognitive decline observed in Alzheimer's disease, with reduced levels associated with weak synaptic plasticity and neuronal survival. This insight supports the exploration of BDNF-enhancing strategies, possibly through pharmacological agents, lifestyle changes, and exercise, to promote cognitive health and slow disease progression. 26. Sleep disturbances, including insomnia and altered sleep-wake cycles, are common in Alzheimer's disease and can exacerbate cognitive symptoms, increase caregiver stress, and affect overall health, making sleep assessment and management an essential component in the comprehensive care and quality of life improvement of individuals with this condition. 27. The potential role of cholesterol metabolism in Alzheimer's disease has drawn interest given its effect on amyloid beta production and clearance, suggesting a possible link between dyslipidemias and increased disease risk, with ongoing studies exploring the impact of statin use and other lipid-modifying therapies as part of a multifaceted approach to disease management and prevention. 28. Advanced neuroimaging techniques, such as diffusion tensor imaging, DTI, and functional MRI, fMRI, provide deeper insights into structural and functional changes within the brains of Alzheimer's patients, allowing for a more detailed understanding of neural connectivity disturbances and the development of biomarkers for early disease detection and monitoring therapy responses. 29. Individuals with Down syndrome have a significantly increased risk of developing Alzheimer's disease, typically at an earlier age, due in part to the presence of an extra copy of chromosome 21, which harbors the gene for amyloid precursor protein, AP, highlighting the importance of targeted surveillance and early intervention strategies in this high-risk population. 30. Systemic inflammation, such as that resulting from chronic infections or autoimmune conditions, has been implicated in the progression of Alzheimer's disease, suggesting that managing systemic inflammatory processes might hold potential as a therapeutic approach to delaying or mitigating neurodegenerative changes associated with this condition. 31. The role of synaptic dysfunction in Alzheimer's disease is pivotal, with the loss of synapses considered a primary driver of cognitive decline, focusing research interest on synaptic repair and protection strategies, including the development of neurotrophic factors and modulators of synaptic plasticity, aiming to restore cognitive functions and halt disease progression. Recent research into Alzheimer's has highlighted the potential of neurotrophins, such as nerve growth factor and brain-derived neurotrophic factor, which support neuronal growth and survival. Targeting these molecules could lead to novel therapeutic interventions aimed at promoting neuroregeneration and functional recovery in patients affected by the disease. The use of multi-domain lifestyle interventions, encompassing diet, exercise, cognitive training, and social engagement, as observed in the Finger study and subsequent trials, shows promise in reducing the risk of cognitive decline and preserving cognitive function in at-risk populations, suggesting the importance of a holistic approach to Alzheimer's disease prevention. Metal homeostasis, particularly the interactions of copper, zinc, and iron, is an area of increasing interest in Alzheimer's research, given the role these metals play in amyloid beta aggregation and tau phosphorylation, raising the prospect of metal-modulating therapies as a means to alter disease course and improve patient outcomes. The presence of neurofibrillary tangles, composed of hyperphosphorylated tau protein, is a hallmark of Alzheimer's disease, disrupting intracellular transport and contributing to neuronal death, with ongoing research exploring tau-directed therapies to prevent tangle formation and spread, thereby offering potential for disease-modifying treatments. Alzheimer's disease is associated with alterations in neurotransmitter systems beyond acetylcholine, including glutamate, gamma-aminobutyric acid, GABA, and serotonin pathways. Understanding these changes informs the development of new pharmacological treatments aiming to restore neurotransmitter balance and alleviate cognitive and behavioral symptoms. While age remains the most significant risk factor for Alzheimer's disease, other modifiable risk factors like physical inactivity, smoking, obesity, and midlife hypertension offer opportunities for preventive interventions, underscoring the importance of public health strategies focusing on lifestyle modification to reduce disease burden and enhance longevity. The proteinopathy hypothesis postulates that misfolded proteins, such as amyloid beta and tau, propagate through neural networks via prion-like mechanisms, contributing to the progression of Alzheimer's disease, driving research into therapies that target these propagation pathways to halt or slow the spread of neuropathological changes across brain regions. Recent trials with monoclonal antibodies like aducanumab have provided insights into the feasibility and challenges of amyloid-targeted therapies, showing potential in reducing amyloid plaque burden. Yet the clinical significance regarding cognitive benefits remains under debate, necessitating continued evaluation in larger and more diverse patient populations. The cholinergic hypothesis of Alzheimer's disease proposes that a deficiency in acetylcholine contributes to cognitive deficits and memory loss, providing the rationale for the development of cholinesterase inhibitors as symptomatic treatments and stimulating ongoing research into novel therapies aiming to enhance cholinergic function in the brain. Depression and anxiety are common comorbidities in Alzheimer's patients, complicating the clinical picture and impacting quality of life. Recognizing and addressing these mood disorders through pharmacological and non-pharmacological means is crucial for comprehensive care and improving patient and caregiver well-being. Autophagy, the cellular process of degrading and recycling damaged components, has been implicated in Alzheimer's disease, with research suggesting disruptions in autophagic flux may lead to the accumulation of misfolded proteins. This highlights the potential for therapies aimed at enhancing autophagy as a strategy to clear amyloid beta and tau aggregates. 43. Understanding the interplay between cerebrovascular changes and Alzheimer's disease has led to the concept of mixed dementia, where vascular pathology coexists with neurodegenerative changes, stressing the need for integrated diagnostic approaches and interventions addressing both vascular health and neurodegeneration for optimal patient outcomes. '44. The phenomenon of anosognosia, or lack of awareness of one's cognitive deficits, is frequently observed in Alzheimer's patients, presenting challenges for diagnosis, management, and patient care, and necessitating the development of supportive strategies that involve caregivers in decision-making and care planning to address safety concerns and enhance quality of life. 45. Amyloid beta oligomers are considered highly neurotoxic entities contributing to synaptic dysfunction and neurodegeneration in Alzheimer's disease, focusing therapeutic research on targeting these soluble assemblies to prevent synaptic impairment and promote cognitive preservation, expanding potential avenues for disease-modifying interventions. 46. Alzheimer's disease-related amyloid angiopathy involves the deposition of amyloid beta in cerebral blood vessels, leading to increased risk of microbleeds and hemorrhagic stroke, highlighting the importance of vascular health monitoring and management of cerebrovascular risk factors as part of comprehensive care strategies for affected individuals. 47. The role of mitochondrial dysfunction in Alzheimer's disease pathogenesis has gained attention, with evidence suggesting that impaired energy dynamics and increased oxidative stress contribute significantly to neuronal death, driving research into mitochondrial-targeted therapies aiming to restore energy balance and protect against neurodegeneration. 48. The APOE4 allele is the most common genetic risk factor associated with sporadic Alzheimer's disease, increasing the likelihood of developing the condition and influencing age of onset, but ongoing research is exploring gene editing technologies and other novel strategies that could alter APOE expression or function to modify disease risk. 49. The selection of potential therapeutic targets in Alzheimer's disease often relies on preclinical models, including transgenic animals engineered to develop amyloid plaques and tau tangles, which provide critical insights into disease mechanisms and facilitate the evaluation of disease-modifying treatments, though translating findings from models to human patients remains a challenge. 50. Multimodal intervention trials highlight the potential benefits of combining pharmacological treatments with lifestyle modifications and cognitive training to optimize care for Alzheimer's patients, underscoring the significance of early intervention and individualized care plans that address both the biological and environmental aspects of disease management. '1. Bronchial asthma is a chronic inflammatory disease of the airways characterized by reversible airway obstruction due to bronchial hyperreactivity, leading to episodes of wheezing, breathlessness, chest tightness, and coughing, which vary in frequency and severity. 2. The pathophysiology of bronchial asthma involves a complex interaction between genetic predisposition and environmental factors that result in airway inflammation, leading to bronchoconstriction, increased mucus production, and airway remodeling over time. 3. Environmental triggers for bronchial asthma include allergens such as pollen, dust mites, and pet dander, as well as irritants like tobacco smoke, air pollution, and strong odors, which can exacerbate symptoms and lead to acute asthma attacks. 4. Asthma symptoms can be worse at night or early in the morning, which is a phenomenon known as nocturnal asthma, and is thought to be related to circadian variations in bronchial tone and lung function. 5. Spirometry is a crucial diagnostic tool for asthma, assessing lung function by measuring the volume and speed of air that can be inhaled and exhaled, helping to confirm the reversibility of airway obstruction. 6. In asthma management, peak flow meters are used for monitoring disease progression and controlling symptoms by measuring the highest speed of expiration across various asthma conditions and treatments. Seven. The role of eosinophils in asthma pathophysiology is significant as these white blood cells contribute to inflammation, airway hyperreactivity, and tissue damage when activated during the allergic response. 8. Inhaled corticosteroids are considered the first-line treatment for persistent asthma, as they effectively reduce airway inflammation, decrease mucus production, and improve overall lung function when used regularly. 9. Acute asthma exacerbations are often managed with short-acting beta-agonists, like albuterol, which act quickly to relax the muscles around the airways, providing prompt relief from acute wheezing and breathlessness. 10. Long-acting beta-agonists, LABAs, can be used in combination with inhaled corticosteroids for better control of moderate to severe persistent asthma, providing prolonged bronchodilation lasting up to 12 hours. 11. Asthma action plans are personalized written guidelines developed for patients that include directions on medication usage, identification of symptom exacerbations, and emergency contact information for effective self-management. 12. The hygiene hypothesis suggests that a lack of early childhood exposure to infectious agents, symbiotic microorganisms, and parasites may increase susceptibility to allergic diseases, including asthma, due to an underdeveloped immune system. 13. Leukotriene receptor antagonists, such as montelukast, offer an alternative or adjunctive treatment option for asthma by blocking the effects of leukotrienes, which are inflammatory chemicals that contribute to bronchoconstriction and airway inflammation. 14. The autonomic nervous system plays a critical role in respiratory function, with sympathetic nerves promoting bronchodilation and parasympathetic nerves contributing to bronchoconstriction, affecting airway tone and reactivity in asthma. 15. The role of genetic factors in asthma development is significant, with variations in genes like ADAM33, ORMDL3, and IL-13 being associated with susceptibility to asthma and influencing the severity and course of the disease. 16. Exercise-induced bronchoconstriction, a condition associated with asthma, causes temporary narrowing of the airways during or after physical activity, resulting in shortness of breath, wheezing, and chest tightness, often mitigated by pre-exercise inhalation of a short-acting beta-agonist. 17. Omalizumab, a monoclonal anti-IgE antibody, is used in the management of severe allergic asthma by binding to IgE and preventing it from attaching to mast cells and basophils, reducing allergic inflammation and asthma symptoms. 18. Asthma control tests, ACT, are self-administered questionnaires used to assess the control of asthma symptoms over the past 4 weeks, helping healthcare providers make informed decisions regarding treatment adjustments. 19. Airway remodeling in asthma refers to structural changes in the bronchial walls, including subepithelial fibrosis, smooth muscle hypertrophy, and angiogenesis, which contribute to fixed airway obstruction and progressive decline in lung function. 20. An increased understanding of the role of Th2 cells and associated cytokines like IL-4, IL-5, and IL-13 has been instrumental in the development of targeted biologic therapies for asthma, which aim to reduce inflammation and improve clinical outcomes. 21. The asthma-COPD overlap syndrome, ACOS, denotes the coexistence of features from both asthma and chronic obstructive pulmonary disease, COPD, requiring unique strategies for diagnosis and management to address the complex pathophysiology present in affected individuals. 22. Bronchial thermoplasty is a novel, non-pharmacological intervention for severe asthma, involving controlled thermal energy application to the airway walls to reduce excess smooth muscle mass, thereby decreasing bronchoconstriction and improving asthma control. 23. The fractional exhaled nitric oxide (FeNO) test is an emerging non-invasive method for assessing airway inflammation through the measurement of nitric oxide levels in exhaled breath, providing valuable information for asthma diagnosis and management. 24. Aspergillus contributes to the exacerbation of asthma symptoms in cases of allergic bronchopulmonary aspergillosis, ABPA, an exaggerated immune response to the fungus, leading to airway inflammation, mucus plugging, and potential lung damage. '25. Hormonal changes during menstruation, pregnancy, and menopause can affect asthma severity and control, with potential fluctuations in symptoms related to changes in estrogen and progesterone levels affecting airway reactivity. 26. Vocal cord dysfunction frequently mimics asthma, characterized by paradoxical vocal cord motion causing stridor and dyspnea, with distinct treatment approaches focusing on speech therapy and breathing exercises to address the issue. 27. Occupational asthma results from exposure to specific allergens or irritants in the workplace, necessitating a thorough history and identification of potential triggers for appropriate management and prevention strategies, including workplace modifications. 28. In asthma, the Dutch hypothesis proposes a heterogeneity of the disease involving different phenotypes with varying underlying causes, leading to personalized approaches in diagnosis, treatment, and management of each specific asthma phenotype. 29. Global Initiative for Asthma, GINA, guidelines provide evidence-based recommendations for asthma management, emphasizing a stepwise approach, regular assessment, and the importance of non-pharmacological interventions alongside medication use. 30. The psychological impact of asthma can be considerable, with anxiety and depression being common comorbidities, affecting treatment adherence and quality of life, highlighting the importance of addressing mental health in comprehensive asthma care. 31. The identification of specific asthma phenotypes, such as allergic, non-allergic, eosinophilic, and neutrophilic asthma, guides personalized treatment and management decisions, tailoring therapies according to underlying mechanisms and patient characteristics. 32. The role of the microbiome in asthma is a growing area of research, with studies suggesting that alterations in gut and airway bacterial composition may influence immune responses and play a role in the development and exacerbation of asthma. 3. Cold air is a common trigger for asthma symptoms, leading to bronchoconstriction by increasing airway hyperreactivity in susceptible individuals, with pre-exposure inhalation of beta agonists often recommended for prevention. 34. Aspirin-exacerbated respiratory disease, AERD, is characterized by asthma, nasal polyps, and aspirin intolerance, with typical management involving avoidance of nonsteroidal anti-inflammatory drugs, NSAIDs, and potential aspirin desensitization under medical supervision. 35. Smoking cessation is a critical component of asthma management, as tobacco smoke exposure can exacerbate symptoms, reduce treatment effectiveness, and increase the risk of respiratory infections and further lung damage. 36. Vitamin D deficiency has been associated with poor asthma control, increased airway inflammation, and heightened risk of exacerbations, suggesting that vitamin D supplementation may be beneficial in certain patients with asthma. 37. Advanced imaging techniques, such as high-resolution computed tomography, HRCT, offer detailed visualization of airway structures, aiding in the assessment of airway remodeling, mucus plugging, and differential diagnosis in complicated asthma cases. 38. The airway hyperresponsiveness in asthma to nonspecific stimuli, such as methacholine or histamine, is often evaluated through provocation tests, helping to confirm diagnosis and assess the severity of the disease. 39. Asthma-related education interventions focus on patient empowerment, providing essential knowledge about disease management, medication adherence, recognition of exacerbation signs, and trigger avoidance strategies to improve clinical outcomes. 40. The assessment of exacerbation risk in asthma includes evaluating factors such as previous hospitalizations, frequent emergency visits, high SABA use, and poor symptom control, guiding decisions on treatment intensification and preventive strategies. 41. Nutrition and dietary factors, including a high intake of antioxidants, omega-3 fatty acids, and a diet rich in fruits and vegetables, have been associated with reduced inflammation and improved asthma control. 42. The burden of asthma in the elderly population involves unique challenges, given the presence of comorbid conditions, age-related physiological changes, and potential polypharmacy that can complicate diagnosis and management. 43. Innovative drug delivery systems, such as breath-actuated nebulizers and dry powder inhalers, aim to improve medication adherence and effectiveness, addressing issues related to incorrect inhalation technique commonly seen in asthma patients. 44. Epithelial barrier dysfunction plays a key role in asthma pathogenesis by allowing allergen penetration that triggers immune responses and inflammation. Ongoing research is exploring therapeutic strategies aimed at restoring epithelial integrity. 45. The use of biomarkers, such as periostin and blood eosinophil count, is becoming increasingly important in identifying specific asthma endotypes, leading to more targeted approaches in the treatment and management of complex cases. 46. Non-pharmacological interventions, including allergen avoidance, environmental control measures, and respiratory muscle training, form an essential part of a comprehensive asthma management plan, supporting optimal clinical outcomes. 47. Psychosocial support, including counseling and peer support groups, can significantly impact asthma management by addressing emotional and social factors that influence patient adherence and overall disease control. 48. Traditional allergy testing through skin prick tests and specific IgE antibody testing assists in identifying relevant allergens, guiding targeted allergen avoidance strategies, and planning immunotherapy for asthma associated with allergic sensitization. 49. Environmental health interventions that reduce exposure to indoor pollutants, such as improved ventilation, use of air purifiers, and removal of carpeting, play a crucial role in reducing asthma symptoms and preventing exacerbations. 50. The development of digital health technologies, like mobile applications and wearable sensors, provides new avenues for real-time monitoring, patient engagement, and personalized management of asthma, improving overall disease control and patient outcomes. 1. Gastric cancer, commonly known as stomach cancer, predominantly occurs in the stomach's lining and is most frequently found in the farthest section of the stomach, posing a significant health problem worldwide due to its relatively late presentation and poor prognosis. Two, the pathophysiology of gastric cancer is intricate, involving multifactorial processes such as the transformation of normal gastric epithelial cells into cancer cells driven by genetic mutations, epigenetic alterations, and environmental influences, including diet and infection with Helicobacter pylori. Three, one of the most significant risk factors for developing gastric cancer is chronic infection with Helicobacter pylori, a bacterium that leads to chronic inflammation and, in some cases, can contribute to the development of precancerous lesions and eventually gastric malignancy. Four, gastric cancer often presents asymptomatically in its early stages, making early detection challenging, with common symptoms including unexplained weight loss, abdominal pain, early satiety, dysphagia, and symptoms of upper gastrointestinal bleeding like hematemesis or melena only appearing in more advanced stages. Five, the diagnosis of gastric cancer requires a combination of upper gastrointestinal endoscopy, which allows direct visualization and biopsy of suspicious lesions, combined with histopathological examination for confirmation and staging purposes, often enhanced by imaging studies like CT scans for assessment of local and distant spread. Six, treatment of gastric cancer is multidisciplinary and may involve surgical resection, which provides the best chance for cure in early-stage disease, alongside chemotherapy, radiotherapy, or targeted therapy, chosen based on the cancer's stage, location, and molecular characteristics, as well as patient factors. 7. Molecular profiling of gastric tumors can reveal distinct subtypes, such as the Epstein-Barr virus-associated type or the microsatellite instability high group, each having unique prognostic and therapeutic implications that guide personalized treatment strategies in modern oncology practice. Eight. Early gastric cancer, confined to the mucosa or submucosa regardless of lymph node involvement, offers the potential for curative treatment through endoscopic resection techniques in select cases, emphasizing the importance of early diagnosis and intervention in improving patient outcomes. 9. Advanced gastric cancer, which has penetrated beyond the gastric wall into surrounding structures or metastasized to distant organs, often necessitates palliative approaches focusing on symptom management and quality of life improvement, given limited curative options. Risk reduction strategies for gastric cancer include dietary modifications such as increasing fruit and vegetable intake, reducing consumption of smoked or pickled foods, and eliminating tobacco and alcohol use, alongside eradicating Helicobacter pylori infection when detected. The Loren classification divides gastric cancer into intestinal and diffuse types. The intestinal type is often associated with environmental factors and better prognosis, whereas the diffuse type is more likely linked to hereditary syndromes and poses a worse prognosis. Hereditary diffuse gastric cancer, HDGC, syndrome, caused by mutations in the CDH1 gene, is a genetic condition that dramatically increases the risk of developing gastric cancer at an early age, often necessitating prophylactic gastrectomy in affected individuals. Gastric cancer survival rates vary significantly depending on the stage at diagnosis, with localized cancer having the highest 5-year survival rate, while metastatic disease is associated with a much poorer prognosis, underscoring the importance of early detection. Peritoneal carcinomatosis is a common metastatic pattern of gastric cancer, whereby cancer cells disseminate within the peritoneal cavity, often leading to complications such as ascites and intestinal obstruction, and posing significant challenges in management. Signet ring cell carcinoma is a histological variant of gastric cancer characterized by cells containing mucin-filled vacuoles that displace the nucleus, often associated with diffuse-type cancer, and is linked with a more aggressive clinical course and poorer prognosis. The role of Helicobacter pylori in gastric carcinogenesis is well documented, with the infection leading to chronic gastritis, which can progress to atrophic gastritis, intestinal metaplasia, dysplasia, and eventually carcinoma, especially in genetically predisposed individuals. A positive family history is a recognized risk factor for gastric cancer, suggesting a hereditary component in certain individuals, thus warranting consideration for genetic counseling and surveillance in at-risk families to facilitate early detection and management. Helicobacter pylori eradication has been shown to reduce the incidence of gastric cancer in high-risk populations when implemented effectively, highlighting the importance of public health interventions focused on screening and treatment of this bacterial infection. Nutritional factors play a significant role in gastric cancer risk, with high salt intake and consumption of smoked foods increasing the risk, while diets rich in fresh fruits, vegetables, and antioxidants are believed to confer a protective effect against the development of gastric malignancies. Helicobacter pylori infection's role in gastric cancer has led to the development of serological and urea breath tests for its detection, forming the basis of case-finding strategies in endemic areas to help reduce gastric cancer incidence through early intervention. Gastric cancer can also metastasize to distant organs like the liver, lungs, and bones, with such hematogenous spread indicating an advanced stage of the disease that typically requires systemic chemotherapy and palliative care approaches. Various genetic mutations, such as those found in the APC, TP53, and KRAS genes, are associated with the development of gastric cancer, emphasizing the growing importance of genetic testing and personalized medicine approaches in the management of this disease. Prognostic factors for gastric cancer include tumor stage, lymph node involvement, histological grade, and subtype, with these factors playing a crucial role in guiding treatment decisions and predicting patient outcomes. Advanced imaging techniques, such as endoscopic ultrasound, EUS, are invaluable in the staging of gastric cancer by assessing the depth of tumor invasion and evaluating regional lymph nodes, aiding in planning appropriate treatment strategies. Palliative care in gastric cancer focuses on symptom management, including control of pain, nausea, and nutritional support, ensuring patient comfort and quality of life in those with advanced disease where curative treatment is not feasible. Trastuzumab, a monoclonal antibody targeting the HER2 receptor, is used in the treatment of HER2-positive advanced gastric cancer, offering a targeted therapeutic option that has improved outcomes for patients with this specific molecular subtype of the disease. Minimally invasive surgical techniques, such as laparoscopic gastrectomy, are increasingly employed in the treatment of early-stage gastric cancer, offering benefits in terms of reduced postoperative pain, faster recovery, and improved cosmetic outcomes. Gastric cancer screening programs have been implemented in some high-incidence countries, utilizing tools such as endoscopy and serological biomarkers to detect early-stage disease, which is crucial for improving survival rates through timely intervention. The role of chronic atrophic gastritis as a precursor to gastric cancer is well established, with long-standing inflammation leading to mucosal atrophy, intestinal metaplasia, and dysplasia, representing critical steps in gastric carcinogenesis. 30. For patients with localized advanced gastric cancer, neoadjuvant chemotherapy can be administered before surgery to reduce tumor size and improve resectability, often enhancing survival outcomes compared to surgery alone. 31. The use of single-agent or combination chemotherapy remains a cornerstone in managing metastatic gastric cancer, with regimens including drugs like fluorouracil, cisplatin, and irinotecan aimed at controlling disease progression and extending survival. 32. Gastric cancer exhibits marked geographic variation in incidence, being more prevalent in East Asian countries compared to Western nations, reflecting differences in environmental risk factors, dietary habits, and genetic predispositions. 3. Gastric cancer can lead to perineoplastic syndromes, such as acanthosis nigricans, where darkened, velvety skin patches appear, often serving as an early indicator of an underlying malignancy that warrants further diagnostic evaluation. 34. Nutritional management is pivotal in the care of patients with gastric cancer, particularly those undergoing treatment, as maintaining adequate nutritional status helps mitigate treatment-related side effects and supports recovery and overall well-being. 35. Emerging immunotherapies, such as checkpoint inhibitors, are being explored in gastric cancer treatment, offering promising avenues to harness the immune system's power to recognize and destroy cancer cells, potentially improving outcomes in select patient populations. 36. The diffuse-type gastric cancer, characterized by poorly cohesive, invasive growth, often presents at a more advanced stage and is associated with a poorer prognosis, posing challenges in management due to its aggressive nature and resistance to conventional therapies. 37. Understanding the molecular mechanisms of gastric cancer has paved the way for novel targeted therapies, focusing on specific pathways altered in cancer cells, such as angiogenesis, cell proliferation, and survival pathways, providing new hope for personalized treatment. 38. The presence of lymphovascular invasion in gastric cancer specimens is a critical prognostic indicator, associated with an increased risk of metastasis, and underscores the importance of thorough pathological examination in guiding clinical decision-making. 39. The development and validation of molecular biomarkers for gastric cancer are crucial in enhancing diagnostic accuracy, treatment selection, and prognosis stratification, ultimately leading to more tailored patient care and improved outcomes. 40. Gastric cancer can disrupt normal gastric function, leading to complications like gastric outlet obstruction and bleeding, which require prompt intervention, ranging from endoscopic procedures to surgical bypass, depending on the situation's severity. 41. Polyps, such as hyperplastic or adenomatous polyps, can be precursors to gastric cancer, particularly when they undergo dysplastic changes, necessitating regular surveillance and removal when found during endoscopic evaluations. 42. Anemia, often due to chronic blood loss from the tumor or nutritional deficiencies, is a common finding in gastric cancer patients, requiring comprehensive evaluation and management to ensure optimal patient care and quality of life. 43. The staging system for gastric cancer, such as the TNM classification, is vital in determining the extent of disease spread, guiding treatment approaches, and providing prognostic information to patients and healthcare providers. 44. The pathogenesis of intestinal-type gastric cancer often involves a sequence of histological changes starting with chronic gastritis, progressing to atrophic gastritis, then intestinal metaplasia, followed by dysplasia, and ultimately culminating in carcinoma. 45. Genetic testing for hereditary cancer syndromes, such as Lynch syndrome, is recommended for individuals with a strong family history of gastric cancer, enabling risk assessment and informing surveillance and management strategies. 46. Host-immune response to Helicobacter pylori infection plays a role in gastric cancer development, with genetic and environmental factors influencing the level of inflammation and subsequent progression to malignancy in susceptible individuals. 47. The survival advantage of gastric cancer patients treated with adjuvant chemoradiotherapy post-gastrectomy has been demonstrated in several clinical trials, highlighting the importance of a multimodal approach in managing resectable disease. 48. Proximal gastric cancer, affecting the upper part of the stomach near the esophagus, is increasingly recognized, requiring distinct surgical approaches like total or proximal gastrectomy, often combined with esophageal resection, to achieve oncological clearance. 49. Psychological support is essential for gastric cancer patients, given the emotional and physical challenges of the disease and its treatment, ensuring holistic care that addresses both medical and mental health needs for optimal patient outcomes. 50. The role of circulating tumor DNA, ctDNA, as a non-invasive biomarker in gastric cancer is being investigated, offering potential for early detection, monitoring treatment response, and detecting minimal residual disease, paving the way for more personalized treatment approaches. 1. Bronchial asthma is a chronic inflammatory disease of the airways characterized by reversible airway obstruction due to bronchial hyperreactivity, leading to episodes of wheezing, breathlessness, chest tightness, and coughing, which vary in frequency and severity. 2. The pathophysiology of bronchial asthma involves a complex interaction between genetic predisposition and environmental factors that result in airway inflammation, leading to bronchoconstriction, increased mucus production, and airway remodeling over time. 3. Environmental triggers for bronchial asthma include allergens such as pollen, dust mites, and pet dander, as well as irritants like tobacco smoke, air pollution, and strong odors, which can exacerbate symptoms and lead to acute asthma attacks. 4. Asthma symptoms can be worse at night or early in the morning, which is a phenomenon known as nocturnal asthma, and is thought to be related to circadian variations in bronchial tone and lung function. 5. Spirometry is a crucial diagnostic tool for asthma, assessing lung function by measuring the volume and speed of air that can be inhaled and exhaled, helping to confirm the reversibility of airway obstruction. 6. In asthma management, peak flow meters are used for monitoring disease progression and controlling symptoms by measuring the highest speed of expiration across various asthma conditions and treatments. 7. The role of eosinophils in asthma pathophysiology is significant as these white blood cells contribute to inflammation, airway hyperreactivity, and tissue damage when activated during the allergic response. 8. Inhaled corticosteroids are considered the first-line treatment for persistent asthma, as they effectively reduce airway inflammation, decrease mucus production, and improve overall lung function when used regularly. 9. Acute asthma exacerbations are often managed with short-acting beta agonists, like albuterol, which act quickly to relax the muscles around the airways, providing prompt relief from acute wheezing and breathlessness. 10. 10. Long-acting beta agonists, LABAs, can be used in combination with inhaled corticosteroids for better control of moderate to severe persistent asthma, providing prolonged bronchodilation lasting up to 12 hours. Asthma action plans are personalized written guidelines developed for patients that include directions on medication usage, identification of symptom exacerbations, and emergency contact information for effective self-management. 12. The hygiene hypothesis suggests that a lack of early childhood exposure to infectious agents, symbiotic microorganisms, and parasites may increase susceptibility to allergic diseases, including asthma, due to an underdeveloped immune system. 13. Leukotriene receptor antagonists, such as montelukast, offer an alternative or adjunctive treatment option for asthma by blocking the effects of leukotrienes, which are inflammatory chemicals that contribute to bronchoconstriction and airway inflammation. 14. The autonomic nervous system plays a critical role in respiratory function, with sympathetic nerves promoting bronchodilation and parasympathetic nerves contributing to bronchoconstriction, affecting airway tone and reactivity in asthma. 15. The role of genetic factors in asthma development is significant, with variations in genes like ADAM33, ORMDL3, and IL-13 being associated with susceptibility to asthma and influencing the severity and course of the disease. Exercise-induced bronchoconstriction, a condition associated with asthma, causes temporary narrowing of the airways during or after physical activity, resulting in shortness of breath, wheezing, and chest tightness, often mitigated by pre-exercise inhalation of a short-acting beta agonist. 17. Omalizumab, a monoclonal anti-IgE antibody, is used in the management of severe allergic asthma by binding to IgE and preventing it from attaching to mast cells and basophils, reducing allergic inflammation and asthma symptoms. 18. Asthma control tests, ACT, are self-administered questionnaires used to assess the control of asthma symptoms over the past 4 weeks, helping healthcare providers make informed decisions regarding treatment adjustments. 19. Airway remodeling in asthma refers to structural changes in the bronchial walls, including subepithelial fibrosis, smooth muscle hypertrophy, and angiogenesis, which contribute to fixed airway obstruction and progressive decline in lung function. 20. An increased understanding of the role of Th2 cells and associated cytokines like IL-4, IL-5, and IL-13 has been instrumental in the development of targeted biologic therapies for asthma, which aim to reduce inflammation and improve clinical outcomes. 21. The asthma-COPD overlap syndrome, ACOS, denotes the coexistence of features from both asthma and chronic obstructive pulmonary disease, COPD, requiring unique strategies for diagnosis and management to address the complex pathophysiology present in affected individuals. 22. Bronchial thermoplasty is a novel, non-pharmacological intervention for severe asthma, involving controlled thermal energy application to the airway walls to reduce excess smooth muscle mass, thereby decreasing bronchoconstriction and improving asthma control. 23. The fractional exhaled nitric oxide (FeNO) test is an emerging non-invasive method for assessing airway inflammation through the measurement of nitric oxide levels in exhaled breath, providing valuable information for asthma diagnosis and management. 24. Aspergillus contributes to the exacerbation of asthma symptoms in cases of allergic bronchopulmonary aspergillosis, ABPA, an exaggerated immune response to the fungus, leading to airway inflammation, mucus plugging, and potential lung damage. 25. Hormonal changes during menstruation, pregnancy, and menopause can affect asthma severity and control, with potential fluctuations in symptoms related to changes in estrogen and progesterone levels affecting airway reactivity. 26. Vocal cord dysfunction frequently mimics asthma, characterized by paradoxical vocal cord motion causing stridor and dyspnea, with distinct treatment approaches focusing on speech therapy and breathing exercises to address the issue. 27. Occupational asthma results from exposure to specific allergens or irritants in the workplace, necessitating a thorough history and identification of potential triggers for appropriate management and prevention strategies, including workplace modifications. 28. In asthma, the Dutch hypothesis proposes a heterogeneity of the disease involving different phenotypes with varying underlying causes, leading to personalized approaches in diagnosis, treatment, and management of each specific asthma phenotype. 29. Global Initiative for Asthma, GINA, guidelines provide evidence-based recommendations for asthma management, emphasizing a stepwise approach, regular assessment, and the importance of non-pharmacological interventions alongside medication use. 30. The psychological impact of asthma can be considerable, with anxiety and depression being common comorbidities, affecting treatment adherence and quality of life, highlighting the importance of addressing mental health in comprehensive asthma care. 31. The identification of specific asthma phenotypes, such as allergic, non-allergic, eosinophilic, and neutrophilic asthma, guides personalized treatment and management decisions, tailoring therapies according to underlying mechanisms and patient characteristics. 32. The role of the microbiome in asthma is a growing area of research, with studies suggesting that alterations in gut and airway bacterial composition may influence immune responses and play a role in the development and exacerbation of asthma. 3. Cold air is a common trigger for asthma symptoms, leading to bronchoconstriction by increasing airway hyperreactivity in susceptible individuals, with pre-exposure inhalation of beta agonists often recommended for prevention. 34. Aspirin-exacerbated respiratory disease, AERD, is characterized by asthma, nasal polyps, and aspirin intolerance, with typical management involving avoidance of nonsteroidal anti-inflammatory drugs, NSAIDs, and potential aspirin desensitization under medical supervision. 35. Smoking cessation is a critical component of asthma management, as tobacco smoke exposure can exacerbate symptoms, reduce treatment effectiveness, and increase the risk of respiratory infections and further lung damage. 36. Vitamin D deficiency has been associated with poor asthma control, increased airway inflammation, and heightened risk of exacerbations, suggesting that vitamin D supplementation may be beneficial in certain patients with asthma. 37. Advanced imaging techniques, such as high-resolution computed tomography, HRCT, offer detailed visualization of airway structures, aiding in the assessment of airway remodeling, mucus plugging, and differential diagnosis in complicated asthma cases. 38. The airway hyperresponsiveness in asthma to nonspecific stimuli, such as methacholine or histamine, is often evaluated through provocation tests, helping to confirm diagnosis and assess the severity of the disease. 39. Asthma-related education interventions focus on patient empowerment, providing essential knowledge about disease management, medication adherence, recognition of exacerbation signs, and trigger avoidance strategies to improve clinical outcomes. 40. The assessment of exacerbation risk in asthma includes evaluating factors such as previous hospitalizations, frequent emergency visits, high SABA use, and poor symptom control, guiding decisions on treatment intensification and preventive strategies. (41) Nutrition and dietary factors, including a high intake of antioxidants, omega-3 fatty acids, and a diet rich in fruits and vegetables, have been associated with reduced inflammation and improved asthma control. (42) The burden of asthma in the elderly population involves unique challenges, given the presence of comorbid conditions, age-related physiological changes, and potential polypharmacy that can complicate diagnosis and management. (43) Innovative drug delivery systems, such as breath-actuated nebulizers and dry powder inhalers, aim to improve medication adherence and effectiveness, addressing issues related to incorrect inhalation technique commonly seen in asthma patients. (44) Epithelial barrier dysfunction plays a key role in asthma pathogenesis by allowing allergen penetration that triggers immune responses and inflammation. Ongoing research is exploring therapeutic strategies aimed at restoring epithelial integrity. (45) The use of biomarkers, such as periostin and blood eosinophil count, is becoming increasingly important in identifying specific asthma endotypes, leading to more targeted approaches in the treatment and management of complex cases. (46) Non-pharmacological interventions, including allergen avoidance, environmental control measures, and respiratory muscle training, form an essential part of a comprehensive asthma management plan, supporting optimal clinical outcomes. (47) Psychosocial support, including counseling and peer support groups, can significantly impact asthma management by addressing emotional and social factors that influence patient adherence and overall disease control. (48) Traditional allergy testing through skin prick tests and specific IgE antibody testing assists in identifying relevant allergens, guiding targeted allergen avoidance strategies, and planning immunotherapy for asthma associated with allergic sensitization. (49) Environmental health interventions that reduce exposure to indoor pollutants, such as improved ventilation, use of air purifiers, and removal of carpeting, play a crucial role in reducing asthma symptoms and preventing exacerbations. (50) The development of digital health technologies, like mobile applications and wearable sensors, provides new avenues for real-time monitoring, patient engagement, and personalized management of asthma, improving overall disease control and patient outcomes. (1) Prostate cancer, most frequently diagnosed in men over 65, often begins its insidious course when normal prostate cells mutate their DNA, leading to uncontrolled growth influenced by male hormones like testosterone, creating a local lesion that can sometimes remain asymptomatic for years until peripheral nerves are affected, causing characteristic lower back pain or radical changes in urinary patterns. (2) The prostate-specific antigen (PSA) test, although controversial due to its potential for false positives, remains a crucial tool in the early detection of prostate cancer, with elevated levels suggesting the need for further investigative procedures such as a digital rectal exam, DRE, or magnetic resonance imaging (MRI), to visualize suspect areas within the gland. (3) One innovative area in prostate cancer treatment is the use of high-intensity focused ultrasound, HIFU, which precisely targets cancerous tissues via sound waves, thereby minimizing damage to surrounding healthy tissues, an advantage that is especially palpable in situations where traditional radiation therapy would pose a higher risk to neighboring structures. (4) In understanding the pathophysiology of prostate cancer, it's crucial to recognize the role of genetic alterations, such as PTEN loss or TMPRSS2-ERG fusion, which can drive aggressive phenotypes and underlie castration-resistant pathways, often necessitating the subsequent use of androgen receptor pathway inhibitors like enzalutamide. 5. The concept of active surveillance in prostate cancer acknowledges that many tumors grow so slowly that immediate treatment might be unnecessary. Thus, the patient undergoes regular monitoring for any indication of progression, often reserved for those with low-risk profiles to avoid the morbidities associated with premature intervention. 6. Multiparametric MRI has revolutionized the diagnostic landscape of prostate cancer, providing detailed images that not only help in defining the tumor's size and extent, but also direct targeted biopsies, offering greater accuracy over traditional random biopsy approaches, especially in distinguishing significant cancers from indolent ones. 7. The genetic landscape of prostate cancer is varied, with tumors often exhibiting a stable genome compared to other malignancies, yet exhibiting mutations in BRCA1 and BRCA2 genes that confer heightened aggressiveness and poorer outcomes, necessitating careful consideration of family history in the clinical context. 8. Prostate cancer pathophysiology can involve transitions from androgen-dependent to androgen-independent states, a conundrum that complicates treatment, enhancing the importance of novel therapies like PARP inhibitors, which exploit DNA repair vulnerabilities specific to cancer cells, thereby increasing the sensitivity of the tumors to subsequent therapies. 9. Proton beam therapy offers a cutting-edge approach for treating prostate cancer, using proton particles that deposit most of their energy directly in the tumor, sparing surrounding tissues with remarkable precision and reducing common side effects like urinary or bowel dysfunction compared to more conventional photon-based radiotherapy. 10. Understanding prostate cancer metastasis requires an appreciation for the molecular changes that allow tumor cells to detach and traverse bodily systems, particularly the lymphatic pathways leading to nearby lymph nodes and bones, where they establish secondary growths, often necessitating systemic treatment modalities beyond localized therapy. 11. The Gleason scoring system remains a cornerstone in predicting prostate cancer behavior, assigning a score based on glandular patterns observed under a microscope, where higher scores indicate a greater degree of aberration, aiding in tailoring management strategies to individual patient risk levels. 12. Androgen deprivation therapy, ADT, has long been a mainstay in the management of advanced prostate cancer, aiming to reduce circulating testosterone through either surgical orchiectomy or pharmaceutical agents such as GnRH agonists, which ultimately starve the cancer of its growth-promoting hormones. 13. Immunotherapy, such as the use of sipuleucel T, represents a novel frontier in prostate cancer treatment, whereby a patient's immune cells are engineered to recognize and combat prostate cancer cells, offering a personalized approach that can extend survival in select patients with advanced disease. 14. There is growing evidence that the microbiome, particularly within the gut, may play an influential role in prostate cancer development and progression, with certain microbial compositions potentially modulating systemic inflammation and hormonal balances that encourage or suppress oncogenic pathways. 15. Radioligand therapy, targeting prostate-specific membrane antigen, PSMA, provides a promising avenue for metastatic prostate cancer, leveraging radioactive isotopes bound to molecules that selectively attach to cancer cells, delivering lethal doses of radiation while sparing healthy tissue to a greater extent than traditional methods. 16. Transperineal prostate biopsy, performed under ultrasound guidance, minimizes infection risk compared to transrectal approaches, and provides more comprehensive sampling of the prostate, enhancing diagnostic precision especially in previously biopsied individuals with persistently elevated PSA levels. (17) Obesity has been implicated in the pathogenesis of more aggressive prostate cancer forms, potentially due to increased levels of inflammatory cytokines and insulin-like growth factors, which may promote tumor growth, highlighting the importance of lifestyle interventions as adjuncts in the prevention and management of prostate cancer. (18) The influence of dietary patterns on prostate cancer risk and progression has gained attention, with studies suggesting that diets rich in tomatoes, due to their lycopene content, and polyphenol-rich foods like green tea, may confer protective effects through their antioxidant and anti-inflammatory properties. (19) Focal therapy, including cryoablation and laser thermal therapy, targets prostate cancer lesions with precision, potentially offering a middle ground between active surveillance and radical treatments, aiming to eradicate cancerous tissues while preserving prostate function and patient quality of life. (20) Circulating tumor cells, CTCs, and DNA, ctDNA, are emerging biomarkers in the blood that may offer real-time insights into prostate cancer dynamics, potentially guiding treatment decisions and prognostication by reflecting tumor burden and molecular changes in response to therapy. (21) Radiotherapy advancements now permit hypofractionated regimens for prostate cancer, where higher doses per session shorten treatment duration, maintaining efficacy while offering greater convenience and reducing time spent by patients undergoing therapy, demonstrating comparable side effect profiles to conventional schedules. (22) The phenomenon of neuroendocrine differentiation in prostate cancer, often occurring in the setting of advanced, treatment-resistant disease, represents a shift in tumor phenotype, where cells acquire neuroendocrine-like features that are less reliant on androgen receptors, complicating therapeutic approaches, and often indicating a poorer prognosis. (23) Dietary supplementation with vitamin D has been investigated for its potential role in reducing prostate cancer risk and progression, given that this nutrient is thought to influence cellular differentiation and proliferation. Yet evidence remains mixed, warranting further study to elucidate its impact fully. (24) Magnetic resonance imaging ultrasound (MRI-US) fusion biopsy technology allows for the precise targeting of suspicious areas within the prostate identified on MRI, providing increased accuracy over traditional biopsy techniques, potentially reducing the number of necessary samples and improving cancer detection rates. (25) The advent of genomic profiling in prostate cancer has facilitated the identification of actionable mutations, enabling targeted therapies such as those aimed at the PI3K, AKT, mTOR pathway, which are currently being explored in clinical trials to determine their efficacy in improving outcomes in certain genetic subpopulations. (26) Early-stage prostate cancer may be asymptomatic, but as the disease progresses, symptoms such as difficulty urinating, blood in urine or semen, and erectile dysfunction can develop, emphasizing the importance of regular screening and early intervention to mitigate the impact on quality of life. (27) Hormone-refractory prostate cancer, also known as castration-resistant prostate cancer, CRPC, occurs when the disease progresses despite androgen deprivation, necessitating the use of additional therapies such as chemotherapy with docetaxel or cabazitaxel, which target rapidly dividing cancer cells through distinct cytotoxic mechanisms. 28. The relationship between chronic inflammation and prostate cancer has been a focal point in research, with inflammatory conditions potentially leading to genetic mutations over time, thus providing a fertile ground for cancer development, encouraging explorations into anti-inflammatory compounds as preventive measures. '29. Prostate cancer risk is significantly augmented by family history, with men having a first-degree relative diagnosed with prostate cancer being about twice as likely to develop the disease themselves, suggesting a substantial genetic component that could inform personalized screening strategies. 30. The use of 5-alpha reductase inhibitors in prostate cancer prevention is predicated on their ability to block the conversion of testosterone to dihydrotestosterone, a potent androgen that drives prostatic growth, though these medications are typically reserved for specific cases due to potential side effects. 31. The complexity of the tumor microenvironment in prostate cancer, including interactions between cancer cells, stromal cells, and extracellular matrix components, plays a crucial role in disease progression, influencing tumor growth, resistance to treatment, and metastatic potential, thus providing a rich target for novel therapeutic strategies. 32. Bone-targeted therapies such as bisphosphonates and denosumab play a pivotal role in managing bone metastasis in prostate cancer, working to reduce skeletal-related events by inhibiting osteoclast-mediated bone resorption, thereby enhancing patient quality of life and potentially extending survival. 3. Epidural spinal cord compression is a critical complication of metastatic prostate cancer that requires immediate medical intervention, often involving steroids, radiotherapy, or surgery to alleviate pressure on the spinal cord, thus preventing irreversible neurological damage and preserving functional status. 34. Prostate cancer staging with radiolabeled tracers like choline, or more recently PSMA, in positron emission tomography, PET, scanning, significantly improves detection of both local and distant metastasis, providing a comprehensive picture of disease burden that informs subsequent treatment planning. 35. Contemporary surgical techniques, such as robotic-assisted laparoscopic prostatectomy, have revolutionized prostate cancer surgery by offering enhanced dexterity and visualization, thereby improving outcomes related to oncological control, continence, and erectile function compared to traditional open procedures. 36. Chemoprevention trials in prostate cancer are exploring the use of dietary agents such as soy isoflavones and selenium, hypothesized to exert protective effects through modulation of hormonal and inflammatory pathways, though findings to date remain inconclusive and warrant further investigation. 37. Prostate cancer cell dormancy represents a significant clinical challenge, as disseminated tumor cells may remain quiescent for years before reactivation, complicating treatment strategies and necessitating ongoing research into the triggers of dormancy and potential interventions to eliminate dormant cells. 38. In the landscape of personalized medicine, molecular subtyping of prostate cancer is becoming increasingly important, with classification systems identifying distinct subsets of the disease based on genetic and molecular signatures, which can guide targeted therapeutic interventions and prognostic assessments. 39. The impact of psychosocial factors on prostate cancer outcomes is profound, with stress, depression, and lack of social support been associated with poorer survival, reinforcing the importance of holistic approaches that incorporate mental health and well-being support alongside traditional clinical care. 40. The risk stratification of prostate cancer recurrence post-treatment is enhanced by tools such as the Cancer of the Prostate Risk Assessment (CAPRA) score, which evaluates pre- and post-treatment variables to predict the likelihood of biochemical recurrence, thereby informing ongoing patient monitoring and management decisions. 41. In the exploration of resistance mechanisms, prostate cancer research has unveiled the role of aberrant CRIP signaling and DNA repair processes in conferring treatment resistance, emphasizing the need for combination regimens targeting multiple pathways to delay or overcome resistance in advanced cases. The role of somatic mutations in genes such as SPOP, FOXA1, and CHD1 is being elucidated in the context of prostate cancer, with these mutations associated with specific clinicopathological features and treatment responses, offering the potential for enriched patient stratification in clinical trials. In the realm of advanced imaging, 3D histological reconstruction from biopsy samples provides a deeper insight into the spatial arrangement of cancerous tissues within the prostate, offering potential improvements in understanding tumor biology and enhancing the precision of treatment planning. Genetic counseling and testing for hereditary prostate cancer syndromes, particularly in families with BRCA mutations, are crucial components of risk assessment and management, enabling tailored screening protocols and consideration of prophylactic measures in high-risk individuals. The use of metabolism-targeted therapies, such as inhibitors of fatty acid synthase or those impacting mitochondrial function, represents a burgeoning frontier in prostate cancer treatment, aiming to exploit the metabolic adaptations that cancer cells undergo to support rapid proliferation. Tracking therapeutic responses in prostate cancer through advanced biomarkers, such as changes in circulating microRNA profiles, provides a non-invasive tool to monitor disease dynamics in real time, enabling adjustments to therapeutic regimens in response to detected changes. In assessing and managing the side effects of prostate cancer treatments, integrative approaches combining conventional medical treatment with complementary methods such as acupuncture or yoga may offer relief from therapy-related symptoms, such as fatigue and anxiety, enhancing overall quality of life. Ongoing research into the prostate cancer stem cell hypothesis suggests that tumorigenesis may be driven by a subset of stem-like cells capable of self-renewal and resistance to conventional therapies, presenting a profound challenge but also a potentially transformative target in the quest for more effective long-term treatments. In the journey of a patient with prostate cancer, survivorship programs play an essential role in addressing long-term health outcomes, focusing on lifestyle modifications, routine health screenings, and psychological support as part of an integrated approach to life beyond cancer. Advancements in cryobiopsy for prostate cancer allow for the preservation of tissue architecture and viability for extensive histopathological analyses, providing critical insights into tumor heterogeneity and molecular characterizations that guide personalized treatment plans and novel research directions. Dyslipidemia, primarily characterized by abnormal lipid levels in the bloodstream, often involves elevated levels of low-density lipoprotein cholesterol, LDL-C, reduced high-density lipoprotein cholesterol, HDL-C, and increased triglycerides, fostering a conducive environment for atherosclerosis development, thus increasing the risk for coronary artery disease and cerebrovascular incidence. The pathophysiology of dyslipidemia largely involves the dysregulation of lipid metabolism, which is influenced by genetic predispositions, lifestyle factors, and underlying conditions such as obesity, insulin resistance, and chronic kidney disease, all contributing to an imbalance in lipid transport and synthesis. Clinical diagnosis of dyslipidemia typically requires a fasting lipid panel, assessing total cholesterol, LDL-C, HDL-C, and triglycerides, where variations suggest potential lipoprotein metabolism disorders, confirming a need for further investigation or intervention. 4. Statins, as HMG-CoA reductase inhibitors, represent the cornerstone of dyslipidemia treatment, effectively reducing LDL-C levels, stabilizing atherosclerotic plaques, and ultimately decreasing cardiovascular morbidity and mortality rates in patients with high cholesterol. Five. Lifestyle modifications, including a heart-healthy diet rich in omega-3 fatty acids, regular physical activity, maintenance of a healthy weight, and smoking cessation, are fundamental components of dyslipidemia management, aimed at enhancing lipid profiles and reducing associated cardiovascular risks. Six. Genetic factors play a critical role in dyslipidemia, with familial hypercholesterolemia being a notable genetic disorder characterized by mutations in the LDL receptor gene, leading to severely elevated LDL-C levels and an increased propensity for premature cardiovascular disease. 7. Emerging therapies for dyslipidemia, such as monoclonal antibodies targeting proprotein convertase subtilisin, Cushing type 9, PCSK9 inhibitors, provide a novel mechanism for dramatically lowering LDL-C levels by enhancing the liver's ability to clear circulating LDL particles. 8. The relationship between dyslipidemia and inflammation has been increasingly recognized, with studies suggesting that systemic inflammation, as measured by markers such as C-reactive protein, may exacerbate cholesterol-driven atherosclerosis and contribute to adverse cardiovascular events. 9. Non-alcoholic fatty liver disease, NAFLD, is frequently associated with dyslipidemia due to lipid accumulation in hepatocytes, which may further exacerbate insulin resistance, creating a vicious cycle that promotes metabolic syndrome and cardiovascular complications. 10. Dyslipidemia is not limited to adult populations, as children and adolescents are increasingly diagnosed with lipid disorders, often linked to obesity, sedentary lifestyles, and poor dietary habits, warranting early intervention to prevent lifelong cardiovascular disease risk. 11. Apolipoproteins, such as ApoB and ApoAI, play critical roles in lipoprotein structure and function, where ApoB is associated with atherogenic particles like LDL, while ApoAI is the primary apolipoprotein of HDL, highlighting the significance of apolipoprotein ratios in evaluating dyslipidemia's cardiovascular risk. 12. The role of lipoprotein A or Lp(a) in dyslipidemia and cardiovascular disease is gaining attention, as elevated levels are genetically determined and contribute to atherogenesis and thrombosis, making it a challenging target for therapeutic intervention. 13. Advanced lipid testing, which includes assessment of lipoprotein particle size and number, can offer additional insights into cardiovascular risk by differentiating between small, dense LDL particles known to be more atherogenic and larger, less harmful ones. 14. Diabetes mellitus significantly augments the risk of dyslipidemia, often characterized by a triad of elevated triglycerides, low HDL-C, and predominance of small dense LDL particles, necessitating aggressive lipid management to mitigate cardiovascular risk. 15. The interplay between hypothyroidism and dyslipidemia is well established, as reduced thyroid hormone levels can diminish lipid clearance, leading to elevated cholesterol and triglyceride levels, thereby necessitating thyroid function assessment in patients presenting with lipid abnormalities. 16. Dyslipidemia in postmenopausal women is frequently observed due to hormonal changes, particularly reduced estrogen levels, which impact hepatic lipoprotein metabolism, leading to elevated LDL-C and decreased HDL-C levels, increasing cardiovascular disease incidence. 17. The Mediterranean diet, characterized by high intake of fruits, vegetables, whole grains, and healthy fats such as olive oil, has been shown to significantly improve lipid profiles in individuals with dyslipidemia, thereby reducing cardiovascular disease risks. Secondary causes of dyslipidemia should always be considered, including conditions such as nephrotic syndrome, hypothyroidism, alcohol use, and medications like corticosteroids and beta blockers, as managing these underlying issues can improve lipid levels. 19. Dyslipidemia is often a silent condition, lacking obvious symptoms until the occurrence of significant cardiovascular events such as myocardial infarction or stroke, underscoring the importance of regular screening and proactive management in at-risk populations. 20. Regular physical activity is one of the most effective lifestyle interventions in managing dyslipidemia, as aerobic exercise helps increase HDL-C and decrease triglycerides, while also reducing visceral fat and improving overall cardiovascular health. 21. Polyphenol-rich foods, such as berries, dark chocolate, and red wine, contain bioactive compounds that have been shown to favorably influence lipid levels by reducing cholesterol absorption and oxidative stress, providing adjunctive benefits in dyslipidemia management. 22. Omega-3 fatty acids, abundant in fatty fish like salmon and mackerel, play a crucial role in reducing serum triglyceride levels and exerting cardiovascular protective effects, making them a beneficial dietary addition for individuals with hyperlipidemia. 23. Dyslipidemia is a critical component of metabolic syndrome, a cluster of conditions that include hypertension, insulin resistance, and abdominal obesity, collectively elevating the risk of developing type 2 diabetes and cardiovascular diseases. 24. Niacin, also known as vitamin B3, can significantly elevate HDL-C levels and lower triglycerides, although its use in clinical practice has declined due to the development of more effective and better tolerated lipid-lowering medications like statins and PCSK9 inhibitors. 25. Dyslipidemia management in chronic kidney disease is challenging due to altered lipoprotein metabolism, with patients commonly exhibiting elevated triglycerides and low HDL-C, necessitating careful selection of lipid-lowering therapies to avoid further renal impairment. 26. The role of coenzyme Q10 in dyslipidemia management remains controversial, as some studies suggest it may help mitigate the myalgic side effects of statin therapy, thereby potentially enhancing patient adherence to lipid-lowering medications. 27. Phytosterols, naturally occurring compounds found in plant-based foods, effectively lower LDL-C levels by competing with cholesterol absorption in the intestinal tract, offering a natural adjunct to conventional dyslipidemia therapies. 28. Dyslipidemia in pregnancy can be physiologically normal due to hormonal changes. However, severely elevated lipid levels may require intervention, especially if they pose additional risks such as gestational diabetes or preeclampsia. 29. Clinicians should consider the atherogenic index of plasma, AIP, calculated as the logarithm of the ratio between plasma triglycerides and HDL-C, as a predictive marker for cardiovascular risk assessment in patients with dyslipidemia. 30. Dyslipidemia is a prevalent comorbidity in chronic inflammatory conditions, such as rheumatoid arthritis and psoriasis, where systemic inflammation exacerbates lipid abnormalities, prompting integrated approaches for cardiovascular risk reduction in these populations. 31. Statin intolerance, whether due to muscle-related side effects or biochemical abnormalities, remains a significant barrier in dyslipidemia management, necessitating alternative therapies such as ezetimibe, bile acid sequestrants, or PCSK9 inhibitors to achieve lipid targets. Monoclonal antibodies against PCSK9 represent a breakthrough in dyslipidemia treatment, especially for familial hypercholesterolemia patients unable to achieve target LDL-C levels despite maximal statin therapy, highlighting personalized approaches in lipid management. The liver plays a central role in lipid regulation, and conditions such as cirrhosis or hepatitis can drastically alter lipid profiles, often resulting in atypical presentations of dyslipidemia that require specialized diagnostic and therapeutic strategies. Investigations into the gut microbiome's impact on lipid metabolism suggest that specific microbial compositions can influence lipid levels, opening novel avenues for dyslipidemia treatment through probiotics or dietary modifications aimed at beneficial gut flora alterations. Bempedoic acid offers a non-statin alternative for dyslipidemia management, particularly beneficial for patients intolerant to statins, as it lowers LDL-C by inhibiting ATP citrate lyase, an enzyme involved in the biosynthesis of cholesterol and fatty acids. Alcohol consumption impacts lipid profiles, where moderate intake of certain types, like red wine with resveratrol, may confer cardiovascular benefits, while excessive alcohol can exacerbate dyslipidemia by raising triglyceride levels and contributing to hepatic steatosis. Proprotein convertase subtilisin Cushing type 9, PCSK9 inhibitors have revolutionized the treatment landscape for dyslipidemia, providing a powerful option for significantly reducing LDL cholesterol levels, especially in patients with genetic lipid disorders like familial hypercholesterolemia. Dyslipidemia plays a critical role in cerebrovascular disease pathogenesis, where elevated cholesterol levels contribute to the formation and progression of carotid artery plaques, increasing the risk for ischemic stroke and necessitating aggressive lipid management. Hemoglobin A1C, traditionally used for diabetes management, can be a useful additional marker in assessing cardiovascular risk in patients with dyslipidemia, as hyperglycemia exacerbates lipid abnormalities and accelerates atherogenesis. Lipid-lowering therapies in elderly patients with dyslipidemia require careful consideration of comorbidities and potential polypharmacy, balancing the benefits of cardiovascular risk reduction with the risks of adverse drug interactions and side effects. Lipoprotein-lowering strategies targeting very low-density lipoprotein, VLDL, are crucial in managing dyslipidemia associated with hypertriglyceridemia, given VLDL's role in triglyceride transport and its contribution to atherogenic remnant particle formation. Dyslipidemia is intricately linked with hypertension, as elevated cholesterol levels contribute to endothelial dysfunction and arterial stiffness, further exacerbating cardiovascular risk and necessitating integrated management approaches. Recent advancements in genetic testing allow for more precise identification of dyslipidemia subtypes, particularly in familial hypercholesterolemia, enabling personalized treatment plans and enhanced risk stratification for patients and their families. Comprehensive cardiovascular disease prevention in patients with dyslipidemia includes optimizing other risk factors such as hypertension and diabetes management, reinforcing the importance of a holistic approach to reduce overall cardiovascular morbidity and mortality. Psychological factors, including stress, have been shown to impact lipid profiles adversely, potentially aggravating dyslipidemia through increased cortisol levels and promoting unhealthy lifestyle behaviors, highlighting the need for stress management interventions. (46) Dyslipidemia influences the pathogenesis of chronic endothelial injury, wherein excess circulating lipids lead to oxidative stress and endothelial cell dysfunction, forming the initial step in atherogenesis and necessitating interventions aimed at restoring vascular health. (47) Vitamin D's potential role in dyslipidemia management continues to be explored, given its involvement in various metabolic processes, although evidence remains mixed regarding its ability to significantly alter lipid profiles or improve cardiovascular outcomes. (48) The pharmacogenomics of statin therapy in dyslipidemia is an evolving field, providing insights into genetic factors that may influence statin metabolism and response, guiding personalized medication strategies to optimize efficacy and minimize adverse effects. (49) Dyslipidemia is an important modifiable risk factor in cancer development, as elevated lipid levels contribute to chronic inflammation and oxidative stress, fostering an environment conducive to oncogenesis, thereby necessitating integrated preventive efforts in high-risk populations. (50) The concept of residual cardiovascular risk in dyslipidemia management emphasizes that despite achieving optimal LDL-C levels, patients may still suffer cardiovascular events, prompting research into other potential targets, such as triglycerides and lipoprotein (A), for comprehensive risk reduction. (1) Brain tumors, particularly gliomas, can disrupt the blood-brain barrier, altering its permeability and potentially making the brain environment more susceptible to the influx of macromolecules and peripheral inflammatory cells, which can exacerbate cerebral edema and influence the tumor's microenvironment, requiring tailored therapeutic strategies to manage these effects alongside the primary treatment. (2) The distinction between primary and secondary brain tumors is critical, as primary brain tumors originate within the brain itself and may include glioblastomas or meningiomas, while secondary brain tumors, or brain metastasis, result from cancer spreading from another part of the body, such as the lungs, emphasizing the need for comprehensive systemic cancer management. (3) Advances in neuroimaging, including functional MRI and PET scans, enable not only the precise localization of brain tumors but also the assessment of tumor metabolism and potential malignancy, thereby refining preoperative planning and post-treatment monitoring, which enhances surgical outcomes and minimizes damage to critical brain areas. (4) The application of precision medicine in the treatment of brain tumors involves utilizing genetic and molecular profiling of tumors, which allows clinicians to tailor therapies based on specific mutations, such as IDH1 and IDH2 in gliomas, potentially improving response rates and minimizing unnecessary exposure to broader chemotherapeutic agents. (5) Tumor Treating Fields, TT fields, are an innovative non-invasive treatment modality for glioblastoma that employs alternating electric fields to disrupt cancer cell division by targeting the meiotic spindle, offering an additional therapeutic option that can be combined with surgery, radiation, and chemotherapy for comprehensive multimodal treatment. (6) The role of the tumor microenvironment in brain tumor pathophysiology is significant, with components such as hypoxia, immune cell infiltration, and extracellular matrix modulation influencing tumor growth, angiogenesis, and resistance to therapy, making it a focal area for developing novel therapeutic agents that can alter these pathways. (7) The utilization of stereotactic radiosurgery, SRS, such as Gamma Knife or CyberKnife, provides a highly precise irradiation method that delivers concentrated doses to brain tumors while sparing surrounding healthy tissue, making it particularly beneficial for small to medium-sized tumors or those located in surgically challenging areas. Eight. Brain tumors can cause neurocognitive deficits, including memory impairment and executive dysfunction, due to direct neural disruption and indirect effects of treatments such as radiation and chemotherapy, necessitating cognitive evaluations and rehabilitation programs as integral components of comprehensive patient management. 9. The growing field of oncolytic virotherapy explores the use of genetically engineered viruses to selectively infect and kill brain tumor cells while sparing healthy cells, combining direct oncolytic effects with immune-mediated tumor suppression, holding promise as a novel approach especially in immunoresponsive tumors. Dexamethasone is commonly utilized in brain tumor management to reduce vasogenic edema and improve neurological symptoms by decreasing capillary permeability and stabilizing the blood-brain barrier, yet its long-term use requires careful monitoring for side effects such as hyperglycemia and immunosuppression. Bevacizumab, an anti-angiogenic monoclonal antibody targeting vascular endothelial growth factor, VEGF, is utilized in recurrent glioblastoma to hinder abnormal blood vessel formation, thereby reducing tumor vascularity and edema, although its use requires consideration of potential adverse effects and the development of resistance. Neuro-oncology has witnessed the promising advancement of immunotherapy, including checkpoint inhibitors and CAR T-cell therapies, that harness the body's immune system to recognize and eradicate tumor cells, although challenges remain in overcoming the immunosuppressive environment inherent to brain tumors. The integration of artificial intelligence in brain tumor diagnosis allows for the automation and enhancement of imaging interpretation through machine learning algorithms, improving accuracy and consistency in identifying tumor characteristics, predicting outcomes, and aiding in the early detection of subtle tumor changes. Enhancing the delivery of chemotherapeutic agents in brain tumor therapy involves various strategies, such as the development of nanoparticles and liposomal formulations, which can cross the blood-brain barrier more effectively, increase drug concentrations at the tumor site, and reduce systemic toxicity. In molecular pathology, the detection of 1p19q co-deletion in oligodendrogliomas not only serves as an essential diagnostic marker distinguishing them from other types but also indicates a favorable response to chemotherapy, highlighting the necessity of genetic testing in establishing a precise diagnosis and treatment plan. Diffusion tensor imaging, DTI, is a specialized MRI technique that enables visualization and mapping of white matter tracts in the brain, assisting neurosurgeons in assessing tumor infiltration and preserving vital neural pathways during surgical resection, thus optimizing functional outcomes for patients. Chordomas, rare malignant tumors arising from embryonic notochord remnants, predominantly occur at the skull base or spinal column and require meticulous surgical excision, often followed by proton beam therapy for radiation-sensitive tissues, underscoring the need for specialized multidisciplinary care. Seizures are commonly associated symptoms in patients with brain tumors due to epileptogenic changes within the cerebral cortex, often managed with anti-epileptic drugs such as levetiracetam, although careful titration and monitoring are necessary to avoid adverse effects and interactions with other cancer therapies. The discovery of EGFR mutations and amplifications in certain glioblastomas has opened avenues for targeted therapies using tyrosine kinase inhibitors, although resistance mechanisms and heterogeneity within tumors present ongoing challenges that require the development of combination therapeutic strategies. 20. The blood-brain barrier, BBB, poses a significant obstacle in the delivery of effective chemotherapy for brain tumors, prompting research into methods to transiently and safely disrupt the BBB using focused ultrasound or osmotic agents without compromising the protection it affords the central nervous system. 21. Understanding the progression of brain tumors from low-grade to high-grade malignancies is crucial, as it often involves distinct molecular pathways and genetic alterations, necessitating vigilant monitoring and potential intervention to halt or delay malignant transformation and improve long-term outcomes. 22. Integrating palliative care early in the treatment of brain tumors focuses on optimizing quality of life by addressing symptoms, psychosocial support, and patient and family education, ensuring that holistic care is provided alongside curative or life-prolonging treatments for a balanced approach to the disease. 23. Tumor heterogeneity within brain tumors contributes to variable responses to treatment and recurrence rates, emphasizing the importance of obtaining tissue biopsies from multiple tumor areas and employing comprehensive genomic profiling to guide personalized therapeutic interventions effectively. 24. The incidence of pituitary adenoma, generally benign tumors, can lead to hormonal imbalances and pressure effects on nearby structures such as the optic chiasm, requiring a combination of endocrinological management and surgical intervention via transsphenoidal resection when indicated. 25. Optic gliomas, associated with neurofibromatosis type 1, can lead to progressive visual loss in children and are managed through a combination of observation, chemotherapy, and in some cases, radiation therapy, with ongoing research into targeted molecular treatments aimed at preserving vision and stabilizing tumor growth. 26. Recognizing the signs and symptoms of increased intracranial pressure, such as headache, nausea, and papilledema, is vital in patients with brain tumors, prompting immediate intervention with measures like shunt placement or craniotomy to relieve pressure and prevent further neurological deterioration. 27. Novel techniques in intraoperative visualization and navigation, such as intraoperative MRI and fluorescence-guided surgery using 5-ALA, have enhanced the precision of tumor resection, allowing surgeons to distinguish neoplastic tissue more reliably, thereby improving surgical margins and patient outcomes. 28. Studying the role of microRNAs in brain tumor biology has unveiled their functions in regulating gene expression, tumor growth, and metastasis, paving the way for therapeutic targeting of these small non-coding RNAs to disrupt oncogenic pathways and improve the efficacy of existing treatments. 29. The exploration of epigenetic modifications, such as DNA methylation and histone acetylation, in brain tumors has revealed their influence on gene expression and tumor behavior, leading to the potential for developing epigenetic drugs that can reverse aberrant changes and restore normal cellular functions. 30. The prognostic significance of MGMT promoter methylation in glioblastoma lies in its correlation with improved response to alkylating agents like temozolomide, offering insight into personalized treatment planning and highlighting the critical role of molecular profiling in guiding therapeutic decisions. 31. Cerebellar tumors, such as medulloblastomas, primarily affecting children, can disrupt coordination and balance, requiring a combination of surgical resection, craniospinal irradiation, and chemotherapy, with ongoing research into molecular subtyping aiming to optimize treatment strategies and reduce long-term side effects. 32. Unveiling the potential of chimeric antigen receptor (CAR) T-cell therapy for targeting specific antigens expressed on brain tumors represents a promising frontier, but challenges remain in ensuring T-cell penetration into the central nervous system and sustaining durable responses in patients. 3.3. Assessment of tumor-associated epilepsy in brain tumor patients involves distinguishing between seizure types and understanding the complex relationship between epileptogenic networks and tumor pathology, highlighting the necessity for individualized anti-epileptic regimens and neurosurgical consultation when refractory seizures persist. 34. Recognizing the role of neuroinflammation in the progression and treatment resistance of brain tumors opens avenues for therapeutic targeting of inflammatory pathways, with agents such as COX-2 inhibitors and immune modulators being explored for potential anti-tumor efficacy and symptom relief. 35. Pseudoprogression in brain tumor imaging, often seen after radiation therapy and characterized by transient inflammatory changes rather than true tumor growth, poses diagnostic challenges requiring differentiation from actual progression through serial imaging studies and potentially utilizing advanced metabolic imaging techniques. 36. Ethical considerations in brain tumor clinical trials encompass informed consent, balancing innovation with patient safety, and equitable access to experimental treatments, necessitating robust ethical frameworks and communication strategies to ensure patients and families make informed decisions regarding participation. 37. Managing the neurocognitive side effects of radiation therapy for brain tumors involves implementing strategies such as hippocampal sparing techniques, cognitive rehabilitation, and pharmacological interventions aimed at reducing the risk of long-term intellectual impairment and ensuring sustained quality of life. 38. The potential use of ketogenic diets in brain tumor management explores the hypothesis that reducing glucose availability may affect tumor metabolism and growth, although this requires rigorous clinical investigation to verify efficacy and ensure safety in combination with standard oncological treatments. 39. Glioma stem cells are implicated in tumor recurrence and resistance to therapy, highlighting the importance of targeting these cells specifically with treatments that can impede their self-renewal and differentiation capabilities, thereby improving long-term control and patient prognosis. 40. The exploration of biomarkers, such as circulating tumor DNA, ctDNA, in the blood of brain tumor patients, offers a non-invasive method for monitoring disease status, treatment response, and early detection of relapse, providing a valuable tool for precision medicine approaches in neuro-oncology. 41. Neurofibromatosis type 2, NF2, is characterized by the development of multiple nervous system tumors, including schwannomas and meningiomas, requiring vigilant surveillance and, when necessary, intervention with surgery or newer medical therapies such as VEGF inhibitors to manage tumor growth and maintain neurological function. 42. Differentiating between tumor recurrence and radiation necrosis in brain cancer patients involves evaluating clinical presentation and employing advanced imaging modalities such as perfusion MRI or PET scans, aiding in determining the appropriate management pathway and avoiding unnecessary interventions. 43. Innovative surgical techniques in skull-base tumor resection, utilizing endoscopic approaches, allow for minimally invasive access to complex regions while reducing patient morbidity, emphasizing the critical role of specialized multidisciplinary teams in achieving optimal surgical outcomes and preserving neurological function. 44. The neuropeptide Y, NPY, receptor system has been implicated in brain tumor growth and angiogenesis, presenting a potential target for therapeutic intervention with antagonists designed to disrupt these pathways and complement existing treatments aimed at brain tumor control. 45. Olfactory neuroblastomas, originating in the nasal cavity extending into the brain, demand a multidisciplinary approach involving surgery, radiation, and sometimes chemotherapy, highlighting the complexities and importance of specialized care in managing these rare and challenging tumors. 46. Understanding the epidemiology and risk factors associated with brain tumors, including genetic predispositions and environmental exposures, provides essential insights for public health strategies aimed at early detection, prevention, and improved patient education on potential risks and symptoms. 47. The intricate relationship between neural stem cells and brain tumor development suggests potential strategies for therapeutic targeting, as alterations in stem cell regulatory pathways may contribute to tumorigenicity, requiring an understanding of stem cell biology in the context of oncogenesis and therapy. 48. Intracranial germ cell tumors, though rare, often present in pediatric patients and typically respond well to chemotherapy and radiation, depending on the type and location, underscoring the need for age-appropriate treatment protocols and long-term follow-up to monitor for potential late effects. 49. The role of metabolic reprogramming in brain tumor cells includes alterations in glucose and lipid metabolism to support rapid growth and survival, providing a potential target for novel therapies aimed at disrupting these pathways to reduce tumor proliferation and enhance treatment efficacy. 50. Exploring the potential of biodegradable polymer implants delivering localized chemotherapy directly to the site of brain tumor resection offers a method to maximize drug delivery while minimizing systemic toxicity, demonstrating a novel approach in the quest to improve patient outcomes and quality of life post-surgery. 1. Cerebral aneurysms, which occur due to weakened blood vessels in the brain, can remain asymptomatic until they rupture. This highlights the need for proactive screening in individuals with high risk factors like hypertension, smoking, or family history of aneurysms, as early detection through imaging modalities such as MRI and CT angiography can be critical for prevention. 2. The pathophysiology of cerebral aneurysms involves complex hemodynamic changes that exert excess pressure on arterial walls, where undeveloped collagen and elastin fibers fail to provide adequate resistance, leading to focal dilation, while genetic predispositions may further exacerbate these vulnerabilities by altering vascular structural integrity. 3. Technological advancements in endovascular techniques have revolutionized the treatment of cerebral aneurysms, with the deployment of flow diverters and stent-assisted coiling offering minimally invasive options that significantly reduce recovery time, complications, and the risk of recurrence when compared to traditional surgical clipping. 4. An underlying cause of cerebral aneurysms is hemodynamic stress, which arises from turbulent blood flow, primarily at bifurcations of cerebral arteries where high shear stress leads to endothelial injury and subsequent vascular wall remodeling, setting the stage for aneurysm formation as the vascular architecture becomes compromised. 5. Ruptured cerebral aneurysms are a cause of subarachnoid hemorrhage, a serious clinical condition associated with elevated mortality and morbidity, where rapid intervention is crucial. Key symptoms like sudden severe headache, neck stiffness, and altered consciousness should prompt immediate diagnostic evaluations including CT scan and lumbar puncture. 6. The genetic factors contributing to cerebral aneurysms can include mutations in genes related to connective tissue formation such as COL3A1, which disrupts collagen synthesis leading to weakened arterial walls, highlighting the importance of genetic counseling for at-risk individuals and their families. 7. Early signs of an unruptured cerebral aneurysm might present subtly, with neurological deficits manifesting as cranial nerve palsies, localized headaches, or transient visual disturbances, a situation that necessitates vigilant clinical evaluations and neuroimaging where high-resolution detectors can reveal early aneurysmal changes. 8. 8. Risk factors for cerebral aneurysms include modifiable lifestyle influences such as smoking, which accelerates atherosclerosis and hypertension by promoting endothelial dysfunction, along with non-modifiable factors like age and female gender. Therefore, lifestyle modification and regular screening are integral to disease management and prevention. 9. In cases where surgical intervention is indicated, microsurgical clipping requires precise intracranial navigation to apply a titanium clip at the neck of the aneurysm, effectively isolating it from cerebral circulation to prevent rupture, significantly lowering the chances of hemorrhagic events with a relatively low complication rate. 10. Intracranial pressure (ICP) monitoring is critical in patients with suspected or confirmed ruptured cerebral aneurysms, as elevated ICP can lead to compromised cerebral perfusion and herniation. Aggressive management with mannitol, hypertonic saline, or CSF drainage may be necessary to maintain optimal cerebral hemodynamics. Dual antiplatelet therapy is recommended post-coiling in aneurysm management to prevent thromboembolic complications, as the presence of foreign material in the cerebral circulation can stimulate platelet aggregation and thrombus formation, which might otherwise negate the benefits of endovascular repair. The detection of cerebral aneurysms has been greatly improved with the use of 3D rotational angiography, which provides high-resolution images that assist in assessing aneurysm morphology and characteristics to aid clinicians in formulating customized intervention strategies, thereby enhancing patient outcomes. With growing evidence of inflammation contributing to aneurysm formation, researchers are exploring pharmacotherapeutics aimed at mitigating inflammatory pathways, as inflammatory cytokines like TNF-alpha and IL-6 play a significant role in destabilizing the vascular matrix and facilitating aneurysmal growth. Vasospasm is a common sequel to subarachnoid hemorrhage caused by cerebral aneurysm rupture, where intense cerebral artery vasoconstriction can lead to ischemic complications. Treatment approaches like nimodipine administration aim to alleviate these occurrences by inhibiting calcium influx into vascular smooth muscle cells. Asymptomatic patients with small cerebral aneurysms often undergo a watchful waiting approach, where routine non-invasive imaging studies like MR angiography are employed at regular intervals to monitor aneurysm growth and the potential requirement for intervention, thus minimizing unnecessary surgical risks in stable cases. Histological examination of aneurysmal sacs has shown macrophage infiltration and apoptosis within the medial layer, suggesting that therapeutic approaches targeting apoptotic pathways may hold promise in stabilizing aneurysmal walls and preventing subsequent enlargement or rupture. The interplay of genetics and environment in cerebral aneurysm pathogenesis is becoming clearer with genome-wide association studies identifying loci like 9p21.3 associated with vascular disease susceptibility, promoting avenues for personalized medicine and targeted therapies for high-risk individuals. Hypertension is a primary contributor to the formation and rupture of cerebral aneurysms, as chronic pressure overload results in endothelial injury and vascular remodeling, necessitating stringent blood pressure control and antihypertensive therapy as preventive measures in patients with known or suspected aneurysmal disease. Dietary modification, including reducing sodium intake and increasing fruit and vegetable consumption, may lower aneurysm formation risk by mitigating hypertension and vascular inflammation, thereby complementing clinical management strategies and enhancing overall vascular health outcomes. Neurointerventionalists are at the forefront of treating stable cerebral aneurysms with cutting-edge techniques that include the use of embolic agents or coils engineered to promote thrombosis within the aneurysm sac, effectively excluding it from circulation and reducing the likelihood of future rupture. 21. Advances in computational fluid dynamics modeling allow researchers to simulate blood flow patterns within cerebral vasculature, offering insights into the hemodynamic forces that contribute to aneurysm formation and influencing the design of novel flow-modifying devices for individualized aneurysm management. 22. Effective public awareness campaigns and education initiatives about cerebral aneurysm symptoms and risk factors play a crucial role in early detection and intervention, as they empower individuals to seek timely medical evaluations and adhere to preventive health measures, reducing overall aneurysm-related morbidity. 23. Postoperative management of cerebral aneurysm patients focuses heavily on rehabilitation therapies, which might include physical, occupational, or cognitive therapies, to address any neurological deficits or impairments resulting from aneurysm rupture or surgical intervention, facilitating improved functional recovery. 24. The presence of multiple cerebral aneurysms in individuals is not uncommon, necessitating a comprehensive diagnostic approach that involves advanced imaging studies to map the entirety of the cerebral vasculature, ensuring all potential sites of aneurysm formation are identified and appropriately managed. 25. Pharmacological agents like statins, known for their lipid-lowering effects, are being investigated for their vascular protective properties, which might extend to reducing the growth and rupture risk of cerebral aneurysms by enhancing endothelial function and reducing vascular inflammation. 26. Epidemiological studies reveal regional variations in cerebral aneurysm prevalence and rupture rates, likely reflecting differences in genetic predispositions, lifestyle factors, and healthcare access, underscoring the need for tailored public health strategies to address these disparities and improve regional outcomes. 27. Imaging biomarkers are being developed to enhance the prediction of cerebral aneurysm rupture risk, with studies investigating the correlation between aneurysm wall enhancement on MRI and instability, which could guide clinical decision-making and the timing of interventional therapies. 28. With family history being a significant risk factor for cerebral aneurysms, first-degree relatives of affected individuals are likely to benefit from early screening strategies, helping to identify potentially life-threatening aneurysms before they rupture and in settings where genetic counseling and testing are available. 29. Innovative biodegradable stents are the subject of ongoing research aimed at decreasing long-term thrombogenicity and foreign body reactions associated with aneurysm repair, offering the potential for safer, more effective long-term outcomes in patients undergoing endovascular treatment. 30. Cognitive outcomes post-aneurysm rupture depend on rupture severity, treatment modality, and promptness of medical intervention, with comprehensive neuropsychological assessments and supportive therapies being essential to improve cognitive recovery and enhance patients' quality of life. Artificial intelligence and machine learning algorithms are increasingly being applied to cerebral aneurysm imaging for enhanced diagnostic accuracy, by improving the identification of aneurysm characteristics that indicate rupture propensity, thus optimizing individual patient management plans. 32. Glucocorticoids have emerged as a potential therapeutic option in the acute management of cerebral aneurysms by reducing perianeurysmal edema and inflammatory response, although their long-term efficacy and safety profile require further clinical investigation to inform treatment protocols. 3. The role of neurotransmitters in cerebral aneurysm rupture is being explored, with particular attention to serotonin and its effects on vascular tone and platelet aggregation, possibly revealing novel pharmacological targets for the prevention of aneurysm-related hemorrhagic events. 34. Interdisciplinary teams consisting of neurologists, neurosurgeons, and interventional radiologists are crucial in the comprehensive management of cerebral aneurysms, facilitating personalized treatment pathways that integrate medical, surgical, and rehabilitative care tailored to patient-specific health profiles. '35. Cerebrovascular autoregulation can be disrupted post-aneurysm intervention, necessitating meticulous monitoring of cerebral perfusion pressure to prevent secondary ischemic injury, with management strategies involving both pharmacologic and supportive measures to stabilize cerebral blood flow and oxygenation. '36. Nutrition plays a role in aneurysm recovery, where a diet rich in omega-3 fatty acids, antioxidants, and anti-inflammatory foods can support vascular health, aiding in the reduction of sequelae associated with aneurysm formation and rupture, and contributing to more favorable long-term outcomes. '37. Serological biomarkers such as matrix metalloproteinases are under investigation for their potential to predict cerebral aneurysm growth and rupture, as their involvement in extracellular matrix degradation may provide insights into aneurysm pathogenesis and offer targets for therapeutic intervention. '38. The development of patient simulation models in cerebral aneurysm education provides interactive opportunities for medical professionals to rehearse complex scenarios, enhance diagnostic acuity, and practice innovative treatment techniques, thereby improving clinical skills and patient safety. '39. The connection between brain aneurysms and polycystic kidney disease is well documented. Specifically, individuals with autosomal dominant polycystic kidney disease have an increased risk of intracranial aneurysms due to inherent vascular abnormalities, necessitating proactive screening measures. '40. Environmental influences such as pollution and low socioeconomic status have been implicated in cerebral aneurysm development, possibly through effects on systemic inflammation and access to healthcare, highlighting the importance of addressing social determinants of health in prevention strategies. '41. MicroRNAs are emerging as key regulatory molecules in the pathogenesis of cerebral aneurysms, where their modulation of gene expression related to vascular remodeling and inflammatory processes may provide novel therapeutic targets to halt or reverse aneurysmal progression. '42. Nanomedicine is finding application in cerebral aneurysm therapy, with nanoparticulate systems being designed to deliver drugs or genes directly to aneurysmal sites, thereby enhancing localized action while reducing systemic side effects, opening new frontiers for minimally invasive treatment strategies. '43. For patients contraindicated for surgery, balloon-assisted coiling provides a viable alternative for aneurysm management, where a balloon is temporarily inflated in the parent vessel to aid coil placement, proving particularly effective in achieving complete occlusion of wide-necked aneurysms. '44. The connection between hormonal factors and aneurysm formation, particularly in postmenopausal women, is under scrutiny, with studies examining the protective role of estrogen on vascular integrity, potentially offering insights into hormone replacement therapy as a preventive measure against aneurysm development. '45. Workplace challenges faced by individuals with cerebral aneurysms require specific rehabilitation strategies, ensuring an effective return-to-work process that addresses cognitive, emotional, and physical reconditioning, thereby enabling seamless reintegration and productive living post-intervention. '46. Circulating endothelial cells have been proposed as potential biomarkers for detecting aneurysm instability, providing a non-invasive means to assess endothelial damage and disruption, which are critical factors in aneurysm integrity and associated hemorrhagic risk. 47. The use of computational fluid dynamics in analyzing hemodynamic impacts post-endovascular therapy is essential, as these models provide valuable insights into flow modification effects, contributing to the refinement of devices and techniques aimed at improving treatment efficacy and patient outcomes. Cross-disciplinary research involving epidemiologists, geneticists, and neuroscientists is pivotal in uncovering the multifaceted etiologies of cerebral aneurysms, building comprehensive models that integrate genetic, environmental, and lifestyle factors to inform preventative healthcare policies. Preclinical studies using animal models of cerebral aneurysms are vital for understanding disease progression and testing potential therapeutic approaches, providing a controlled environment to investigate pathophysiological mechanisms and evaluate the translational potential of novel treatments. The future of cerebral aneurysm management lies in personalized medicine, where advancements in genomic profiling and biomarker identification will facilitate tailored therapeutic interventions and preventive strategies, ensuring optimal outcomes based on individual genetic, physiological, and lifestyle contexts. 1. Gastric cancer, commonly known as stomach cancer, predominantly occurs in the stomach's lining and is most frequently found in the farthest section of the stomach, posing a significant health problem worldwide due to its relatively late presentation and poor prognosis. The pathophysiology of gastric cancer is intricate, involving multifactorial processes such as the transformation of normal gastric epithelial cells into cancer cells driven by genetic mutations, epigenetic alterations, and environmental influences, including diet and infection with Helicobacter pylori. One of the most significant risk factors for developing gastric cancer is chronic infection with Helicobacter pylori, a bacterium that leads to chronic inflammation and, in some cases, can contribute to the development of precancerous lesions and eventually gastric malignancy. Gastric cancer often presents asymptomatically in its early stages, making early detection challenging, with common symptoms including unexplained weight loss, abdominal pain, early satiety, dysphagia, and symptoms of upper gastrointestinal bleeding like hematemesis or melena only appearing in more advanced stages. The diagnosis of gastric cancer requires a combination of upper gastrointestinal endoscopy, which allows direct visualization and biopsy of suspicious lesions, combined with histopathological examination for confirmation and staging purposes, often enhanced by imaging studies like CT scans for assessment of local and distant spread. Treatment of gastric cancer is multidisciplinary and may involve surgical resection, which provides the best chance for cure in early-stage disease, alongside chemotherapy, radiotherapy, or targeted therapy, chosen based on the cancer's stage, location, and molecular characteristics, as well as patient factors. Molecular profiling of gastric tumors can reveal distinct subtypes, such as the Epstein-Barr virus-associated type or the microsatellite instability high group, each having unique prognostic and therapeutic implications that guide personalized treatment strategies in modern oncology practice. Early gastric cancer, confined to the mucosa or submucosa regardless of lymph node involvement, offers the potential for curative treatment through endoscopic resection techniques in select cases, emphasizing the importance of early diagnosis and intervention in improving patient outcomes. Advanced gastric cancer, which has penetrated beyond the gastric wall into surrounding structures or metastasized to distant organs, often necessitates palliative approaches focusing on symptom management and quality of life improvement, given limited curative options. 10. Risk reduction strategies for gastric cancer include dietary modifications such as increasing fruit and vegetable intake, reducing consumption of smoked or pickled foods, and eliminating tobacco and alcohol use, alongside eradicating Helicobacter pylori infection when detected. (11) The Laurin classification divides gastric cancer into intestinal and diffuse types. The intestinal type is often associated with environmental factors and better prognosis, whereas the diffuse type is more likely linked to hereditary syndromes and poses a worse prognosis. (12) Hereditary diffuse gastric cancer, HDGC, syndrome, caused by mutations in the CDH1 gene, is a genetic condition that dramatically increases the risk of developing gastric cancer at an early age, often necessitating prophylactic gastrectomy in affected individuals. (13) Gastric cancer survival rates vary significantly depending on the stage at diagnosis, with localized cancer having the highest 5-year survival rate, while metastatic disease is associated with a much poorer prognosis, underscoring the importance of early detection. (14) Peritoneal carcinomatosis is a common metastatic pattern of gastric cancer, whereby cancer cells disseminate within the peritoneal cavity, often leading to complications such as ascites and intestinal obstruction, and posing significant challenges in management. (15) Signet ring cell carcinoma is a histological variant of gastric cancer characterized by cells containing mucin-filled vacuoles that displace the nucleus, often associated with diffuse-type cancer, and is linked with a more aggressive clinical course and poorer prognosis. (16) The role of Helicobacter pylori in gastric carcinogenesis is well documented, with the infection leading to chronic gastritis, which can progress to atrophic gastritis, intestinal metaplasia, dysplasia, and eventually carcinoma, especially in genetically predisposed individuals. (17) A positive family history is a recognized risk factor for gastric cancer, suggesting a hereditary component in certain individuals, thus warranting consideration for genetic counseling and surveillance in at-risk families to facilitate early detection and management. (18) Helicobacter pylori eradication has been shown to reduce the incidence of gastric cancer in high-risk populations when implemented effectively, highlighting the importance of public health interventions focused on screening and treatment of this bacterial infection. (19) Nutritional factors play a significant role in gastric cancer risk, with high salt intake and consumption of smoked foods increasing the risk, while diets rich in fresh fruits, vegetables, and antioxidants are believed to confer a protective effect against the development of gastric malignancies. (20) Helicobacter pylori infection's role in gastric cancer has led to the development of serological and urea breath tests for its detection, forming the basis of case-finding strategies in endemic areas to help reduce gastric cancer incidence through early intervention. (21) Gastric cancer can also metastasize to distant organs like the liver, lungs, and bones, with such hematogenous spread indicating an advanced stage of the disease that typically requires systemic chemotherapy and palliative care approaches. (22) Various genetic mutations, such as those found in the APC, TP53, and KRAS genes, are associated with the development of gastric cancer, emphasizing the growing importance of genetic testing and personalized medicine approaches in the management of this disease. (23) Prognostic factors for gastric cancer include tumor stage, lymph node involvement, histological grade, and subtype, with these factors playing a crucial role in guiding treatment decisions and predicting patient outcomes. 24. Advanced imaging techniques, such as endoscopic ultrasound, EUS, are invaluable in the staging of gastric cancer by assessing the depth of tumor invasion and evaluating regional lymph nodes, aiding in planning appropriate treatment strategies. 25. Palliative care in gastric cancer focuses on symptom management, including control of pain, nausea, and nutritional support, ensuring patient comfort and quality of life in those with advanced disease where curative treatment is not feasible. 26. Trastuzumab, a monoclonal antibody targeting the HER2 receptor, is used in the treatment of HER2-positive advanced gastric cancer, offering a targeted therapeutic option that has improved outcomes for patients with this specific molecular subtype of the disease. 27. Minimally invasive surgical techniques, such as laparoscopic gastrectomy, are increasingly employed in the treatment of early-stage gastric cancer, offering benefits in terms of reduced postoperative pain, faster recovery, and improved cosmetic outcomes. 28. Gastric cancer screening programs have been implemented in some high-incidence countries, utilizing tools such as endoscopy and serological biomarkers to detect early-stage disease, which is crucial for improving survival rates through timely intervention. 29. The role of chronic atrophic gastritis as a precursor to gastric cancer is well established, with long-standing inflammation leading to mucosal atrophy, intestinal metaplasia, and dysplasia, representing critical steps in gastric carcinogenesis. 30. For patients with localized advanced gastric cancer, neoadjuvant chemotherapy can be administered before surgery to reduce tumor size and improve resectability, often enhancing survival outcomes compared to surgery alone. The use of single-agent or combination chemotherapy remains a cornerstone in managing metastatic gastric cancer, with regimens including drugs like fluorouracil, cisplatin, and irinotecan aimed at controlling disease progression and extending survival. 32. Gastric cancer exhibits marked geographic variation in incidence, being more prevalent in East Asian countries compared to Western nations, reflecting differences in environmental risk factors, dietary habits, and genetic predispositions. 3. Gastric cancer can lead to paraneoplastic syndromes, such as acanthosis nigricans, where darkened, velvety skin patches appear, often serving as an early indicator of an underlying malignancy that warrants further diagnostic evaluation. 34. Nutritional management is pivotal in the care of patients with gastric cancer, particularly those undergoing treatment, as maintaining adequate nutritional status helps mitigate treatment-related side effects and supports recovery and overall well-being. 35. Emerging immunotherapies, such as checkpoint inhibitors, are being explored in gastric cancer treatment, offering promising avenues to harness the immune system's power to recognize and destroy cancer cells, potentially improving outcomes in select patient populations. The diffuse-type gastric cancer, characterized by poorly cohesive, invasive growth, often presents at a more advanced stage and is associated with a poorer prognosis, posing challenges in management due to its aggressive nature and resistance to conventional therapies. 37. Understanding the molecular mechanisms of gastric cancer has paved the way for novel targeted therapies, focusing on specific pathways altered in cancer cells, such as angiogenesis, cell proliferation, and survival pathways, providing new hope for personalized treatment. 38. The presence of lymphovascular invasion in gastric cancer specimens is a critical prognostic indicator, associated with an increased risk of metastasis, and underscores the importance of thorough pathological examination in guiding clinical decision-making. 39. The development and validation of molecular biomarkers for gastric cancer are crucial in enhancing diagnostic accuracy, treatment selection, and prognosis stratification, ultimately leading to more tailored patient care and improved outcomes. 40. Gastric cancer can disrupt normal gastric function, leading to complications like gastric outlet obstruction and bleeding, which require prompt intervention, ranging from endoscopic procedures to surgical bypass, depending on the situation's severity. 41. Polyps, such as hyperplastic or adenomatous polyps, can be precursors to gastric cancer, particularly when they undergo dysplastic changes, necessitating regular surveillance and removal when found during endoscopic evaluations. 42. Anemia, often due to chronic blood loss from the tumor or nutritional deficiencies, is a common finding in gastric cancer patients, requiring comprehensive evaluation and management to ensure optimal patient care and quality of life. 43. The staging system for gastric cancer, such as the TNM classification, is vital in determining the extent of disease spread, guiding treatment approaches, and providing prognostic information to patients and healthcare providers. 44. The pathogenesis of intestinal-type gastric cancer often involves a sequence of histological changes starting with chronic gastritis, progressing to atrophic gastritis, then intestinal metaplasia, followed by dysplasia, and ultimately culminating in carcinoma. 45. Genetic testing for hereditary cancer syndromes, such as Lynch syndrome, is recommended for individuals with a strong family history of gastric cancer, enabling risk assessment and informing surveillance and management strategies. 46. Host immune response to Helicobacter pylori infection plays a role in gastric cancer development, with genetic and environmental factors influencing the level of inflammation and subsequent progression to malignancy in susceptible individuals. 47. The survival advantage of gastric cancer patients treated with adjuvant chemoradiotherapy post-gastrectomy has been demonstrated in several clinical trials, highlighting the importance of a multimodal approach in managing resectable disease. 48. Proximal gastric cancer, affecting the upper part of the stomach near the esophagus, is increasingly recognized, requiring distinct surgical approaches like total or proximal gastrectomy, often combined with esophageal resection, to achieve oncological clearance. 49. Psychological support is essential for gastric cancer patients, given the emotional and physical challenges of the disease and its treatment, ensuring holistic care that addresses both medical and mental health needs for optimal patient outcomes. 50. The role of circulating tumor DNA, ctDNA, as a non-invasive biomarker in gastric cancer is being investigated, offering potential for early detection, monitoring treatment response, and detecting minimal residual disease, paving the way for more personalized treatment approaches. 1. Esophageal cancer primarily arises from the squamous cells lining the esophagus or from glandular cells in Barrett's esophagus, with adenocarcinoma more prevalent in Western countries, resulting from a chronic cycle of gastroesophageal reflux disease inducing metaplastic changes. 2. Diagnosing esophageal cancer often involves endoscopic ultrasonography combined with biopsy, aiming to accurately determine the tumor's depth and the involvement of surrounding lymph nodes, critical for effective staging and treatment planning. 3. The correlation between tobacco use and esophageal squamous cell carcinoma has been strongly established, with carcinogens within tobacco triggering genetic mutations that disrupt normal cellular machinery, promoting malignant transformation and proliferation. Four. Treatment modalities for esophageal cancer include neoadjuvant chemoradiotherapy, which seeks to downsize tumors before surgical resection, improving resection success rates and potentially enhancing overall survival. 5. Advances in molecular biology have illuminated the role of receptor tyrosine kinases such as HER2 in esophageal adenocarcinoma, paving the way for targeted therapies aimed at these aberrant signaling pathways to curb cancer progression. 6. Esophageal cancer symptoms often present late in the disease course, with progressive dysphagia being the most prominent sign, initially for solids and then liquids, as the esophageal lumen narrows due to tumor growth. 7. The prognosis for esophageal cancer remains grave, with a 5-year survival rate generally under 20%, heavily influenced by early-stage detection and the availability of comprehensive multimodal treatment strategies. 8. A significant advancement in the prevention of esophageal adenocarcinoma is the successful management of Barrett's esophagus with proton pump inhibitors or endoscopic ablative therapies, reducing dysplasia progression to invasive carcinoma. 9. Histopathological examination of resected esophageal cancer tissue often reveals key characteristics such as poorly differentiated cells in squamous cell carcinoma or glandular formation in adenocarcinoma that assist in confirming the cancer subtype. 10. Radiation therapy in esophageal cancer can be delivered via external beam methods or brachytherapy, targeting cancer cells while sparing the surrounding healthy tissue, thus managing symptoms such as pain and dysphagia effectively. 11. In the burgeoning field of immunotherapy for esophageal cancer, the use of checkpoint inhibitors targeting PD-1 and PD-L1 pathways has shown promise, leading to immune system engagement against tumor cells and eliciting durable responses. 12. Intriguingly, preventive measures against esophageal adenocarcinoma include rigorous lifestyle modification, like adopting a Mediterranean diet rich in fruits, vegetables, and omega-3 fatty acids, which may yield a protective anti-inflammatory benefit. 13. The phenomenon of field cancerization, where the entire esophageal mucosa exhibits precancerous changes, underscores the need for regular surveillance endoscopies in high-risk populations to catch potential malignancies at an actionable stage. 14. Endoscopic therapies, such as mucosal resection or submucosal dissection, have revolutionized the management of superficial esophageal cancer, offering a less invasive approach with lower complication rates compared to traditional esophagectomy. 15. Genomic studies have identified recurring mutations and amplifications in genes like TP53 and cyclin D1 in esophageal cancer, driving oncogenic pathways and presenting novel targets for future therapeutic interventions. 16. While squamous cell carcinoma of the esophagus has long been linked with nitrosamine-rich diets, ongoing epidemiological studies suggest that reducing such dietary components could contribute to a lower incidence of this cancer subtype. 17. For patients unable to tolerate surgery, definitive chemoradiotherapy remains a mainstay treatment for esophageal cancer, providing a non-operative cure potential while addressing both the local and systemic nature of the disease. 18. The role of minimally invasive esophagectomy in treating esophageal cancer is being increasingly recognized, offering comparable long-term outcomes to open procedures, with the potential for reduced postoperative morbidity and quicker recovery. Emerging liquid biopsy techniques, such as the detection of circulating tumor DNA, hold promise for the non-invasive monitoring of esophageal cancer progression and response to treatment, allowing for more personalized therapy adjustments. An exploration of microRNA profiles in esophageal cancer has revealed their significant involvement in tumorigenesis and metastasis, suggesting that these small non-coding RNAs could serve as biomarkers for earlier detection and novel therapeutic targets. Despite chemotherapy being a cornerstone in treating locally advanced and metastatic esophageal cancer, resistance often develops through various mechanisms, including drug efflux pump expression and DNA repair pathway enhancement. As alcohol consumption is a known risk factor for esophageal squamous cell carcinoma, public health initiatives focusing on reducing alcohol intake are essential components of comprehensive cancer prevention strategies. In esophageal cancer, the intricate relationship between chronic inflammation and cancer development is highlighted by the molecular interplay between inflammatory cytokines in the nitrogen monofluoride Kb pathway, orchestrating a supportive microenvironment for tumor growth. The development of organoids derived from esophageal cancer tissues presents a promising tool for personalized medicine, enabling drug testing and response prediction tailored to the patient's unique tumor biology. Pioneering research into the esophageal cancer microbiome indicates that an altered bacterial composition might contribute to carcinogenesis, opening avenues for novel diagnostic markers and treatment adjuncts targeting microbial imbalances. Nutritional challenges in esophageal cancer patients necessitate multidisciplinary care, with dietitians playing a critical role in ensuring adequate nutritional intake and managing cachexia, crucial for maintaining strength during aggressive treatment regimens. The feasibility and efficacy of natural compounds, such as curcumin, are being evaluated in the context of esophageal cancer, postulating that their anti-inflammatory and apoptotic properties might harbor therapeutic significance when used alongside conventional treatments. Integration of artificial intelligence in the analysis of endoscopic images is revolutionizing esophageal cancer diagnosis, enhancing the accuracy and speed of detecting lesions that might be missed by the human eye alone. Factors such as obesity and metabolic syndrome contribute to the risk of esophageal adenocarcinoma through chronic inflammation and insulin resistance, signifying an intersection of metabolic health and cancer prevention strategies. Studies on the epidemiology of esophageal cancer highlight a higher prevalence among males compared to females, with research exploring the mechanisms linked to hormones and environmental exposure differences responsible for this disparity. Multidisciplinary tumor boards for esophageal cancer encourage collaboration among specialists, ensuring that each patient receives a comprehensive treatment plan optimized for both local control and systemic disease. Vocal cord paralysis is a lesser-known complication of advanced esophageal cancer, arising from invasion or compression of the recurrent laryngeal nerve, which may necessitate speech therapy or surgical intervention to restore voice function. 3.3. An examination of disparities in esophageal cancer care reveals that socioeconomic factors significantly influence both access to early detection and advanced treatment options, necessitating policy reforms aimed at equitable healthcare delivery. 34. Recent trials focusing on the de-escalation of post-esophagectomy adjuvant therapy explore whether reduced treatment intensity can still deliver survival benefits, minimizing the burden of treatment-related toxicity. 35. Notably, the TREFS classification describes distinct anatomical and pathological characteristics of esophageal cancer, enabling a nuanced approach to understanding the disease's diverse presentations and informing surgical technique refinement. 36. Cirrhosis and chronic liver disease, through mechanisms involving portal hypertension and esophageal varices, can complicate the management of esophageal cancer, leading to increased treatment complexity and necessitating coordinated care. 37. The utilization of PET-CT imaging in staging esophageal cancer allows for sensitive detection of distant metastasis, providing critical information that impacts the treatment strategy and overall prognostic considerations. 38. Comparative studies analyzing the outcomes of robotic-assisted versus traditional open esophagectomy reveal potential advantages in reducing surgical trauma and postoperative complications, while ensuring oncological efficacy. 39. Emerging research into pro-inflammatory cytokines, such as IL-6, reveals their influential role in creating a tumor-permissive environment in esophageal cancer, highlighting potential therapeutic targets in inflammatory modulation. 40. An understanding of lymphatic spread patterns in esophageal cancer assists in precise staging and tailoring surgical and radiation fields, thereby potentially improving disease control and patient outcomes. 41. Cutting-edge advancements in photodynamic therapy for esophageal cancer harness the power of light-activated drugs, providing a focused approach to tumor ablation, particularly for palliative care where conventional options prove challenging. 42. Calcium channel blockers, typically used for cardiovascular conditions, are under investigation for their potential to modulate cancer cell growth and apoptosis in esophageal cancer, suggesting a possible repurposing as adjunctive therapy. 43. The adoption of patient-reported outcome measures in clinical trials for esophageal cancer underscores the importance of capturing the patient perspective in assessing treatment impact, thus enhancing care models focused on quality of life. 44. In-depth studies on esophageal cancer cell lines have revealed insights into their genetic heterogeneity, emphasizing the necessity for personalized therapeutic approaches that account for tumor-specific mutational landscapes. 45. The complex interplay between host immunity and tumor evasion in esophageal cancer emphasizes the critical role of the immune microenvironment, propelling research into immune-modulating therapies that can recalibrate this balance. 46. Colloidal gold nanoparticles are being explored for enhanced imaging and targeted drug delivery in esophageal cancer, capitalizing on their size, biodistribution, and ability to conjugate with molecular agents. 47. The impact of postoperative complications on long-term survival in esophageal cancer patients indicates that reducing surgical morbidity is integral to improving overall outcomes, necessitating refined techniques and perioperative care. 48. A notable preventive measure for esophageal cancer includes the avoidance of scalding hot beverages known to damage the esophageal lining, potentially contributing to corrosive esophagitis and facilitating carcinogenic processes. 49. The integration of palliative care early in the treatment of esophageal cancer addresses complex symptom management, psychological support, and advanced care planning, ensuring comprehensive care beyond tumor-focused treatments. 50. Surveillance strategies for individuals with familial Barrett's esophagus syndromes highlight the importance of genetic counseling and regular monitoring processes in intercepting esophageal cancer at its nascent stage, offering improved prognostic prospects. One, lung cancer, primarily caused by smoking, is often classified into two main types: small cell lung cancer, SCLC, and non-small cell lung cancer, NSCLC, with NSCLC being the more prevalent, revolving around cellular differences that impact management and prognostic approaches. Two, smoking cessation is crucial in both prevention and management of lung cancer, as cigarette smoke contains carcinogens that lead to genetic mutations which disrupt normal cell cycles, ultimately resulting in malignant lung tumors over time. 3. Lung cancer screening using low-dose computed tomography, LDCT, can significantly reduce mortality by identifying tumors at an early, more treatable stage, particularly in high-risk populations such as older adults with a significant smoking history. Four, symptoms of lung cancer often include persistent cough, hemoptysis, chest pain, and unexplained weight loss, and these symptoms typically reflect advanced disease, highlighting the importance of early detection for effective treatment outcomes. 5. The pathophysiology of non-small cell lung cancer involves various genetic mutations such as EGFR and ALK rearrangements, which have led to targeted therapies that significantly improve outcomes in patients with specific genetic profiles. Six, small cell lung cancer is characterized by rapid growth and early metastasis, often initially presenting with paraneoplastic syndromes such as SIADH or ACTH production, complicating diagnosis and requiring prompt and aggressive treatment including chemotherapy and radiotherapy. 7. Staging of lung cancer is crucial for determining the treatment regimen and is based on the TNM system, evaluating the size and extent of the tumor, lymph node involvement, and the presence of metastasis. 8. Pleural effusion can occur in lung cancer patients due to tumor infiltration or obstruction of lymphatic drainage, often requiring thoracentesis for diagnosis and symptomatic relief. 9. Immunotherapy has revolutionized the treatment landscape for advanced NSCLC, utilizing immune checkpoint inhibitors that help the immune system recognize and attack cancer cells, specifically by targeting PD-1 and PD-L1 pathways. Palliative care plays a vital role in lung cancer management, aiming to improve quality of life by addressing symptoms management, emotional support, and advanced care planning alongside curative or control therapies. 11. Lung cancer metastasis is common, often spreading to the brain, bones, liver, and adrenal glands, with each site of metastasis requiring a tailored approach either through direct treatment or adjunctive supportive care to alleviate symptoms. 12. PET cord scans are frequently used in the evaluation of lung cancer, offering metabolic information that complements anatomical findings of CT alone, important for accurate staging and management decisions. 13. Brachytherapy, a form of radiotherapy, can be used as a localized treatment for certain cases of lung cancer, delivering radiation directly to the tumor site, thereby minimizing exposure to surrounding healthy tissues and potentially reducing side effects. 14. Angiogenesis inhibitors like bevacizumab are used in certain NSCLC regimens to block the tumor's blood supply, potentially starving cancer cells of nutrients and inhibiting tumor growth. 15. Risk factors for lung cancer extend beyond smoking and include exposure to radon, asbestos, and secondhand smoke, as well as having a family history of the disease, emphasizing the importance of multidisciplinary approaches for prevention. 16. Pulmonary function tests can be integral in assessing lung cancer patients' respiratory status prior to surgery or radiotherapy, helping predict postoperative outcomes and guiding the management of potential treatment complications. 17. Sabermetric radiotherapy, SABR, offers a non-invasive treatment modality for early-stage lung cancer, utilizing precise, high-dose radiation therapy to target tumors with minimal damage to surrounding tissues, ideal for patients who are poor surgical candidates. 18. Liquid biopsy, an emerging diagnostic tool, involves analyzing circulating tumor DNA in the blood for mutations and biomarkers, providing a less invasive means for monitoring treatment response and detecting relapse in lung cancer patients. 19. Smoking contributes to the development of lung cancer by causing DNA damage and chronic inflammation, creating an environment conducive to the formation of malignant cells, with the cumulative risk increasing with the number of pack years smoked. 20. Neuroendocrine tumors of the lung, including small cell lung cancer, display unique molecular and clinical features, often producing hormones that lead to systemic symptoms, requiring distinct approaches from non-neuroendocrine tumors. 21. Targeted therapies for lung cancer, such as tyrosine kinase inhibitors, TKIs, for EGFR-mutated NSCLC, have demonstrated effectiveness by inhibiting specific pathways essential for cancer cell growth, offering a personalized treatment option for suitable patients. 22. Pulmonary lobectomy is the standard surgical approach for resectable non-small cell lung cancer, involving the removal of an entire lobe of the lung, often combined with lymph node dissection to provide comprehensive cancer clearance. 23. Metabolic heterogeneity seen in lung cancer tumors poses challenges for treatment, as variable glucose uptake can affect both imaging accuracy in PET scans and the responsiveness to therapies like chemotherapy and radiotherapy. 24. Clubbing and hypertrophic osteoarthropathy, manifesting in distal phalanx changes and joint pain, represent potential paraneoplastic manifestations of lung cancer, necessitating evaluation for underlying malignancy, especially in smokers. 25. Recurrent respiratory infections or pneumonia can be an indicative symptom of lung cancer, driven by tumor-induced airway obstruction resulting in poor drainage and subsequent bacterial proliferation. 26. Nutritional support is vital for lung cancer patients experiencing cachexia or treatment-related appetite loss, focusing on high-calorie, protein-rich diets to maintain energy and muscle mass, which are crucial for withstanding aggressive cancer therapy. 27. Lung cancer patients receiving radiotherapy may experience radiation pneumonitis, characterized by cough, fever, and dyspnea, usually manifesting weeks after treatment and managed with corticosteroids to reduce inflammation. 28. The presence of KRAS mutations in lung cancer often correlates with poor prognosis and limited response to certain targeted therapies, presenting ongoing challenges in developing effective treatment strategies for affected patients. 29. 29. Cachexia, a syndrome of unexplained weight loss and muscle atrophy, is commonly associated with advanced lung cancer, negatively impacting prognosis and quality of life, necessitating a multidisciplinary approach for management including nutritional and pharmacologic interventions. Bronchoscopy with biopsy is a diagnostic cornerstone for lung cancer, allowing direct visualization of the airway, tumor tissue sampling, and sometimes therapeutic interventions such as stenting or laser treatment to relieve obstruction. Early-stage non-small cell lung cancer has the potential to be curatively treated with surgical resection alone, highlighting the significance of early detection through screening methods to improve survival rates. Lung cancer's molecular landscape is dynamic, often evolving under selective pressure of therapies, leading to acquired resistance to drugs like EGFR inhibitors, necessitating the development of next-generation inhibitors and combination strategies. Central lung tumors frequently cause airway obstruction, leading to post-obstructive pneumonia, atelectasis, or hemoptysis, and require accurate localization and intervention, often through bronchoscopic or radiologic techniques. In addition to tobacco, environmental air pollutants, including particulate matter and diesel exhaust, have been identified as contributing factors to lung cancer development, emphasizing the multifaceted nature of carcinogen exposure. Emerging evidence suggests that chronic obstructive pulmonary disease, COPD, independently increases lung cancer risk, irrespective of smoking history, likely due to shared inflammatory pathways and genetic susceptibilities. Hormonal therapy is not typically used in lung cancer treatment, except in specific cases where small cell lung cancer presents with ectopic production of hormones like ACTH, which requires management of related syndromes. Persistent voice hoarseness in lung cancer patients can be indicative of recurrent laryngeal nerve involvement, often due to tumor invasion or lymphadenopathy in the mediastinum, necessitating thorough evaluation and imaging. In lung cancer management, multidisciplinary tumor boards comprising oncologists, radiologists, pathologists, surgeons, and palliative care professionals enhance patient outcomes by tailoring individualized treatment plans based on comprehensive expert input. Oncogenes like ALK are important in lung cancer pathogenesis, with translocations resulting in oncogenic fusion proteins driving cancer growth, leading to the development of ALK inhibitors that provide significant clinical benefits in affected patients. Proton beam therapy offers an advanced form of radiation therapy for lung cancer, utilizing charged particles that deliver energy more precisely, potentially reducing collateral damage to surrounding healthy tissues compared to traditional photon-based radiotherapy. Recent studies have highlighted that certain lung cancer subtypes associated with EGFR mutations may demonstrate increased susceptibility to tyrosine kinase inhibitors, underscoring the importance of genetic profiling in guiding targeted treatment. Occupational exposure to asbestos is a well-known risk factor for lung cancer, specifically linked to mesothelioma and other pleural malignancies, highlighting necessary preventive measures in at-risk industrial settings. Advanced lung cancer can present with systemic symptoms such as night sweats and fatigue, which, although nonspecific, warrant comprehensive evaluation given their potential indication of widespread disease or associated paraneoplastic phenomena. Despite therapeutic advancements, lung cancer remains one of the leading causes of cancer-related mortality globally, underscoring the crucial need for ongoing research into prevention, early detection, and novel treatment modalities. Lymphangitic carcinomatosis is a unique presentation where lung cancer spreads through lymphatic channels, leading to shortness of breath and cough, requiring prompt diagnosis as it often signals advanced and diffuse disease. Rarely, lung cancer can present as a secondary effect of systemic embolization, where tumor cells invade the vasculature, resulting in peripheral symptoms like digital ischemia in a phenomenon known as tumor embolism. The management of brain metastasis from lung cancer may involve whole brain radiotherapy, stereotactic radiosurgery, or surgical intervention depending on the number, size, and location of lesions, as well as patient performance status. Carcinoid tumors of the lung, though rare, can be the source of typical or atypical presentations depending on their biologic activity and hormone secretion, requiring distinct surgical and medical management approaches compared to other lung neoplasms. E-smoking or vaping has been investigated for its potential role in lung cancer risk, with ongoing studies evaluating the carcinogenicity of flavored aerosols and nicotine substitutes used in electronic cigarettes. Advancements in telemedicine have facilitated the provision of comprehensive care for lung cancer patients, enabling remote consultations, treatment monitoring, and multidisciplinary team discussions, greatly improving access to oncology expertise. Cardiovascular disease encompasses a range of heart and blood vessel disorders, with the most common being coronary artery disease, which can lead to myocardial infarction and is primarily caused by atherosclerosis, a complex pathophysiological process involving lipid deposition, inflammation, and endothelial dysfunction. The heart's electrical system, crucial for maintaining regular cardiac rhythms, can be disrupted in arrhythmias like atrial fibrillation, which increase the risk of thromboembolism, often requiring anticoagulant therapy to prevent stroke and other serious cardiovascular events. Hypertension, often dubbed the silent killer due to its asymptomatic nature, exerts chronic pressure on the cardiovascular system, leading to left ventricular hypertrophy, heart failure, and increased risk for ischemic heart disease if not managed through lifestyle modification and pharmacotherapy. Heart failure is a clinical syndrome characterized by the heart's inability to pump sufficient blood to meet the body's needs, stemming from either systolic or diastolic dysfunction, and is often managed with a combination of ACE inhibitors, beta blockers, and diuretics to alleviate symptoms and improve survival. Lipoprotein A is a genetically determined molecule that plays a significant role as an independent risk factor for cardiovascular diseases due to its pro-atherogenic and prothrombotic properties, necessitating targeted therapeutic approaches like PCSK9 inhibitors in high-risk individuals. Kawasaki disease is an acute, self-limited vasculitis primarily affecting children and poses a considerable risk for coronary artery aneurysms, requiring prompt treatment with high-dose intravenous immunoglobulin and aspirin to reduce cardiovascular complications and ensure long-term heart health. The intricate process of atherosclerosis begins with endothelial injury followed by LDL cholesterol infiltration and oxidation, triggering a cascade of immune responses that culminate in plaque formation and potential rupture, necessitating lifestyle changes and statin therapy for risk reduction. 8. The Ankle Brachial Index (ABI) is a simple, non-invasive diagnostic tool used to assess peripheral artery disease, wherein an ABI of less than 0.90 suggests a high likelihood of significant arterial obstruction and increased cardiovascular risk, guiding further diagnostic and therapeutic interventions. (9) Takotsubo cardiomyopathy, also known as stress-induced cardiomyopathy or broken heart syndrome, mimics acute coronary syndrome but typically resolves with supportive care, highlighting the profound impact of emotional and physical stress on cardiovascular function. (10) Coronary artery bypass grafting, CABG, is a surgical procedure that improves blood flow to the heart in cases of severe coronary artery disease by using grafts from other vessels to bypass blocked arteries, significantly enhancing quality of life and reducing mortality when medical therapy alone is insufficient. (11) In hypertrophic cardiomyopathy, genetic mutations lead to an abnormally thickened heart muscle, particularly the septum, resulting in outflow obstruction, arrhythmias, and sudden cardiac death, often requiring genetic counseling, lifestyle adjustments, and medications such as beta blockers or surgical intervention for management. (12) Angiotensin-converting enzyme inhibitors not only lower blood pressure but also exert protective effects on the cardiovascular system through mechanisms like reducing remodeling, preventing left ventricular hypertrophy, and improving endothelial function, making them a cornerstone in the treatment of heart failure and hypertension. (13) Peripheral artery disease is marked by atherosclerotic blockages in the arteries of the legs, leading to intermittent claudication, rest pain, or critical limb ischemia. Early diagnosis and treatment with exercise therapy, antiplatelet agents, and revascularization are crucial to prevent limb loss and cardiovascular events. (14) Cardiac biomarkers, including high-sensitivity troponins, are pivotal in diagnosing myocardial infarction, as they are sensitive indicators of cardiac myocyte injury, guiding early treatment strategies such as anticoagulation, antiplatelet therapy, and reperfusion to improve patient outcomes. (15) Rheumatic heart disease is a chronic sequela of rheumatic fever caused by group A streptococcal infection, resulting in progressive damage to the heart valves, predominantly the mitral valve, necessitating long-term antibiotics and potentially surgical valve repair or replacement to prevent cardiac failure. (16) The baroreceptor reflex plays a critical role in short-term blood pressure regulation by adjusting heart rate and vascular tone in response to changes in arterial wall stretch, crucial in preventing rapid fluctuations in blood pressure that could lead to syncope or hypertension-related complications. (17) Endothelial cells, lining the interior of blood vessels, are indispensable for maintaining vascular health by secreting substances like nitric oxide, which promote vasodilation, inhibit platelet aggregation, and improve blood flow, and their dysfunction is a pivotal event in the pathogenesis of cardiovascular diseases. (18) One hallmark of chronic heart failure is neurohormonal activation, where systems like the renin-angiotensin-aldosterone system are upregulated, leading to detrimental effects such as vasoconstriction, sodium retention, and cardiac remodeling, which are targeted by life-saving medications like ACE inhibitors and aldosterone antagonists. (19) The QT interval on an electrocardiogram is a critical measure of ventricular repolarization, and its prolongation is associated with an increased risk of life-threatening arrhythmias such as torsades de pointes, necessitating careful monitoring and correction of electrolyte imbalances and medication adjustments as needed. (20) Pulmonary embolism, a potentially fatal cardiovascular emergency, results from a thrombus typically originating in the deep veins of the legs or pelvis, and manifests with acute dyspnea, chest pain, and hypoxemia. Rapid diagnosis via imaging and treatment with anticoagulation is essential for improving survival. 21. The inflammatory biomarker C-reactive protein, CRP, is utilized in cardiovascular risk assessment, as elevated levels correlate with increased risks of atherosclerosis and heart attacks, prompting preventive measures such as lifestyle modifications and pharmacologic interventions aimed at reducing systemic inflammation. 22. Valvular heart diseases, such as aortic stenosis or mitral regurgitation, result from structural abnormalities causing impaired valve function, leading to volume or pressure overload that can progress to heart failure, necessitating regular monitoring and interventions like valve repair or replacement when symptomatic. 23. Essential hypertension is a complex, multifactorial disorder with contributions from genetic, environmental, and lifestyle factors, and it presents a major risk factor for cardiovascular morbidity and mortality, with treatment focused on achieving target blood pressures through lifestyle changes and evidence-based medication regimens. 24. In acute coronary syndromes, prompt recognition and management through the door-to-balloon protocol for angioplasty within 90 minutes in ST elevation myocardial infarction significantly improve outcomes by restoring blood flow and minimizing cardiac muscle damage, emphasizing the importance of time-sensitive intervention. 25. The role of platelets extends beyond hemostasis. In vascular injury, activated platelets contribute to thrombus formation by releasing mediators like thromboxane A2 and inducing coagulation pathways, making antiplatelet therapy a cornerstone in the prevention of recurrent cardiovascular events after an initial infarction. 26. Myocarditis, an inflammation of the heart muscle often due to viral infections, can lead to dilated cardiomyopathy and heart failure, with clinical management ranging from supportive care and anti-inflammatory treatments to advanced therapies like mechanical circulatory support in severe cases. 27. B-type natriuretic peptide, BNP, and its precursor NT-proBNP are crucial diagnostic tools in distinguishing heart failure from other causes of dyspnea, as they are elevated in response to ventricular stretch, guiding the initiation and adjustment of heart failure therapies to optimize patient care. 28. The Framingham Heart Study provided invaluable insights into cardiovascular risk factors, establishing the association between cholesterol levels, hypertension, and smoking with coronary artery disease, thereby shaping modern preventive strategies through risk calculators and lifestyle interventions. 29. Coarctation of the aorta, a congenital narrowing of the aorta typically distal to the left subclavian artery, results in hypertension in the upper extremities and reduced perfusion to the lower body, requiring careful monitoring and surgical repair or balloon angioplasty to prevent long-term complications like heart failure. 30. Sudden cardiac death, often precipitated by ventricular arrhythmias, poses a significant risk in patients with coronary artery disease or cardiomyopathy, with implantable cardioverter defibrillators providing life-saving intervention by restoring normal heart rhythm upon detecting life-threatening disturbances. 31. Triglycerides, though primarily an energy source, are also implicated in atherosclerotic cardiovascular disease risk, with hypertriglyceridemia contributing to small, dense LDL particles and endothelial impairment, necessitating dietary modification and medications like fibrates in conjunction with statins for management. 32. The cardiac stress testing involves assessing the heart's response to exercise or pharmacologic stress, identifying ischemia and functional capacity, with imaging modalities like echocardiography or nuclear scans enhancing diagnostic accuracy for coronary artery disease assessment and guiding treatment strategies. 33. Heart rate variability, HRV, the physiological phenomenon of variation in the time interval between heartbeats, serves as a marker of autonomic nervous system function and cardiovascular health, with reduced HRV associated with increased risk of cardiovascular morbidity and mortality in various populations. The concept of cardiometabolic risk encompasses the clustering of cardiovascular risk factors, including insulin resistance, hypertension, dyslipidemia, and central obesity, necessitating comprehensive management approaches oriented towards lifestyle modification and pharmacotherapy to reduce the risk of cardiovascular events and diabetes. Alcohol consumption has a complex relationship with cardiovascular health, where moderate intake may confer cardioprotective effects through HDL elevation and anti-inflammatory actions, yet excessive use poses risks for hypertension, cardiomyopathy, and atrial fibrillation, informing guidelines for responsible consumption. The intricate process of heart muscle contraction, governed by the sliding filament theory, involves the interaction of actin and myosin filaments within cardiac muscle cells, regulated by calcium ion flux and essential for effective cardiac output, highlighting the significance of calcium channel blockers in treating conditions like hypertension and angina. Patent ductus arteriosus, a common congenital heart defect, results from the failure of the ductus arteriosus to close after birth, causing left-to-right shunting, leading to pulmonary overcirculation and heart failure if untreated, advocating early diagnosis and intervention with either pharmacologic closure or surgical repair. The J-curve phenomenon in hypertension management illustrates the potential for excessively low blood pressure to increase cardiovascular risk, prompting careful titration of antihypertensive therapy to balance optimizing blood pressure control while mitigating the risk of hypotension-related adverse events. The renin-angiotensin-aldosterone system plays a pivotal role in blood pressure regulation and fluid balance, with dysregulation contributing to pathologies like hypertension, heart failure, and chronic kidney disease, where inhibitors of this system, such as ACE inhibitors and ARBs, are the mainstays of treatment. Novel cardiovascular imaging techniques like coronary CTA and cardiac MRI enhance diagnostic precision by non-invasively characterizing coronary artery disease, myocardial function, and structure, guiding personalized management and optimizing therapeutic outcomes in complex cardiovascular cases. Physical inactivity is recognized as a modifiable risk factor for cardiovascular disease, with regular exercise promoting cardiovascular health by improving endothelial function, reducing blood pressure and LDL cholesterol levels, and enhancing insulin sensitivity, underscoring the importance of active lifestyle interventions for disease prevention. The metabolic syndrome, characterized by a constellation of factors including abdominal obesity, dyslipidemia, insulin resistance, and hypertension, increases cardiovascular disease risk exponentially, necessitating multifaceted therapeutic strategies focusing on weight reduction, physical activity, and pharmacotherapy for optimal risk reduction. Mitral valve prolapse, a condition where the valve leaflets bulge into the left atrium during systole, can lead to mitral regurgitation, arrhythmias, and in some cases, significant cardiovascular symptoms requiring surgical intervention, highlighting the importance of regular monitoring and risk stratification. The sodium-potassium pump maintains cellular electrochemical gradients essential for cardiac function, and its impairment can lead to elevated intracellular sodium and calcium levels, affecting myocardial contractility and rhythm, with digoxin influencing this pump to manage heart failure and atrial fibrillation effectively. Homocysteine, an amino acid, is implicated in cardiovascular disease pathogenesis when elevated, promoting endothelial dysfunction, oxidative stress, and thrombotic events, leading to consideration of folic acid supplementation and lifestyle changes as potential therapeutic strategies for reducing associated cardiovascular risks. '46. Cardiovascular risk reduction in diabetes patients extends beyond glucose control, emphasizing management of blood pressure, lipid profiles, and lifestyle factors, with SGLT2 inhibitors and GLP-1 receptor agonists showing promise in reducing cardiovascular events and enhancing overall heart health in this high-risk population. '47. Myocardial perfusion imaging involves the assessment of blood flow to the heart muscle using tracers, providing valuable insight into coronary artery disease severity and therapeutic response, informing decisions on revascularization strategies like PCI or CABG to improve symptom relief and survival outcomes. '48. The progression of left bundle branch block alters ventricular depolarization and is indicative of underlying structural heart disease, often necessitating further evaluation and intervention strategies, such as device implantation in heart failure patients to optimize synchronicity and improve clinical outcomes. '49. Cardiogenic shock, characterized by inadequate tissue perfusion secondary to severe cardiac dysfunction, poses a critical condition with high mortality, demanding prompt intervention with inotropes, mechanical circulatory support, and definitive treatment strategies like PCI or CABG to stabilize hemodynamics and enhance survival prospects. '50. High-density lipoprotein, HDL, cholesterol, often referred to as good cholesterol, plays a vital role in reverse cholesterol transport and endothelial protection, with higher levels traditionally associated with decreased cardiovascular risk, though recent studies suggest functionality may be equally critical, prompting ongoing research into therapeutic HDL targeting approaches. '1. Gastric ulcers, a common form of peptic ulcers, occur when the protective mucosal lining of the stomach is damaged, most often due to Helicobacter pylori infection or chronic use of nonsteroidal anti-inflammatory drugs, NSAIDs, resulting in symptoms like burning stomach pain, bloating, and nausea, and are diagnosed through endoscopy and treated with proton pump inhibitors, antibiotics, and lifestyle modifications to reduce stress and dietary irritants. 2. Inflammatory bowel disease, IBD, encompassing Crohn's disease and ulcerative colitis, is characterized by chronic inflammation of the gastrointestinal tract, with Crohn's affecting any part from mouth to anus and ulcerative colitis limited to the colon and rectum, presenting with symptoms such as abdominal pain, diarrhea, weight loss, and fatigue, and requiring a combination of diagnostic imaging, endoscopic evaluation, and serological markers for diagnosis and management with anti-inflammatory drugs, immunosuppressants, and occasionally surgery. '3. Irritable bowel syndrome, IBS, a functional gastrointestinal disorder, manifests with symptoms of abdominal pain, bloating, diarrhea, and constipation, often triggered by stress, hormonal changes, or certain foods, but lacks structural abnormalities, making diagnosis reliant on exclusion of other conditions and Rome IV criteria, with treatment focused on dietary modifications, stress management, and pharmacological agents such as fiber supplements, antispasmodics, and laxatives to alleviate symptoms and improve patient quality of life. 4. Celiac disease is an autoimmune disorder triggered by ingestion of gluten, a protein found in wheat, barley, and rye, leading to small intestinal villus atrophy and malabsorption, manifesting with symptoms like diarrhea, bloating, weight loss, and fatigue, and diagnosed through serologic testing for antibodies such as tissue transglutaminase IgA, with confirmation via duodenal biopsy. Strict lifelong adherence to a gluten-free diet is the cornerstone of treatment to alleviate symptoms and prevent complications such as osteoporosis and malignancy. 5. Gastroesophageal reflux disease, GERD, occurs when stomach acid frequently flows back into the esophagus, irritating its lining and leading to symptoms such as heartburn, regurgitation, and difficulty swallowing, often due to lower esophageal sphincter relaxation or hiatal hernia, and can cause complications like esophagitis or Barrett's esophagus if untreated. Diagnosis is based on clinical presentation, pH monitoring, and endoscopy, with lifestyle modifications, antacids, and proton pump inhibitors forming the backbone of treatment. 6. Acute pancreatitis, an inflammatory condition of the pancreas, is commonly caused by gallstones or alcohol intake, presenting with sudden onset severe epigastric pain radiating to the back, nausea, vomiting, and elevated serum amylase and lipase levels. It is diagnosed through clinical evaluation and imaging studies such as CT scan, and management involves supportive care with fluid resuscitation, pain control, and avoidance of oral intake to rest the pancreas, while addressing the underlying etiology to prevent future attacks. 7. Barrett's esophagus is a condition in which the normal squamous epithelium of the distal esophagus is replaced by columnar-lined epithelium due to chronic gastroesophageal reflux disease, GERD, increasing the risk for esophageal adenocarcinoma, and is often asymptomatic, diagnosed through endoscopic biopsy revealing intestinal metaplasia. Surveillance with periodic endoscopy and management of reflux through lifestyle modification and proton pump inhibitors are critical for reducing carcinoma risk. 8. Diverticulitis occurs when small bulging pouches, or diverticula, in the digestive tract lining become inflamed or infected, typically presenting with abdominal pain, fever, and altered bowel habits, often in the lower left quadrant, and a diet low in fiber and high in refined foods is a major risk factor. It is diagnosed with imaging such as CT scan, and treatment involves bowel rest, antibiotics, and dietary adjustments, with surgery reserved for recurrent or complicated cases. 9. Hepatitis, an inflammation of the liver, can be caused by viral infections, notably hepatitis A, B, C, D, and E, alcohol, drugs, or autoimmune disease, presenting with symptoms such as jaundice, abdominal pain, fatigue, and elevated liver enzymes, and diagnosis involves serological testing and liver function tests, with treatment tailored to the etiology, such as antiviral drugs for chronic viral hepatitis, abstinence from alcohol, immunosuppressants for autoimmune hepatitis, and lifestyle modifications to preserve liver function. 10. Gallstones or cholelithiasis are solid particles that form in the gallbladder from bile components, often due to supersaturation of cholesterol, biliary stasis, or increased bilirubin, and are largely asymptomatic but can cause biliary colic, cholecystitis, pancreatitis, or cholangitis if obstructive. Diagnosis is confirmed by ultrasound, and management ranges from observation to laparoscopic cholecystectomy, especially in symptomatic cases or complications. 11. Ulcerative colitis is a form of inflammatory bowel disease that specifically affects the colon and rectum, causing continuous colonic mucosal inflammation beginning in the rectum and extending proximally, with symptoms including bloody diarrhea, abdominal cramping, and urgency, diagnosed through colonoscopy and histopathological examination, and treated with aminosalicylates, corticosteroids, immunomodulators, and biologic agents to induce and maintain remission, with colectomy as a surgical option for refractory or complicated disease. 12. Crohn's disease is an inflammatory bowel disease that can affect any part of the gastrointestinal tract from mouth to anus, characterized by transmural inflammation, skip lesions, and complications such as strictures, fistulas, and abscesses, presenting with abdominal pain, diarrhea, weight loss, and nutritional deficiencies. Diagnosis is made through endoscopic evaluation, imaging, and biopsy, and management involves anti-inflammatory medications, biologics, nutritional support, and, when necessary, surgical intervention to manage complications or treatment resistance. 13. Hepatic encephalopathy is a complex neuropsychiatric syndrome resulting from liver dysfunction, often triggered by acute or chronic liver disease, marked by confusion, altered level of consciousness, and asterixis, due to buildup of neurotoxic substances like ammonia, and diagnosed clinically and supported by blood ammonia levels. Management focuses on reducing ammonia production and absorption with lactulose and antibiotics, addressing precipitating factors, and consideration of liver transplantation in severe or refractory cases. 14. Achalasia is a motility disorder of the esophagus characterized by failure of the lower esophageal sphincter to relax and absent or impaired peristalsis, leading to symptoms of progressive dysphagia for solids and liquids, regurgitation, and chest pain, with diagnostic confirmation via esophageal manometry, barium swallow, and endoscopy. Treatment options include pneumatic dilation, surgical myotomy, and pharmacologic therapies such as botulinum toxin injections to relieve obstruction and improve swallowing function. 15. Clostridioides difficile infection is a significant cause of antibiotic-associated diarrhea, resulting from disruption of normal colonic microbiota, typically due to broad-spectrum antibiotic use, leading to toxin-mediated colitis with symptoms of watery diarrhea, fever, and abdominal pain, confirmed by stool toxin assays or PCR. Management involves cessation of the offending antibiotic, initiation of oral vancomycin or fidaxomicin, and infection control measures, with fecal microbiota transplantation considered in recurrent cases. 16. Celiac disease requires lifelong adherence to a gluten-free diet to manage symptoms and prevent complications, as it is an autoimmune disorder where ingestion of gluten leads to small intestinal mucosal injury, malabsorption, and symptoms like diarrhea, anemia, and neurological issues, confirmed by serologic testing for specific antibodies and duodenal biopsy showing villus atrophy, with diligent dietary management necessary to improve patient outcomes and quality of life significantly. 17. Colorectal cancer screening, crucial for early detection and improved survival, involves methods such as fecal occult blood testing, fecal immunochemical tests, sigmoidoscopy, and colonoscopy beginning at age 45 to 50 for average-risk individuals, aiming to identify and remove precancerous polyps and detect cancer at an early, more treatable stage, with high-risk individuals requiring earlier and more frequent screening intervals based on personal or family history and genetic factors. 18. Wilson's disease is a rare genetic disorder characterized by excessive copper accumulation in the body due to defective hepatic copper transport, leading to hepatic, neurologic, and psychiatric manifestations, often with Kayser-Fleischer rings on examination, and diagnostic confirmation includes serum ceruloplasmin, 24-hour urinary copper excretion, liver biopsy, or genetic testing. It is managed with copper chelating agents such as D-penicillamine or trientine, and zinc therapy to prevent disease progression and maintain normal copper balance. 19. Portal hypertension, most commonly resulting from cirrhosis, is characterized by increased pressure in the portal venous system, leading to complications such as variceal bleeding, ascites, and hepatic encephalopathy, with diagnosis made by assessing clinical signs and using imaging modalities like Doppler ultrasound and hepatic venous pressure gradient measurement, while treatment aims at lowering portal pressure through beta blockers, endoscopic variceal ligation, TIPS, transjugular intrahepatic portosystemic shunt, and managing underlying liver disease. 20. Lactose intolerance is the inability to digest lactose, a sugar found in milk and dairy products, due to deficient levels of the enzyme lactase produced by the small intestine, resulting in symptoms like bloating, diarrhea, and abdominal pain after consuming lactose-containing foods, diagnosed by hydrogen breath test, lactose tolerance test, or lactase gene testing, and managed through dietary modifications, lactose-free products, and lactase enzyme supplements to improve symptoms and dietary tolerance. 21. Gastrointestinal bleeding can present as hematemesis, melena, or hematochezia, with upper GI bleeding most commonly caused by peptic ulcers, esophageal varices, and Mallory-Weiss tears, while lower GI bleeding often results from diverticulosis, colorectal cancer, or hemorrhoids. Diagnosis involves endoscopic evaluation, imaging, and laboratory tests assessing hematologic and coagulation status, while management depends on stabilization with intravenous fluids and blood products, endoscopic hemostatic procedures, and treating the underlying cause. (22) Dumping syndrome, often seen post-gastric surgery, occurs when ingested food moves too quickly from the stomach into the small intestine, causing early and late postprandial symptoms such as nausea, bloating, abdominal cramps, diarrhea, dizziness, and tachycardia, and is mitigated by dietary changes focusing on smaller, more frequent meals with reduced simple carbohydrates, along with medications to retard gastric emptying or surgery in refractory cases to restore normal gastric physiology. 23. Zollinger-Ellison syndrome is a rare condition characterized by gastrin-secreting tumors, gastrinomas, situated primarily in the pancreas or duodenum, leading to hypersecretion of gastric acid, peptic ulcer disease, and diarrhea, with diagnosis supported by elevated fasting gastrin levels, stomach pH measurement, and imaging studies to locate gastrinomas. Treatment includes high-dose proton pump inhibitors to control acid secretion and surgical resection or somatostatin analogs for tumor management. 24. Giardiasis is a common protozoal infection of the small intestine caused by Giardia lamblia, transmitted by contaminated water or food, leading to symptoms such as diarrhea, flatulence, stomach cramps, and weight loss. Diagnosis is confirmed by stool examination for cysts or trophozoites, antigen detection, or PCR testing, and it is treated effectively with antiparasitic agents like metronidazole or tinidazole, emphasizing the importance of safe drinking water and hygienic practices to prevent transmission. 25. Hepatocellular carcinoma, the most common primary liver cancer, often arises in the background of chronic liver disease and cirrhosis secondary to hepatitis B or C infection, alcohol abuse, or non-alcoholic fatty liver disease, presenting insidiously with weight loss, jaundice, and abdominal mass. Diagnosis is achieved through a combination of imaging modalities like ultrasound or MRI and serum alpha-fetoprotein measurement, with treatment options ranging from surgical resection, transarterial chemoembolization, local ablative therapies, to systemic treatments including kinase inhibitors and immunotherapy. 26. Constipation, a common digestive complaint, is characterized by infrequent bowel movements or difficulty evacuating stools, often due to inadequate dietary fiber, fluid intake, physical inactivity, or medications, and can be functional or secondary to underlying disorders like irritable bowel syndrome or neurological conditions. Management includes dietary modifications to increase fiber and water, behavioral interventions to establish regular bowel habits, and pharmacological treatments such as laxatives, stool softeners, or prokinetic agents to relieve symptoms and ensure regular bowel activity. 27. Non-alcoholic fatty liver disease, NAFLD, is the hepatic manifestation of metabolic syndrome, characterized by fat accumulation in the liver, which can progress to non-alcoholic steatohepatitis, NASH, fibrosis, and cirrhosis, associated with obesity, diabetes, dyslipidemia, and hypertension. Diagnosis involves imaging studies like ultrasound or MRI, and serological testing to exclude other liver diseases, while management focuses on lifestyle modifications, including dietary changes, physical activity, weight loss, and pharmacologic interventions targeting insulin resistance and hepatic inflammation. 28. Gastric cancer, often adenocarcinoma, is a malignancy arising from the stomach lining, associated with risk factors such as Helicobacter pylori infection, smoking, dietary factors, and certain genetic syndromes, presenting with vague symptoms like abdominal pain, weight loss, nausea, and early satiety, typically diagnosed through endoscopy with biopsy and staging through CT or PET scans. Management depends on the stage and may involve surgical resection, chemotherapy, radiation, and targeted therapies, with a focus on early detection and intervention to improve prognosis. 29. Bile acid malabsorption can lead to chronic diarrhea and stearia due to excessive bile acids reaching the colon after conditions such as ileal resection, Crohn's disease, or idiopathic causes. Diagnosis is often clinical, supported by a say CAT scan or response to bile acid sequestrants, and management involves dietary modifications alongside medications like cholestyramine or colesevelam to bind unabsorbed bile acids in the gastrointestinal tract and reduce diarrhea. 30. Appendicitis is the inflammation of the vermiform appendix, often due to obstruction by fecalix or lymphoid hyperplasia, presenting acutely with periumbilical pain that localizes to the right lower quadrant, accompanied by nausea, vomiting, and fever, with diagnosis supported by clinical examination, laboratory tests, and imaging like ultrasound or CT scan. Surgical removal via appendectomy, typically performed laparoscopically, is the definitive treatment to prevent complications such as perforation and peritonitis. 31. Primary sclerosing cholangitis (PSC) is a chronic liver disease characterized by progressive inflammation and fibrosis of the bile ducts, leading to strictures, cholestasis, and eventual cirrhosis, often associated with inflammatory bowel disease, particularly ulcerative colitis. Diagnosis is confirmed using cholangiography revealing a beaded appearance of biliary ducts, and management focuses on symptom relief, monitoring for complications, and liver transplantation in advanced cases, as no specific curative medical therapy exists. Hemochromatosis is an iron overload disorder, predominantly genetic, characterized by excessive intestinal iron absorption and deposition in various organs, leading to symptoms including fatigue, arthralgia, diabetes, and skin hyperpigmentation, with diagnosis confirmed by elevated serum ferritin, transferrin saturation, and genetic testing for HFE mutations, while management involves regular phlebotomy to normalize iron levels and prevent organ damage, with liver biopsy used to assess the extent of hepatic fibrosis or cirrhosis. 3. Intussusception is a condition where a segment of the bowel telescopes into an adjacent segment, commonly seen in infants, resulting in symptoms such as sudden abdominal pain, vomiting, and current jelly stools, with diagnosis often confirmed by ultrasound showing the characteristic target sign. Treatment may involve air or contrast enema reduction, which is both diagnostic and therapeutic, with surgical intervention necessary in cases of failed non-operative reduction or signs of bowel necrosis or perforation. 34. Esophageal cancer, most commonly squamous cell carcinoma or adenocarcinoma, presents with progressive dysphagia, weight loss, odynophagia, and hoarseness, primarily affecting men over women, and associated with risk factors like tobacco use, alcohol consumption, Barrett's esophagus, and achalasia. Diagnosis requires endoscopy with biopsy and imaging for staging, while treatment varies by stage, including surgical resection, chemoradiotherapy, and palliative care to manage symptoms and improve quality of life. 35. Gastric polyps are growths found on the stomach lining, often discovered incidentally during endoscopy, and can be non-neoplastic, such as hyperplastic polyps, or neoplastic, like adenoma, with potential to progress to cancer. Management involves histological assessment via biopsy, with surveillance and removal of neoplastic polyps, especially those with high-grade dysplasia, to prevent malignant transformation, alongside evaluation for underlying conditions such as chronic gastritis or atrophic gastritis. 36. Steatohepatitis, characterized by liver inflammation and damage due to lipid accumulation, is an intermediate stage between simple fatty liver and cirrhosis, commonly seen in alcohol abuse, alcoholic steatohepatitis, or as part of non-alcoholic fatty liver disease, NAFLD, diagnosed through liver function tests and imaging showing fat infiltration, possibly confirmed with biopsy. Management focuses on lifestyle adjustments like weight reduction and abstinence from alcohol or steatosis-inducing agents to halt progression and prevent cirrhosis. 37. Intestinal obstruction can be caused by mechanical factors such as adhesions, hernias, or neoplasms, or functional issues like ileus, resulting in symptoms of abdominal pain, vomiting, distension, and constipation. Diagnosis is based on clinical examination and imaging, particularly abdominal X-ray or CT scan showing dilated bowel loops, air fluid levels, and potential transition points, while management often requires hospitalization for fluid and electrolyte replacement, bowel rest, and surgery when indicated, particularly in complete or strangulated obstructions. Dyspepsia, often known as indigestion, encompasses chronic or recurrent upper abdominal discomfort or pain, typically related to eating, and may be functional, peptic ulcer related, or indicative of underlying biliary or pancreatic disorders. Diagnosis involves clinical evaluation, exclusion of alarm features, and possible endoscopy, with treatment consisting of lifestyle adjustments, dietary changes, and pharmacologic agents such as acid suppressants or prokinetics, tailored to patient response and underlying etiology. Eosinophilic esophagitis is a chronic immune-mediated disease characterized by eosinophil infiltration in the esophagus, leading to symptoms like dysphagia and food impaction, triggered by food allergens or environmental factors. Diagnosis is confirmed by endoscopic findings of rings or furrows and a high eosinophil count in esophageal biopsies, with management involving dietary elimination, proton pump inhibitors, and topical corticosteroids to reduce inflammation and prevent structural changes in the esophagus. Gastric emptying disorders, such as gastroparesis, involve delayed gastric emptying without an obstructive cause, leading to symptoms of nausea, vomiting, early satiety, and bloating, often associated with diabetes mellitus, post-surgical conditions, or idiopathic origins. Diagnosis requires gastric emptying scintigraphy to measure retention, and treatment focuses on dietary modifications, glycemic control in diabetic patients, and medications like prokinetics or antiemetics to manage symptoms effectively and enhance gastric motility. Peritonitis, an inflammation of the peritoneum, usually due to bacterial infection from gastrointestinal perforation, rupture of an abdominal organ, or dialysis complications, presents with severe abdominal pain, tenderness, rigidity, and systemic symptoms like fever or shock, diagnosed by clinical examination and supported by laboratory tests and imaging. Prompt treatment involves broad-spectrum antibiotics and often surgical intervention to address the underlying cause and drain infectious material or perform necessary repairs. Hepatorenal syndrome is a functional kidney failure complication associated with severe liver disease like cirrhosis, characterized by intense renal vasoconstriction and reduced renal perfusion, with criteria for diagnosis including cirrhosis with ascites and exclusion of other causes of renal dysfunction. Management includes addressing precipitating factors, using vasoconstrictors to improve renal function, and considering liver transplantation when feasible to provide long-term resolution through improved liver function. Short bowel syndrome results from extensive surgical resection of the small intestine, causing malabsorption, diarrhea, and malnutrition due to insufficient intestinal absorptive surface, necessitating a multidisciplinary approach involving dietary adjustments, vitamin and mineral supplementation, and medications such as antidiarrheals or proton pump inhibitors. In severe cases, patients may require parenteral nutrition or surgical interventions like bowel lengthening procedures to improve nutritional status and quality of life. Hemorrhoids are swollen vascular structures in the anal canal, often associated with increased intra-abdominal pressure from straining during defecation or prolonged sitting, manifesting as rectal bleeding, pain, pruritus, and palpable masses, classified into internal or external hemorrhoids based on location. Management includes dietary modifications to increase fiber intake, topical treatments, sclerotherapy, rubber band ligation, and surgical hemorrhoidectomy for persistent or complicated cases requiring resolution. Mesenteric ischemia, involving reduced blood flow to the intestines, can be acute due to arterial embolism, thrombosis, or chronic from atherosclerotic disease. It presents with severe abdominal pain, particularly postprandial in chronic cases, often coupled with fear of eating leading to significant weight loss. Diagnosis relies on a combination of clinical suspicion, laboratory tests, and imaging modalities such as CT angiography, while management involves prompt revascularization, anticoagulation, and surgical intervention tailored to the underlying cause and clinical stability of the patient. (46) Diverticulosis refers to the presence of diverticula in the colon, often asymptomatic but identified incidentally during imaging or colonoscopy, related to increased intraluminal pressure and chronic low-fiber diet. While benign, they can lead to complications such as diverticulitis or bleeding, with management emphasizing dietary fiber intake to prevent progression and regular monitoring for symptoms indicating complications, which may need further medical or surgical intervention. 47. Autoimmune hepatitis is a chronic inflammatory liver disease characterized by immune-mediated hepatocytic injury, with diagnostic features including elevated liver enzymes, positive serology for autoimmune antibodies, such as ANA, SMA, or LKM1, and liver biopsy showing interface hepatitis with lymphoplasmacytic infiltrate. Treatment requires immunosuppression, typically starting with corticosteroids like prednisone, often in combination with azathioprine, to induce and maintain remission and prevent disease progression to cirrhosis or liver failure. (48) Gastroparesis, often idiopathic or associated with underlying conditions like diabetes mellitus, involves delayed gastric emptying leading to symptoms such as nausea, vomiting, early satiety, and bloating without mechanical obstruction. Diagnosis is confirmed by gastric emptying scintigraphy and exclusion of structural causes, with management focused on dietary modifications, glycemic control, prokinetic medications like metoclopramide, and symptomatic relief through antiemetics or gastric electrical stimulation in refractory cases. (49) SIBO, small intestinal bacterial overgrowth, is characterized by an increased number or alteration of bacteria in the small intestine, leading to symptoms like bloating, diarrhea, abdominal pain, and malabsorption. Diagnosis involves breath tests, such as lactulose or glucose, and treatment includes antibiotics such as rifaximin or metronidazole, probiotics, and addressing underlying anatomical or motility disorders to prevent recurrence and maintain a balanced gut microbiome. (50) Pyloric stenosis, typically seen in infants, involves hypertrophy of the pyloric muscle, causing gastric outlet obstruction with projectile vomiting, dehydration, and failure to thrive, diagnosed through ultrasound revealing elongation and thickening of the pylorus. Treatment is surgical, with pyloromyotomy to relieve obstruction and restore normal feeding and hydration status, emphasizing the importance of early recognition and intervention to prevent severe electrolyte imbalances and nutritional deficits. (1) Non-alcoholic fatty liver disease, NAFLD, the hepatic manifestation of metabolic syndrome, is characterized by excessive fat accumulation in liver cells, often due to insulin resistance, and is the most common cause of chronic liver disease worldwide, affecting nearly 1 billion individuals and potentially leading to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, fibrosis, cirrhosis, or hepatocellular carcinoma if left unchecked over the years. 2. The pathophysiology of fatty liver disease involves a two-hit hypothesis where the first hit is the accumulation of triglycerides in the hepatocytes, creating a state vulnerable to lipotoxicity, and the second hit involves oxidative stress, cytokines, and mitochondrial dysfunction that progress hepatic inflammation and fibrosis, emphasizing the complexity and multifactorial nature of this condition. 3. Magnetic resonance imaging, MRI, proton density fat fraction, PDFF, is emerging as a non-invasive gold standard for quantifying hepatic steatosis in NAFLD, providing a comprehensive assessment of liver fat content that is more precise than ultrasound and CT and lacking the invasiveness and risks associated with liver biopsy, thus contributing to better disease management and monitoring of therapeutic responses. 4. The primary treatment approach for non-alcoholic fatty liver disease focuses on lifestyle interventions, primarily weight loss through dietary modifications and increased physical activity, with evidence showing that a modest reduction of 5 to 10% in body weight can significantly reduce liver fat, ameliorate inflammation and fibrosis, and improve overall liver function, often reversing fatty liver changes. 5. The use of vitamin E as a therapeutic agent in non-alcoholic steatohepatitis has gained traction due to its antioxidant properties, with studies demonstrating that high-dose vitamin E supplementation can improve liver histology, reduce hepatic inflammation, and increase indices of liver function in non-diabetic NASH patients, although caution is advised regarding long-term use and potential cardiovascular risks. 6. In NAFLD, the liver enzyme alanine aminotransferase (ALT) is often elevated. However, normal ALT levels do not exclude the presence of significant liver damage, emphasizing the importance of considering a full panel of liver function tests alongside imaging techniques and histological assessment when diagnosing and monitoring this stealthy and often silent hepatic condition. 7. Advances in our understanding of gut-liver axis dysregulation in NAFLD have highlighted the role of dysbiosis and intestinal permeability in promoting hepatic fat accumulation and inflammation, pointing to the therapeutic potential of probiotics, prebiotics, and fecal microbiota transplantation in modulating gut microbiota composition and function as a novel avenue for treatment. 8. Insulin resistance is a crucial player in the pathogenesis of non-alcoholic fatty liver disease, where excessive lipolysis and increased free fatty acid influx into the liver, driven by hyperinsulinemia, play a pivotal role in hepatic fat deposition, reinforcing the interconnectivity between metabolic disturbances and liver health, and supporting the utilization of insulin-sensitizing agents like metformin in some patient populations. 9. Hepatocyte apoptosis, mediated by pathways involving endoplasmic reticulum stress and death receptor activation, is a significant contributor to liver injury and progression in NAFLD, suggesting that agents targeting these apoptotic pathways could offer novel therapeutic benefits by interrupting this self-perpetuating cycle of liver cell death and fibrogenesis. 10. Detection of genetic polymorphisms such as in the PNPLA3 gene highlights a genetic predisposition that significantly influences individual susceptibility to fatty liver disease in its progression, thus directing research towards personalized medicine approaches where genetic screening could inform risk assessment, prognosis, and tailored therapeutic strategies. 11. Bariatric surgery, particularly Roux-en-Y gastric bypass, has emerged as a highly effective treatment for morbidly obese patients with NAFLD, resulting in substantial and sustained weight loss, resolution of hepatic steatosis, and regression of fibrosis, positioning it as a viable option in severe cases where conservative management has failed and the risk of progression is high. 12. The mitochondrial dysfunction observed in NAFLD stems from impaired oxidative phosphorylation and an increase in reactive oxygen species, which contribute to steatosis, cellular damage, and fibrosis, indicating a potential therapeutic role for agents aimed at enhancing mitochondrial function and protecting against oxidative stress in the treatment landscape. (13) Obstructive sleep apnea, OSA, has been identified as a contributing factor to the progression of NAFLD through mechanisms involving intermittent hypoxia and sympathetic activation, making the treatment of OSA with continuous positive airway pressure, CPAP, a potentially beneficial adjunct in slowing disease progression and improving liver health. 14. Although traditionally associated with alcohol, steatohepatitis can develop in non-drinkers who consume excessive fructose, which is metabolized in the liver, resulting in de novo lipogenesis and increased triglyceride synthesis, underlining the impact of dietary choices on liver health and the importance of reducing fructose intake for NAFLD patients. (15) The concept of metabolic-associated fatty liver disease, MAFLD, has been proposed to more accurately reflect the metabolic underpinnings and multisystem involvement of fatty liver disease, emphasizing the transition towards a diagnostic approach that integrates metabolic risk factors, allowing for better stratification and management in clinical practice. 16. Emerging evidence suggests that certain medications, such as statins and SGLT2 inhibitors, not only manage associated metabolic conditions but also provide ancillary benefits for liver health, including reductions in liver fat and fibrosis, showcasing the potential of repurposing existing cardiometabolic medications to tackle the hepatic sequelae of metabolic syndrome. Choline, an essential nutrient found in eggs, meat, and fish, plays an important role in preventing liver steatosis by assisting in lipoprotein assembly and VLDL secretion, reinforcing the nutritional importance of adequate choline intake and the potential consequences of deficiency in exacerbating fatty liver conditions. Hepatic macrophages, or Kupffer cells, are key drivers of inflammation in fatty liver disease through the production of pro-inflammatory cytokines, which contribute to the exacerbation of liver injury and fibrosis. Thus, modulating the activity of these immune cells represents a promising therapeutic avenue to mitigate liver inflammation and progression. Ethnic variations in the prevalence and severity of NAFLD suggest that genetic, lifestyle, and environmental factors intersect to influence disease distribution, with studies demonstrating higher susceptibility among Hispanic individuals, highlighting the need for culturally tailored interventions and awareness campaigns that address specific risks and misconceptions. Omega-3 fatty acids, abundant in fish oils, have been shown to reduce liver fat, inflammation, and triglyceride levels, indicating their potential as a supportive therapy in NAFLD management, especially for individuals who may not respond adequately to lifestyle changes alone, and underscoring the importance of dietary management in liver health. The endocannabinoid system is increasingly recognized as a crucial modulator of hepatic energy storage, inflammation, and fibrosis in NAFLD, thus emerging as a potential target for treatment. Cannabinoid receptor antagonists, despite controversy, offer exciting possibilities for intervening in this pathway and controlling disease progression. The presence of liver fibrosis in NAFLD significantly increases the risk of adverse outcomes, making fibrosis staging vital in risk stratification and management decisions, with non-invasive biomarkers and elastography techniques offering reliable alternatives to liver biopsy, providing accessible and safer methods for assessing fibrosis risk. Identifying and managing comorbid conditions such as type 2 diabetes, hypertension, and dyslipidemia is crucial in NAFLD management, as these conditions share underlying pathophysiological links with liver disease and can exacerbate NAFLD progression, necessitating a comprehensive and multidisciplinary approach for optimal outcomes. Alcoholic fatty liver disease and non-alcoholic fatty liver disease share similar histological features, making clinical distinction based on history and risk factors essential for diagnosis, with alcohol abstinence serving as a critical and effective intervention for those with alcohol-related liver disease, whereas lifestyle changes remain foundational for NAFLD. Given the silent nature of early-stage NAFLD, routine screening for fatty liver in patients with obesity, metabolic syndrome, or type 2 diabetes is recommended to facilitate early diagnosis and intervention, underscoring the importance of awareness and vigilance in primary care and the potential benefit of periodic liver assessments in at-risk populations. Leptin resistance, often noted in individuals with obesity, contributes to steatosis by impairing the regulation of appetite and energy expenditure and promoting pro-inflammatory cytokines that exacerbate liver inflammation and fibrosis, presenting a target for novel therapies aimed at restoring leptin sensitivity and breaking the cycle of metabolic dysregulation. 27. The prevalence of pediatric NAFLD is rising alarmingly, mirroring the increase in childhood obesity, with studies indicating that early onset of fatty liver can predispose youth to severe liver complications in adulthood, highlighting the urgency for public health interventions focusing on diet, physical activity, and lifestyle in childhood and adolescence. The gut-derived hormone fibroblast growth factor 19, FGF19, is implicated in the regulation of bile acid synthesis and glucose metabolism. Its therapeutic modulation offers intriguing prospects for correcting metabolic dysfunction and reducing liver fat content in patients with NAFLD, representing a promising area for novel therapeutic development. 29. Studies on liver fat quantification techniques have illuminated the efficacy of controlled attenuation parameter, CAP, via transient elastography, which provides a reliable, non-invasive, and widely accessible method for assessing hepatic steatosis, facilitating early diagnosis and monitoring while circumventing the risks and discomfort of liver biopsy. 30. Gender differences in NAFLD reveal that men tend to develop the disease earlier, while women, particularly postmenopausal women, face a higher risk of disease progression, suggesting the influence of hormonal factors in disease dynamics and underlining the importance of gender-specific research and treatment approaches. 31. Pharmacological interventions targeting the insulin pathway, such as thiazolidinediones, are undergoing investigation to address insulin resistance in NAFLD patients, offering potential benefits in reducing liver fat, inflammation, and fibrosis, although balanced against potential side effects such as weight gain and cardiovascular risk. 32. Ectopic fat deposition, not only in the liver but also in muscles and the pancreas, constitutes an important aspect of the metabolic disturbances associated with NAFLD, highlighting the interconnected nature of metabolic health and the necessity for interventions that address overall body composition and systemic insulin sensitivity. 3. Oxidative stress biomarkers such as melandialdehyde and 8-isoprostane provide valuable insights into the oxidative damage occurring in NAFLD, serving as potential diagnostic and prognostic tools for assessing the severity and progression of the disease and guiding antioxidant-based therapeutic strategies. 34. Emerging research into the role of bile acids and the farnesoid X receptor, FXR, in NAFLD pathogenesis underscores their influence on lipid metabolism, hepatic inflammation, and fibrosis, identifying FXR agonists as promising candidates in the development of targeted therapeutics aimed at mitigating disease progression. 35. The utilization of artificial intelligence and machine learning in analyzing electronic health records and imaging data holds great promise for enhancing the accuracy of NAFLD diagnosis and risk stratification, expediting the identification of high-risk individuals, and optimizing personalized treatment plans in a rapidly evolving healthcare landscape. 36. The increase in lipotoxic intermediates such as diacylglycerol and ceramides in the liver has been linked to insulin resistance and hepatic inflammation, pointing to these lipid species as potential therapeutic targets in efforts to reduce liver fat accumulation and improve insulin sensitivity in patients with NAFLD. 37. Advanced glycation end products, AGEs, accumulate in NAFLD due to high blood sugar levels and oxidative stress, contributing to liver inflammation and fibrosis, and emphasizing the importance of managing glycemic control and reducing dietary age intake as part of a comprehensive liver health strategy. 38. Studies indicate a pivotal shift in lipid droplet biology and homeostasis within hepatocytes during NAFLD, with proteins involved in droplet formation and breakdown offering insights into novel therapeutic targets focused on normalizing lipid storage and mobilization processes within the liver. 39. Visceral adiposity is closely linked to NAFLD, with evidence suggesting that reduction of visceral fat through targeted interventions such as aerobic and resistance exercise significantly diminishes liver fat and inflammation, reinforcing the importance of managing central obesity as a cornerstone of NAFLD prevention and treatment. 40. Various cellular types within the liver, including hepatic stellate cells and ductular reaction cells, contribute to fibrogenesis in NAFLD through the secretion of extracellular matrix proteins, highlighting the diverse cellular contributions to liver fibrosis and the need for therapies targeting multiple cellular and molecular pathways. #41. Plasma biomarkers like cytokeratin 18 fragments offer non-invasive means of diagnosing steatohepatitis in NAFLD patients by reflecting hepatocyte apoptosis, providing an important diagnostic alternative that may guide treatment decisions and evaluate responses without resorting to invasive liver biopsy techniques. #42. Disruption of circadian rhythms, often due to modern lifestyle patterns like shift work and poor sleep hygiene, can exacerbate metabolic disorders such as NAFLD by altering hepatic glucose and lipid metabolism, underlining the potential benefits of chronotherapeutic approaches that align treatment and lifestyle modifications with natural circadian rhythms. #43. Using dietary supplements like berberine, an alkaloid derived from plants, has shown promise in improving insulin sensitivity, reducing hepatic steatosis, and exerting overall beneficial metabolic effects, suggesting an additional, complementary role in managing NAFLD when combined with lifestyle interventions. #44. Iron overload, often detected through elevated serum ferritin levels in NAFLD patients, has been associated with increased hepatic inflammation and fibrosis, advocating for the assessment of iron status in NAFLD management and considering therapeutic phlebotomy or iron chelation as potential interventions in cases of significant iron burden. #45. The inconspicuous clinical course of NAFLD contrasts with its potential for serious complications, necessitating vigilant, regular follow-ups, including metabolic health assessments and liver function tests, to promptly identify transitions to more advanced liver disease and initiate timely interventions. #46. Genetic studies of NAFLD have also identified contributions from variants like TM6SF2 and GCKR, further elucidating the complex heritability and genetic risk factors involved in susceptibility and progression, reinforcing the potential for future genetic screening approaches to personalize and optimize patient management. #47. Pharmacological advances in the form of dual peroxisome proliferator activated receptor (PPAR) agonists are currently under investigation as potential NAFLD treatments due to their capacity to modulate lipid metabolism, reduce inflammation, and improve insulin sensitivity, offering a promising multifaceted approach to care. #48. Inflammation in NAFLD is driven not just by classic cytokines like TNF-alpha but also by novel mediators like TGF-beta and IL-1-beta, highlighting the importance of targeted anti-inflammatory strategies that can halt the progressive nature of this disease and address underlying molecular inflammations. #49. The measurement of liver stiffness via elastography provides an indirect yet valuable assessment of liver fibrosis in NAFLD patients, offering a non-invasive diagnostic tool that stratifies fibrosis risk and guides clinical decision-making in managing the disease without the need for invasive procedures. #50. Emerging therapeutic strategies for NAFLD include targeting microRNAs, which regulate gene expression involved in lipid metabolism, fibrogenesis, and inflammation, representing a new frontier in the molecular treatment of NAFLD and offering exciting possibilities for future pharmacologic development. 1. Chronic obstructive pulmonary disease COPD, is primarily caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. It is characterized by restricted airflow and inflammation in the airways, leading to symptoms such as shortness of breath, chronic cough, and sputum production, and is diagnosed using spirometry, which measures the volume of air the patient can exhale in 1 second. 2. Asthma is a chronic respiratory condition marked by recurrent episodes of wheezing, breathlessness, chest tightness, and coughing, typically triggered by allergens, cold air, exercise, or stress. It involves airway inflammation, hyperreactivity, and reversible airflow obstruction, and is diagnosed with lung function tests that show variable airflow limitation. 3. Pulmonary embolism is a blockage in one of the pulmonary arteries in the lungs, typically caused by blood clots that travel to the lungs from the legs or other parts of the body. Deep vein thrombosis. Symptoms include sudden shortness of breath, chest pain, and a rapid heartbeat, and diagnosis often involves a CT pulmonary angiogram. 4. Pneumonia is an infection that inflames the air sacs in one or both lungs, which may fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. It can be caused by a variety of organisms, including bacteria, viruses, and fungi, and is often diagnosed with chest X-rays and sputum tests. 5. Tuberculosis (TB) is a potentially serious infectious disease that mainly affects the lungs, spread through inhalation of airborne particles released from an infected individual, and is characterized by cough, chest pain, weight loss, night sweats, and fever. Diagnosis usually requires a skin test, blood tests, or culturing bacteria from clinical specimens. 6. Interstitial lung disease (ILD) encompasses a large group of disorders characterized by progressive scarring of lung tissue, leading to irreversible lung damage, reduced oxygen exchange, and symptoms such as a dry cough and shortness of breath. Diagnosis often involves a high-resolution CT scan and lung biopsy to assess the pattern of fibrosis. 7. Bronchiectasis is a chronic condition where the walls of the bronchi are thickened from inflammation and infection, leading to persistent cough, large amounts of sputum, and recurrent chest infections. Diagnosis typically involves a high-resolution CT scan to visualize dilated airways and assess the extent of lung damage. 8. Cystic fibrosis is a genetic disorder that affects mostly the lungs, leading to thick, sticky mucus production that can clog the airways, resulting in persistent lung infections and declining respiratory function. Diagnosis is confirmed with a sweat chloride test and genetic testing for mutations in the CFTR gene. (9) Idiopathic pulmonary fibrosis (IPF) is a type of chronic, progressive interstitial lung disease characterized by a gradual scarring of lung tissue, which leads to a persistent cough and worsening shortness of breath. Lung biopsy or high-resolution computed tomography (HRCT) are often used to diagnose this condition and differentiate it from other interstitial lung diseases. 10. Acute respiratory distress syndrome (ARDS) is a severe lung condition occurring when fluid fills up the alveoli in the lungs, leading to severe shortness of breath and respiratory failure. It can be caused by a variety of factors, including trauma, sepsis, and pneumonia, and is diagnosed by clinical symptoms and imaging studies showing bilateral lung infiltrates. 11. Pleural effusion is the accumulation of excess fluid between the layers of the pleura outside the lungs, which can cause respiratory distress, chest pain, and cough. Potential causes include congestive heart failure, pneumonia, and malignancies, and it is diagnosed with imaging such as chest X-ray or ultrasound and confirmed by thoracentesis to analyze the pleural fluid. 12. Lung cancer is a malignant tumor characterized by uncontrolled cell growth in tissues of the lung, often asymptomatic in the early stages but can eventually lead to a persistent cough, hemoptysis, chest pain, and weight loss. It is commonly diagnosed through imaging such as CT scans and confirmed by a biopsy to determine histological type. 13. Obstructive sleep apnea, OSA, is a common disorder characterized by repetitive episodes of complete or partial upper airway obstruction during sleep, causing breathing disturbances, snoring, and excessive daytime sleepiness. It is diagnosed using polysomnography, which evaluates breathing patterns, oxygen levels, and heart rate during sleep. 14. Legionnaire's disease is a type of pneumonia caused by Legionella bacteria, typically contracted through inhalation of aerosolized water containing the bacteria. Symptoms may include high fever, chills, cough, and muscle aches, and diagnosis is confirmed through urine antigen tests and cultures of respiratory secretions. (15) Sarcoidosis is an inflammatory disease that affects multiple organs in the body, especially the lungs, characterized by the formation of granulomas, which can lead to cough, respiratory dysfunction, and fatigue. Diagnosis often involves a combination of clinical evaluation, imaging studies such as chest X-rays or CT scans, and biopsy of affected tissue. 16. Pneumothorax occurs when air leaks into the space between the lung and chest wall, causing the lung to collapse, which results in sudden chest pain and shortness of breath. It can result from trauma, lung disease, or spontaneous causes and is diagnosed with a chest X-ray or CT scan that shows the presence of air in the pleural space. 17. Respiratory tract infection is a group of infections of either the upper or lower respiratory tract, commonly caused by viruses such as rhinoviruses and influenza, leading to symptoms like sore throat, cough, fever, or difficulty breathing, and diagnosis is primarily based on clinical symptoms supported by laboratory tests when needed. 18. Pulmonary hypertension is high blood pressure in the arteries of the lungs that can lead to right-sided heart failure. It presents with shortness of breath, fatigue, and chest pain, often requiring right heart catheterization for definitive diagnosis and echocardiography for initial assessment of pulmonary arterial pressure. 19. Silicosis is an occupational lung disease caused by inhalation of silica dust, leading to inflammation and scarring of lung tissue, resulting in breathing difficulties and increased risk of tuberculosis. Diagnosis typically includes a history of occupational exposure, characteristic chest X-ray or CT findings, and pulmonary function tests. 20. Bronchiolitis, most commonly affecting infants and young children, is a viral infection primarily caused by the respiratory syncytial virus, RSV, resulting in inflammation and congestion in the bronchioles, with symptoms such as wheezing, cough, and difficulty breathing. Diagnosis is usually clinical but may include nasopharyngeal swabs to identify the virus. 21. Coal workers' pneumoconiosis, also known as black lung disease, is caused by long-term exposure to coal dust, leading to lung inflammation, fibrosis, and structural damage. Symptoms include chronic cough and shortness of breath, and diagnosis is typically made through occupational history, chest X-ray, and pulmonary function tests. 22. Pulmonary edema is a condition characterized by excess fluid in the lungs, causing difficulty breathing, coughing, and wheezing. It can result from left-sided heart failure, kidney failure, or acute respiratory distress, and is diagnosed based on physical examination, chest X-ray showing fluid accumulation in the lungs, and relevant laboratory tests. 23. Asbestosis is a chronic lung disease caused by inhaling asbestos fibers, leading to pulmonary fibrosis and increased risk of lung cancer and mesothelioma. Symptoms include shortness of breath and a persistent cough, and diagnosis relies on a thorough history of asbestos exposure, imaging such as chest X-ray or high-resolution CT, and lung function tests. 24. Pleurisy involves inflammation of the pleura, the membrane around the lungs, causing sharp chest pain that worsens with breathing, coughing, or sneezing. Potential causes include infections, autoimmune conditions, or pulmonary embolism, and diagnostic procedures include chest imaging to assess pleural thickening and laboratory tests to identify the underlying cause. 25. Croup is a viral infection of the upper airway, notably in children, resulting in swelling around the larynx, trachea, and bronchi, characterized by a distinctive barking cough, stridor, and hoarseness. Diagnosis is often clinical, based on the classic symptoms and presentation, with supportive care as the mainstay of treatment. (26) Chemical pneumonitis is inflammation of the lung tissue due to inhalation of irritants such as smoke, fumes, or vapors, which can lead to cough, difficulty breathing, and chest pain. Diagnosis relies on clinical history, imaging studies to assess lung inflammation, and exclusion of other causes of pneumonia. (27) Alpha-1 antitrypsin deficiency is a genetic disorder affecting the lungs and liver, due to lack of a protein that protects the lungs from damage, leading to emphysema and chronic obstructive pulmonary disease. Symptoms develop in adulthood and include progressive shortness of breath, and it is diagnosed by measuring serum alpha-1 antitrypsin levels. (28) Respiratory failure is a condition in which the respiratory system fails in oxygenation and/or carbon dioxide elimination, leading to hypoxemia and/or hypercapnia. It can be classified into type 1, hypoxemic, and type 2, hypercapnic, with diagnosis involving arterial blood gas analysis and treatment tailored to the underlying cause. (29) Aspirational pneumonia occurs when a person inhales food, liquid, or vomit into the lungs, leading to infection and inflammation. Symptoms include cough, fever, chest discomfort, and breathing difficulties, and diagnosis is based on clinical presentation, risk factors, and imaging studies such as a chest X-ray showing infiltrates in the lung. (30) Pulmonary thromboembolism involves the obstruction of the pulmonary artery or one of its branches by blood clots that travel from the legs, causing sudden shortness of breath, chest pain, and potentially life-threatening complications. Computed tomography pulmonary angiography is the most common method for confirming diagnosis. (31) Legionnaire's disease, a severe form of pneumonia caused by Legionella bacteria, presents with symptoms such as high fever, cough, and muscle aches. It is contracted by inhaling contaminated water droplets from sources like cooling towers, and diagnosis involves urine antigen tests or culture of the bacteria from respiratory secretions. (32) Anthracosis, often seen in coal miners, is characterized by accumulation of carbon-laden macrophages in the lung tissues, which can lead to chronic coughing and bronchial irritation. Diagnosis is usually made through bronchoscopy and examination of lung tissues for characteristic black pigmentation due to carbon deposits. (3) Mycoplasma pneumonia, known as walking pneumonia, is caused by Mycoplasma pneumoniae bacteria, which causes milder respiratory symptoms such as persistent cough, headache, and low-grade fever. Diagnosis is often clinical, supported by serological tests or PCR to detect specific antibodies or DNA of the bacteria. (34) Histoplasmosis is a fungal infection caused by inhaling the spores of the Histoplasma capsulatum, primarily affecting the lungs and leading to symptoms similar to flu, including cough and fever. Diagnosis is confirmed through culture, serology, or molecular testing of respiratory samples to detect the presence of the fungus. (35) Klebsiella pneumoniae is a bacterial pathogen causing a form of atypical pneumonia with clinical signs such as high fever, production of thick blood-tinged sputum, and lung infiltration. It frequently affects individuals with weakened immune systems, diagnosed by culturing the organism from respiratory secretions or blood samples. (36) The hantavirus pulmonary syndrome, HPS, is a severe respiratory disease caused by the hantavirus, transmitted to humans through contact with the urine, droppings, or saliva of infected rodents. Initial symptoms resemble flu-like illness, quickly progressing to acute respiratory failure, diagnosed via serological tests identifying hantavirus antibodies. 37. Alpha-1 antitrypsin deficiency is a genetic disorder that leads to the development of chronic obstructive pulmonary disease, COPD, and liver disease due to the lack of alpha-1 antitrypsin protein, which protects tissues from enzymatic breakdown, diagnosed by measuring serum levels of the protein and identifying genetic mutations. 38. Allergic rhinitis, commonly known as hay fever, is an allergic response to specific airborne allergens, resulting in symptoms like nasal congestion, sneezing, and itchy eyes. Diagnosis often involves a combination of clinical evaluation, skin prick tests, and specific IgE blood tests to identify triggering allergens. 39. Tracheobronchitis, often caused by viral infections such as influenza or bacterial agents like Bordetella pertussis, is characterized by inflammation of the trachea and bronchi, leading to symptoms including persistent cough, sore throat, and wheezing. Diagnosis is usually clinical, supported by throat swabs or cultures if necessary. 40. Respiratory syncytial virus, RSV, infection is a common cause of respiratory tract infections in infants and young children, manifesting as bronchiolitis or pneumonia, characterized by coughing, wheezing, and difficulty breathing. Diagnosis is confirmed by detecting the virus in nasal secretions through rapid antigen testing or PCR. 41. Lung fibrosis can develop as a progressive scarring process in the lungs, potentially resulting from chronic exposure to certain toxic inhalants, infections, or autoimmune diseases, leading to cough and restrictive lung disease. Diagnosis involves high-resolution computed tomography and pulmonary function tests revealing decreased lung volumes. 42. Lymphangioliomyomatosis, LAM, is a rare lung disease that predominantly affects women of childbearing age, characterized by abnormal growth of smooth muscle cells in the lungs, resulting in cystic lung changes, dyspnea, and spontaneous pneumothorax. The diagnosis is established through clinical assessment, imaging, and tissue biopsy to observe characteristic changes. 43. Chronic bronchitis, part of the chronic obstructive pulmonary disease spectrum, involves long-term inflammation of the bronchi, leading to symptoms such as a persistent productive cough and shortness of breath, usually diagnosed by evaluating the chronicity of symptoms and pulmonary function tests indicating airflow obstruction. 44. Pulmonary alveolar proteinosis is a rare disease where proteinaceous material accumulates in the alveoli, causing progressive respiratory impairment, cough, and increased risk of lung infections. Diagnosis is confirmed through bronchoalveolar lavage showing characteristic milky fluid and histopathological examination of lung tissue samples. 45. Pertussis, also known as whooping cough, is a highly contagious bacterial disease caused by Bordetella pertussis, characterized by severe coughing fits followed by a high-pitched, whoop sound. Diagnosis involves nasopharyngeal swab samples for culture or PCR testing to detect the bacterium, with vaccination as a key prevention strategy. 46. Diffuse alveolar hemorrhage syndrome is a group of diseases characterized by bleeding into the alveoli, leading to symptoms like cough, hemoptysis, anemia, and respiratory distress, often linked with autoimmune disorders. Diagnosis requires bronchoalveolar lavage and imaging studies to establish the presence and extent of alveolar bleeding. 47. The common cold is a viral infection of the upper respiratory tract caused by numerous types of rhinoviruses, resulting in symptoms such as nasal congestion, sore throat, and cough. Diagnosis is generally clinical, without the need for specific tests, unless distinguishing it from other more severe conditions such as influenza. 48. Wegener's granulomatosis, now known as granulomatosis with polyangiitis, is an autoimmune disorder that causes inflammation of blood vessels in the respiratory tract and other organs, producing symptoms like cough, sinusitis, and hemoptysis. Diagnosis is confirmed by serological tests for anti-neutrophil cytoplasmic antibodies, ANCA, and tissue biopsy. 49. The influenza virus causes an acute respiratory illness characterized by sudden onset of fever, cough, sore throat, and muscle aches, presenting in seasonal outbreaks with potential for significant morbidity and mortality. Diagnosis is often clinical, supported by rapid antigen tests or PCR for confirmation during epidemic peaks to guide antiviral treatment. Emphysema, a type of COPD, involves the destruction of the alveoli and subsequent loss of lung elasticity, leading to symptoms like shortness of breath and limited exercise tolerance, mainly caused by smoking. Diagnosis typically involves pulmonary function tests showing reduced airflow and lung capacity, alongside imaging such as chest X-ray or CT scan. 1. Chronic obstructive pulmonary disease, COPD, is a progressive inflammatory lung disease characterized by obstructed airflow from the lungs due to emphysema and chronic bronchitis, which makes it a significant cause of morbidity and mortality worldwide, with smoking identified as the primary risk factor but also including genetic predispositions such as alpha-1 antitrypsin deficiency. 2. In COPD, the small airways become narrowed and the alveolar walls are destroyed, a phenomenon known as emphysema, which traps air during expiration and leads to hyperinflation of the lungs, making it hard for the patient to exhale completely, causing chronic airflow limitation and dramatically impairing quality of life. 3. COPD diagnosis is confirmed through spirometry, which measures the forced expiratory volume in 1 second, FEV1, and the forced vital capacity, FVC, resulting in a reduced FEV1-FVC ratio that is not significantly reversible with bronchodilators, indicating a persistent obstructive pattern. 4. The hallmark symptoms of COPD include chronic and progressive dyspnea, persistent cough often with sputum production, and wheezing, with exacerbations characterized by an increase in symptom intensity, often triggered by infections or environmental pollutants, thereby significantly impacting patient well-being. 5. Long-term exposure to noxious gases and particulate matter, primarily from cigarette smoke and occupational exposure to dust and chemicals, accounts for the majority of COPD cases, but recent research is exploring the role of indoor air pollution from biomass fuels used in cooking and heating, especially in developing countries. 6. Pulmonary rehabilitation is a cornerstone in the management of COPD, comprising of exercise training, education, and psychological support, which aims to improve the physical and emotional condition of people with respiratory diseases and empower them to better manage their symptoms. 7. Pharmacological treatments for COPD focus on relieving symptoms and preventing exacerbations, with bronchodilators like long-acting beta-agonists, LABAs, and long-acting muscarinic antagonists, LAMAs, being first-line therapies, often used in combination to maximize dilation of airways and improve lung function. 8. In COPD, systemic corticosteroids are used during acute exacerbations to reduce inflammation and improve lung function, although chronic use is limited due to potential side effects, so maintenance therapy often involves inhaled corticosteroids in conjunction with bronchodilators for patients with frequent exacerbations. 9. Emerging treatments for COPD include the use of phosphodiesterase 4 inhibitors such as roflumilast, which works by reducing inflammation in the airways and has been shown to decrease the frequency of exacerbations in patients with severe COPD and chronic bronchitis. 10. In COPD pathophysiology, the process of oxidative stress plays a pivotal role wherein the imbalance between oxidants and antioxidants within the lungs leads to tissue damage, ongoing inflammation, and further degradation of lung function, reinforcing the progression of the disease. 11. The destruction of elastic fibers in the alveolar walls in COPD is largely mediated by enzyme systems such as matrix metalloproteinases (MMPs) and neutrophil elastase, which become overactive due to chronic inflammation and contribute to the loss of lung elasticity and alveolar integrity. Genetic factors in COPD play a crucial role, with the most well-documented being the deficiency of alpha-1 antitrypsin, a protein that protects lung tissue from enzyme-induced damage, and individuals with severe deficiency are at a much higher risk of developing COPD regardless of smoking status. Imaging studies such as chest X-rays and computed tomography (CT) scans are used in COPD to assess for evidence of hyperinflation, increased lung volume, and possible complications like pneumothorax, with CT scans providing greater detail in visualizing emphysematous changes and bulli in the lungs. The chronic inflammation in COPD is predominantly neutrophilic, contrasting with the eosinophilic inflammation commonly seen in asthma, which results in different pathophysiological mechanisms and therapeutic responses, highlighting the intricate immune dysregulation present in COPD. Comorbidities frequently associated with COPD include cardiovascular diseases, osteoporosis, metabolic syndrome, anxiety, and depression, all of which severely affect the health status and quality of life of patients, warranting a comprehensive and multidisciplinary approach to management. The Global Initiative for Chronic Obstructive Lung Disease (GOLD) guidelines provide a framework for the diagnosis, management, and prevention of COPD by categorizing the disease based on the severity of airflow limitation, symptom burden, and frequency of exacerbations, offering a personalized approach to treatment. Oxygen therapy is a life-saving intervention for COPD patients with chronic respiratory failure, particularly those with resting hypoxemia, as it improves survival by preventing the harmful effects of chronic hypoxia and relieving some of the physiological stress on the cardiovascular system. Smoking cessation remains the most effective strategy in slowing the progression of COPD, and nicotine replacement therapy, varenicline, and bupropion have been shown in clinical trials to increase the rates of sustained abstinence from smoking, thereby preserving lung function and improving long-term outcomes. Lung volume reduction surgery, LVRS, can be considered for selected patients with severe emphysema-dominant COPD, as it reduces hyperinflation and improves lung mechanics, leading to better respiratory function and quality of life, although careful patient selection is crucial due to the associated surgical risks. The impact of air pollution on COPD exacerbations is significant, with exposure to pollutants such as nitrogen dioxide, sulfur dioxide, and particulate matter leading to increased hospital admissions and mortality rates among COPD patients, emphasizing the importance of improving air quality through public health initiatives. The use of non-invasive ventilation (NIV) during acute COPD exacerbations with hypercapnic respiratory failure can significantly reduce the need for intubation, improve gas exchange, and decrease mortality, making it an essential tool in the acute management of severe exacerbations. Patients with COPD often experience muscle wasting and weakness, particularly in the lower limbs, which is attributed to a combination of systemic inflammation, inactivity, altered muscle metabolism, and nutritional deficits, necessitating targeted interventions such as strength training and nutritional support. Advanced COPD often leads to pulmonary hypertension due to chronic hypoxic vasoconstriction, which results in remodeling of the pulmonary vasculature and increased pressure in the pulmonary arteries, eventually leading to right-sided heart failure or cor pulmonale. 24. In the progression of COPD, the concept of the phenotypic approach is gaining traction, recognizing that patients might have differing prevalent symptoms and pathophysiological characteristics, such as asthma-COPD overlap, ACO, which requires specific diagnostic and therapeutic strategies. 25. Exacerbation prevention in COPD relies heavily on vaccination, with annual influenza vaccination and pneumococcal vaccines being recommended as they significantly reduce hospitalization rates and improve survival by protecting against respiratory infections that can precipitate exacerbations. 26. In COPD, the mucus hypersecretion seen in chronic bronchitis results from an overproduction of mucus by enlarged goblet cells and submucosal glands in response to chronic irritation and inflammation, which contributes to airway obstruction and chronic cough in affected individuals. 27. Regular physical activity is associated with improved exercise tolerance and quality of life in people with COPD, as well as reduced risk of hospital readmissions after exacerbations, underscoring the importance of incorporating physical activity into the routine management plan for these patients. 28. Bronchoscopic lung volume reduction is a minimally invasive alternative to surgical interventions in COPD, using devices such as endobronchial valves to occlude airways in targeted areas of emphysematous lungs, achieving volume reduction and improved ventilatory efficiency. 29. Hospital-at-home programs for managing COPD exacerbations have shown to be as effective as hospital care in appropriately selected patients, providing benefits such as reduced healthcare costs, improved patient satisfaction, and a lower risk of acquiring hospital-associated infections. 30. Digital health technologies, including telemedicine, remote monitoring, and wearable devices, are increasingly being integrated into the management of COPD, offering opportunities for continuous monitoring of physiological parameters, patient education, and timely intervention, potentially reducing exacerbation rates. 31. The role of long-term antibiotics in preventing COPD exacerbations is being explored through the use of agents such as macrolides, which have anti-inflammatory properties and have been shown to reduce exacerbation frequency in certain patients with frequent and severe exacerbations. 32. Dysregulated repair mechanisms in COPD lead to structural changes in the airways and alveoli, including airway wall thickening and fibrosis, which contribute to the disease's chronic and progressive nature, highlighting the need for therapies targeting these underlying pathological processes. 3. Recognition of the single nucleotide polymorphisms, SNPs, associated with COPD susceptibility has opened the door to personalized medicine approaches and could lead to tailored preventive and therapeutic strategies specific to individual genetic profiles in the future. 34. COPD profoundly affects the systemic circulation, leading to extrapulmonary manifestations such as atherosclerosis and an increased risk of cardiovascular events, mediated by systemic inflammation, oxidative stress, and alterations in lipid metabolism, requiring cardiovascular risk assessment in COPD management. 35. Bacterial colonization of the lower airways is common in COPD due to compromised host defenses, contributing to chronic inflammation and exacerbations, with common colonizers including Haemophilus influenzae, Streptococcus pneumoniae, and Moraxella catarrhalis. 36. Cognitive impairment, including deficits in attention, memory, and executive function, has been observed in patients with COPD, possibly due to chronic hypoxia, systemic inflammation, and the presence of comorbid depression, impacting daily functioning and quality of life. 37. The economic burden of COPD is substantial, with direct costs related to medical visits, hospitalizations, and medications, while indirect costs arise from lost productivity and premature mortality, making it imperative to implement cost-effective preventive and management strategies. (38) Mitochondrial dysfunction is implicated in COPD pathogenesis, where oxidative stress and inflammation lead to impaired energy metabolism and cell death in pulmonary tissues, suggesting potential therapeutic targets focusing on mitochondrial health to slow disease progression. 39. In COPD, breathlessness is exacerbated by dynamic hyperinflation, where the increased end expiratory lung volume due to expiratory flow limitation and gas trapping during physical activity leads to increased respiratory workload and early onset of dyspnea. 40. The use of biomarkers in COPD, such as blood eosinophil counts and exhaled nitric oxide levels, is being researched to better stratify patients and personalize therapy, as they may help predict response to inhaled corticosteroids and other targeted treatments. (41) The development of fibrosis in the small airways in COPD contributes to fixed airflow obstruction, complicating the disease and limiting reversibility with bronchodilators, as the fibrotic tissue causes airway narrowing and impaired ventilation. (42) COPD complications include pneumothorax, particularly in patients with emphysema, where ruptured lung bully can lead to air escaping into the pleural space, causing the lung to collapse and necessitating emergency medical intervention. (43) End-stage COPD may require considerations for lung transplantation in eligible patients when medical therapies fail to provide sufficient symptomatic relief, with indicators for transplantation including severe airflow obstruction, hypercapnia, and frequent exacerbations despite maximal treatment. (44) Anxiety and panic attacks are prevalent in COPD patients, often exacerbated by breathlessness, leading to a vicious cycle of avoidance, deconditioning, and worsening symptoms that necessitates psychological interventions alongside pulmonary rehabilitation. (45) The heterogeneity of COPD is reflected in various phenotypes characterized by differing emphysema and bronchitis components, smoking history, and genetic factors, necessitating individualized treatment plans that cater to the specificities of each patient's disease presentation. (46) The use of statins in COPD patients is being investigated for their potential to reduce inflammation and improve outcomes beyond their lipid-lowering effects, as observational studies have suggested a possible reduction in all-cause mortality and exacerbations. (47) Sleep disturbances are common in COPD, with studies indicating increased occurrence of insomnia, nocturnal hypoxia, restless leg syndrome, and sleep apnea, further contributing to impaired daytime functioning and required specialized management to improve sleep quality. (48) The relationship between COPD and malnutrition is complex, as the increased work of breathing, systemic inflammation, and metabolic changes can lead to weight loss and muscle wasting, highlighting the need for nutritional assessment and intervention as part of comprehensive COPD care. (49) The role of endothelin in COPD is being explored, with increased levels associated with vascular remodeling and pulmonary hypertension in COPD patients, representing a potential therapeutic target to address cardiovascular complications associated with the disease. (50) Bronchiectasis can coexist with COPD, particularly in those with recurrent infections and mucus hypersecretion, characterized by permanent dilation and thickening of the bronchi, necessitating specific management strategies to address the overlapping disease presentations and optimize patient outcomes. 1. Ischemic heart disease, primarily caused by atherosclerosis, reduces blood flow to myocardial tissues, often resulting in angina pectoris and increasing the risk of myocardial infarction, thus necessitating prompt clinical intervention to prevent irreversible myocardial damage. Two, understanding the pathophysiology of ischemic heart disease involves recognizing the complex interplay of endothelial dysfunction, lipid accumulation, inflammation, and thrombosis that ultimately compromises coronary artery blood flow and myocardial perfusion. Three, the diagnostic process for ischemic heart disease involves tools such as electrocardiograms to detect street segment changes, stress tests for evaluating exercise-induced ischemia, and coronary angiography, which provides direct visualization of coronary artery obstruction. Four, medical management of ischemic heart disease often includes antiplatelet agents like aspirin, which reduce thrombotic events, statins to lower LDL cholesterol and stabilize atherosclerotic plaques, and nitrates to alleviate chest pain by dilating coronary vasculature. 5. Lifestyle modifications, such as smoking cessation, dietary changes to reduce saturated fats, and regular aerobic exercise, play a crucial role in managing ischemic heart disease by mitigating risk factors and supporting cardiovascular health. 6. Coronary artery bypass grafting presents a surgical option for patients with severe ischemic heart disease, creating alternative pathways for blood to reach the myocardium by grafting veins or arteries to bypass occluded coronary vessels. Seven. Percutaneous coronary intervention, often involving the placement of a stent, is a minimally invasive procedure that reopens narrowed coronary arteries, restoring adequate blood flow and reducing the incidence of angina in ischemic heart disease patients. 8. Advanced imaging modalities, such as cardiac MRI and CT angiography, provide detailed anatomical and functional assessment of coronary arteries, myocardial tissue, and perfusion deficits, enhancing diagnostic accuracy in ischemic heart disease. Nine. Ischemic preconditioning, where brief episodes of ischemia make myocardial tissue more resistant to subsequent ischemic episodes, offers a fascinating area of research with potential therapeutic implications for ischemic heart disease management. 10. The role of inflammation in ischemic heart disease is increasingly recognized, with biomarkers like C-reactive protein serving as indicators of systemic inflammation and potential targets for therapeutic intervention to reduce cardiovascular risk. 11. Despite the predominance of atherosclerosis in ischemic heart disease, coronary microvascular dysfunction also contributes significantly, particularly in women, highlighting the need for gender-specific diagnostic and therapeutic approaches. 12. Silent ischemia presents a diagnostic challenge in ischemic heart disease, as patients exhibit myocardial ischemia without typical anginal symptoms, necessitating vigilance and regular monitoring in high-risk patient populations. 13. Genetic factors contribute to an individual's susceptibility to ischemic heart disease, with polygenic risk scores and family history aiding in risk stratification and personalized preventive strategies tailored to genetic profiles. The phenomenon of coronary artery spasm, wherein transient vasoconstriction leads to ischemic events, underscores the importance of identifying and managing triggers such as stress, cold exposure, and vasoconstrictive drugs in ischemic heart disease. 15. Ischemic heart disease disproportionately affects individuals with comorbid conditions like diabetes mellitus, which accelerates atherosclerosis through mechanisms such as glycation and oxidative stress, necessitating rigorous glycemic control. 16. Heart rate variability analysis provides insights into autonomic dysfunction in ischemic heart disease, where reduced variability signals sympathetic predominance and heightened risk for adverse cardiovascular events. (17) Advances in regenerative medicine, such as stem cell therapy, hold promise for repairing ischemic damage in the heart by regenerating myocardial tissue and improving cardiac function post-myocardial infarction. 18. The role of mental health in ischemic heart disease is gaining attention, with conditions such as depression and anxiety linked to increased cardiovascular risk through stress-related pathophysiological mechanisms like hypercortisolemia. 19. Hyperhomocystinemia, an elevated blood level of homocysteine, is a modifiable risk factor for ischemic heart disease, emphasizing the importance of dietary interventions and supplementation with folic acid and B vitamins for cardiovascular prevention. 20. The potential cardioprotective effects of omega-3 fatty acids in ischemic heart disease are attributed to their anti-inflammatory properties, which help reduce plaque formation, improve endothelial function, and lower triglyceride levels. 21. Remote ischemic conditioning, involving repetitive episodes of limb ischemia to confer organ protection against ischemic injury, represents a novel non-invasive intervention with potential applicability in ischemic heart disease. 22. The use of ambulatory blood pressure monitoring in ischemic heart disease patients provides valuable insights into nocturnal hypertension and blood pressure variability, correlating with cardiovascular outcomes and guiding antihypertensive therapy. 23. Pulmonary hypertension can complicate ischemic heart disease, impairing right ventricular function and exacerbating heart failure symptoms, necessitating vigilant assessment and management of both pulmonary and cardiac components. 24. The phenomenon of hibernating myocardium, where myocardial contractility is reversibly impaired due to chronic ischemia, highlights the importance of revascularization in restoring myocardial function and optimizing heart performance. 25. Cardiac rehabilitation programs, combining supervised exercise, nutritional guidance, and psychological support, enhance recovery and quality of life for ischemic heart disease patients, reducing recurrent cardiovascular events. 26. The endothelial glycocalyx, a protective layer lining blood vessels, plays a crucial role in maintaining vascular health, and its disruption in ischemic heart disease contributes to atherogenesis and endothelial dysfunction. 27. Myocardial stunning refers to the transient post-ischemic dysfunction of myocardial tissue, despite restored blood flow, necessitating careful differential diagnosis from irreversible myocardial damage in ischemic heart disease cases. 28. The gut-heart axis explores the interplay between gut microbiota and cardiovascular health, where dysbiosis may contribute to ischemic heart disease via inflammatory pathways and microbial metabolites such as TMAO. 29. Identifying and managing obstructive sleep apnea is essential in ischemic heart disease, as untreated apnea exacerbates hypertension, sympathetic activation, and inflammation, further elevating cardiovascular risk. 30. Antianginal medications like beta blockers and calcium channel blockers not only alleviate ischemic symptoms but also provide prognostic benefits by reducing myocardial oxygen demand and preventing arrhythmias. 31. Utilization of dual antiplatelet therapy, particularly after percutaneous coronary intervention, is critical in ischemic heart disease to prevent stent thrombosis and ensure sustained patency of revascularized vessels. 32. Oxidative stress, characterized by an imbalance between reactive oxygen species and antioxidants, accelerates atherosclerosis and endothelial dysfunction in ischemic heart disease, supporting the exploration of antioxidant therapies. 3. Early intervention with fibrinolytic therapy in acute myocardial infarction, particularly in settings without percutaneous coronary intervention availability, saves myocardium by rapidly dissolving thrombi, restoring coronary perfusion. 34. Cardiac troponin levels serve as a pivotal biomarker in diagnosing acute coronary syndromes, with high-sensitivity assays providing early detection and risk stratification in ischemic heart disease emergencies. 35. Systemic lupus erythematosus and other autoimmune conditions increase ischemic heart disease risk due to accelerated atherosclerosis linked to chronic inflammation, necessitating vigilant cardiovascular monitoring in autoimmune populations. 36. The concept of residual inflammatory risk in ischemic heart disease, despite optimal lipid management, highlights the ongoing quest for therapies targeting persistent inflammation in plaque stabilization and event reduction. 37. Platelet hyperreactivity in ischemic heart disease contributes to thrombotic complications, with pharmacogenomics guiding personalized antiplatelet strategies to prevent adverse outcomes and optimize dual antiplatelet therapy. 38. The interplay between hypercoagulability and ischemic heart disease necessitates consideration of anticoagulant therapy, especially in patients with concomitant atrial fibrillation, to balance thrombosis prevention with bleeding risk. 39. Investigating the impact of systemic nitric oxide availability in ischemic heart disease reveals its crucial role in vasodilation and endothelial function, with therapeutic implications for enhancing nitric oxide pathways. 40. The metabolic syndrome synergistically amplifies ischemic heart disease risk through interconnected components like abdominal obesity, insulin resistance, dyslipidemia, and hypertension, requiring a comprehensive approach to management. 41. Emerging research on the Klotho protein suggests a protective role against cardiovascular aging and ischemic heart disease, highlighting potential therapeutic avenues for promoting longevity and vascular health. 42. Heat shock proteins, induced by stressors, serve protective roles in myocardial cells by preventing protein aggregation and enhancing survival pathways during ischemic events, with potential therapeutic exploitation in cardioprotection. 43. Chronic kidney disease exacerbates ischemic heart disease through mechanisms such as hypertension, mineral metabolism disturbances, and uremic toxins, necessitating joint nephrological and cardiovascular management strategies. 44. Advances in nanotechnology aim to revolutionize ischemic heart disease treatment through targeted drug delivery systems, enhancing therapeutic efficacy and minimizing off-target effects in the cardiovascular system. 45. The association between migraines and ischemic heart disease underscores shared pathophysiological pathways like endothelial dysfunction, auguring the need for integrated care in patients presenting with both conditions. 46. Exploring proteomics in ischemic heart disease can unveil novel biomarkers and therapeutic targets, offering insights into disease mechanisms and individualized treatment approaches tailored to proteomic profiles. 47. Cardiac amyloidosis complicates ischemic heart disease by infiltrating and stiffening myocardial tissue, posing diagnostic and therapeutic challenges in distinguishing from primary ischemic cardiomyopathies. 48. Transthoracic echocardiography remains a non-invasive cornerstone in assessing cardiac structure and function in ischemic heart disease, aiding in evaluation of ventricular size, wall motion abnormalities, and ejection fraction. '49. The promise of gene editing technologies, such as CRISPR-Cas9, beckons an era of precision medicine for ischemic heart disease, potentially correcting genetic predispositions and ushering tailored therapeutic interventions. '50. Understanding the circadian patterns of ischemic heart disease events, where peak incidence occurs in the morning, informs timing of medication administration and lifestyle modifications to align with biological rhythms for optimal outcomes. 1. Esophageal cancer is a malignancy arising from the esophagus characterized by two main histological types: squamous cell carcinoma, which typically affects the upper portion of the esophagus and is strongly associated with smoking and alcohol consumption, and adenocarcinoma, which often develops in the lower part of the esophagus and is linked to chronic gastroesophageal reflux disease and Barrett's esophagus. 2. The pathophysiology of esophageal cancer involves the uncontrolled proliferation of cells lining the esophagus, often initiated by chronic irritation or inflammation caused by factors such as tobacco, alcohol, and gastroesophageal reflux, which over time can lead to genetic mutations and the development of neoplasms. 3. Early-stage esophageal cancer is often asymptomatic or presents with subtle symptoms like difficulty swallowing, dysphagia, which is frequently noticed with solid foods and can progressively worsen to include liquids as the tumor grows, causing obstruction within the esophageal lumen. 4. Diagnosis of esophageal cancer commonly involves upper endoscopy with biopsy for histological examination, offering direct visualization of the mucosal abnormalities, combined with imaging techniques such as CT and PET scans to assess tumor staging and metastatic spread. 5. The most significant risk factor for esophageal adenocarcinoma is chronic gastroesophageal reflux disease, GERD, which can cause Barrett's esophagus, a precancerous condition marked by the metaplastic transformation of normal squamous epithelium to columnar-lined epithelium over time. 6. Squamous cell carcinoma of the esophagus is more prevalent in certain geographic regions such as East Asia and Eastern Africa, with dietary influences, consumption of very hot beverages, and nutritional deficiencies playing contributory roles in its etiology. 7. Treatment for esophageal cancer varies based on the stage and location of the tumor but generally involves a combination of surgery, radiation, and chemotherapy, with esophagectomy being the mainstay curative approach for localized tumors, while systemic chemotherapy is pivotal for metastatic disease. 8. Barrett's esophagus represents a premalignant condition in which the squamous epithelium of the distal esophagus is replaced by intestinal columnar epithelium, increasing the risk of developing esophageal adenocarcinoma due to chronic acid exposure and inflammation. 9. Endoscopic ultrasound, EUS, serves as a critical tool in the staging of esophageal cancer, allowing for detailed assessment of tumor penetration into the esophageal wall and surrounding lymph nodes, which is crucial for planning effective treatment strategies. 10. The prognosis of esophageal cancer varies significantly by stage of diagnosis, with localized disease offering the best chance of cure, whereas advanced or metastatic disease is associated with a poor prognosis and a 5-year survival rate of less than 20%. 11. Symptomatic treatments for esophageal cancer may include esophageal dilation or stenting to alleviate obstructive symptoms, thereby improving swallowing and nutritional intake, especially in cases where the tumor is unresectable or the patient is unfit for surgery. 12. Molecular markers and genetic profiling are gaining attention in the prognosis and targeted therapy of esophageal cancer, with HER2 overexpression and PD-L1 expression being examples of biomarkers that can influence treatment plans, including the use of targeted therapies like trastuzumab or immune checkpoint inhibitors. Smoking cessation is crucial in reducing the risk of esophageal squamous cell carcinoma, as tobacco smoke contains numerous carcinogens that contribute to the development of various intraepithelial lesions and malignant transformations in the esophagus. 14. The role of the p53 tumor suppressor gene is pivotal in esophageal carcinogenesis, with mutations in this gene frequently encountered in both adenocarcinomas and squamous cell carcinomas, leading to impaired cell cycle regulation and increased susceptibility to neoplastic transformation. 15. Nutritional support is a key component of managing esophageal cancer, especially when advanced disease or treatment side effects compromise oral intake, necessitating interventions such as enteral feeding or supplementation to maintain adequate nutrition and weight. 16. Esophageal leiomyoma is the most common benign esophageal tumor, often asymptomatic and discovered incidentally on imaging, and differs from malignant lesions by its smooth muscle origin and low potential for malignant transformation. Surgical removal is warranted only if symptomatic. 17. PET cord scanning is invaluable for detecting metabolic activity and assessing distant metastasis in esophageal cancer, giving comprehensive information on disease spread that cannot be obtained through conventional imaging alone, thereby influencing decisions on the need for neoadjuvant therapy. 18. Alcohol use is a major risk factor for esophageal squamous cell carcinoma, with a dose-dependent relationship indicating that higher alcohol intake significantly elevates the risk of developing this type of cancer, emphasizing the importance of moderation or avoidance in at-risk populations. 19. Chemoradiotherapy can serve as a neoadjuvant treatment for esophageal cancer, intending to shrink the tumor preoperatively, improve the surgical outcome, and address microscopic metastatic disease, particularly in patients with locally advanced but still resectable tumors. 20. The development of minimally invasive esophagectomy (MIE) techniques has revolutionized the surgical management of esophageal cancer, offering reduced postoperative morbidity, faster recovery times, and comparable oncological outcomes to traditional open surgical approaches. 21. The expression of matrix metalloproteinases (MMPs) in esophageal cancer correlates with aggressive tumor behavior and metastatic potential, as these enzymes degrade extracellular matrix components, facilitating tumor invasion and spread, making them potential targets for therapeutic intervention. 22. Regular monitoring through endoscopic surveillance is critical for patients with Barrett's esophagus to detect dysplastic changes early, allowing for timely intervention strategies aimed at preventing progression to esophageal adenocarcinoma, including endoscopic resection or ablation techniques. 23. Dysphagia, or difficulty swallowing, is often one of the earliest and most common presenting symptoms of esophageal cancer, primarily resulting from tumor-induced luminal narrowing, progressing from solids to liquids as the disease advances, warranting prompt diagnostic evaluation. 24. The incidence of esophageal adenocarcinoma has been rising in Western countries, likely related to increased prevalence of obesity and gastroesophageal reflux disease, highlighting the role of lifestyle modification and surveillance in at-risk populations to curb this trend. 25. Adenocarcinoma of the esophagus frequently exhibits overexpression or amplification of the HER2/Neu oncogene, which has made the trastuzumab-based therapeutic regimen a viable option for improving outcomes in HER2-positive esophageal cancer, similar to its use in breast cancer. 26. Genetic syndromes such as tylosis, characterized by palmoplantar keratoderma, are associated with esophageal cancer, particularly squamous cell carcinoma, underscoring the importance of genetic counseling and early surveillance in affected families due to their markedly increased risk. 27. The role of E-cadherin, a cell adhesion molecule, is significant in esophageal cancer, with loss of its expression being linked to epithelial to mesenchymal transition, increased invasiveness, and metastatic potential, suggesting its potential utility as a prognostic marker. 28. Achalasia, a primary esophageal motility disorder, increases the risk of esophageal squamous cell carcinoma due to long-standing stasis and inflammation, making periodic endoscopic surveillance vital in patients with this condition to detect early neoplastic changes. 29. Proton pump inhibitors, PPIs, are commonly prescribed to manage gastroesophageal reflux disease and can play a role in preventing progression to Barrett's esophagus and esophageal adenocarcinoma by significantly reducing acid exposure and subsequent esophageal inflammation. 30. The overexpression of VEGF, a potent angiogenic factor, in esophageal cancer correlates with poor prognosis due to its role in promoting tumor angiogenesis and growth, making it a potential target for anti-angiogenic therapies such as bevacizumab in the treatment of advanced disease. 31. Photodynamic therapy, PDT, is an endoscopic treatment option for early-stage esophageal cancer or dysplasia in Barrett's esophagus, utilizing photosensitizing agents activated by light to destroy cancerous cells with minimal damage to surrounding healthy tissue. 32. Multidisciplinary management of esophageal cancer, incorporating input from gastroenterologists, oncologists, surgeons, radiologists, and nutritionists, is essential to delivering comprehensive care tailored to individual patient needs and maximizing therapeutic outcomes. 3. Epstein-Barr virus, EBV, has been implicated in certain cases of esophageal squamous cell carcinoma, with studies suggesting a possible etiological role, though the exact mechanisms of oncogenesis remain unclear and warrant further investigation to establish causation. 34. The assessment of esophageal tumor margins post-resection is critical to ensure complete excision and prevent local recurrence, often involving frozen section analysis intraoperatively to guide the surgical approach and achieve clear margins for optimal oncological outcomes. 35. Targeted therapies, such as monoclonal antibodies and small molecule inhibitors, are increasingly explored in esophageal cancer treatment, with ongoing research focusing on biomarkers like EGFR, MET, and PD-1, PD-L1 pathways to enhance response rates and survival benefits. 36. Monitoring treatment response in esophageal cancer often involves serial imaging studies, including CT or PET scans, combined with clinical evaluation of symptom resolution, providing key insights into therapeutic effectiveness and facilitating timely adjustments in management plans. 37. Obesity is a known risk factor for esophageal adenocarcinoma, primarily through its association with gastroesophageal reflux and subsequent Barrett's esophagus, emphasizing the importance of weight management and lifestyle modifications in lowering cancer incidence in overweight populations. 38. Human papillomavirus, HPV, has been investigated for its potential role in esophageal squamous cell carcinoma, with some studies identifying HPV DNA in tumor tissue, yet its significance remains controversial, and additional research is needed to clarify its impact on esophageal carcinogenesis. 39. The use of serological markers, such as squamous cell carcinoma antigen, SCC-AG, provides supplementary information in monitoring and prognosticating esophageal squamous cell carcinoma, although their utility is limited by specificity and the need for further validation. Brachytherapy, a form of internal radiation therapy, can be employed as a palliative treatment in esophageal cancer, particularly in advanced or recurrent disease, to provide symptomatic relief from dysphagia and improve the quality of life, especially when external beam radiation is not feasible. 41. Robotic-assisted esophagectomy offers a modern surgical approach with advantages including enhanced precision, reduced blood loss, and shorter hospital stays compared to traditional methods, though it requires specialized training and equipment, contributing to its limited availability. 42. Chronic esophagitis, resulting from prolonged gastroesophageal reflux, can cause progressive cellular alterations, ultimately leading to Barrett's esophagus and increasing the risk for esophageal adenocarcinoma, hence the importance of early and effective management of reflux symptoms. 43. The gut microbiome's role in esophageal cancer is an emerging field of study, with research suggesting that dysbiosis or alterations in the microbial balance may influence carcinogenesis, although the precise mechanisms and implications for prevention and therapy remain to be fully elucidated. 44. Neoangiogenesis, the formation of new blood vessels, is crucial for esophageal tumor growth and progression, often driven by factors like VEGF, making anti-angiogenic agents an appealing therapeutic option to limit nutrient supply and impair tumor expansion in advanced cancer stages. 45. Inflammatory mediator overproduction, such as prostaglandins, in chronic reflux esophagitis can exacerbate tissue damage and increase cancer risk, supporting the use of anti-inflammatory drugs, like COX-2 inhibitors, in potentially reducing the progression to esophageal cancer. 46. Salvage surgery is sometimes employed in esophageal cancer for recurrent disease following chemoradiation, offering the possibility of disease control or cure when initial non-surgical treatments fail, though it is associated with higher morbidity and requires careful patient selection. 47. Nanotechnology applications in esophageal cancer encompass drug delivery systems aimed at enhancing therapeutic efficacy and reducing systemic toxicity, utilizing nanoparticles to target cancer cells more precisely, representing a burgeoning area of research with promising potential. 48. Esophageal cancer screening is not widely implemented due to the lack of a sufficiently sensitive and cost-effective method for the general population, although high-risk groups, such as those with Barrett's esophagus, may benefit from regular endoscopic surveillance to identify early malignancies. 49. Dysregulation of cyclooxygenase 2, COX2, expression in esophageal cancer is associated with increased proliferation and resistance to apoptosis, providing a rationale for using COX2 inhibitors as a potential therapeutic strategy to enhance treatment response and inhibit tumor progression. 50. Cryotherapy is an emerging endoscopic treatment for early esophageal cancer or precancerous lesions, utilizing extreme cold to ablate dysplastic tissue with minimal invasiveness and complications, offering an alternative to more invasive surgical options in select patients. 1. Cardiac arrhythmia refers to any disruption in the heart's normal rhythm, commonly resulting from chaotic electrical impulses within the heart muscle, which can lead to various symptoms such as palpitations, dizziness, syncope, or in severe cases, sudden cardiac death, emphasizing the importance of comprehensive cardiovascular examination and electrocardiogram (ECG) evaluation as part of the diagnostic process. Two, the pathophysiology of cardiac arrhythmias often involves alterations in ion channel function, which can be attributed to genetic mutations, myocardial ischemia, or structural heart changes, leading to the development of conditions like atrial fibrillation, ventricular tachycardia, and other conduction disorders that necessitate tailored therapeutic strategies to mitigate risks and manage symptoms. 3. Atrial fibrillation, the most prevalent form of cardiac arrhythmia, is characterized by rapid, irregular beating of the atrial chambers and can increase the risk of stroke and heart failure, making anticoagulation therapy an essential component of management alongside rate control medications like beta blockers or calcium channel blockers to improve patient outcomes. Four. Ventricular fibrillation is a life-threatening cardiac arrhythmia caused by disorganized electrical activity in the ventricles, leading to cardiac arrest if not promptly treated with immediate defibrillation and advanced cardiac life support measures, underscoring the critical need for emergency response and intervention. 5. The diagnostic approach for cardiac arrhythmias often involves Holter monitoring or event monitors, which provide continuous ECG recordings over 24 hours or longer, enabling clinicians to capture transient episodes of arrhythmia, correlating them with symptoms and aiding in the accurate identification of both the type and cause of arrhythmia. 6. Supraventricular tachycardia, SVT, is a common arrhythmia originating above the ventricles, characterized by an abnormally fast heartbeat, often exceeding 150 beats per minute, which can be managed acutely with vagal maneuvers, adenosine, or, in recurrent cases, catheter ablation, highlighting the importance of individualized patient care. 7. Long QT syndrome is a potentially dangerous arrhythmia disorder that prolongs ventricular repolarization, predisposing individuals to torsades de pointes, a form of polymorphic ventricular tachycardia, necessitating regular monitoring, avoidance of QT prolonging medications, and possibly the use of beta blockers or implantable cardioverter defibrillators, ICDs, in high-risk patients. 8. Bradycardia is an arrhythmic condition defined by a heart rate of fewer than 60 beats per minute, which can be physiological or pathological, requiring thorough assessment to determine if management with pacemaker implantation is required to prevent symptoms like fatigue, dizziness, or syncope associated with insufficient cardiac output. 9. Wolff-Parkinson-White syndrome is an arrhythmia condition caused by an accessory pathway that allows electrical impulses to bypass the heart's normal conduction system, leading to episodes of tachycardia that can be effectively treated with catheter ablation to prevent recurrence and improve quality of life. 10. Premature ventricular contractions, PVCs, are early heartbeats originating in the ventricles, and while often benign, frequent PVCs should be evaluated with an electrocardiogram and echocardiogram to rule out underlying structural heart disease. Beta blockers may be considered if symptomatic or if there is an associated cardiomyopathy. 11. Carotid sinus hypersensitivity, a cause of bradyarrhythmia, results from exaggerated response to stimulation of the carotid sinus, leading to episodes of syncope or presyncope that can impact quality of life and require head-up tilt testing for diagnosis, with dual-chamber pacemaker implantation being an effective treatment for recurrent symptomatic cases. 12. The ventricular tachycardia storm, characterized by frequent episodes of ventricular tachycardia requiring repeated interventions within a short period, is a critical arrhythmic emergency demanding aggressive treatment, including antiarrhythmic drugs, catheter ablation, and in some cases, sympathetic blockade, highlighting the importance of prompt therapy to prevent cardiomyopathy. 13. Sinus tachycardia, a common arrhythmic condition where the heart rate exceeds 100 beats per minute, can result from physiological responses to exercise or stress, but requires assessment to exclude underlying cardiac or systemic pathology, with management focusing on treating the root causes, reducing anxiety, and avoiding stimulants. Atrioventricular nodal reentrant tachycardia, AVNRT, is a type of reentrant supraventricular tachycardia that can cause palpitations and lightheadedness, often diagnosed through characteristic ECG findings and effectively managed with the use of adenosine, rate-controlling medications, or radiofrequency catheter ablation for definitive treatment. Atrial flutter, an arrhythmia characterized by a rapid and regular atrial rate, typically presents with a sawtooth pattern on ECG and can lead to rapid ventricular responses, necessitating rate control or rhythm control strategies similar to those used in atrial fibrillation, including electrical cardioversion, antiarrhythmic drugs, and potentially catheter ablation. The Brugada syndrome is an inherited arrhythmic disorder with a distinct ECG pattern predisposing individuals to sudden cardiac death, particularly at rest or during sleep, where risk stratification is critical, and patients may benefit from ICD implantation to prevent life-threatening arrhythmic events despite being often asymptomatic. Junctional rhythm refers to an arrhythmic condition where the heart's electrical activity originates in or near the atrioventricular node, leading to slower heart rates and occasionally retrograde atrial conduction, necessitating evaluation for causes such as digitalis toxicity or intrinsic conduction system disease with management tailored to the underlying etiology. The multifocal atrial tachycardia, typically associated with underlying lung disease or metabolic disturbances, presents as an irregular rhythm with at least 3 different P-wave morphologies on ECG, requiring a multifaceted approach to treatment that includes correction of underlying conditions and the cautious use of rate-controlling agents. Antiarrhythmic drugs play a pivotal role in the management of various arrhythmias, classified into different classes based on their electrophysiological properties, necessitating careful selection and monitoring due to potential proarrhythmic effects and interactions with other medications, emphasizing their use in conjunction with non-pharmacological methods when appropriate. AV block, or atrioventricular block, is a type of heart block where the electrical conduction between the atria and ventricles is impaired, which can range from first-degree blocks with delayed conduction to third-degree blocks with complete dissociation, requiring pacemaker intervention in symptomatic high-grade blocks to maintain adequate hemodynamic stability. Sinus syndrome, involving dysfunction of the sinus node, can result in episodes of bradycardia, sinus arrest, or alternating bradycardia-tachycardia syndrome, with symptomatic patients often requiring the implantation of a permanent pacemaker to alleviate symptoms and improve heart rate responses during daily activities. Catecholaminergic polymorphic ventricular tachycardia is an inherited condition where adrenergic stress can trigger life-threatening arrhythmias in structurally normal hearts, mandating a combination of lifestyle modifications, beta blockers for arrhythmia prevention, and ICDs for high-risk patients to prevent sudden cardiac events during emotional or physical stress. Digoxin, a cardiac glycoside used in the management of certain arrhythmias and heart failure, works by increasing vagal tone and improving heart contractility. However, it demands careful dose adjustment and monitoring to avoid toxicity characterized by gastrointestinal disturbances, visual changes, and potentially life-threatening arrhythmias due to its narrow therapeutic window. Transvenous pacemaker insertion is a standard intervention for symptomatic bradyarrhythmias, involving the placement of pacing electrodes through the venous system to the heart, providing reliable electrical stimulation to correct slow heart rates, with advancements in technology offering options for dual-chamber or even leadless pacemakers tailored to patient-specific needs. 25. Idiopathic ventricular fibrillation refers to VF occurring in the absence of identifiable structural heart disease or known trigger factors, necessitating comprehensive evaluation to exclude reversible causes or genetic predispositions, with ICD therapy often being the cornerstone of prevention against recurrence and sudden cardiac death. 26. The tilt table test is a diagnostic tool used to evaluate unexplained episodes of syncope or presyncope, designed to provoke symptoms through postural changes, allowing assessment of autonomic function and vasoactive responses, with results guiding treatment options like lifestyle changes, medical therapies, or pacemaker implantation, particularly in neurally mediated syncope. 27. Atrial tachycardia, resulting from an abnormal focus of impulse generation outside the sinus node, often appears as regular narrow complex tachycardia on ECG, and management may involve pharmacological agents like calcium channel blockers or beta blockers and consider non-pharmacological approaches like catheter ablation for long-term control. 28. Amiodarone is a broad-spectrum antiarrhythmic agent effective against a wide range of arrhythmias, including atrial fibrillation and ventricular tachycardia, although its use may be limited by side effects such as thyroid dysfunction, pulmonary fibrosis, and liver toxicity, demanding vigilant long-term monitoring and consideration of risk-benefit balance. 29. AVRT, or atrioventricular reciprocating tachycardia, commonly results from an accessory pathway like in Wolff-Parkinson-White syndrome, presenting on ECG with delta waves, and treatment options include vagal maneuvers, pharmacological interventions, or catheter ablation to sever the accessory pathway for definitive resolution of the arrhythmia. 30. The Maze procedure, a surgical intervention for atrial fibrillation, involves creating a series of strategically placed incisions or ablations in the atria to disrupt reentrant circuits and restore sinus rhythm, typically reserved for patients undergoing cardiac surgery for other indications or those who have failed catheter-based therapies. 31. Beta blockers, often used in the management of various arrhythmias, work by blocking beta-adrenergic receptors, reducing heart rate, and decreasing myocardial oxygen demand, proving effective in rate control for atrial fibrillation and preventing recurrent ventricular arrhythmias, with the selection of specific agents guided by patient comorbidities and cardiovascular risk. 32. Lown-Gannon-Levine syndrome is characterized by a short PR interval without the presence of delta waves on the ECG, resulting from accelerated atrioventricular conduction, with management focusing on symptom alleviation through the use of medications like verapamil or catheter ablation, tailored to individual patient presentation and pathway determination. 3.3. Electrolyte imbalances, such as hypokalemia and hypomagnesemia, are common reversible causes of arrhythmias, leading to increased cardiac excitability and the risk of ventricular tachyarrhythmias, necessitating prompt correction of deficiencies through oral or intravenous supplementation alongside continuous cardiac monitoring for patients at risk. 34. The physiological basis of reentry arrhythmias, a frequent mechanism in conditions like atrial flutter and ventricular tachycardia, involves the presence of anatomical or functional circuit pathways that allow a reentrant current of electrical activity, perpetuating tachycardia, and is typically managed through targeted ablation therapy to interrupt these circuits. 35. Sinus node dysfunction is often implicated in nocturnal bradycardia, resulting from an interplay of autonomic factors and sleep-disordered breathing, highlighting the importance of assessing for conditions like obstructive sleep apnea which may exacerbate this arrhythmia, with therapeutic approaches including positive airway pressure therapy and pacemaker considerations for persistent symptoms. 36. In atrial fibrillation management, novel oral anticoagulants, NOACs, play a key role in stroke prevention, offering alternatives to traditional warfarin therapy free from frequent INR monitoring, with choices of dabigatran, rivaroxaban, apixaban, or edoxaban being driven by patient renal function, bleeding risks, and individual patient preferences. #37. Familial atrial fibrillation, a heritable form of arrhythmia, highlights the role of genetic predisposition in arrhythmogenesis, necessitating genetic counseling and consideration of vigilance in family members, with treatment strategies paralleling those of sporadic atrial fibrillation, emphasizing the balance of rate versus rhythm control approaches. #38. The implantable cardioverter defibrillator, ICD, remains a cornerstone in preventing sudden cardiac death in high-risk population segments like those with ischemic cardiomyopathy or inherited channelopathies, capable of delivering life-saving shocks or anti-tachycardia pacing to terminate ventricular tachyarrhythmias and restore sinus rhythm. #39. Premature atrial contractions, PACs. Frequent ectopic beats originating in the atria are usually benign but can serve as a precursor to more significant arrhythmias like atrial fibrillation, with lifestyle modifications being advised if symptomatic and consideration of beta blockers or calcium channel blockers for suppression. #40. The vagal maneuvers, simple physical techniques aimed at stimulating the vagus nerve, can induce reflexive slowing of heart rate, proving advantageous in terminating reentrant arrhythmias like supraventricular tachycardia, and should be included in initial therapeutic instruction for patients at risk of acute episodes alongside medical therapies. #41. QT interval prolongation, an ECG finding indicative of delayed cardiac repolarization, poses a significant arrhythmia risk for developing torsades de pointes, requiring careful evaluation and avoidance of QT prolonging substances, with therapeutic correction focusing on withdrawal of offending agents, electrolyte repletion, or use of specific antiarrhythmics. #42. The Holter monitor, a portable device providing continuous ECG recording over a day or more, plays a vital role in uncovering paroxysmal arrhythmias difficult to detect with standard examinations, guiding diagnosis and therapeutic decisions by correlating symptomatic episodes with underlying cardiac rhythm abnormalities. #43. Dopamine receptor agonists, sometimes involved in the management of Parkinson's disease or prolactinomas, carry the potential for inducing arrhythmic events through disturbance of sympathetic and parasympathetic balance, underscoring the need for baseline cardiac assessment and ongoing ECG monitoring to prevent adverse cardiac outcomes. #44. Accessory pathways in the heart predispose to arrhythmias by allowing electrical impulses to bypass normal conduction, creating scenarios like Wolff-Parkinson-White syndrome, with catheter ablation offering definitive management by selectively destroying the pathway, leading to permanent resolution and prevention of recurrence. #45. Recurrence of atrial fibrillation post-cardioversion is common and often necessitates the use of antiarrhythmic medications for rhythm maintenance, underscoring the need for consideration of rate control, lifestyle interventions, and assessment of secondary causes to sustain sinus rhythm and improve patient quality of life. #46. Ventricular premature beats, VPBs, or extrasystoles are isolated electrical impulses originating in the ventricles, commonly detected on routine ECGs, and while often benign, warrant evaluation for possible underlying heart disease in symptomatic patients or those with frequent VPBs, utilizing treatment strategies like beta blockers if deemed necessary. #47. The electrophysiological study, EPS, serves as a diagnostic tool for elucidating complex arrhythmia mechanisms, guiding therapeutic interventions by mapping cardiac electrical activity, and determining the exact location of aberrant pathways, forming a basis for decisions regarding catheter ablation or device therapy in refractory cases. 48. Respiratory sinus arrhythmia, a benign variation of heart rate with breathing, reflects the normal interaction between the respiratory cycle and the parasympathetic nervous system, often more pronounced in younger individuals and athletes, representing a physiological, non-pathological finding with no need for clinical intervention. 49. QRS widening on ECG signifies impaired conduction through the ventricles, seen commonly in bundle branch blocks, electrolyte imbalances, or drug effects, requiring assessment to determine if chronic or acute changes necessitate further cardiac workup, with specific treatment guided by underlying etiology and associated symptoms. The HAS-BLED score is a clinical tool used to estimate bleeding risk in patients with atrial fibrillation undergoing anticoagulation therapy, aiding in individualized risk assessment and optimization of therapeutic strategies, balancing the benefits of stroke mitigation against the potential for major bleeding complications. A staggering diversity of microbial symbionts thrives within the human gastrointestinal tract, with the gut microbiota encompassing trillions of bacteria that wield profound influence over digestion and overall health. Yet disruptions in this microbiome, such as through antibiotics or a Western diet, can precipitate conditions like inflammatory bowel disease, irritable bowel syndrome, and metabolic disorders, emphasizing the importance of maintaining microbial balance for gastrointestinal homeostasis. 2. Crohn's disease, a type of inflammatory bowel disease, manifests with transmural inflammation that can affect any part of the gastrointestinal tract from mouth to anus, often leading to complications such as strictures, fistulas, and nutrient malabsorption. Despite its immune-modulated pathophysiology being not entirely understood, innovative biologic therapies targeting TNF-alpha and other inflammatory mediators have significantly improved patients' quality of life. 3. Gastroesophageal reflux disease, GERD, represents a chronic condition characterized by the retrograde flow of stomach contents into the esophagus, leading to symptoms such as heartburn and regurgitation, with potential complications including esophagitis and Barrett's esophagus, and lifestyle modifications like dietary changes and elevation of the head during sleep are often first-line therapies, supplemented by proton pump inhibitors to reduce acid production when necessary. 4. Celiac disease is an autoimmune disorder where ingestion of gluten leads to damage in the small intestine, with specific genetic markers HLA-DQ2 and HLA-DQ8 playing central roles in pathogenesis, and strict adherence to a gluten-free diet is currently the sole management strategy, underscoring the need for vigilance in identifying hidden sources of gluten to prevent malabsorption and related complications such as osteoporosis and anemia. 5. Acute pancreatitis, often precipitated by gallstones or excessive alcohol intake, involves the autodigestion of pancreatic tissue by prematurely activated digestive enzymes, and while mild cases may resolve with supportive care like hydration and fasting, severe forms can result in necrosis and systemic inflammatory response syndrome, necessitating intensive medical interventions and sometimes surgical debridement. 6. Irritable bowel syndrome, IBS, is a functional GI disorder characterized by a combination of abdominal pain, bloating, and altered bowel habits without any detectable organic cause, distinguishing itself with the brain-gut interaction being pivotal in its pathophysiology, and a personalized approach to treatment incorporating dietary adjustments, like low FODMAP diet, psychological support, and specific medication targets hallmark symptoms. 7. Peptic ulcer disease is primarily caused by Helicobacter pylori infection or chronic use of nonsteroidal anti-inflammatory drugs, leading to erosions in the gastric or duodenal mucosa due to imbalances between protective and aggressive gastric factors, and eradication of H. pylori through antibiotic regimens or cessation of offending NSAIDs, coupled with acid suppression therapy, typically results in ulcer healing and symptom resolution. 8. Diverticulosis refers to the presence of herniations or pouches in the colonic wall that become inflamed or infected, resulting in diverticulitis, a condition characterized by acute abdominal pain, fever, and digestive disturbances, highlighting dietary fiber's role in prevention and antibiotics or, in severe cases, surgery's necessity for resolving complications like perforations or fistulas. 9. Chronic liver disease can culminate in portal hypertension, a condition where increased pressure in the portal venous system leads to complications such as esophageal varices, splenomegaly, and ascites, with non-invasive elastography providing a modern diagnostic tool for assessing liver stiffness and therapeutic advancements like TIPS procedure offering significant relief and management options. Gallstones are crystalline concretions formed in the gallbladder due to imbalances in the composition of bile, with cholesterol stones being the most prevalent type in the Western world. And while many remain asymptomatic, if a stone obstructs the cystic duct, it can lead to cholecystitis, biliary colic, or pancreatitis, necessitating potential cholecystectomy as a definitive treatment. 11. The human gastrointestinal system displays a fascinatingly complex layered structure with the enteric nervous system operating as a second brain, capable of autonomous function in orchestrating peristalsis and secretion, with neuronal interconnectivity and neuromodulators reminiscent of the central nervous system, asserting its foundational role in maintaining digestive function and influencing emotional states. Cirrhosis, the final common pathway for a myriad of chronic liver diseases, results from progressive fibrosis and nodular regeneration within the liver parenchyma, ultimately compromising hepatic function and leading to complications such as jaundice, coagulopathy, and hepatic encephalopathy, with liver transplantation remaining the only curative option for end-stage cirrhosis despite ongoing advancements in antifibrotic therapies. 13. Malabsorption syndromes are marked by defective nutrient absorption in the intestine, with conditions like lactose intolerance and tropical sprue affecting various digestive processes, leading to symptoms such as diarrhea, weight loss, and nutritional deficiencies, and they necessitate both accurate differential diagnosis via tests like breath hydrogen and stool analysis, as well as targeted dietary and pharmacological interventions. 14. Gastric cancer, predominantly adenocarcinoma, poses a major global health concern with risk factors including H. pylori infection, dietary influences, and genetic predispositions, often presenting in late stages due to nonspecific early symptoms, but advances in endoscopic surveillance techniques, alongside surgical and chemotherapeutic modalities, have provided tangible improvements in early detection and patient survival outcomes. 15. Functional dyspepsia, a chronic disorder characterized by upper abdominal discomfort and related symptoms, presents without an underlying structural cause, challenging clinicians with its complex interplay of gastric motility disturbance, visceral hypersensitivity, and psychosocial factors, thus mandating a multifaceted approach that may include prokinetics, acid suppression, and psychological therapies like cognitive behavioral therapy. 16. Hepatitis C, a blood-borne viral infection that predominantly targets hepatocytes, can progress silently to chronic liver disease and cirrhosis over decades, but recent developments in direct-acting antiviral agents have revolutionized its management, providing cure rates above 95% and reducing the incidence of liver-related complications, thereby offering a beacon of hope for managing viral-induced liver diseases. 17. Hepatic encephalopathy, resulting from the buildup of neurotoxic substances like ammonia due to liver dysfunction, manifests with a spectrum of neurological impairments ranging from confusion to coma in advanced cases, and treatment strategies focus on reducing ammonia levels using lactulose or rifaximin, alongside addressing the precipitating factors like infections or dehydration to prevent flares of this debilitating condition. 18. Clostridium difficile infection is a leading cause of healthcare-associated diarrhea due to alteration of normal gut flora following antibiotic usage, and the hallmark pseudomembranous colitis can progress to severe fulminant colitis, necessitating prompt recognition and management with oral vancomycin or fidaxomicin, and fecal microbiota transplantation has emerged as an innovative therapy for recurrent cases. (19) Barrett's esophagus, a precursor for esophageal adenocarcinoma, results from chronic gastroesophageal reflux causing metaplasia of the esophageal lining, with endoscopic surveillance and biopsy forming the cornerstone of monitoring, and advanced interventions like radiofrequency ablation or endoscopic mucosal resection in selected cases offer potential measures to mitigate cancer progression risk. 20. Intussusception occurs when one segment of intestine telescopes into another, causing bowel obstruction and ischemia if untreated, predominantly affecting young children who present with classic triad of intermittent abdominal pain, current jelly, stools, and a palpable abdominal mass, with treatment often involving a therapeutic enema or surgical intervention to resolve the obstruction. 21. Non-alcoholic fatty liver disease encompasses a spectrum from simple steatosis to non-alcoholic steatohepatitis, reflecting fat accumulation in hepatocytes primarily linked to metabolic syndrome. Features such as obesity, insulin resistance, and dyslipidemia, demanding lifestyle modifications as the primary therapeutic approach, while pharmacological interventions focusing on insulin sensitizers show promise in reversing hepatic steatosis and inflammation. 22. Helicobacter pylori's unique spiral morphology and urease production enable survival and colonization within the acidic gastric environment, causing chronic gastritis, peptic ulcers, and being a recognized carcinogen associated with gastric cancer, making eradication regimens combining multiple antibiotics and acid suppression pivotal in reducing its clinical burden and preventing associated gastric malignancies. 23. Acute appendicitis, the most common surgical emergency, results from obstruction and subsequent infection of the appendix leading to inflammation and potential perforation, presenting with periumbilical pain migrating to the right lower quadrant, and timely diagnosis and surgical intervention, typically in the form of appendectomy, remain crucial to avoid complications like peritonitis or abscess formation. 24. Hirschsprung's disease is a congenital condition resulting from the absence of ganglion cells in the distal colon, leading to functional bowel obstruction and chronic constipation in neonates, with rectal biopsy being the definitive diagnostic tool, and surgical resection of the aganglionic segment forming the cornerstone of treatment to restore normal bowel function and prevent enterocolitis. 25. Autoimmune hepatitis, characterized by chronic inflammation of the liver due to immune-mediated attack on hepatocytes, presents with varied symptoms from asymptomatic elevations in liver enzymes to fulminant hepatic failure, and although precise etiology remains elusive, treatment typically involves immunosuppression with corticosteroids and azathioprine to control inflammation and prevent progression to cirrhosis. 26. Esophageal achalasia, a disorder of esophageal motility characterized by impaired relaxation of the lower esophageal sphincter and loss of peristalsis, presents with progressive dysphagia to solids and liquids, and high-resolution manometry aids its diagnosis, with treatment options including pneumatic dilation, surgical myotomy, or peroral endoscopic myotomy offering symptomatic relief and improving esophageal function. 27. Microscopic colitis, comprising collagenous and lymphocytic variants, is an inflammatory bowel condition causing chronic watery diarrhea with normal endoscopic findings, but distinctive histopathological features on biopsy, and management generally involves cessation of potential offending agents like NSAIDs, with budesonide providing effective resolution of symptoms in many cases. 28. Zollinger-Ellison syndrome is a rare disorder caused by gastrin-secreting tumors, usually in the pancreas or duodenum, leading to gastric acid hypersecretion and recurrent peptic ulcers, with gastrin levels and imaging for tumor localization aiding in diagnosis, and management encompasses not only acid suppression but also surgical resection or somatostatin analogs to control hormone production. 29. Gluten sensitivity, a non-celiac adverse response to gluten ingestion, presents with symptoms overlapping with irritable bowel syndrome, including abdominal discomfort and bloating, without the autoimmune component seen in celiac disease, necessitating exclusion of other potential causes, and a gluten-free diet often providing symptomatic improvement, although the long-term necessity of dietary restrictions remains a topic of ongoing research. 30. Incarcerated inguinal hernias present when a segment of intestine becomes trapped within the inguinal canal, risking obstruction and ischemia, with acute presentation involving localized pain, irreducible mass, and possible systemic signs if strangulation occurs, and urgent surgical intervention is imperative not only to release the incarcerated bowel but also to repair the hernia to prevent recurrence. 31. Gastritis refers to inflammation of the gastric mucosa, which may be acute or chronic, and although often asymptomatic, it can manifest with epigastric pain, nausea, or bloating, with etiological factors ranging from infection by H. pylori to NSAID use and alcohol consumption, highlighting the importance of addressing the underlying cause alongside acid suppression to facilitate mucosal healing. 32. Hemochromatosis, a genetic disorder characterized by excessive iron absorption and accumulation in tissues, leads to organ damage, particularly in the liver, heart, and pancreas, presenting with liver cirrhosis, diabetes, and skin pigmentation changes. An early diagnosis facilitated by genetic testing allows for effective management through regular phlebotomy to prevent long-term complications. 3. Gastrointestinal stromal tumors, GISTs, are mesenchymal tumors arising predominantly in the stomach or small intestine, characterized by mutations in the KIT or PDGFRA genes, and present with nonspecific symptoms such as gastrointestinal bleeding or pain, with management advancing significantly through the use of imatinib, a tyrosine kinase inhibitor, besides surgical resection for localized disease. 34. Ascites, the abnormal accumulation of fluid in the peritoneal cavity, commonly arises from portal hypertension or malignancy, presenting with abdominal distension and discomfort, and evaluating the serum ascites albumin gradient aids in establishing the etiology, while therapeutic paracentesis provides symptomatic relief, with albumin infusion and diuretics being adjunctive therapy to manage fluid overload and prevent recurrence. 35. Behçet's disease is a systemic vasculitis characterized by recurrent oral ulcers, genital ulcers, and uveitis, with potential gastrointestinal involvement leading to ulceration and bleeding, and although its precise pathophysiology remains unclear, treatment with immunosuppressive agents like colchicine, corticosteroids, or biologics targeting tumor necrosis factor alpha plays a pivotal role in controlling systemic and gastrointestinal manifestations. 36. Functional abdominal pain syndrome is a chronic pain condition characterized by continual or frequent abdominal pain not associated with altered bowel patterns, distinguishing it from other functional gastrointestinal disorders, with its management necessitating a biopsychosocial approach involving pharmacologic measures targeting pain pathways, psychological therapies, and supportive care for comprehensive symptom management. 37. The role of ghrelin in the gastrointestinal system extends beyond its well-known hunger-promoting action, with this peptide hormone influencing gastric motility, pancreatic hormone secretion, and potentially exerting protective effects on gastric mucosa, positioning it as an intriguing target for therapeutic research in conditions ranging from gastroparesis to cachexia due to its multifaceted physiological and pathophysiological roles. 38. Eosinophilic esophagitis is a chronic immune-mediated condition characterized by eosinophil infiltration in the esophageal mucosa leading to dysphagia and potential esophageal remodeling, often linked with atopic conditions, and its management involves dietary exclusion of allergens, typically guided by allergy testing, alongside topical corticosteroids to reduce eosinophilic inflammation and prevent disease progression. 39. Helicobacter pylori's involvement in extragastric manifestations such as idiopathic thrombocytopenic purpura and iron deficiency anemia continues to intrigue researchers, with evidence suggesting that eradication of H. pylori can lead to resolution or improvement in these conditions, thus necessitating consideration of this bacterium's far-reaching impact beyond the confines of the gastrointestinal tract in certain clinical scenarios. 40. The curiously named Meckel's diverticulum is a remnant of the omphallomesenteric duct found in the ileum, which may become symptomatic if it harbors ectopic tissue-producing acid, or causes obstruction, and while often asymptomatic, it remains the most common congenital anomaly of the gastrointestinal tract, with technetium 99M scintigraphy aiding in diagnosis when symptomatic presentations resembling appendicitis or gastrointestinal bleeding emerge. 41. Gastroparesis is a disorder characterized by delayed gastric emptying without mechanical obstruction, presenting with symptoms such as nausea, vomiting, and early satiety, often associated with diabetes or idiopathic causes, and management includes dietary modifications, prokinetic agents, and potentially gastric electrical stimulation to improve gastric motility and alleviate symptoms. 42. Chronic intestinal pseudo-obstruction mimics mechanical bowel obstruction without a physical blockage, resulting from significant abnormalities in enteric smooth muscle or nerves, leading to gastrointestinal dysmotility with symptoms like abdominal distension, pain, and malnutrition, necessitating a multifaceted approach including dietary adjustments, pharmacological motility agents, and sometimes parenteral nutrition for effective management. 43. The multifactorial etiology of colorectal cancer encompasses genetic predispositions, including familial adenomatous polyposis and Lynch syndrome, alongside environmental influences like diet, with screening colonoscopy playing a crucial role in early detection and prevention, while advances in molecular profiling deride personalized approaches to therapy, including targeted therapies and immunotherapies, in improving patient outcomes. 44. Primary biliary cholangitis is a chronic liver disease driven by autoimmune destruction of intrahepatic bile ducts, presenting with fatigue, pruritus, and eventual progression to cirrhosis. And while its precise etiology remains enigmatic, treatment with ursodeoxycholic acid and emerging drugs like obeticholic acid can slow disease progression, providing a favorable prognosis when diagnosed early. 45. Biliary atresia, a life-threatening congenital liver disorder, involves progressive obliteration of extrahepatic bile ducts leading to cholestasis and cirrhosis, requiring the Kasai procedure, a surgical intervention connecting the intestine to the liver, as a timely measure to restore bile flow and delay liver transplantation, which remains inevitable in many cases for long-term survival. 46. Small intestinal bacterial overgrowth, SIBO, results from excessive bacteria in the small intestine, often due to impaired motility or anatomical abnormalities, leading to symptoms like bloating, diarrhea, and malabsorption, with diagnosis supported by breath testing, and management involving antibiotics and probiotics aimed at restoring normal bacterial populations and alleviating symptoms. 47. The gut-brain axis embodies the complex bidirectional communication network between the central nervous system and the enteric nervous system, influencing not only gastrointestinal processes but also psychological states and behaviors, with emerging evidence highlighting the role of gut microbiota in modulating this interaction, opening novel therapeutic avenues for disorders like anxiety and depression linked to gut dysbiosis. 48. Esophageal strictures occur due to fibrosis and narrowing of the esophageal lumen from conditions such as chronic reflux esophagitis, malignancy, or radiation, presenting with progressive dysphagia, and management typically involves endoscopic dilation to restore luminal patency, while addressing the underlying cause is critical for preventing recurrence and ensuring durable symptom relief. '49. Hepatorenal syndrome, a serious complication of liver cirrhosis, arises from renal vasoconstriction secondary to systemic circulatory changes, leading to acute kidney injury in the absence of intrinsic renal disease, and its management includes vasoconstrictors like terlipressin and albumin infusion to improve renal perfusion, while liver transplantation offers definitive treatment and resolution of this life-threatening condition. '50. Carcinoid tumors, slow-growing neoplasms originating from enterochromaffin cells in the gastrointestinal tract, typically secrete serotonin and other vasoactive substances, leading to carcinoid syndrome characterized by flushing, diarrhea, and valvular heart disease. And while surgical resection remains curative for localized disease, somatostatin analogs provide symptom control and reduced hormone secretion in metastatic cases. 1. Non-alcoholic fatty liver disease, NAFLD. The hepatic manifestation of metabolic syndrome is characterized by excessive fat accumulation in liver cells, often due to insulin resistance, and is the most common cause of chronic liver disease worldwide, affecting nearly 1 billion individuals and potentially leading to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, fibrosis, cirrhosis, or hepatocellular carcinoma if left unchecked over the years. 2. The pathophysiology of fatty liver disease involves a two-hit hypothesis where the first hit is the accumulation of triglycerides in the hepatocytes, creating a state vulnerable to lipotoxicity, and the second hit involves oxidative stress, cytokines, and mitochondrial dysfunction that progress hepatic inflammation and fibrosis, emphasizing the complexity and multifactorial nature of this condition. 3. Magnetic resonance imaging, MRI, proton density fat fraction, PDFF, is emerging as a non-invasive gold standard for quantifying hepatic steatosis in NAFLD, providing a comprehensive assessment of liver fat content that is more precise than ultrasound and CT and lacking the invasiveness and risks associated with liver biopsy, thus contributing to better disease management and monitoring of therapeutic responses. 4. The primary treatment approach for non-alcoholic fatty liver disease focuses on lifestyle interventions, primarily weight loss through dietary modifications and increased physical activity, with evidence showing that a modest reduction of 5 to 10% in body weight can significantly reduce liver fat, ameliorate inflammation and fibrosis, and improve overall liver function, often reversing fatty liver changes. 5. The use of vitamin E as a therapeutic agent in non-alcoholic steatohepatitis has gained traction due to its antioxidant properties, with studies demonstrating that high-dose vitamin E supplementation can improve liver histology, reduce hepatic inflammation, and increase indices of liver function in non-diabetic NASH patients, although caution is advised regarding long-term use and potential cardiovascular risks. 6. In NAFLD, the liver enzyme alanine aminotransferase (ALT) is often elevated. However, normal ALT levels do not exclude the presence of significant liver damage, emphasizing the importance of considering a full panel of liver function tests alongside imaging techniques and histological assessment when diagnosing and monitoring this stealthy and often silent hepatic condition. 7. Advances in our understanding of gut-liver axis dysregulation in NAFLD have highlighted the role of dysbiosis and intestinal permeability in promoting hepatic fat accumulation and inflammation, pointing to the therapeutic potential of probiotics, prebiotics, and fecal microbiota transplantation in modulating gut microbiota composition and function as a novel avenue for treatment. 8. Insulin resistance is a crucial player in the pathogenesis of non-alcoholic fatty liver disease, where excessive lipolysis and increased free fatty acid influx into the liver, driven by hyperinsulinemia, play a pivotal role in hepatic fat deposition, reinforcing the interconnectivity between metabolic disturbances and liver health, and supporting the utilization of insulin-sensitizing agents like metformin in some patient populations. Nine. Hepatocyte apoptosis, mediated by pathways involving endoplasmic reticulum stress and death receptor activation, is a significant contributor to liver injury and progression in NAFLD, suggesting that agents targeting these apoptotic pathways could offer novel therapeutic benefits by interrupting this self-perpetuating cycle of liver cell death and fibrogenesis. 10. Detection of genetic polymorphisms such as in the PNPLA3 gene highlights a genetic predisposition that significantly influences individual susceptibility to fatty liver disease in its progression, thus directing research towards personalized medicine approaches where genetic screening could inform risk assessment, prognosis, and tailored therapeutic strategies. Bariatric surgery, particularly Roux-en-Y gastric bypass, has emerged as a highly effective treatment for morbidly obese patients with NAFLD, resulting in substantial and sustained weight loss, resolution of hepatic steatosis, and regression of fibrosis, positioning it as a viable option in severe cases where conservative management has failed and the risk of progression is high. The mitochondrial dysfunction observed in NAFLD stems from impaired oxidative phosphorylation and an increase in reactive oxygen species, which contribute to steatosis, cellular damage, and fibrosis, indicating a potential therapeutic role for agents aimed at enhancing mitochondrial function and protecting against oxidative stress in the treatment landscape. Obstructive sleep apnea, OSA, has been identified as a contributing factor to the progression of NAFLD through mechanisms involving intermittent hypoxia and sympathetic activation, making the treatment of OSA with continuous positive airway pressure, CPAP, a potentially beneficial adjunct in slowing disease progression and improving liver health. Although traditionally associated with alcohol, steatohepatitis can develop in non-drinkers who consume excessive fructose, which is metabolized in the liver, resulting in de novo lipogenesis and increased triglyceride synthesis, underlining the impact of dietary choices on liver health and the importance of reducing fructose intake for NAFLD patients. The concept of metabolic-associated fatty liver disease, MAFLD, has been proposed to more accurately reflect the metabolic underpinnings and multisystem involvement of fatty liver disease, emphasizing the transition towards a diagnostic approach that integrates metabolic risk factors, allowing for better stratification and management in clinical practice. Emerging evidence suggests that certain medications, such as statins and SGLT2 inhibitors, not only manage associated metabolic conditions but also provide ancillary benefits for liver health, including reductions in liver fat and fibrosis, showcasing the potential of repurposing existing cardiometabolic medications to tackle the hepatic sequelae of metabolic syndrome. Choline, an essential nutrient found in eggs, meat, and fish, plays an important role in preventing liver steatosis by assisting in lipoprotein assembly and VLDL secretion, reinforcing the nutritional importance of adequate choline intake and the potential consequences of deficiency in exacerbating fatty liver conditions. Hepatic macrophages, or Kupffer cells, are key drivers of inflammation in fatty liver disease through the production of pro-inflammatory cytokines, which contribute to the exacerbation of liver injury and fibrosis. Thus, modulating the activity of these immune cells represents a promising therapeutic avenue to mitigate liver inflammation and progression. Ethnic variations in the prevalence and severity of NAFLD suggest that genetic, lifestyle, and environmental factors intersect to influence disease distribution, with studies demonstrating higher susceptibility among Hispanic individuals, highlighting the need for culturally tailored interventions and awareness campaigns that address specific risks and misconceptions. 20. Omega-3 fatty acids, abundant in fish oils, have been shown to reduce liver fat, inflammation, and triglyceride levels, indicating their potential as a supportive therapy in NAFLD management, especially for individuals who may not respond adequately to lifestyle changes alone, and underscoring the importance of dietary management in liver health. 21. The endocannabinoid system is increasingly recognized as a crucial modulator of hepatic energy storage, inflammation, and fibrosis in NAFLD, thus emerging as a potential target for treatment. Cannabinoid receptor antagonists, despite controversy, offer exciting possibilities for intervening in this pathway and controlling disease progression. 22. The presence of liver fibrosis in NAFLD significantly increases the risk of adverse outcomes, making fibrosis staging vital in risk stratification and management decisions, with non-invasive biomarkers and elastography techniques offering reliable alternatives to liver biopsy, providing accessible and safer methods for assessing fibrosis risk. 23. Identifying and managing comorbid conditions such as type 2 diabetes, hypertension, and dyslipidemia is crucial in NAFLD management, as these conditions share underlying pathophysiological links with liver disease and can exacerbate NAFLD progression, necessitating a comprehensive and multidisciplinary approach for optimal outcomes. 24. Alcoholic fatty liver disease and non-alcoholic fatty liver disease share similar histological features, making clinical distinction based on history and risk factors essential for diagnosis, with alcohol abstinence serving as a critical and effective intervention for those with alcohol-related liver disease, whereas lifestyle changes remain foundational for NAFLD. 25. Given the silent nature of early-stage NAFLD, routine screening for fatty liver in patients with obesity, metabolic syndrome, or type 2 diabetes is recommended to facilitate early diagnosis and intervention, underscoring the importance of awareness and vigilance in primary care and the potential benefit of periodic liver assessments in at-risk populations. 26. Leptin resistance, often noted in individuals with obesity, contributes to steatosis by impairing the regulation of appetite and energy expenditure and promoting pro-inflammatory cytokines that exacerbate liver inflammation and fibrosis, presenting a target for novel therapies aimed at restoring leptin sensitivity and breaking the cycle of metabolic dysregulation. 27. The prevalence of pediatric NAFLD is rising alarmingly, mirroring the increase in childhood obesity, with studies indicating that early onset of fatty liver can predispose youth to severe liver complications in adulthood, highlighting the urgency for public health interventions focusing on diet, physical activity, and lifestyle in childhood and adolescence. 28. The gut-derived hormone fibroblast growth factor 19, FGF19, is implicated in the regulation of bile acid synthesis and glucose metabolism. Its therapeutic modulation offers intriguing prospects for correcting metabolic dysfunction and reducing liver fat content in patients with NAFLD, representing a promising area for novel therapeutic development. 29. Studies on liver fat quantification techniques have illuminated the efficacy of controlled attenuation parameter, CAP, via transient elastography, which provides a reliable, non-invasive, and widely accessible method for assessing hepatic steatosis, facilitating early diagnosis and monitoring while circumventing the risks and discomfort of liver biopsy. 30. Gender differences in NAFLD reveal that men tend to develop the disease earlier, while women, particularly postmenopausal women, face a higher risk of disease progression, suggesting the influence of hormonal factors in disease dynamics and underlining the importance of gender-specific research and treatment approaches. 31. Pharmacological interventions targeting the insulin pathway, such as thiazolidinediones, are undergoing investigation to address insulin resistance in NAFLD patients, offering potential benefits in reducing liver fat, inflammation, and fibrosis, although balanced against potential side effects such as weight gain and cardiovascular risk. 32. Ectopic fat deposition, not only in the liver but also in muscles and the pancreas, constitutes an important aspect of the metabolic disturbances associated with NAFLD, highlighting the interconnected nature of metabolic health and the necessity for interventions that address overall body composition and systemic insulin sensitivity. 3.3. Oxidative stress biomarkers such as melandialdehyde and 8-isoprostane provide valuable insights into the oxidative damage occurring in NAFLD, serving as potential diagnostic and prognostic tools for assessing the severity and progression of the disease and guiding antioxidant-based therapeutic strategies. Emerging research into the role of bile acids and the farnesoid X receptor, FXR, in NAFLD pathogenesis underscores their influence on lipid metabolism, hepatic inflammation, and fibrosis, identifying FXR agonists as promising candidates in the development of targeted therapeutics aimed at mitigating disease progression. The utilization of artificial intelligence and machine learning in analyzing electronic health records and imaging data holds great promise for enhancing the accuracy of NAFLD diagnosis and risk stratification, expediting the identification of high-risk individuals, and optimizing personalized treatment plans in a rapidly evolving healthcare landscape. The increase in lipotoxic intermediates such as diacylglycerol and ceramides in the liver has been linked to insulin resistance and hepatic inflammation, pointing to these lipid species as potential therapeutic targets in efforts to reduce liver fat accumulation and improve insulin sensitivity in patients with NAFLD. Advanced glycation end products, AGEs, accumulate in NAFLD due to high blood sugar levels and oxidative stress, contributing to liver inflammation and fibrosis, and emphasizing the importance of managing glycemic control and reducing dietary AGE intake as part of a comprehensive liver health strategy. Studies indicate a pivotal shift in lipid droplet biology and homeostasis within hepatocytes during NAFLD, with proteins involved in droplet formation and breakdown offering insights into novel therapeutic targets focused on normalizing lipid storage and mobilization processes within the liver. Visceral adiposity is closely linked to NAFLD, with evidence suggesting that reduction of visceral fat through targeted interventions such as aerobic and resistance exercise significantly diminishes liver fat and inflammation, reinforcing the importance of managing central obesity as a cornerstone of NAFLD prevention and treatment. Various cellular types within the liver, including hepatic stellate cells and ductular reaction cells, contribute to fibrogenesis in NAFLD through the secretion of extracellular matrix proteins, highlighting the diverse cellular contributions to liver fibrosis and the need for therapies targeting multiple cellular and molecular pathways. Plasma biomarkers like cytokeratin 18 fragments offer non-invasive means of diagnosing steatohepatitis in NAFLD patients by reflecting hepatocyte apoptosis, providing an important diagnostic alternative that may guide treatment decisions and evaluate responses without resorting to invasive liver biopsy techniques. Disruption of circadian rhythms, often due to modern lifestyle patterns like shift work and poor sleep hygiene, can exacerbate metabolic disorders such as NAFLD by altering hepatic glucose and lipid metabolism, underlining the potential benefits of chronotherapeutic approaches that align treatment and lifestyle modifications with natural circadian rhythms. Using dietary supplements like berberine, an alkaloid derived from plants, has shown promise in improving insulin sensitivity, reducing hepatic steatosis, and exerting overall beneficial metabolic effects, suggesting an additional, complementary role in managing NAFLD when combined with lifestyle interventions. Iron overload, often detected through elevated serum ferritin levels in NAFLD patients, has been associated with increased hepatic inflammation and fibrosis, advocating for the assessment of iron status in NAFLD management and considering therapeutic phlebotomy or iron chelation as potential interventions in cases of significant iron burden. The inconspicuous clinical course of NAFLD contrasts with its potential for serious complications, necessitating vigilant, regular follow-ups, including metabolic health assessments and liver function tests, to promptly identify transitions to more advanced liver disease and initiate timely interventions. Genetic studies of NAFLD have also identified contributions from variants like TM6SF2 and GCKR, further elucidating the complex heritability and genetic risk factors involved in susceptibility and progression, reinforcing the potential for future genetic screening approaches to personalize and optimize patient management. Pharmacological advances in the form of dual peroxisome proliferator activated receptor (PPAR) agonists are currently under investigation as potential NAFLD treatments due to their capacity to modulate lipid metabolism, reduce inflammation, and improve insulin sensitivity, offering a promising multifaceted approach to care. Inflammation in NAFLD is driven not just by classic cytokines like TNF-alpha but also by novel mediators like TGF-beta and IL-1-beta, highlighting the importance of targeted anti-inflammatory strategies that can halt the progressive nature of this disease and address underlying molecular inflammations. The measurement of liver stiffness via elastography provides an indirect yet valuable assessment of liver fibrosis in NAFLD patients, offering a non-invasive diagnostic tool that stratifies fibrosis risk and guides clinical decision-making in managing the disease without the need for invasive procedures. Emerging therapeutic strategies for NAFLD include targeting microRNAs, which regulate gene expression involved in lipid metabolism, fibrogenesis, and inflammation, representing a new frontier in the molecular treatment of NAFLD and offering exciting possibilities for future pharmacologic development. Hepatitis B is a viral infection caused by the hepatitis B virus that primarily affects the liver, leading to both acute and chronic disease states, with symptoms such as jaundice, fatigue, and abdominal pain often seen in acute cases, while chronic infection can progress to cirrhosis or liver cancer over several years if left untreated, highlighting the importance of early diagnosis and intervention. The hepatitis B virus is a small, enveloped DNA virus belonging to the Hepidnaviridae family, and it replicates through an RNA intermediate using reverse transcription, which is a unique feature among DNA viruses and contributes to its ability to establish a persistent infection in the host liver cells. Diagnosis of hepatitis B infection involves serological testing for surface antigens, HBsAg, surface antibodies, anti-HBs, and core antibodies, anti-HBC, which together help to determine the infection status, such as acute, chronic, or resolved infection, and vaccination response. Hepatitis B surface antigen, HBsAg, is often the first marker to appear in the blood following infection and serves as an indicator of active viral replication, while the persistence of HBsAg beyond 6 months usually indicates progression to chronic hepatitis B infection. The presence of hepatitis B antigen, HBsAg, in the blood is associated with higher levels of viral replication and infectivity, and its conversion to anti-HBe antibodies, HBe seroconversion, often signifies a reduction in viral activity and an improved prognosis in chronic hepatitis B patients. In chronic hepatitis B, liver histopathology may reveal varying degrees of inflammation, fibrosis, or cirrhosis, and liver biopsy remains a useful diagnostic tool to assess the extent of liver damage and guide therapeutic decisions, although non-invasive tests are increasingly used to evaluate liver fibrosis. 7. The primary treatment goals in managing chronic hepatitis B are to prevent disease progression such as cirrhosis or hepatocellular carcinoma, reduce viral load to undetectable levels, and enhance the patient's quality of life. These are achieved through antiviral therapy with drugs like tenofovir or entecavir. 8. Antiviral medications like tenofovir disoproxil fumarate or entecavir are recommended as first-line therapy for chronic hepatitis B due to their high barrier to developing viral resistance, potent suppression of viral replication, and satisfactory safety profile, though patient monitoring for potential renal or bone side effects is necessary. 9. Pegylated interferon alpha therapy can be an alternative treatment option for some patients with chronic hepatitis B, particularly in those with genotype A infection or younger patients, as it may lead to higher rates of HBsAg clearance, representing functional cure, though the treatment is limited by its considerable side effects. 10. The prevention of hepatitis B transmission relies heavily on vaccination, with the hepatitis B vaccine, consisting of purified HBsAg, being highly effective at inducing protective immunity and recommended for all infants at birth, healthcare workers, and other high-risk groups to curb the spread of the virus. 11. Mother-to-child transmission of hepatitis B can be significantly reduced by administering the hepatitis B vaccine and hepatitis B immune globulin, HBIG, to newborns within 12 hours of birth, especially if the mother is HBsAg positive, thereby preventing the development of chronic hepatitis B in the infant. 12. Chronic hepatitis B infection is a major global health issue, with over 296 million people estimated to be infected worldwide, leading to significant morbidity and mortality as it causes liver-related complications such as cirrhosis and hepatocellular carcinoma, highlighting the importance of public health measures for prevention and control. 13. Hepatitis B virus can be transmitted in several ways, including through unprotected sexual contact, exposure to infected blood, perinatal transmission from an infected mother to her child, and through unsafe injections or blood transfusions, necessitating comprehensive prevention strategies to reduce transmission rates. 14. The incubation period for hepatitis B ranges from 30 to 180 days, during which time the virus proliferates in liver cells, leading to symptoms of acute hepatitis as the immune system mounts a response. Symptoms include malaise, anorexia, nausea, and jaundice, which often indicate liver inflammation. 15. In early acute hepatitis B infection, liver enzymes such as alanine aminotransferase (ALT) and aspartate aminotransferase (AST) are elevated, reflecting liver cell injury. While the return of these enzymes to normal levels often indicates recovery, although chronic infection may develop in a minority of cases. 16. The interplay between the hepatitis B virus and the host immune system plays a crucial role in determining the outcome of infection. The virus employs various mechanisms to evade immune detection, and the strength of the host's immune response influences whether the infection resolves spontaneously or becomes chronic. 17. Regular monitoring of individuals with chronic hepatitis B involves periodic assessments of liver enzymes, hepatitis B viral DNA levels through PCR testing, and imaging studies to screen for liver cancer, which helps guide treatment decisions and detect complications such as cirrhosis or hepatocellular carcinoma at an early stage. 18. Hepatitis B infection management has evolved with guidelines recommending risk stratification based on factors like age, family history of liver disease or cancer, and the presence of cirrhosis, which help tailor treatment approaches to individual patients for optimizing outcomes and preventing liver complications. 19. Hepatitis B immunity can be conferred by past infection or vaccination, with the presence of anti-HBs antibodies indicating protective immunity, while individuals lacking these antibodies after successful vaccination may benefit from booster doses if they remain at high risk of exposure to the virus. Hepatitis B-related liver cancer is one of the leading causes of cancer-related deaths worldwide, and the development of hepatocellular carcinoma, HCC, is more common in patients with ongoing viral replication, co-infections with hepatitis C or D, or lifestyle factors like heavy alcohol consumption, emphasizing the need for routine HCC screening in high-risk populations. Hepatitis B DNA polymerase enzyme is a key target for antiviral drugs as it is essential for viral replication. Nucleose T-ide analogs inhibit this enzyme effectively, leading to suppression of viral replication and reduction of liver inflammation and fibrosis in treated individuals, although therapy may be lifelong in some cases. Chronic hepatitis B can progress through different phases, including immune tolerance, immune clearance, inactive carrier state, and reactivation, with each phase characterized by distinct viral replication levels and liver inflammation profiles, which inform monitoring and treatment strategies for managing the infection. Co-infection with hepatitis D virus, HDV, can occur in patients with hepatitis B, leading to more severe liver disease, as HDV requires hepatitis B surface antigen for replication. This combination requires specialized management as it poses a higher risk for rapid progression to cirrhosis and liver cancer. Pregnancy in women with chronic hepatitis B requires careful management, with antiviral therapy recommended in the third trimester for mothers with high viral loads to decrease the risk of mother-to-child transmission, alongside routine neonatal vaccination and administration of HBIG to at-risk newborns. Many individuals with occult hepatitis B infection have undetectable HB-Zag despite being carriers of the virus, posing a diagnostic challenge. These individuals often demonstrate the presence of HBV DNA in liver or serum samples and are at increased risk for the development of liver disease, particularly if co-infected with HCV or HIV. Hepatitis B can cause a wide range of extrahepatic manifestations such as polyarthritis nodosa, glomerulonephritis, and vasculitis, which result from immune complex deposition and hypersensitivity reactions, necessitating vigilant identification and multisystem management in affected individuals. The hepatitis B vaccine is an inactivated vaccine composed of non-infectious HB-Zag particles produced through recombinant DNA technology, and its administration induces an immune response that protects over 95% of vaccinated individuals for at least 20 years, although routine booster doses are not generally recommended for immunocompetent persons. Vaccination against hepatitis B has resulted in a dramatic decrease in the incidence of new infections, particularly among children and young adults due to robust immunization programs initiated globally, which has contributed significantly to the decrease in hepatitis B-related morbidity and mortality over the past few decades. Liver function tests, LFTs, are crucial in the assessment of hepatitis B infection, as they provide information on the extent of liver damage, with elevated levels of ALT and AST indicating hepatocellular injury, while monitoring changes in these enzymes is critical in evaluating treatment efficacy and liver disease progression. Antiviral therapy for hepatitis B has evolved significantly, with the introduction of potent nucleose T-ide analogs that offer patients prolonged viral suppression, thereby reducing the risk of liver disease progression and complications. And while viral eradication remains challenging, functional cure defined by the loss of HB-Zag is an achievable treatment endpoint for some patients. 31. In individuals with resolved hepatitis B infection, characterized by the presence of anti-HBC and anti-HBs antibodies without detectable HBs AG, reactivation of hepatitis B can occur under certain circumstances, such as immunosuppressive therapy, necessitating prophylactic antiviral treatment to prevent flare-ups of hepatitis. 32. The innate immune response plays a critical role in the initial defense against hepatitis B infection by recognizing viral components through pattern recognition receptors, including toll-like receptors, leading to the activation of interferon-stimulated genes which modulate the replication of the virus. 33. Lamivudine was one of the first antiviral drugs approved for hepatitis B, and although it was effective in reducing viral load and improving liver function initially, its long-term use is limited by the rapid emergence of drug-resistant HBV strains, emphasizing the need for newer agents with a higher genetic barrier to resistance. 34. Sequencing of the hepatitis B virus genome has led to the identification of several genotypes, labeled A to J, which have variable geographical distribution and slightly differing replication efficiency, clinical outcomes, and response to therapy, thereby influencing regional treatment guidelines and vaccination programs. 35. In cases of acute hepatitis B, the virus is often cleared spontaneously in immunocompetent adults, with less than 5% of these cases progressing to chronic infection, in contrast to neonates and young children who have a higher risk of developing chronic hepatitis B due to their immature immune system. 36. Hepatitis B is considered an occupational hazard for healthcare workers due to potential exposure to infectious blood and body fluids, and strict adherence to standard precautions, along with vaccination, is essential in preventing transmission among healthcare professionals. 37. The detection of hepatitis B DNA levels through quantitative PCR testing is a key component in monitoring chronic hepatitis B management as it provides information on viral replication activity, helps assess treatment response, and guides adjustments in therapeutic strategies to achieve optimal virologic suppression. 38. In patients with compensated cirrhosis secondary to hepatitis B, antiviral therapy can improve liver function and reduce the risk of decompensation, although close monitoring is necessary given the potential for serious complications, including hepatic decompensation and liver cancer, even during successful treatment. 39. The hepatitis B precore and basal core promoter mutations affect viral replication and expression of the hepatitis B e antigen, commonly seen in patients with HBsAg-negative chronic hepatitis B. These mutations often result in more severe liver disease and require vigilant management to prevent adverse outcomes. 40. The introduction of direct-acting antivirals for hepatitis C treatment has led to many coinfected with hepatitis B experiencing viral reactivation upon HCV clearance, necessitating careful monitoring and consideration of prophylactic antiviral therapy against hepatitis B in these patients. 41. Hepatitis B can have profound psychosocial effects on affected individuals, as the stigma associated with chronic infection and potential transmission to others can lead to anxiety, depression, and social isolation, warranting comprehensive support and counseling to address these challenges alongside medical treatment. 42. Chronic hepatitis B infection can significantly impact pregnancy outcomes, including increased risks of gestational diabetes, preterm birth, and low birth weight, and therefore requires collaboration between hepatologists and obstetricians to optimize maternal and neonatal health through careful monitoring and interventions. 43. Hepatitis B-related acute liver failure, though rare, is a life-threatening condition that requires immediate medical attention and potentially liver transplantation, with rapid deterioration seen in patients who develop severe coagulopathy, encephalopathy, and multi-organ failure. 44. Monitoring hepatitis B surface antigen quantification can provide prognostic information in chronic hepatitis B management, as a decline in HBs Ag levels is often associated with favorable clinical outcomes, including spontaneous disease resolution or successful response to antiviral therapy. 45. Adolescents and adults with hepatitis B often require vaccinations against hepatitis A if they are not already immune, as co-infection with both viruses can lead to more severe liver disease. Thus, hepatitis A vaccination is routinely recommended to reduce the risk of concomitant liver insults. 46. Patients with chronic kidney disease often have a higher prevalence of hepatitis B infection due to increased exposure from dialysis procedures, necessitating routine screening, vaccination of susceptible individuals, and careful evaluation of antiviral treatment regimens to minimize nephrotoxicity. 47. The adoption of universal blood screening for hepatitis B in blood donation centers has greatly reduced the risk of transfusion-related transmission, as blood donors are routinely tested for HBs Ag, ensuring that blood supplies are safer and protecting recipients from acquiring the virus through transfusions. 48. Chronic hepatitis B infection potentially elevates the risk of metabolic syndrome and cardiovascular disease secondary to chronic inflammation and liver disease, requiring integrated management strategies that address metabolic risk factors alongside liver-specific treatments. 49. Individuals co-infected with hepatitis B virus and HIV may require specialized antiretroviral therapy regimens that effectively target both viruses, as some medications used in HIV management, such as tenofovir, are also active against HBV, necessitating coordination between hepatologists and infectious disease specialists. 50. Understanding the transmission dynamics of hepatitis B in communities with a high prevalence of infection is critical for effective public health strategies, as tailoring prevention efforts, such as vaccination campaigns and education on safe practices, can substantially impact the overall burden of disease. One. Breast cancer is not a singular disease but rather a heterogeneous group with various subtypes such as luminal A, luminal B, HER2 positive, and triple negative, each exhibiting distinct molecular profiles and clinical behaviors, which necessitate personalized treatment strategies including targeted therapy, chemotherapy, radiation, or hormone therapy, thereby highlighting the importance of precision medicine in improving patient outcomes. 2. While most breast cancers originate in the lobules, starting as ductal carcinoma in situ, DCIS, the cancer can also arise from the connective tissue, leading to rarer forms like phyllodes tumors, which require a surgical approach due to their tendency to recur locally despite being typically benign or borderline. 3. The triple-negative breast cancer subtype, characterized by the absence of estrogen receptor, progesterone receptor, PR, and HER2 amplification, remains one of the most aggressive forms, with limited targeted therapies, making ongoing research into immune checkpoint inhibitors and PARP inhibitors crucial to expanding therapeutic options for improving survival rates in affected women. 4. Novel imaging techniques such as contrast-enhanced mammography and automated breast ultrasound systems are increasingly used to improve sensitivity and specificity in detecting breast cancer, especially in women with dense breast tissue, potentially catching malignancies that could be missed using traditional mammography alone. 5. Dr. William Stewart Halsted pioneered the radical mastectomy in the late 19th century as a definitive treatment for breast cancer. However, advances in surgical techniques and a better understanding of tumor biology have shifted preference towards breast-conserving surgery and sentinel lymph node biopsy, significantly reducing surgical morbidity while maintaining oncologic efficacy. 6. The process of epithelial mesenchymal transition, EMT, plays a crucial role in the metastatic spread of breast cancer, as tumor cells lose their epithelial characteristics and gain mesenchymal traits, enhancing their mobility and invasiveness, which can lead to metastatic lesions in distant organs such as the bone, liver, lungs, and brain. 7. Oncotype DX and MammaPrint are two genomic assays that analyze the expression of multiple cancer-related genes in early-stage breast cancer, providing critical insights into recurrence risk and helping guide treatment decisions regarding the necessity of adjuvant chemotherapy, thus contributing to more personalized approaches for patient management. 8. Breast conservation therapy, BCT, which combines lumpectomy with radiation therapy, is as effective as mastectomy in early-stage breast cancer for survival outcomes and is associated with better cosmetic results in quality of life for many women, making it a preferred choice for eligible patients. 9. The risk of breast cancer increases with age, and around 80% of breast cancers occur in women over the age of 50, underscoring the importance of regular screening through mammography for early detection, as early-stage cancers are more amenable to treatment and have a higher likelihood of cure. 10. Inflammatory breast cancer is a rare but highly aggressive form of breast cancer characterized by skin changes resembling an infection, such as redness and warmth, and often presents without a distinct lump, requiring immediate treatment with chemotherapy followed by surgery and radiation to improve the historically poor prognosis associated with its rapid progression. 11. Breast cancer survivors face the long-term health challenges of treatment-induced side effects, including cardiotoxicity from anthracyclines and trastuzumab, lymphedema post-axillary surgery, and osteoporosis from aromatase inhibitors, necessitating a multidisciplinary follow-up to monitor and manage these chronic conditions to enhance survivors' quality of life. 12. Prophylactic mastectomy, the surgical removal of one or both breasts to reduce cancer risk, is considered in women with a high genetic predisposition to breast cancer, particularly those carrying BRCA1 or BRCA2 mutations, reducing the risk of developing breast cancer by about 90%, although the decision remains deeply personal and complex. 13. Neoadjuvant chemotherapy, administered before surgical intervention, is increasingly utilized in locally advanced breast cancer to shrink tumors, potentially allowing for less extensive surgery and providing early indication of how responsive the cancer is to the treatment regimen, which can inform further therapeutic strategy. 14. The role of the tumor microenvironment in breast cancer progression and treatment resistance is gaining attention, with the surrounding stromal cells, immune cells, and extracellular matrix components interacting dynamically with cancer cells, suggesting potential therapeutic targets that could prevent or alter metastatic spread. 15. Recent advances in biomarker discovery, such as the identification of circulating tumor cells, CTCs, and cell-free DNA, cfDNA, in the bloodstream, hold promise for creating less invasive diagnostic and prognostic tools for monitoring breast cancer progression and treatment response, providing real-time insights into disease dynamics. 16. Some breast cancer treatments target the angiogenesis process, crucial for tumor blood supply, with drugs like bevacizumab inhibiting the vascular endothelial growth factor, VEGF, though its use remains controversial due to varying responses and concerns about side effects outweighing survival benefits, prompting ongoing evaluations of optimal clinical settings for its application. 17. Male breast cancer, comprising about 1% of all breast cancer cases, often presents at a more advanced stage partly due to limited awareness and lack of routine screening, highlighting the need for increased recognition and tailored screening strategies that address the distinct risk factors and genetic predispositions unique to men. 18. Breast cancer incidence shows significant geographical variability worldwide, influenced by factors such as lifestyle, diet, reproductive history, and access to screening, enabling epidemiologists to construct risk prediction models that contribute to targeted prevention strategies within diverse populations. Emerging breast cancer vaccine research aims to harness the immune system to recognize and target tumor-specific antigens, with experimental vaccines showing promise in eliciting immune responses in preclinical trials, potentially offering adjuvant tools for preventing recurrence in high-risk individuals and improving long-term survival. Bisphosphonates and denosumab are agents used in breast cancer with bone metastasis to reduce skeletal-related events, such as pathologic fractures and spinal cord compression, by inhibiting cancer-induced bone resorption, thereby improving quality of life for patients with advanced stage disease. Breast density, categorized through mammographic assessment, is a strong independent risk factor for breast cancer, with women having dense breast tissue at a higher risk due to the difficulty in detecting tumors and the increased probability of harboring aggressive features, sparking conversations on supplemental screening modalities like MRI and ultrasound. Breast cancer metastasis to the brain occurs in approximately 10 to 15% of metastatic cases and is more common in patients with HER2-positive or triple-negative subtypes, necessitating systemic treatment with HER2-targeted therapies and the consideration of stereotactic radiosurgery or whole-brain radiotherapy to manage neurological symptoms and maintain life quality. Breast cancer prognosis is evaluated using the TNM staging system, which considers the size and extent of the primary tumor, T, lymph node involvement, N, and metastatic spread, M, providing valuable information on the severity of the disease and guiding treatment decisions, with higher stages typically indicating more aggressive therapy is needed. Hormone receptor-positive breast cancers, characterized by the expression of estrogen and/or progesterone receptors, often respond well to hormonal therapies such as tamoxifen or anastrozole, which block the oncogenic signaling pathways activated by these hormones, and are key components in both adjuvant and metastatic treatment settings. The concept of oncogene addiction in breast cancer highlights how tumors may become reliant on particular genetic drivers, like the amplification of HER2, making targeted therapies addressing these vulnerabilities an effective strategy, as evidenced by the success of HER2 inhibitors like trastuzumab and pertuzumab in transforming the treatment landscape for these cancers. The Gale model is a widely used tool for assessing breast cancer risk, employing a combination of factors such as age, family history, hormonal factors, and reproductive history to calculate an individual's risk of developing breast cancer, aiding in decision-making regarding preventive interventions like increased surveillance or chemoprevention. The presence of tumor-infiltrating lymphocytes, TILs, in breast cancer, particularly in triple-negative and HER2-positive subtypes, is associated with better prognosis and response to chemotherapy, indicating that the host immune response plays a crucial role in modulating cancer progression and therapeutic outcomes. The introduction of digital mammography has revolutionized breast cancer screening by offering superior image quality, better detection rates, and lower radiation doses compared to traditional film mammography, making it a cornerstone in the early detection of malignancies and contributing significantly to decreased mortality rates through early intervention. Microenvironmental hypoxia, often present in rapidly growing breast tumors, is a critical factor that drives cancer cell adaptation and therapy resistance by activating hypoxia-inducible factors, HIFs, which promotes angiogenesis, metabolic reprogramming, and an aggressive phenotype, presenting opportunities for therapeutic intervention with HIF inhibitors. 30. The American Joint Committee on Cancer, AJCC, introduced the 8th edition breast cancer staging system incorporating genomic panels and biomarkers like the 21 gene recurrence score, emphasizing the adoption of molecular data in refining prognostication and guiding the use of adjuvant systemic therapies more precisely. The risk of developing breast cancer is influenced by lifestyle factors, with increased alcohol consumption, obesity, and sedentary behaviors contributing to higher risks, encouraging interventions focused on lifestyle modifications, such as diet, exercise, and reducing alcohol intake, to potentially lower the incidence of breast cancer in the general population. 32. Sentinel lymph node biopsy has become the standard practice for axillary staging in early breast cancer, significantly reducing the morbidity of axillary lymph node dissection by targeting the first draining nodes, allowing you to determine if cancer cells have spread without the need for extensive node removal in the absence of metastatic disease. 3. Breast cancer during pregnancy presents unique challenges, as diagnostic and treatment options must be carefully balanced to protect fetal health while ensuring effective cancer management, with strategies often involving modified chemotherapy regimens compatible with pregnancy and coordinated multidisciplinary care to guide optimal outcomes. 34. The role of the BRCA1 and BRCA2 genes in breast cancer risk extends beyond simple genetic predisposition. These genes are crucial components of the homologous recombination DNA repair pathway, and their mutation results in genomic instability, making cells more susceptible to malignant transformation but also creating opportunities for treatment with PARP inhibitors. 35. Triple-negative breast cancer, TNBC, is being explored for novel therapeutic targets like the androgen receptor, AR, and other non-estrogen receptor pathways, as some TNBCs may express AR, offering potential for anti-androgen therapies to complement existing treatment paradigms and enhance outcomes in this challenging breast cancer subtype. 36. Breast cancer patients may exhibit cancer-related cognitive impairment, often referred to as chemobrain, which includes symptoms such as memory lapses, difficulty concentrating, and mental fog, likely resulting from chemotherapy agents, stress, and inflammatory cytokines, warranting support strategies and cognitive rehabilitation to improve daily functioning. 37. HER2 amplification in breast cancer, traditionally considered as an adverse prognostic indicator, has evolved as a therapeutic target with the development of monoclonal antibodies like trastuzumab, which specifically targets the HER2 receptor, demonstrating improved survival rates and being paramount in the management of HER2-positive breast cancer. 38. Recent studies suggest a possible link between night shift work and elevated breast cancer risk, potentially due to altered levels of melatonin, which is hypothesized to have cancer protective properties, emphasizing the need for additional research and interventions that could mitigate occupational risk factors in shift workers. 39. The integration of artificial intelligence, AI, in breast cancer diagnostics is advancing, with AI algorithms being developed to enhance mammogram interpretations, identify patterns indicative of malignancies with high accuracy, and assist radiologists in reducing false positives and unnecessary biopsies, further streamlining the diagnostic process. 40. Breast cancer recurrence can occur years after initial treatment completion, often influenced by factors such as tumor biology, treatment adherence, and lifestyle, reinforcing the necessity for long-term follow-up and vigilance in survivorship care to detect and manage recurrences early, ensuring timely intervention and improved survival chances. 41. The phenomenon of liquid biopsy is emerging as a game-changer in breast cancer management. It entails the non-invasive collection of blood samples to detect circulating tumor cells or tumor-derived fragments, enabling real-time monitoring of tumor burden, treatment efficacy, and the detection of minimal residual disease, potentially guiding timely therapeutic adjustments. 42. Breast cancer care disparities exist across socioeconomic and racial lines, with access to screening programs, treatment availability, and quality of care often affecting outcomes, calling for public health initiatives to bridge these gaps, ensuring equitable access to preventive measures and treatments for all demographics. 43. While traditionally limited to invasive approaches, focal therapy for breast cancer, including techniques like cryoablation and high-intensity focused ultrasound, offers minimally invasive alternatives to surgical excision, potentially allowing for effective tumor control while preserving breast tissue integrity and patient quality of life. 44. Axillary locoregional recurrence is a concern after initial breast cancer surgery, with the risk factors including incomplete resection and aggressive histology, highlighting the need for careful surgical planning and the potential benefit of adjuvant radiation in cases with unfavorable pathological features to reduce recurrence likelihood. 45. Breast cancer molecular subtyping has transformed therapeutic approaches, as differences in genetic expression profiles guide treatment selection between hormone therapy, HER2-targeted agents, and chemotherapy, tailoring regimens to the unique biology of each case and maximizing treatment efficacy. 46. Phyllodes tumors, a rare form of breast tumors, exhibit a spectrum of behavior from benign to malignant, distinguished by the stromal overgrowth component, and are predominantly treated with wide local excision to ensure clear margins, as the risk of local recurrence is significant, often mandating vigilant follow-up. 47. Radiation therapy advancements, such as intensity-modulated radiation therapy, IMRT, allow for better targeting of breast tumors while sparing healthy tissue, reducing side effects, and improving cosmetic outcomes, representing a substantial progression in adjuvant breast cancer therapy for individuals undergoing conservative surgery. 48. Breast cancer prevention strategies go beyond lifestyle modifications and familial risk assessments. They also include chemoprevention with agents like tamoxifen and raloxifene in high-risk women, which have shown efficacy in reducing breast cancer incidence by modulating estrogen receptor pathways and acting as selective estrogen receptor modulators. 49. Breast cancer metastasis remains a major therapeutic challenge, as disseminated disease becomes less curable and focuses on prolonging survival and maintaining quality of life, highlighting the importance of understanding the molecular mechanisms driving metastasis and exploring targeted therapies to prevent or retard the spread of tumors. 50. The role of autophagy in breast cancer is a double-edged sword, where it can be both tumor suppressive by removing damaged organelles and protein aggregates, and tumor promotive by providing nutrients through cellular recycling during metabolic stress, making it a complex target for therapeutic manipulation in enhancing treatment outcomes. 1. Breast cancer is not a singular disease but rather a heterogeneous group with various subtypes such as luminal A, luminal B, HER2 positive, and triple negative, each exhibiting distinct molecular profiles and clinical behaviors, which necessitate personalized treatment strategies including targeted therapy, chemotherapy, radiation, or hormone therapy, thereby highlighting the importance of precision medicine in improving patient outcomes. 2. While most breast cancers originate in the lobules, starting as ductal carcinoma in situ, DCIS, the cancer can also arise from the connective tissue, leading to rarer forms like phyllodes tumors, which require a surgical approach due to their tendency to recur locally despite being typically benign or borderline. 3. The triple-negative breast cancer subtype, characterized by the absence of estrogen receptor, progesterone receptor, PR, and HER2 amplification, remains one of the most aggressive forms, with limited targeted therapies, making ongoing research into immune checkpoint inhibitors and PARP inhibitors crucial to expanding therapeutic options for improving survival rates in affected women. 4. Novel imaging techniques such as contrast-enhanced mammography and automated breast ultrasound systems are increasingly used to improve sensitivity and specificity in detecting breast cancer, especially in women with dense breast tissue, potentially catching malignancies that could be missed using traditional mammography alone. 5. Dr. William Stewart Halsted pioneered the radical mastectomy in the late 19th century as a definitive treatment for breast cancer. However, advances in surgical techniques and a better understanding of tumor biology have shifted preference towards breast-conserving surgery and sentinel lymph node biopsy, significantly reducing surgical morbidity while maintaining oncologic efficacy. 6. The process of epithelial mesenchymal transition, EMT, plays a crucial role in the metastatic spread of breast cancer, as tumor cells lose their epithelial characteristics and gain mesenchymal traits, enhancing their mobility and invasiveness, which can lead to metastatic lesions in distant organs such as the bone, liver, lungs, and brain. 7. Oncotype DX and MammaPrint are two genomic assays that analyze the expression of multiple cancer-related genes in early-stage breast cancer, providing critical insights into recurrence risk and helping guide treatment decisions regarding the necessity of adjuvant chemotherapy, thus contributing to more personalized approaches for patient management. 8. Breast conservation therapy, BCT, which combines lumpectomy with radiation therapy, is as effective as mastectomy in early-stage breast cancer for survival outcomes and is associated with better cosmetic results and quality of life for many women, making it a preferred choice for eligible patients. 9. The risk of breast cancer increases with age, and around 80% of breast cancers occur in women over the age of 50, underscoring the importance of regular screening through mammography for early detection, as early-stage cancers are more amenable to treatment and have a higher likelihood of cure. 10. Inflammatory breast cancer is a rare but highly aggressive form of breast cancer characterized by skin changes resembling an infection, such as redness and warmth, and often presents without a distinct lump, requiring immediate treatment with chemotherapy followed by surgery and radiation to improve the historically poor prognosis associated with its rapid progression. 11. Breast cancer survivors face the long-term health challenges of treatment-induced side effects, including cardiotoxicity from anthracyclines and trastuzumab, lymphedema post-axillary surgery, and osteoporosis from aromatase inhibitors, necessitating a multidisciplinary follow-up to monitor and manage these chronic conditions to enhance survivors' quality of life. 12. Prophylactic mastectomy, the surgical removal of one or both breasts to reduce cancer risk, is considered in women with a high genetic predisposition to breast cancer, particularly those carrying BRCA1 or BRCA2 mutations, reducing the risk of developing breast cancer by about 90%, although the decision remains deeply personal and complex. 13. Neoadjuvant chemotherapy, administered before surgical intervention, is increasingly utilized in locally advanced breast cancer to shrink tumors, potentially allowing for less extensive surgery and providing early indication of how responsive the cancer is to the treatment regimen, which can inform further therapeutic strategy. 14. The role of the tumor microenvironment in breast cancer progression and treatment resistance is gaining attention, with the surrounding stromal cells, immune cells, and extracellular matrix components interacting dynamically with cancer cells, suggesting potential therapeutic targets that could prevent or alter metastatic spread. 15. 15. Recent advances in biomarker discovery, such as the identification of circulating tumor cells, CTCs, and cell-free DNA, cfDNA, in the bloodstream, hold promise for creating less invasive diagnostic and prognostic tools for monitoring breast cancer progression and treatment response, providing real-time insights into disease dynamics. Some breast cancer treatments target the angiogenesis process, crucial for tumor blood supply, with drugs like bevacizumab inhibiting the vascular endothelial growth factor, VEGF, though its use remains controversial due to varying responses and concerns about side effects outweighing survival benefits, prompting ongoing evaluations of optimal clinical settings for its application. 17. Male breast cancer, comprising about 1% of all breast cancer cases, often presents at a more advanced stage partly due to limited awareness and lack of routine screening, highlighting the need for increased recognition and tailored screening strategies that address the distinct risk factors and genetic predispositions unique to men. 18. Breast cancer incidence shows significant geographical variability worldwide, influenced by factors such as lifestyle, diet, reproductive history, and access to screening, enabling epidemiologists to construct risk prediction models that contribute to targeted prevention strategies within diverse populations. 19. Emerging breast cancer vaccine research aims to harness the immune system to recognize and target tumor-specific antigens, with experimental vaccines showing promise in eliciting immune responses in preclinical trials, potentially offering adjuvant tools for preventing recurrence in high-risk individuals and improving long-term survival. 20. Bisphosphonates and denosumab are agents used in breast cancer with bone metastasis to reduce skeletal-related events, such as pathologic fractures and spinal cord compression, by inhibiting cancer-induced bone resorption, thereby improving quality of life for patients with advanced stage disease. 21. Breast density, categorized through mammographic assessment, is a strong independent risk factor for breast cancer, with women having dense breast tissue at a higher risk due to the difficulty in detecting tumors and the increased probability of harboring aggressive features, sparking conversations on supplemental screening modalities like MRI and ultrasound. 22. Breast cancer metastasis to the brain occurs in approximately 10 to 15% of metastatic cases and is more common in patients with HER2-positive or triple-negative subtypes, necessitating systemic treatment with HER2-targeted therapies and the consideration of stereotactic radiosurgery or whole-brain radiotherapy to manage neurological symptoms and maintain life quality. 23. Breast cancer prognosis is evaluated using the TNM staging system, which considers the size and extent of the primary tumor, T, lymph node involvement, N, and metastatic spread, M, providing valuable information on the severity of the disease and guiding treatment decisions, with higher stages typically indicating more aggressive therapy is needed. 24. Hormone receptor-positive breast cancers, characterized by the expression of estrogen and/or progesterone receptors, often respond well to hormonal therapies such as tamoxifen or anastrozole, which block the oncogenic signaling pathways activated by these hormones, and are key components in both adjuvant and metastatic treatment settings. 25. The concept of oncogene addiction in breast cancer highlights how tumors may become reliant on particular genetic drivers, like the amplification of HER2, making targeted therapies addressing these vulnerabilities an effective strategy, as evidenced by the success of HER2 inhibitors like trastuzumab and pertuzumab in transforming the treatment landscape for these cancers. 26. The Gale model is a widely used tool for assessing breast cancer risk, employing a combination of factors such as age, family history, hormonal factors, and reproductive history to calculate an individual's risk of developing breast cancer, aiding in decision-making regarding preventive interventions like increased surveillance or chemoprevention. 27. The presence of tumor-infiltrating lymphocytes, TILs, in breast cancer, particularly in triple-negative and HER2-positive subtypes, is associated with better prognosis and response to chemotherapy, indicating that the host immune response plays a crucial role in modulating cancer progression and therapeutic outcomes. 28. The introduction of digital mammography has revolutionized breast cancer screening by offering superior image quality, better detection rates, and lower radiation doses compared to traditional film mammography, making it a cornerstone in the early detection of malignancies and contributing significantly to decreased mortality rates through early intervention. 29. Microenvironmental hypoxia, often present in rapidly growing breast tumors, is a critical factor that drives cancer cell adaptation and therapy resistance by activating hypoxia-inducible factors, HIFs, which promotes angiogenesis, metabolic reprogramming, and an aggressive phenotype, presenting opportunities for therapeutic intervention with HIF inhibitors. 30. The American Joint Committee on Cancer, AJCC, introduced the 8th edition breast cancer staging system incorporating genomic panels and biomarkers like the 21 gene recurrence score, emphasizing the adoption of molecular data in refining prognostication and guiding the use of adjuvant systemic therapies more precisely. 31. The risk of developing breast cancer is influenced by lifestyle factors, with increased alcohol consumption, obesity, and sedentary behaviors contributing to higher risks, encouraging interventions focused on lifestyle modifications, such as diet, exercise, and reducing alcohol intake, to potentially lower the incidence of breast cancer in the general population. 32. Sentinel lymph node biopsy has become the standard practice for axillary staging in early breast cancer, significantly reducing the morbidity of axillary lymph node dissection by targeting the first draining nodes, allowing you to determine if cancer cells have spread without the need for extensive node removal in the absence of metastatic disease. 3. Breast cancer during pregnancy presents unique challenges, as diagnostic and treatment options must be carefully balanced to protect fetal health while ensuring effective cancer management, with strategies often involving modified chemotherapy regimens compatible with pregnancy and coordinated multidisciplinary care to guide optimal outcomes. 34. The role of the BRCA1 and BRCA2 genes in breast cancer risk extends beyond simple genetic predisposition. These genes are crucial components of the homologous recombination DNA repair pathway, and their mutation results in genomic instability, making cells more susceptible to malignant transformation but also creating opportunities for treatment with PARP inhibitors. 35. Triple-negative breast cancer, TNBC, is being explored for novel therapeutic targets like the androgen receptor, AR, and other non-estrogen receptor pathways, as some TNBCs may express AR, offering potential for anti-androgen therapies to complement existing treatment paradigms and enhance outcomes in this challenging breast cancer subtype. 36. Breast cancer patients may exhibit cancer-related cognitive impairment, often referred to as chemo brain, which includes symptoms such as memory lapses, difficulty concentrating, and mental fog, likely resulting from chemotherapy agents, stress, and inflammatory cytokines, warranting support strategies and cognitive rehabilitation to improve daily functioning. 37. HER2 amplification in breast cancer, traditionally considered as an adverse prognostic indicator, has evolved as a therapeutic target with the development of monoclonal antibodies like trastuzumab, which specifically targets the HER2 receptor, demonstrating improved survival rates and being paramount in the management of HER2-positive breast cancer. 38. Recent studies suggest a possible link between night shift work and elevated breast cancer risk, potentially due to altered levels of melatonin, which is hypothesized to have cancer protective properties, emphasizing the need for additional research and interventions that could mitigate occupational risk factors in shift workers. 39. The integration of artificial intelligence, AI, in breast cancer diagnostics is advancing, with AI algorithms being developed to enhance mammogram interpretations, identify patterns indicative of malignancies with high accuracy, and assist radiologists in reducing false positives and unnecessary biopsies, further streamlining the diagnostic process. 40. Breast cancer recurrence can occur years after initial treatment completion, often influenced by factors such as tumor biology, treatment adherence, and lifestyle, reinforcing the necessity for long-term follow-up and vigilance in survivorship care to detect and manage recurrences early, ensuring timely intervention and improved survival chances. 41. The phenomenon of liquid biopsy is emerging as a game-changer in breast cancer management. It entails the non-invasive collection of blood samples to detect circulating tumor cells or tumor-derived fragments, enabling real-time monitoring of tumor burden, treatment efficacy, and the detection of minimal residual disease, potentially guiding timely therapeutic adjustments. 42. Breast cancer care disparities exist across socioeconomic and racial lines, with access to screening programs, treatment availability, and quality of care often affecting outcomes, calling for public health initiatives to bridge these gaps, ensuring equitable access to preventive measures and treatments for all demographics. 43. While traditionally limited to invasive approaches, focal therapy for breast cancer, including techniques like cryoablation and high-intensity focused ultrasound, offers minimally invasive alternatives to surgical excision, potentially allowing for effective tumor control while preserving breast tissue integrity and patient quality of life. 44. Axillary locoregional recurrence is a concern after initial breast cancer surgery, with the risk factors including incomplete resection and aggressive histology, highlighting the need for careful surgical planning and the potential benefit of adjuvant radiation in cases with unfavorable pathological features to reduce recurrence likelihood. 45. Breast cancer molecular subtyping has transformed therapeutic approaches, as differences in genetic expression profiles guide treatment selection between hormone therapy, HER2 targeted agents, and chemotherapy, tailoring regimens to the unique biology of each case and maximizing treatment efficacy. 46. Phyllodes tumors, a rare form of breast tumors, exhibit a spectrum of behavior from benign to malignant, distinguished by the stromal overgrowth component, and are predominantly treated with wide local excision to ensure clear margins, as the risk of local recurrence is significant, often mandating vigilant follow-up. 47. Radiation therapy advancements, such as intensity-modulated radiation therapy, IMRT, allow for better targeting of breast tumors while sparing healthy tissue, reducing side effects, and improving cosmetic outcomes, representing a substantial progression in adjuvant breast cancer therapy for individuals undergoing conservative surgery. 48. Breast cancer prevention strategies go beyond lifestyle modifications and familial risk assessments. They also include chemoprevention with agents like tamoxifen and raloxifene in high-risk women, which have shown efficacy in reducing breast cancer incidence by modulating estrogen receptor pathways and acting as selective estrogen receptor modulators. 49. Breast cancer metastasis remains a major therapeutic challenge, as disseminated disease becomes less curable and focuses on prolonging survival and maintaining quality of life, highlighting the importance of understanding the molecular mechanisms driving metastasis and exploring targeted therapies to prevent or retard the spread of tumors. 50. The role of autophagy in breast cancer is a double-edged sword, where it can be both tumor suppressive by removing damaged organelles and protein aggregates, and tumor promotive by providing nutrients through cellular recycling during metabolic stress, making it a complex target for therapeutic manipulation and enhancing treatment outcomes. 1. Esophageal cancer primarily arises from the squamous cells lining the esophagus or from glandular cells in Barrett's esophagus, with adenocarcinoma more prevalent in Western countries, resulting from a chronic cycle of gastroesophageal reflux disease inducing metaplastic changes. 2. Diagnosing esophageal cancer often involves endoscopic ultrasonography combined with biopsy, aiming to accurately determine the tumor's depth and the involvement of surrounding lymph nodes, critical for effective staging and treatment planning. 3. The correlation between tobacco use and esophageal squamous cell carcinoma has been strongly established, with carcinogens within tobacco triggering genetic mutations that disrupt normal cellular machinery, promoting malignant transformation and proliferation. 4. Treatment modalities for esophageal cancer include neoadjuvant chemoradiotherapy, which seeks to downsize tumors before surgical resection, improving resection success rates and potentially enhancing overall survival. 5. Advances in molecular biology have illuminated the role of receptor tyrosine kinases such as HER2 in esophageal adenocarcinoma, paving the way for targeted therapies aimed at these aberrant signaling pathways to curb cancer progression. 6. Esophageal cancer symptoms often present late in the disease course, with progressive dysphagia being the most prominent sign, initially for solids and then liquids, as the esophageal lumen narrows due to tumor growth. 7. The prognosis for esophageal cancer remains grave, with a 5-year survival rate generally under 20%, heavily influenced by early-stage detection and the availability of comprehensive multimodal treatment strategies. 8. A significant advancement in the prevention of esophageal adenocarcinoma is the successful management of Barrett's esophagus with proton pump inhibitors or endoscopic ablative therapies, reducing dysplasia progression to invasive carcinoma. 9. Histopathological examination of resected esophageal cancer tissue often reveals key characteristics such as poorly differentiated cells in squamous cell carcinoma or glandular formation in adenocarcinoma that assist in confirming the cancer subtype. 10. Radiation therapy in esophageal cancer can be delivered via external beam methods or brachytherapy, targeting cancer cells while sparing the surrounding healthy tissue, thus managing symptoms such as pain and dysphagia effectively. 11. In the burgeoning field of immunotherapy for esophageal cancer, the use of checkpoint inhibitors targeting PD-1 and PD-L1 pathways has shown promise, leading to immune system engagement against tumor cells and eliciting durable responses. 12. Intriguingly, preventive measures against esophageal adenocarcinoma include rigorous lifestyle modification, like adopting a Mediterranean diet rich in fruits, vegetables, and omega-3 fatty acids, which may yield a protective anti-inflammatory benefit. 13. The phenomenon of field cancerization, where the entire esophageal mucosa exhibits precancerous changes, underscores the need for regular surveillance endoscopies in high-risk populations to catch potential malignancies at an actionable stage. 14. Endoscopic therapies, such as mucosal resection or submucosal dissection, have revolutionized the management of superficial esophageal cancer, offering a less invasive approach with lower complication rates compared to traditional esophagectomy. 15. Genomic studies have identified recurring mutations and amplifications in genes like TP53 and cyclin D1 in esophageal cancer, driving oncogenic pathways and presenting novel targets for future therapeutic interventions. 16. While squamous cell carcinoma of the esophagus has long been linked with nitrosamine-rich diets, ongoing epidemiological studies suggest that reducing such dietary components could contribute to a lower incidence of this cancer subtype. 17. For patients unable to tolerate surgery, definitive chemoradiotherapy remains a mainstay treatment for esophageal cancer, providing a non-operative cure potential while addressing both the local and systemic nature of the disease. 18. The role of minimally invasive esophagectomy in treating esophageal cancer is being increasingly recognized, offering comparable long-term outcomes to open procedures, with the potential for reduced post-operative morbidity and quicker recovery. 19. Emerging liquid biopsy techniques, such as the detection of circulating tumor DNA, hold promise for the non-invasive monitoring of esophageal cancer progression in response to treatment, allowing for more personalized therapy adjustments. 20. An exploration of microRNA profiles in esophageal cancer has revealed their significant involvement in tumorigenesis and metastasis, suggesting that these small non-coding RNAs could serve as biomarkers for earlier detection and novel therapeutic targets. 21. Despite chemotherapy being a cornerstone in treating locally advanced and metastatic esophageal cancer, resistance often develops through various mechanisms, including drug efflux pump expression and DNA repair pathway enhancement. 22. As alcohol consumption is a known risk factor for esophageal squamous cell carcinoma, public health initiatives focusing on reducing alcohol intake are essential components of comprehensive cancer prevention strategies. 23. In esophageal cancer, the intricate relationship between chronic inflammation and cancer development is highlighted by the molecular interplay between inflammatory cytokines and the nitrogen monofluoride Kb pathway, orchestrating a supportive microenvironment for tumor growth. 24. The development of organoids derived from esophageal cancer tissues presents a promising tool for personalized medicine, enabling drug testing and response prediction tailored to the patient's unique tumor biology. 25. Pioneering research into the esophageal cancer microbiome indicates that an altered bacterial composition might contribute to carcinogenesis, opening avenues for novel diagnostic markers and treatment adjuncts targeting microbial imbalances. 26. Nutritional challenges in esophageal cancer patients necessitate multidisciplinary care, with dietitians playing a critical role in ensuring adequate nutritional intake and managing cachexia, crucial for maintaining strength during aggressive treatment regimens. 27. The feasibility and efficacy of natural compounds, such as curcumin, are being evaluated in the context of esophageal cancer, postulating that their anti-inflammatory and apoptotic properties might harbor therapeutic significance when used alongside conventional treatments. 28. Integration of artificial intelligence in the analysis of endoscopic images is revolutionizing esophageal cancer diagnosis, enhancing the accuracy and speed of detecting lesions that might be missed by the human eye alone. 29. Factors such as obesity and metabolic syndrome contribute to the risk of esophageal adenocarcinoma through chronic inflammation and insulin resistance, signifying an intersection of metabolic health and cancer prevention strategies. 30. Studies on the epidemiology of esophageal cancer highlight a higher prevalence among males compared to females, with research exploring the mechanisms linked to hormones and environmental exposure differences responsible for this disparity. 31. Multidisciplinary tumor boards for esophageal cancer encourage collaboration among specialists, ensuring that each patient receives a comprehensive treatment plan optimized for both local control and systemic disease. 32. Vocal cord paralysis is a lesser-known complication of advanced esophageal cancer, arising from invasion or compression of the recurrent laryngeal nerve, which may necessitate speech therapy or surgical intervention to restore voice function. 3.3. An examination of disparities in esophageal cancer care reveals that socioeconomic factors significantly influence both access to early detection and advanced treatment options, necessitating policy reforms aimed at equitable healthcare delivery. 34. Recent trials focusing on the de-escalation of post-esophagectomy adjuvant therapy explore whether reduced treatment intensity can still deliver survival benefits, minimizing the burden of treatment-related toxicity. 35. Notably, the TREPS classification describes distinct anatomical and pathological characteristics of esophageal cancer, enabling a nuanced approach to understanding the disease's diverse presentations and informing surgical technique refinement. 36. Cirrhosis and chronic liver disease, through mechanisms involving portal hypertension and esophageal varices, can complicate the management of esophageal cancer, leading to increased treatment complexity and necessitating coordinated care. 37. The utilization of PET-CT imaging in staging esophageal cancer allows for sensitive detection of distant metastasis, providing critical information that impacts the treatment strategy and overall prognostic considerations. 38. Comparative studies analyzing the outcomes of robotic-assisted versus traditional open esophagectomy reveal potential advantages in reducing surgical trauma and postoperative complications, while ensuring oncological efficacy. 39. Emerging research into pro-inflammatory cytokines, such as IL-6, reveals their influential role in creating a tumor-permissive environment in esophageal cancer, highlighting potential therapeutic targets in inflammatory modulation. 40. An understanding of lymphatic spread patterns in esophageal cancer assists in precise staging and tailoring surgical and radiation fields, thereby potentially improving disease control and patient outcomes. 41. Cutting-edge advancements in photodynamic therapy for esophageal cancer harness the power of light-activated drugs, providing a focused approach to tumor ablation, particularly for palliative care where conventional options prove challenging. 42. Calcium channel blockers, typically used for cardiovascular conditions, are under investigation for their potential to modulate cancer cell growth and apoptosis in esophageal cancer, suggesting a possible repurposing as adjunctive therapy. 43. The adoption of patient-reported outcome measures in clinical trials for esophageal cancer underscores the importance of capturing the patient perspective in assessing treatment impact, thus enhancing care models focused on quality of life. 44. In-depth studies on esophageal cancer cell lines have revealed insights into their genetic heterogeneity, emphasizing the necessity for personalized therapeutic approaches that account for tumor-specific mutational landscapes. 45. The complex interplay between host immunity and tumor evasion in esophageal cancer emphasizes the critical role of the immune microenvironment, propelling research into immune-modulating therapies that can recalibrate this balance. 46. Colloidal gold nanoparticles are being explored for enhanced imaging and targeted drug delivery in esophageal cancer, capitalizing on their size, biodistribution, and ability to conjugate with molecular agents. 47. The impact of postoperative complications on long-term survival in esophageal cancer patients indicates that reducing surgical morbidity is integral to improving overall outcomes, necessitating refined techniques and perioperative care. A notable preventive measure for esophageal cancer includes the avoidance of scalding hot beverages known to damage the esophageal lining, potentially contributing to corrosive esophagitis and facilitating carcinogenic processes. The integration of palliative care early in the treatment of esophageal cancer addresses complex symptom management, psychological support, and advanced care planning, ensuring comprehensive care beyond tumor-focused treatments. Surveillance strategies for individuals with familial Barrett's esophagus syndromes highlight the importance of genetic counseling and regular monitoring processes in intercepting esophageal cancer at its nascent stage, offering improved prognostic prospects. 1. COPD, or chronic obstructive pulmonary disease, is a group of progressive lung disorders including emphysema and chronic bronchitis, primarily associated with prolonged smoking, characterized by persistent respiratory symptoms and airflow limitation due to airway and/or alveolar abnormalities usually caused by significant exposure to noxious particles or gases, prompting clinicians to advise early smoking cessation and lifestyle modifications as preventive measures. 2. Spirometry is the gold standard diagnostic test for COPD, requiring measurement of forced expiratory volume in 1 second, FEV1, and forced vital capacity, FVC, with an FEV1-FVC ratio of less than 0.70 post-bronchodilator, confirming persistent airflow limitation indicative of COPD, thus differentiating it from asthma and other respiratory conditions. 3. Emphysema, a form of COPD, involves destruction of the alveoli, reducing the surface area available for gas exchange, which leads to symptoms such as shortness of breath, exertional dyspnea, and barrel-shaped chest on physical examination, highlighting the importance of lung volume reduction strategies like smoking cessation and pulmonary rehabilitation. 4. Chronic bronchitis, another variant of COPD, is characterized by productive cough lasting at least 3 months in 2 consecutive years, with hypertrophy and hyperplasia of mucus-secreting glands in the airways leading to excessive mucus production, obstructed airflow, and a higher susceptibility to respiratory infections, thereby necessitating vaccination adherence and prompt treatment of infections. 5. The pathophysiology of COPD involves chronic inflammation of the airways, parenchyma, and pulmonary vasculature, resulting in structural changes, narrowing of small airways, and destruction of lung tissue, driven largely by cigarette smoke and other environmental pollutants, reinforcing the importance of environmental control measures, particularly in occupational settings. 6. Pharmacologic management of COPD primarily involves bronchodilators such as beta-2 agonists and anticholinergics, which work by relaxing airway smooth muscles and improving expiratory flow, often used in combination with inhaled corticosteroids in patients with frequent exacerbations to reduce inflammation and the frequency of acute episodes, aiming for better symptom control and quality of life. 7. Inhaled long-acting muscarinic antagonists, LAMAs, are effective components of COPD therapy, offering prolonged bronchodilation and symptom relief by blocking muscarinic receptors in the airway smooth muscle, which reduces the frequency of exacerbations and improves airflow, thereby becoming a cornerstone in the treatment of moderate to severe COPD. 8. Systemic corticosteroids are commonly used during acute exacerbations of COPD to reduce airway inflammation and hasten recovery, though their use should be limited to short courses due to potential adverse effects like osteoporosis and hyperglycemia, emphasizing the importance of monitoring and managing these risks in long-term COPD care. 9. The use of supplemental oxygen therapy is crucial in managing COPD patients with chronic hypoxemia, as it improves survival, exercise tolerance, and the quality of life in patients meeting criteria like resting PaO2 of 55 mm of mercury or below, or SaO2 of 88% or below, underscoring the need for regular arterial blood gas assessments. Pulmonary rehabilitation is an integral part of COPD management, combining exercise training, education, and behavioral changes to improve the physical and psychological condition of people with COPD, enhancing their overall quality of life and reducing the frequency and severity of exacerbations through personalized care plans. Alpha-1 antitrypsin deficiency is a genetic risk factor for COPD, especially in younger patients or non-smokers presenting with early-onset emphysema, marking the significance of familial screening and the potential benefit of augmentation therapy with plasma-purified human alpha-1 antitrypsin to slow disease progression. Nutritional support is vital in COPD management, as malnutrition and weight loss are common concerns due to increased metabolic demands and reduced appetite from dyspnea. So maintaining a balanced diet with adequate caloric and protein intake is emphasized to optimize pulmonary function and overall health. Smoking cessation is the most effective intervention for halting the progression of COPD and can lead to significant improvements in lung function over time, making support programs, counseling, and pharmacotherapies such as nicotine replacement therapy and varenicline critical components of long-term disease management. COPD exacerbations are acute episodes of worsening respiratory symptoms with increased frequency, severity, or production of sputum, often triggered by viral or bacterial infections, necessitating prompt treatment with bronchodilators, systemic corticosteroids, and antibiotics if indicated, to reduce hospital admissions and improve patient outcomes. The BODE index, which evaluates body mass index, airflow obstruction, dyspnea, and exercise capacity, is a multidimensional scoring system useful for predicting the prognosis of COPD patients by integrating clinical parameters to guide therapeutic decisions and discussions about disease progression and care plans. Chronic inflammation in COPD contributes to systemic effects such as skeletal muscle dysfunction, cardiovascular disease, and osteoporosis, requiring a multidisciplinary approach for management, including regular monitoring, appropriate pharmacotherapy, lifestyle interventions, and optimization of comorbid conditions. Regular vaccination against influenza and pneumococcal pathogens is recommended for COPD patients to reduce the risk of respiratory infections that can lead to exacerbations, hospitalization, and mortality, reinforcing the need for healthcare providers to prioritize immunizations as part of comprehensive COPD care. Psychological distress is prevalent among COPD patients, with depression and anxiety significantly affecting their quality of life and disease outcomes, highlighting the necessity of routine mental health evaluations and the provision of appropriate support, counseling, or pharmacotherapy when needed to address these issues effectively. Inhaler technique is critical in COPD management, as improper use can lead to suboptimal drug delivery and poor disease control, emphasizing the need for regular assessment and patient education on correct inhaler techniques to ensure maximum therapeutic benefit from prescribed medications. Nebulized drug delivery systems offer an alternative for COPD patients struggling with inhaler coordination, providing medication through a fine mist that is easier to inhale, particularly for individuals with severe disease or during exacerbations, ensuring adequate drug deposition and symptom relief. Dyspnea, or shortness of breath, is a hallmark symptom of COPD, often perceived as a constant or episodic air hunger by patients, which warrants timely assessment to differentiate from other potential causes, ensuring targeted interventions like pulmonary rehabilitation and optimized pharmacotherapy are implemented to enhance patient comfort and function. 22. Lung function decline in COPD occurs gradually, with annual reductions in FEV1 typically exceeding those seen with normal aging, thus highlighting the significance of early detection, consistent monitoring, and aggressive management strategies to slow disease progression and preserve lung capacity. 23. The Global Initiative for Chronic Obstructive Lung Disease (GOLD) guidelines provide a classification system for COPD severity based on the degree of airflow limitation, frequency of exacerbations, and patient-reported symptom burden, guiding the tailored pharmacological and non-pharmacological treatment approaches for individual patients. 24. Airway clearance techniques such as chest physiotherapy and the use of devices like the flutter valve or Acapella are beneficial for COPD patients with chronic sputum production, facilitating mucus clearance and improving ventilation, hence preventing secondary infections and improving respiratory function. 25. Endoscopic lung volume reduction procedures, such as endobronchial valve placement, offer an innovative treatment option for patients with severe emphysema, aiming to collapse hyperinflated lung compartments and improve respiratory mechanics, thus enhancing exercise tolerance, pulmonary function, and quality of life. 26. Genetic factors alongside environmental exposures contribute to COPD development, with research indicating specific genetic variants influencing susceptibility to the disease, which underscores the potential for identifying at-risk individuals and developing novel prophylactic or therapeutic strategies through personalized medicine. 27. Breathlessness can exacerbate physical inactivity in COPD patients, resulting in a deconditioning cycle that worsens symptoms and disease outcomes, thus highlighting the importance of individualized exercise programs within pulmonary rehabilitation to break this cycle and promote better health and functionality. 28. Comorbidities such as cardiovascular disease, diabetes, and lung cancer are frequently associated with COPD, complicating disease management and prognosis, emphasizing the necessity for a comprehensive approach that includes routine screening, management of concurrent conditions, and coordinated patient care. 29. Exacerbations in COPD, characterized by a sudden worsening of symptoms, are multifactorial, with a large proportion attributed to respiratory infections and environmental pollutants, necessitating rapid management and preventive strategies, including medications and lifestyle interventions to reduce their occurrence. 30. COPD's economic burden is significant, impacting healthcare systems due to hospitalization, medication costs, and lost productivity, thereby stressing the importance of preventive measures, effective management strategies, and patient education to alleviate the financial burden associated with chronic disease. 31. Pulmonary function tests beyond spirometry, like diffusion capacity for carbon monoxide, DLCO, provide insights into gas exchange efficiency in COPD, which can help differentiate emphysema from other lung pathologies and tailor management strategies to the specific physiological impairments present in each patient. 32. Air pollution is a significant environmental risk factor for COPD exacerbations, with exposure to pollutants like particulate matter and ozone exacerbating symptoms, underscoring the need for strategies to minimize patient exposure and mitigate the health impacts of poor air quality on vulnerable populations. 3. A significant overlap exists between COPD and asthma, with some patients exhibiting characteristics of both, known as asthma-COPD overlap. ACO, necessitating a nuanced diagnostic and therapeutic approach that incorporates treatment regimens from both COPD and asthma guidelines for optimal management. 34. Opioid use in COPD for intractable dyspnea management should be carefully monitored due to the risk of respiratory depression, and is generally reserved for severe cases where other interventions have failed, requiring careful dose titration, monitoring, and evaluation to minimize potential adverse effects. 35. Combining long-acting beta-2 agonists, LABAs, and inhaled corticosteroids can be more effective for patients with frequent exacerbations and higher eosinophilic inflammation in managing COPD, working synergistically to improve lung function, quality of life, and reduce exacerbation frequency and severity. 36. Social support networks play an essential role in managing COPD, as they can provide emotional support, encourage adherence to treatment plans, and facilitate lifestyle changes, emphasizing the importance of engaging family members and care partners in the management process to optimize outcomes. 37. Sputum color and consistency in COPD can provide clues about potential infections, with changes often indicating bacterial colonization, thus guiding antibiotic selection when necessary, highlighting the necessity for healthcare providers to closely monitor these changes and adjust treatment accordingly. 38. Respiratory muscle training can improve respiratory muscle strength in COPD patients, enhancing exercise capacity and reducing the sensation of dyspnea, being an important component of pulmonary rehabilitation programs and contributing to better overall function and quality of life in these patients. 39. COPD can disrupt the sleep patterns of sufferers, often leading to poor sleep quality due to nocturnal breathlessness or frequent coughing, making the assessment and management of sleep disturbances an essential part of comprehensive COPD care to improve patient well-being and daytime functioning. 40. Individualized action plans for COPD patients detail steps to take in response to changes in symptoms or exacerbation warning signs, empowering patients to manage their condition proactively and reducing unnecessary emergency department visits, emphasizing the importance of patient education and engagement in COPD management. 41. Newer targeted therapies are being explored for COPD, focusing on the underlying inflammatory pathways and protease-antiprotease imbalances, which could offer future options to alter the disease process, although current management primarily revolves around symptom relief and exacerbation prevention. 42. Effective communication between COPD patients and their healthcare team is paramount, as it ensures a shared understanding of the disease, treatment goals, and management strategies, fostering adherence to complex therapeutic regimens, mitigating potential barriers, and enhancing patient autonomy and satisfaction. 43. Thromboembolic events are a known complication of COPD, likely due to systemic inflammation and hypoxia-related coagulation abnormalities, necessitating vigilance for signs of deep vein thrombosis or pulmonary embolism and the consideration of prophylactic anticoagulation in high-risk individuals to prevent adverse outcomes. 44. Gas trapping in COPD is a natural consequence of poor airflow and airway collapse during expiration, leading to hyperinflation which can impair respiratory mechanics and cardiac function, underscoring the need for treatments aimed at improving airflow and gas exchange to reduce hyperinflation and symptom burden. 45. Home monitoring devices, including pulse oximeters and spirometers, can empower COPD patients to track their health at home and facilitate early intervention for exacerbations, enhancing self-management skills and allowing for tailored adjustments to their treatment plans by healthcare professionals based on objective data. 46. COPD has a significant burden on mental health, heightening risks for anxiety and depression, which can exacerbate physical symptoms and hinder treatment adherence, necessitating regular psychological assessment and the integration of mental health support within the multidisciplinary care framework for optimal outcomes. '47. Exacerbations can be predicted in COPD by monitoring changes in symptoms, exposure to infection, or environmental pollutants, with machine learning models and wearable technology being developed to provide real-time risk assessment, enabling timely interventions and potentially reducing the frequency of these acute events. '48. Knowing the symptoms and etiology of COPD involves understanding the finely tuned balance of protease and antiprotease activity in the lungs which, when dysregulated due to smoking or genetic predisposition, leads to tissue destruction and the classical features of emphysema, stressing the complexity of pathophysiological pathways that require targeted interventions. '49. Comorbid respiratory infections can perpetuate COPD exacerbations, making the identification and management of pathogens, whether bacterial or viral, integral to reducing symptom burden and preventing further respiratory decline, necessitating vigilant diagnostic approaches and appropriate antimicrobial therapies. '50. The psychosocial aspects of living with COPD, such as the loss of independence and social isolation due to physical limitations, can greatly impact overall well-being, underscoring the importance of integrating social support services, therapy, and encouragement of self-efficacy within comprehensive COPD management programs. '1. Cardiac arrhythmias, often resulting from disruptions in the heart's electrical conduction system, can lead to symptoms such as palpitations, dizziness, and syncope, while potentially increasing the risk for more serious conditions like stroke and heart failure. Hence, understanding the complexities of atrial and ventricular arrhythmias is crucial for effective clinical management. '2. Diagnosing cardiac arrhythmias often involves the use of electrocardiograms, ECGs, as a primary tool, where healthcare providers analyze the electrical activity of the heart through P, QRS, and T waves, which can reveal patterns indicative of atrial fibrillation, tachycardia, or other arrhythmic conditions. '3. Although antiarrhythmic drugs like amiodarone, beta blockers, and calcium channel blockers are integral to the medical management of various cardiac arrhythmias, they come with their own set of pharmacokinetic challenges and side effects, necessitating careful patient monitoring and individualized treatment plans. '4. Atrial fibrillation, one of the most common types of arrhythmias, is characterized by rapid and irregular beating of the atria and is often associated with an increased risk of thromboembolic events, which calls for anticoagulation strategies in addition to rhythm or rate control therapies. '5. The pathophysiology of ventricular arrhythmias can involve abnormalities in ion channel functioning within myocardial cells, leading to conditions such as ventricular tachycardia or fibrillation, which are particularly serious due to their potential to precipitate sudden cardiac arrest. '6. Holter monitoring, which involves continuous ECG recording typically over 24 to 48 hours, is a valuable diagnostic method for identifying transient arrhythmic episodes that may not be captured during a standard ECG test in a clinical setting. '7. In certain cases of refractory arrhythmias or when medical management is insufficient, catheter ablation procedures might be considered. These involve the targeted destruction of arrhythmic foci within the heart tissue via radiofrequency or cryoablation techniques, aiming to restore normal cardiac rhythm. '8. Breach of cellular homeostasis and calcium ion handling in cardiomyocytes can contribute to arrhythmic phenomena, highlighting the importance of calcium channel function in maintaining proper myocardial contraction and electrical stability, often factored into pharmacotherapeutic interventions. 9. Genetic predispositions, sometimes linked to inherited channelopathies such as long QT syndrome or Brugada syndrome, can underpin the development of arrhythmias, indicating the need for genetic counseling and screening in at-risk populations to guide preventive and therapeutic strategies. Cardiac arrhythmias in the context of ischemic heart disease can arise from scarring and fibrosis post-myocardial infarction, which disrupts electrical conduction pathways, thereby necessitating not only direct arrhythmia management but also comprehensive cardiovascular care to mitigate underlying ischemic burden. 11. Lifestyle factors such as excessive caffeine or alcohol consumption, smoking, and stress can exacerbate or trigger arrhythmic episodes, suggesting that a holistic approach to arrhythmia management must include patient education and lifestyle modifications alongside medical interventions. The occurrence of arrhythmias during pregnancy presents unique clinical challenges due to physiologic changes and the need to consider fetal health, often requiring collaborative multidisciplinary care to address rhythm disturbances while minimizing risks to mother and child. For individuals experiencing symptomatic bradyarrhythmias, potentially due to sinus node dysfunction or atrioventricular block, implantation of a pacemaker can provide effective rhythm management, thereby alleviating symptoms and reducing the risk of complications associated with low heart rates. Unlike mere heart rate increase or decrease, arrhythmias involve the intricate disturbance of the heart's electrical impulses, necessitating attentive risk factor stratification and patient-specific treatment protocols, considering the vast array of underlying etiological mechanisms in each case. A comprehensive history and physical examination remain pivotal in the initial assessment of patients presenting with suspected arrhythmias, for symptoms such as palpitations, fatigue, or dyspnea can stem from a vast differential diagnosis, thereby helping clinicians to triage and guide further investigations efficiently. The role of the autonomic nervous system in modulating cardiac rhythms is significant, where imbalances in sympathetic and parasympathetic tone can precipitate arrhythmic events. Clinical interventions sometimes involve modulation of autonomic inputs to stabilize cardiac function. Antiarrhythmic drug therapy carries potential proarrhythmic risk, necessitating diligent monitoring for QT interval prolongation or other adverse effects, especially in drugs that alter ion channels, underscoring the complexity of striking a balance between therapeutic benefits and possible toxicities. Emerging non-invasive technologies like wearable ECG monitors provide continuous cardiac rhythm surveillance, empowering patients with real-time insights and facilitating early detection of arrhythmic phenomena outside of traditional clinical environments, fostering proactive management. Pathological hypertrophy and dilation of cardiac chambers, often seen in conditions such as left ventricular hypertrophy or cardiomyopathies, can induce arrhythmic electrical conduction, highlighting the intersection between structural myocardial changes and electrophysiological disturbance. Psychoemotional factors, including anxiety and depression, have been noted to influence the presentation and perceived burden of arrhythmias, thereby requiring a biopsychosocial model of care that integrates mental health support in managing patients with cardiac arrhythmias. The electrophysiological study, EPS, serves as a cornerstone diagnostic tool for elucidating the mechanisms of arrhythmias, whereby intracardiac electrode catheters help in mapping the heart's electrical activity and understanding specific arrhythmic circuits for targeted therapeutic decisions. 22. The electrophysiology of the cardiac conduction system involves synchronized depolarization and repolarization events, with the sinoatrial and atrioventricular nodes playing critical roles. Disruptions here can result in inefficient cardiac cycles and highlight areas of potential electrophysiological intervention. '23. Structural heart conditions such as valvular diseases may predispose patients to arrhythmias due to resultant atrial enlargement and pressure overload, demonstrating the interconnected nature of mechanical and electrical heart dynamics in arrhythmogenesis. '24. Synchronization of ventricular contraction and improved hemodynamics are the goals of cardiac resynchronization therapy, CRT, used in select cases of heart failure with arrhythmias where biventricular pacing can dissolve dysynchrony and ameliorate symptoms. '25. Pediatric arrhythmias demand careful consideration, as they may manifest differently than in adults, with common etiologies including congenital heart defects or genetic syndromes, necessitating age-appropriate diagnostic and therapeutic approaches tailored to the developmental context. '26. The intricate anatomy of the cardiac conduction system, involving specialized pathways through the atrioventricular node and Purkinje fibers, underpins its vulnerability to disturbances, where even minor alterations in anatomy or physiology can have significant arrhythmic consequences. '27. The multifactorial etiology of arrhythmias often includes electrolyte imbalances such as hypokalemia or hypercalcemia, underscoring the importance of maintaining adequate electrolyte homeostasis in both prevention and treatment regimens for cardiac rhythm disturbances. '28. Lifestyle interventions, such as the incorporation of regular graded exercise, have shown beneficial effects in reducing the incidence of certain arrhythmias, promoting autonomic balance and cardiac fitness, when duly tailored to individual patient capabilities and risk profiles. '29. The risk stratification for sudden cardiac death in individuals with potentially malignant arrhythmias involves assessing factors such as ejection fraction, presence of syncope, and familial history, guiding decisions on the appropriateness of implantable cardioverter defibrillators as prophylactic measures. '30. Cardiac imaging techniques, including echocardiography and cardiac MRI, illuminate structural and functional status, providing essential information to correlate anatomical findings with arrhythmic potential, vital for comprehensive arrhythmia care planning. '31. The pathogenesis of arrhythmias can sometimes be attributed to inflammatory processes, as observed in conditions like myocarditis or cardiac sarcoidosis, where inflammation-induced scarring can alter conductive pathways, necessitating both anti-inflammatory and rhythm management strategies. '32. Clinical innovations, such as the development of bioengineered cardiac tissue grafts, hold promise for repairing arrhythmic substrates by restoring normal myocardial architecture and electrical continuity, offering a glimpse into future regenerative therapies for arrhythmia management. '33. Polymorphic ventricular tachycardia, often associated with electrolyte disturbances or ischemic insult, typifies the diversity within arrhythmias, necessitating nuanced understanding and management approaches, including correction of precipitating conditions and pharmacological stabilization. '34. The potential for asymptomatic arrhythmias to progress undetected adds an element of unpredictability to their management, emphasizing the value of regular cardiac evaluations, especially in high-risk populations, to mitigate possible adverse outcomes through proactive surveillance. '35. The utilization of implantable loop recorders extends diagnostic capabilities over extended periods, capturing sporadic arrhythmic events that might otherwise go undiagnosed, enhancing the diagnostic yield in patients presenting with unexplained syncope or palpitations. 36. Paroxysmal supraventricular tachycardia, PSVT, arises from reentrant circuits within the atria or atrioventricular node, often requiring acute interventions such as vagal maneuvers or adenosine administration, alongside long-term consideration of pharmacological or ablative strategies for persistent cases. 37. The advent of telemedicine and virtual arrhythmia clinics has augmented patient access to specialized cardiac care, allowing remote consultations and monitoring that adapt to patient needs, optimizing management and follow-up in the evolving landscape of digital healthcare. 38. Wolff-Parkinson-White syndrome, a pre-excitation disorder characterized by the presence of an accessory pathway, manifests in tachyarrhythmias due to abnormal electrical conduction, underscoring the importance of accurate ECG interpretation and patient-specific intervention planning. 39. Not all arrhythmias convey the same clinical significance, with distinctions existing between benign ectopic beats and life-threatening tachyarrhythmias, thus imposing the need for differential diagnosis in the context of patient symptoms and overall cardiovascular risk. 40. Environmental factors, such as exposure to certain toxins or medications that prolong the QT interval, can precipitate arrhythmic events, necessitating awareness and mitigation strategies in both clinical and occupational contexts to prevent potential cardiac complications. 41. Cardiac arrhythmias present gender-specific prevalence and risk factors, as hormonal influences and genetic predispositions may differ, warranting consideration of gender in both the research and clinical management paradigms of arrhythmic disorders. 42. Technology-driven advancements in algorithms for arrhythmia detection leverage artificial intelligence to enhance the precision of diagnostic tools, transforming the landscape of non-invasive arrhythmia screening with the potential to improve early detection and intervention outcomes. 43. The therapeutic landscape for arrhythmias continues to evolve with approaches such as gene therapy, targeting underlying molecular defects in inherited arrhythmogenic disorders, offering a frontier in personalized medicine that reaches beyond symptom control to address disease at its genetic root. 44. Emotionally induced arrhythmias exemplify the direct link between mind and heart, where stress can precipitate acute arrhythmic events, highlighting the importance of integrating stress management techniques into comprehensive care plans for patients with cardiac susceptibility. 45. Despite their potential diversity, arrhythmias share a common thread in their potential to affect cardiac output, emphasizing the interconnectedness of electrical dysrhythmia and hemodynamic compromise, necessitating a holistic grasp of cardiovascular physiology in clinical practice. 46. The management of arrhythmias in patients with comorbid conditions, such as diabetes or chronic kidney disease, often involves additional layers of complexity due to interaction with existing therapies and potential alteration of drug metabolism, underscoring the importance of multidisciplinary care teams. 47. Recent studies suggest that the gut microbiome may influence cardiac rhythm through mechanisms involving metabolic byproducts, opening intriguing possibilities for novel approaches to managing arrhythmic disorders via dietary modulation and microbiome-targeted therapies. 48. In some instances, a pacemaker or implantable cardioverter defibrillator interaction with electromagnetic fields necessitates vigilance regarding potential interference, leading to patient education on avoiding certain environments to ensure device functionality remains uncompromised. 49. Considering arrhythmias from a global health perspective unveils disparities in access to arrhythmia care, prompting efforts towards enhancing healthcare infrastructure and education in resource-limited settings to bridge gaps and improve patient outcomes. '50. The use of risk prediction models in arrhythmia care, incorporating variables such as age, comorbidities, and lifestyle factors, facilitates a more tailored risk assessment approach, enhancing predictive accuracy and informing preventive strategies in clinical decision-making processes. 1. Ischemic heart disease, primarily caused by atherosclerosis, reduces blood flow to myocardial tissues, often resulting in angina pectoris and increasing the risk of myocardial infarction, thus necessitating prompt clinical intervention to prevent irreversible myocardial damage. 2. Understanding the pathophysiology of ischemic heart disease involves recognizing the complex interplay of endothelial dysfunction, lipid accumulation, inflammation, and thrombosis that ultimately compromises coronary artery blood flow and myocardial perfusion. 3. The diagnostic process for ischemic heart disease involves tools such as electrocardiograms to detect street segment changes, stress tests for evaluating exercise-induced ischemia, and coronary angiography, which provides direct visualization of coronary artery obstruction. 4. Medical management of ischemic heart disease often includes antiplatelet agents like aspirin, which reduce thrombotic events, statins to lower LDL cholesterol and stabilize atherosclerotic plaques, and nitrates to alleviate chest pain by dilating coronary vasculature. 5. Lifestyle modifications, such as smoking cessation, dietary changes to reduce saturated fats, and regular aerobic exercise, play a crucial role in managing ischemic heart disease by mitigating risk factors and supporting cardiovascular health. 6. Coronary artery bypass grafting presents a surgical option for patients with severe ischemic heart disease, creating alternative pathways for blood to reach the myocardium by grafting veins or arteries to bypass occluded coronary vessels. 7. Percutaneous coronary intervention, often involving the placement of a stent, is a minimally invasive procedure that reopens narrowed coronary arteries, restoring adequate blood flow and reducing the incidence of angina in ischemic heart disease patients. 8. Advanced imaging modalities, such as cardiac MRI and CT angiography, provide detailed anatomical and functional assessment of coronary arteries, myocardial tissue, and perfusion deficits, enhancing diagnostic accuracy in ischemic heart disease. 9. Ischemic preconditioning, where brief episodes of ischemia make myocardial tissue more resistant to subsequent ischemic episodes, offers a fascinating area of research with potential therapeutic implications for ischemic heart disease management. 10. The role of inflammation in ischemic heart disease is increasingly recognized, with biomarkers like C-reactive protein serving as indicators of systemic inflammation and potential targets for therapeutic intervention to reduce cardiovascular risk. 11. Despite the predominance of atherosclerosis in ischemic heart disease, coronary microvascular dysfunction also contributes significantly, particularly in women, highlighting the need for gender-specific diagnostic and therapeutic approaches. 12. Silent ischemia presents a diagnostic challenge in ischemic heart disease, as patients exhibit myocardial ischemia without typical anginal symptoms, necessitating vigilance and regular monitoring in high-risk patient populations. 13. Genetic factors contribute to an individual's susceptibility to ischemic heart disease, with polygenic risk scores and family history aiding in risk stratification and personalized preventive strategies tailored to genetic profiles. 14. The phenomenon of coronary artery spasm, wherein transient vasoconstriction leads to ischemic events, underscores the importance of identifying and managing triggers such as stress, cold exposure, and vasoconstrictive drugs in ischemic heart disease. 15. Ischemic heart disease disproportionately affects individuals with comorbid conditions like diabetes mellitus, which accelerates atherosclerosis through mechanisms such as glycation and oxidative stress, necessitating rigorous glycemic control. (16) Heart rate variability analysis provides insights into autonomic dysfunction in ischemic heart disease, where reduced variability signals sympathetic predominance and heightened risk for adverse cardiovascular events. (17) Advances in regenerative medicine, such as stem cell therapy, hold promise for repairing ischemic damage in the heart by regenerating myocardial tissue and improving cardiac function post-myocardial infarction. 18. The role of mental health in ischemic heart disease is gaining attention, with conditions such as depression and anxiety linked to increased cardiovascular risk through stress-related pathophysiological mechanisms like hypercortisolemia. (19) Hyperhomocystinemia, an elevated blood level of homocysteine, is a modifiable risk factor for ischemic heart disease, emphasizing the importance of dietary interventions and supplementation with folic acid and B vitamins for cardiovascular prevention. (20) The potential cardioprotective effects of omega-3 fatty acids in ischemic heart disease are attributed to their anti-inflammatory properties, which help reduce plaque formation, improve endothelial function, and lower triglyceride levels. (21) Remote ischemic conditioning, involving repetitive episodes of limb ischemia to confer organ protection against ischemic injury, represents a novel non-invasive intervention with potential applicability in ischemic heart disease. (22) The use of ambulatory blood pressure monitoring in ischemic heart disease patients provides valuable insights into nocturnal hypertension and blood pressure variability, correlating with cardiovascular outcomes and guiding antihypertensive therapy. (23) Pulmonary hypertension can complicate ischemic heart disease, impairing right ventricular function and exacerbating heart failure symptoms, necessitating vigilant assessment and management of both pulmonary and cardiac components. (24) The phenomenon of hibernating myocardium, where myocardial contractility is reversibly impaired due to chronic ischemia, highlights the importance of revascularization in restoring myocardial function and optimizing heart performance. (25) Cardiac rehabilitation programs, combining supervised exercise, nutritional guidance, and psychological support, enhance recovery and quality of life for ischemic heart disease patients, reducing recurrent cardiovascular events. (26) The endothelial glycocalyx, a protective layer lining blood vessels, plays a crucial role in maintaining vascular health, and its disruption in ischemic heart disease contributes to atherogenesis and endothelial dysfunction. (27) Myocardial stunning refers to the transient post-ischemic dysfunction of myocardial tissue, despite restored blood flow, necessitating careful differential diagnosis from irreversible myocardial damage in ischemic heart disease cases. (28) The gut-heart axis explores the interplay between gut microbiota and cardiovascular health, where dysbiosis may contribute to ischemic heart disease via inflammatory pathways and microbial metabolites such as TMAO. (29) Identifying and managing obstructive sleep apnea is essential in ischemic heart disease, as untreated apnea exacerbates hypertension, sympathetic activation, and inflammation, further elevating cardiovascular risk. (30) Antianginal medications like beta blockers and calcium channel blockers not only alleviate ischemic symptoms but also provide prognostic benefits by reducing myocardial oxygen demand and preventing arrhythmias. 31. Utilization of dual antiplatelet therapy, particularly after percutaneous coronary intervention, is critical in ischemic heart disease to prevent stent thrombosis and ensure sustained patency of revascularized vessels. 32. Oxidative stress, characterized by an imbalance between reactive oxygen species and antioxidants, accelerates atherosclerosis and endothelial dysfunction in ischemic heart disease, supporting the exploration of antioxidant therapies. 3. Early intervention with fibrinolytic therapy in acute myocardial infarction, particularly in settings without percutaneous coronary intervention availability, saves myocardium by rapidly dissolving thrombi, restoring coronary perfusion. 34. Cardiac troponin levels serve as a pivotal biomarker in diagnosing acute coronary syndromes, with high-sensitivity assays providing early detection and risk stratification in ischemic heart disease emergencies. 35. Systemic lupus erythematosus and other autoimmune conditions increase ischemic heart disease risk due to accelerated atherosclerosis linked to chronic inflammation, necessitating vigilant cardiovascular monitoring in autoimmune populations. 36. The concept of residual inflammatory risk in ischemic heart disease, despite optimal lipid management, highlights the ongoing quest for therapies targeting persistent inflammation in plaque stabilization and event reduction. 37. Platelet hyperreactivity in ischemic heart disease contributes to thrombotic complications, with pharmacogenomics guiding personalized antiplatelet strategies to prevent adverse outcomes and optimize dual antiplatelet therapy. 38. The interplay between hypercoagulability and ischemic heart disease necessitates consideration of anticoagulant therapy, especially in patients with concomitant atrial fibrillation, to balance thrombosis prevention with bleeding risk. 39. Investigating the impact of systemic nitric oxide availability in ischemic heart disease reveals its crucial role in vasodilation and endothelial function, with therapeutic implications for enhancing nitric oxide pathways. 40. The metabolic syndrome synergistically amplifies ischemic heart disease risk through interconnected components like abdominal obesity, insulin resistance, dyslipidemia, and hypertension, requiring a comprehensive approach to management. 41. Emerging research on the Klotho protein suggests a protective role against cardiovascular aging and ischemic heart disease, highlighting potential therapeutic avenues for promoting longevity and vascular health. 42. Heat shock proteins, induced by stressors, serve protective roles in myocardial cells by preventing protein aggregation and enhancing survival pathways during ischemic events, with potential therapeutic exploitation in cardioprotection. 43. Chronic kidney disease exacerbates ischemic heart disease through mechanisms such as hypertension, mineral metabolism disturbances, and uremic toxins, necessitating joint nephrological and cardiovascular management strategies. 44. Advances in nanotechnology aim to revolutionize ischemic heart disease treatment through targeted drug delivery systems, enhancing therapeutic efficacy and minimizing off-target effects in the cardiovascular system. 45. The association between migraines and ischemic heart disease underscores shared pathophysiological pathways like endothelial dysfunction, auguring the need for integrated care in patients presenting with both conditions. 46. Exploring proteomics in ischemic heart disease can unveil novel biomarkers and therapeutic targets, offering insights into disease mechanisms and individualized treatment approaches tailored to proteomic profiles. 47. Cardiac amyloidosis complicates ischemic heart disease by infiltrating and stiffening myocardial tissue, posing diagnostic and therapeutic challenges in distinguishing from primary ischemic cardiomyopathies. Transthoracic echocardiography remains a non-invasive cornerstone in assessing cardiac structure and function in ischemic heart disease, aiding in evaluation of ventricular size, wall motion abnormalities, and ejection fraction. The promise of gene editing technologies, such as CRISPR-Cas9, beckons an era of precision medicine for ischemic heart disease, potentially correcting genetic predispositions and ushering tailored therapeutic interventions. Understanding the circadian patterns of ischemic heart disease events, where peak incidence occurs in the morning, informs timing of medication administration and lifestyle modifications to align with biological rhythms for optimal outcomes. Lung cancer, primarily caused by smoking, is often classified into two main types: small cell lung cancer, SCLC, and non-small cell lung cancer, NSCLC, with NSCLC being the more prevalent, revolving around cellular differences that impact management and prognostic approaches. Smoking cessation is crucial in both prevention and management of lung cancer, as cigarette smoke contains carcinogens that lead to genetic mutations which disrupt normal cell cycles, ultimately resulting in malignant lung tumors over time. Lung cancer screening using low-dose computed tomography, LDCT, can significantly reduce mortality by identifying tumors at an early, more treatable stage, particularly in high-risk populations such as older adults with a significant smoking history. Symptoms of lung cancer often include persistent cough, hemoptysis, chest pain, and unexplained weight loss, and these symptoms typically reflect advanced disease, highlighting the importance of early detection for effective treatment outcomes. The pathophysiology of non-small cell lung cancer involves various genetic mutations such as EGFR and ALK rearrangements, which have led to targeted therapies that significantly improve outcomes in patients with specific genetic profiles. Small cell lung cancer is characterized by rapid growth and early metastasis, often initially presenting with paraneoplastic syndromes such as SIADH or ACTH production, complicating diagnosis and requiring prompt and aggressive treatment including chemotherapy and radiotherapy. Staging of lung cancer is crucial for determining the treatment regimen and is based on the TNM system, evaluating the size and extent of the tumor, lymph node involvement, and the presence of metastasis. Pleural effusion can occur in lung cancer patients due to tumor infiltration or obstruction of lymphatic drainage, often requiring thoracentesis for diagnosis and symptomatic relief. Immunotherapy has revolutionized the treatment landscape for advanced NSCLC, utilizing immune checkpoint inhibitors that help the immune system recognize and attack cancer cells, specifically by targeting PD-1 and PD-L1 pathways. Palliative care plays a vital role in lung cancer management, aiming to improve quality of life by addressing symptoms management, emotional support, and advanced care planning alongside curative or control therapies. Lung cancer metastasis is common, often spreading to the brain, bones, liver, and adrenal glands, with each site of metastasis requiring a tailored approach either through direct treatment or adjunctive supportive care to alleviate symptoms. PET cord scans are frequently used in the evaluation of lung cancer, offering metabolic information that complements anatomical findings of CT alone, important for accurate staging and management decisions. 13. Brachytherapy, a form of radiotherapy, can be used as a localized treatment for certain cases of lung cancer, delivering radiation directly to the tumor site, thereby minimizing exposure to surrounding healthy tissues and potentially reducing side effects. 14. Angiogenesis inhibitors like bevacizumab are used in certain NSCLC regimens to block the tumor's blood supply, potentially starving cancer cells of nutrients and inhibiting tumor growth. 15. Risk factors for lung cancer extend beyond smoking and include exposure to radon, asbestos, and secondhand smoke, as well as having a family history of the disease, emphasizing the importance of multidisciplinary approaches for prevention. 16. Pulmonary function tests can be integral in assessing lung cancer patients' respiratory status prior to surgery or radiotherapy, helping predict postoperative outcomes and guiding the management of potential treatment complications. 17. Sabermetric radiotherapy, SABR, offers a non-invasive treatment modality for early-stage lung cancer, utilizing precise, high-dose radiation therapy to target tumors with minimal damage to surrounding tissues, ideal for patients who are poor surgical candidates. 18. Liquid biopsy, an emerging diagnostic tool, involves analyzing circulating tumor DNA in the blood for mutations and biomarkers, providing a less invasive means for monitoring treatment response and detecting relapse in lung cancer patients. 19. Smoking contributes to the development of lung cancer by causing DNA damage and chronic inflammation, creating an environment conducive to the formation of malignant cells, with the cumulative risk increasing with the number of pack years smoked. 20. Neuroendocrine tumors of the lung, including small cell lung cancer, display unique molecular and clinical features, often producing hormones that lead to systemic symptoms, requiring distinct approaches from non-neuroendocrine tumors. 21. Targeted therapies for lung cancer, such as tyrosine kinase inhibitors, TKIs, for EGFR-mutated NSCLC, have demonstrated effectiveness by inhibiting specific pathways essential for cancer cell growth, offering a personalized treatment option for suitable patients. 22. Pulmonary lobectomy is the standard surgical approach for resectable non-small cell lung cancer, involving the removal of an entire lobe of the lung, often combined with lymph node dissection to provide comprehensive cancer clearance. 23. Metabolic heterogeneity seen in lung cancer tumors poses challenges for treatment, as variable glucose uptake can affect both imaging accuracy in PET scans and the responsiveness to therapies like chemotherapy and radiotherapy. 24. Cluving and hypertrophic osteoarthropathy, manifesting in distal phalanx changes and joint pain, represent potential paraneoplastic manifestations of lung cancer, necessitating evaluation for underlying malignancy, especially in smokers. 25. Recurrent respiratory infections or pneumonia can be an indicative symptom of lung cancer, driven by tumor-induced airway obstruction resulting in poor drainage and subsequent bacterial proliferation. 26. Nutritional support is vital for lung cancer patients experiencing cachexia or treatment-related appetite loss, focusing on high-calorie, protein-rich diets to maintain energy and muscle mass, which are crucial for withstanding aggressive cancer therapy. 27. Lung cancer patients receiving radiotherapy may experience radiation pneumonitis, characterized by cough, fever, and dyspnea, usually manifesting weeks after treatment and managed with corticosteroids to reduce inflammation. 28. The presence of KRAS mutations in lung cancer often correlates with poor prognosis and limited response to certain targeted therapies, presenting ongoing challenges in developing effective treatment strategies for affected patients. 29. Cachexia, a syndrome of unexplained weight loss and muscle atrophy, is commonly associated with advanced lung cancer, negatively impacting prognosis and quality of life, necessitating a multidisciplinary approach for management including nutritional and pharmacologic interventions. 30. Bronchoscopy with biopsy is a diagnostic cornerstone for lung cancer, allowing direct visualization of the airway, tumor tissue sampling, and sometimes therapeutic interventions such as stenting or laser treatment to relieve obstruction. 31. Early-stage non-small cell lung cancer has the potential to be curatively treated with surgical resection alone, highlighting the significance of early detection through screening methods to improve survival rates. 32. Lung cancer's molecular landscape is dynamic, often evolving under selective pressure of therapies, leading to acquired resistance to drugs like EGFR inhibitors, necessitating the development of next-generation inhibitors and combination strategies. 3. Central lung tumors frequently cause airway obstruction, leading to post-obstructive pneumonia, atelectasis, or hemoptysis, and require accurate localization and intervention, often through bronchoscopic or radiologic techniques. 34. In addition to tobacco, environmental air pollutants, including particulate matter and diesel exhaust, have been identified as contributing factors to lung cancer development, emphasizing the multifaceted nature of carcinogen exposure. 35. Emerging evidence suggests that chronic obstructive pulmonary disease, COPD, independently increases lung cancer risk, irrespective of smoking history, likely due to shared inflammatory pathways and genetic susceptibilities. 36. Hormonal therapy is not typically used in lung cancer treatment, except in specific cases where small cell lung cancer presents with ectopic production of hormones like ACTH, which requires management of related syndromes. 37. Persistent voice hoarseness in lung cancer patients can be indicative of recurrent laryngeal nerve involvement, often due to tumor invasion or lymphadenopathy in the mediastinum, necessitating thorough evaluation and imaging. 38. In lung cancer management, multidisciplinary tumor boards comprising oncologists, radiologists, pathologists, surgeons, and palliative care professionals enhance patient outcomes by tailoring individualized treatment plans based on comprehensive expert input. 39. Oncogenes like ALK are important in lung cancer pathogenesis, with translocations resulting in oncogenic fusion proteins driving cancer growth, leading to the development of ALK inhibitors that provide significant clinical benefits in affected patients. 40. Proton beam therapy offers an advanced form of radiation therapy for lung cancer, utilizing charged particles that deliver energy more precisely, potentially reducing collateral damage to surrounding healthy tissues compared to traditional photon-based radiotherapy. 41. Recent studies have highlighted that certain lung cancer subtypes associated with EGFR mutations may demonstrate increased susceptibility to tyrosine kinase inhibitors, underscoring the importance of genetic profiling in guiding targeted treatment. 42. Occupational exposure to asbestos is a well-known risk factor for lung cancer, specifically linked to mesothelioma and other pleural malignancies, highlighting necessary preventive measures in at-risk industrial settings. 43. Advanced lung cancer can present with systemic symptoms such as night sweats and fatigue, which, although non-specific, warrant comprehensive evaluation given their potential indication of widespread disease or associated paraneoplastic phenomena. 44. Despite therapeutic advancements, lung cancer remains one of the leading causes of cancer-related mortality globally, underscoring the crucial need for ongoing research into prevention, early detection, and novel treatment modalities. Lymphangitic carcinomatosis is a unique presentation where lung cancer spreads through lymphatic channels, leading to shortness of breath and cough, requiring prompt diagnosis as it often signals advanced and diffuse disease. 46. Rarely, lung cancer can present as a secondary effect of systemic embolization, where tumor cells invade the vasculature, resulting in peripheral symptoms like digital ischemia in a phenomenon known as tumor embolism. 47. The management of brain metastasis from lung cancer may involve whole brain radiotherapy, stereotactic radiosurgery, or surgical intervention depending on the number, size, and location of lesions, as well as patient performance status. 48. Carcinoid tumors of the lung, though rare, can be the source of typical or atypical presentations depending on their biologic activity and hormone secretion, requiring distinct surgical and medical management approaches compared to other lung neoplasms. 49. E-smoking or vaping has been investigated for its potential role in lung cancer risk, with ongoing studies evaluating the carcinogenicity of flavored aerosols and nicotine substitutes used in electronic cigarettes. 50. Advancements in telemedicine have facilitated the provision of comprehensive care for lung cancer patients, enabling remote consultations, treatment monitoring, and multidisciplinary team discussions, greatly improving access to oncology expertise. 1. Brain trauma, one of the most complex injuries in neuroscience, involves mechanical damage to brain tissue leading to primary injury and subsequent biochemical and molecular alterations termed secondary injury, which can exacerbate cellular and microvascular damage, potentially resulting in significant neuropsychological deficits and long-term disability if not promptly and effectively managed. 2. Diffuse axonal injury, DI, common in traumatic brain injury, TBI, involves shearing forces that disrupt axonal connections, leading to profound neuropsychological impairment because the injury primarily occurs at the gray-white matter interface, which impairs critical communication networks within the brain. 3. In brain trauma cases, the Glasgow Coma Scale, GCS, remains a vital clinical tool for assessing the level of consciousness. However, its limitations include insensitivity to subtle changes in neurological status and a reduced ability to predict long-term outcomes when used in isolation, emphasizing the need for adjunctive assessments. 4. The cerebral edema that frequently follows brain trauma is the result of a complex interplay between cytotoxic, vasogenic, and interstitial processes, which can increase intracranial pressure and reduce cerebral perfusion, leading to a vicious cycle of ischemic injury and further neuronal damage. 5. Post-traumatic epilepsy is a well-recognized complication of brain trauma, with its risk being influenced by factors such as the severity of the injury, the presence of contusions, and early post-traumatic seizures, necessitating careful long-term neurological monitoring and management to optimize outcomes. 6. The concept of neuroplasticity, in the context of brain trauma, refers to the brain's remarkable ability to reorganize neural pathways, which is crucial during rehabilitation as it facilitates recovery of function by compensating for lost neuronal connections through innovative therapies like cognitive rehabilitation and task-specific training. 7. Biomarkers in brain trauma hold promising potential for revolutionizing diagnostic precision and prognostic assessments, as they can provide insights into the underlying pathophysiological processes, detect secondary injury paths, and guide targeted therapeutic strategies aimed at reducing neurological damage. 8. Endocrine dysfunction following brain trauma, such as hypopituitarism, results from injury to the hypothalamic-pituitary axis, leading to alterations in hormone levels that can affect metabolism, stress response, growth, and reproduction, necessitating comprehensive endocrine evaluation and management for optimal recovery and quality of life. 9. The use of hypothermia as a therapeutic intervention in brain trauma aims to mitigate secondary injury by reducing metabolic demands and suppressing deleterious biochemical cascades, although its efficacy is still under active investigation, with current evidence suggesting it may be beneficial in specific contexts and patient populations. 10. Elevated levels of neuroinflammation, characterized by the activation of microglia and astrocytes, play a dual role in brain trauma, contributing to both the healing process and the propagation of secondary injury, which underscores the importance of targeting inflammatory pathways to modulate this response and improve outcomes. 11. Intraoperative monitoring of intracranial pressure, ICP, in patients with severe brain trauma offers critical real-time data on cerebral hemodynamics, allowing surgical teams to make informed decisions about interventions that can prevent herniation and preserve neurological function by maintaining cerebral perfusion. 12. Traumatic brain injury can lead to the phenomenon of brain-gut interactions where the injury may precipitate gastrointestinal disturbances such as impaired motility or increased mucosal permeability, potentially exacerbating central nervous system inflammation through a bidirectional interaction involving the gut microbiome. 13. The role of imaging techniques like diffusion tensor imaging, DTI, in evaluating brain trauma is increasingly recognized for its ability to detect microstructural changes in white matter tracts, providing insight into the degree of axonal damage and potentially guiding prognosis and tailored rehabilitation strategies. 14. The blood-brain barrier's integrity is often compromised following brain trauma, which allows inflammatory mediators, immune cells, and neurotoxic substances to penetrate the central nervous system, exacerbating injury and necessitating research into strategies that can restore and protect barrier function. 15. Secondary hemorrhagic transforms within cranial contusions add complexity to the management of brain trauma, as these developments can increase intracranial pressure and risk of further ischemic injury, often requiring careful monitoring and possibly surgical intervention to mitigate potential complications. 16. The impact of age on brain trauma outcomes is significant, with younger patients exhibiting greater neuroplastic potential and recovery prospects, while older individuals face compounded risks due to age-related brain alterations and comorbidities, increasing the challenge of achieving favorable outcomes. 17. Comorbid conditions such as hypertension or diabetes can magnify the consequences of brain trauma by predisposing individuals to cerebrovascular dysregulation and impaired metabolic responses, thus highlighting the importance of comprehensive risk management and control of these factors in affected patients. 18. Nutrition plays a crucial role in brain trauma recovery, with early and adequate nutritional support being essential for maintaining metabolic balance, supporting immune function, and promoting neurorecovery, underlining the importance of integrating nutritional therapy into the holistic care approach for these patients. 19. Traumatic brain injury often results in an acute hypercoagulable state, where the risk of thromboembolic complications increases due to alterations in coagulation pathways, necessitating the judicious use of anticoagulation therapy tailored to the individual patient's risk profile to prevent secondary complications. 20. Innovations in the management of brain trauma include the development of neuroprotective agents aimed at reducing oxidative stress and excitotoxicity, with research directed at compounds that can stabilize mitochondrial function and prevent the cascade of neuronal apoptosis being particularly promising. 21. The concept of a concussion spectrum of disorders captures the diversity and complexity of post-concussive symptoms arising from mild brain trauma, where patients may experience a range of cognitive, physical, and emotional symptoms that require individualized management strategies focused on gradual reintegration and rehabilitation. '22. Sleep disturbances, common following brain trauma, significantly impact recovery as they exacerbate fatigue, cognitive decline, and mood disorders. Thus, addressing sleep hygiene and, where necessary, pharmacological interventions are essential components of comprehensive brain injury management. 23. Rehabilitation after brain trauma focuses on the principle of neuroplasticity to encourage the re-establishment of neural connections, encompassing therapies like physical, occupational, and speech therapy tailored to the individual's specific needs, aimed at maximizing functional recovery and enhancing quality of life. 24. The catecholamine surge observed following acute brain trauma signifies a physiological stress response, potentially leading to systemic complications like hyperglycemia and cardiac arrhythmias, which healthcare providers must proactively manage to prevent exacerbation of the primary neurological injury. 25. Long-term cognitive outcomes after brain trauma are influenced by the initial severity of injury, extent of axonal damage, and the presence of post-traumatic complications, with emerging evidence suggesting that genetics and pre-existing mental health status also play significant roles in recovery trajectories. 26. Innovative assessment tools such as the Automated Neuropsychological Assessment Metrics, ANAM, are being developed to provide objective, computer-based evaluations of cognitive function in brain trauma patients, facilitating the early detection of cognitive deficits and informing rehabilitation strategies. 27. Technological advancements such as wearable sensors are being incorporated into brain trauma rehabilitation to enhance real-world monitoring of motor and cognitive activities, providing valuable feedback that guides therapeutic interventions and aids in tracking recovery progress in everyday environments. 28. The evolution of telemedicine is transforming the landscape of brain trauma care by increasing accessibility to specialists, enabling remote monitoring and consultations that ensure continuity of care, especially for patients in underserved or rural areas where access to specialized brain injury facilities is limited. '29. The complex interplay of genetic predisposition and environmental factors in brain trauma vulnerability and recovery suggests that personalized approaches incorporating genetic profiling and exposure history may enhance the precision of both preventative strategies and therapeutic interventions. 30. Research into blast-induced brain trauma as a distinct subset of traumatic brain injury highlights unique pathophysiological features such as primary blast wave impact and secondary barotrauma, necessitating specialized approaches for diagnosis, management, and long-term care tailored to the specific injury mechanism. '31. The role of neuroimaging in chronic traumatic encephalopathy, CTE, resulting from repeated brain trauma is evolving, with advanced modalities like positron emission tomography, PET, scans offering potential insights into tau deposition patterns that may herald new diagnostic and therapeutic frameworks. '32. Cognitive reserve, the brain's resilience to pathological damage, is a key factor in brain trauma outcomes, with individuals with higher cognitive reserve often showing better functional recovery, emphasizing the importance of educational and mentally stimulating activities as a form of protective intervention throughout life. '33. The risk of neurodegenerative diseases such as Alzheimer's or Parkinson's following brain trauma indicates that long-term surveillance and risk modification strategies are imperative in at-risk populations to potentially delay the onset or reduce the severity of these chronic conditions. '34. The development of brain organoids from stem cells provides a novel in vitro model for studying brain trauma, offering researchers an unprecedented opportunity to investigate the cellular and molecular mechanisms of injury and repair in a controlled laboratory environment that mimics human brain physiology. '35. Innovative rehabilitative techniques such as virtual reality, VR, are being harnessed in brain trauma therapy, offering immersive experiences that challenge cognitive and motor skills, engaging neural pathways in ways traditional therapies cannot, thus potentially accelerating the rehabilitation process. '36. Traumatic brain injury can disrupt the body's circadian rhythms, leading to a cascade of biological and behavioral changes such as altered sleep-wake cycles and hormone secretion, requiring interventions that aim to re-establish normal rhythmicity for overall well-being and recovery optimization. '37. Neuroendocrine regulation following brain trauma is critical, as dysregulation can result in significant clinical manifestations such as adrenal insufficiency or thyroid dysfunction, which necessitates vigilant hormonal monitoring and replacement therapy when indicated to support the patient's overall recovery. '38. Exploring the gut-brain axis in brain trauma highlights a pathway where changes in gut microbiota composition can influence central nervous system outcomes, with probiotics and dietary interventions potentially providing novel avenues to modulate secondary injury processes and support recovery. '39. The development of smart helmets, embedded with sensors, aims to revolutionize the prevention and immediate impact assessment of head injuries, providing real-time data on the magnitude and biomechanics of impacts that can inform immediate care and potential long-term risk evaluation. '40. The integration of artificial intelligence, AI, in brain trauma care leverages machine learning algorithms to predict outcomes based on a multitude of variables such as imaging findings, clinical data, and genetic information, enabling personalized treatment plans that optimize recovery and minimize complications. '41. Vascular changes after brain trauma, including the development of microthrombi and altered blood flow dynamics, play a crucial role in the progression of secondary brain injury, with research focusing on interventions that target endothelial function and blood-brain barrier repair to mitigate these effects. '42. Advances in understanding the role of exosomes, extracellular vesicles that facilitate cell communication, suggest that they could be harnessed to deliver therapeutic molecules to injured brain tissue, offering a novel strategy for repairing neuronal networks and reducing the impact of traumatic injuries. '43. Post-traumatic amnesia, a common symptom following brain trauma, reflects a transient disruption in anterograde and retrograde memory processing, and its duration can provide critical prognostic information regarding the severity of the injury and expected recovery timeline. '44. Children and adolescents with brain trauma require specially adapted management protocols, as their developing brains and distinct physiological responses necessitate tailored approaches in both acute care and rehabilitation to promote favorable neurodevelopmental outcomes. '45. Innovations in pharmacogenomics offer the potential to tailor drug treatments after brain trauma according to individual genetic profiles, optimizing efficacy and minimizing adverse effects, and opening new frontiers in personalized medicine for these complex injuries. '46. The role of early mobilization in brain trauma recovery is gaining attention as evidence supports that gradual activity resumption, under careful monitoring, can promote neuroplasticity, prevent complications from prolonged immobility, and support the physical and cognitive recovery of the patient. 47. Cognitive behavioral therapy, CBT, is proving to be a valuable adjunctive treatment for managing the psychological sequelae of brain trauma, addressing issues such as anxiety, depression, and cognitive distortions, which are common barriers to full functional recovery. 48. Emerging research into the role of mitochondrial dysfunction in brain trauma suggests that targeting these organelles to enhance bioenergetics and reduce oxidative stress could offer new therapeutic pathways to ameliorate secondary neuronal damage. 49. The development of advanced neuromonitoring techniques, such as near-infrared spectroscopy, NIRS, offers non-invasive means to assess cerebral oxygenation in real time, providing crucial information that could guide interventions during the critical phases of brain trauma management. 50. Brain trauma significantly affects emotional regulation, leading to challenges such as irritability or emotional blunting, which require integrated management strategies involving psychotherapy, pharmacotherapy, and family education to ensure holistic recovery and reintegration into daily life. In gastric cancer, the aberrant activation of the WNT beta-catenin signaling pathway significantly contributes to oncogenesis by promoting cellular proliferation, inhibiting apoptosis, and facilitating tumor invasion through down-regulated E-cadherin expression while enhancing vascular endothelial growth or mediated angiogenesis. Precise staging in gastric cancer hinges on advancements in endoscopic ultrasonography, EUS, which surpasses conventional imaging methods by offering real-time, high-resolution evaluation of tumor invasion depth, T-stage, and regional lymph node involvement, N-stage, thereby guiding prognosis and therapeutic approach. A Helicobacter pylori infection, a class 1 carcinogen, initiates chronic atrophic gastritis and mucosal inflammation, progressing to intestinal metaplasia and dysplasia before culminating in gastric adenocarcinoma, highlighting the bacterium's role in the precancerous cascade and underlining the significance of eradication programs. Peritoneal dissemination, a frequent complication of gastric cancer metastasis, eludes conventional imaging techniques but can be sensitively detected through diagnostic laparoscopy, a crucial step in identifying non-visible carcinomatosis and avoiding futile surgical resections. Tumor microenvironment alterations in gastric cancer encompass hypoxia-induced factor activation, leading to epithelial mesenchymal transition, EMT, and fostering resistance to chemotherapy while supporting immune evasion via upregulated programmed death ligand 1, PDL1, creating an immunosuppressive niche. Despite its rarity in the Western Hemisphere, gastric cancer maintains a formidable global incidence, necessitating universal screening measures in high-risk regions such as East Asia, where endemic Helicobacter pylori prevalence and dietary carcinogens like nitrosamines prevail. Immunotherapy, particularly the use of checkpoint inhibitors targeting PD-1 or PDL1, has emerged as a beacon of hope in advanced gastric cancer, offering durable responses in a subset of patients, although their efficacy is contingent upon biomarkers such as microsatellite instability, MSI, and tumor mutational burden. Hereditary diffuse gastric cancer, HDGC, often resulting from germline mutations in the CDH1 gene encoding E-cadherin, mandates rigorous surveillance and consideration of prophylactic gastrectomy by age 40 for mutation carriers to preclude the development of signet ring cell carcinoma. The application of next-generation sequencing, NGS, in gastric cancer has illuminated an array of actionable genomic alterations, providing a spectrum of targeted therapy options, including anti-HER2 therapies in ERBB2-amplified tumors and MET inhibitors in MET overexpressing cancers. 10. Linitis plastica, a unique subtype of gastric cancer characterized by diffuse infiltration and thickening of the gastric wall leading to a stiff, non-distensible stomach, typically signals a poor prognosis with limited resectional success due to the pervasive tumor spread at diagnosis. Improved nutritional support, a critical component of gastric cancer management, involves multidisciplinary approaches focusing on preoperative optimization through enteral nutrition, essential for reducing postoperative complications and enhancing recovery in malnourished patients. Recent studies highlight the utility of liquid biopsies in gastric cancer, wherein circulating tumor DNA, ctDNA, serves as a non-invasive biomarker for early detection, monitoring treatment response, and identifying resistance mechanisms, fostering personalized, adaptive treatment strategies. Targeting angiogenesis in gastric cancer, notably through agents inhibiting VEGF signaling pathways, offers clinical value in subsets of patients, disrupting neovascularization crucial for tumor growth and metastasis, albeit with careful management of the associated thromboembolic risks. Palliative chemotherapy remains a cornerstone for managing advanced gastric cancer, prioritizing symptom relief and life quality improvement, with regimens such as FOLFOX and FOLFIRI leading the standard offerings supplemented with targeted biological agents in suitable genetic profiles. The integration of tumor-infiltrating lymphocyte (TIL) analyses within the histopathological evaluation of gastric cancer biopsies provides prognostic insights, with an abundant presence often correlating with improved survival outcomes and potential responsiveness to immunotherapeutic interventions. ROS-producing gastric cancer cells demonstrate an altered redox state, leveraging increased oxidative stress to activate survival pathways while promoting genomic instability. Thus, antioxidant defense targeting provides a promising therapeutic angle worth actively exploring. Patients with early gastric cancer detected through dedicated surveillance often benefit from endoscopic submucosal dissection (ESD), a minimally invasive technique ensuring curative resection with organ preservation in localized, non-ulcerated tumors confined to the mucosa and submucosa. Tumor-associated macrophages (TAMs) within the gastric cancer microenvironment exhibit plasticity, toggling between protumorigenic (M2) and anti-tumor (M1) phenotypes, thus serving as pivotal targets in immunomodulatory therapy perspectives geared toward reprogramming TAMs to suppress tumor progression. Gastric carcinogenesis in older adults often presents with distinctive molecular fingerprints and comorbid supportive care requirements, underscoring the importance of tailored therapeutic approaches balancing aggressiveness with the patient's physiological reserve and quality of life considerations. Lorien classification of gastric adenocarcinoma into intestinal and diffuse types remains crucial in prognosis determination and therapeutic decisions, given the differential response rates to conventional chemotherapeutic regimens and varying propensities for peritoneal dissemination. Neuroendocrine tumors of the stomach, though rare in comparison to adenocarcinomas, exhibit unique diagnostic markers such as chromogranin A and synaptophysin, necessitating specific management strategies including somatostatin analogs and surgical resection for localized disease. Heterogeneity in gastric cancer, governed by multiple histological and molecular subtypes, complicates treatment standardization. Hence, precise molecular profiling and histochemical analysis are crucial for tailoring individualized therapeutic regimens in the precision medicine paradigm. The phenomenon of tumor budding, characterized by single cells or small clusters at the invasive front of gastric cancer, serves as a highly significant adverse prognostic predictor, correlating with aggressive behavior, lymphatic invasion, and early metastatic potential. 24. Specific perineural invasion in gastric cancer portends a graver prognosis, elucidating the tumor's predilection for local infiltration along nerve sheaths, necessitating vigilant histological assessment to inform comprehensive treatment planning and adjunctive radiotherapy consideration. #25. Tumor hypoxia in gastric cancer dynamically modulates crucial survival pathways such as HIF-1 alpha, promoting glycolytic metabolism, epithelial mesenchymal transition, and resistance to chemo and radiotherapy, unveiling potential vulnerabilities for therapeutic exploitation through hypoxia-modifying agents. #26. Non-invasive breath tests investigating volatile organic compounds, VOX, have been proposed as innovative diagnostic tools for gastric cancer, exploiting metabolic changes to differentiate cancer patients from healthy individuals, pending further validation for clinical implementation. #27. Gastric cancer-associated fibroblasts, CAF, foster a supportive stromal environment conducive to cancer cell proliferation and invasion by secreting growth factors, matrix remodeling enzymes, and modulating extracellular matrix components, marking them as key targets for stroma-disruptive therapies. #28. Radiofrequency ablation, RFA, for gastric cancer liver metastasis adds a minimally invasive option to local control strategies, significantly prolonging survival in selected cases and synergizing with systemic chemotherapy to enhance overall management outcomes. #29. Microsatellite instability, MSI, high status in gastric cancer not only predicts responsiveness to immune checkpoint inhibitors but also correlates with improved prognoses and distinct clinicopathological features, advocating for routine incorporation of MSI testing in diagnostic workups. #30. Complementary therapies such as traditional Chinese medicine, TCM, have shown promise in adjunctive gastric cancer management, achieving symptom palliation and quality of life improvement, underscoring the importance of integrating evidence-based complementary approaches within mainstream oncology practice. #31. Amplified research into the gut microbiota gastric cancer axis posits that dysbiosis can modulate immune responses and therapeutic outcomes, suggesting the vast potential of microbiome-targeted interventions to enhance patient prognoses and therapy efficacies. #32. The prophylactic use of aspirin in patients at high risk for gastric cancer is undergoing investigation, hinged on its anticarcinogenic properties achieved through cyclooxygenase 2, COX2, inhibition, albeit balanced against gastrointestinal bleeding risks necessitating thorough risk assessments. #33. Positive Epstein-Barr virus, EBV, status in gastric cancer has emerged as a distinct molecular subtype associated with lymphoepithelioma-like histology, heavy lymphoid infiltration, and exclusive therapeutic vulnerabilities amenable to immune-modulating agent exploitation. #34. The innovative use of artificial intelligence algorithms in gastric cancer has unlocked novel pathways for enhancing diagnosis accuracy, prognostic modeling, and treatment stratification, exemplifying a pioneering frontier in augmenting oncological clinical decision support systems. #35. Vitamin and micronutrient supplements, particularly vitamin D and selenium, are subjects of ongoing inquiry into their potential roles in gastric cancer risk reduction and survivorship care, reflecting a growing focus on lifestyle interventions in cancer prevention paradigms. #36. Synchronous and metachronous gastric cancer involvement necessitates stringent surveillance post-resection, with ongoing follow-up endoscopy to detect secondary malignancies, providing early intervention opportunities that may bolster long-term survival prospects. 37. Predictive nomograms in gastric cancer integrate diverse clinical, pathological, and molecular markers, formulating individualized survival and recurrence estimations, which can be instrumental in informing patient-centric therapeutic decision-making and care planning. Photodynamic therapy, PDT, offers a novel technique for superficial gastric cancer ablation, employing light-activated photosensitizers to selectively induce cytotoxicity, thereby furnishing an option for patients ineligible for standard surgical procedures or as palliative treatment. The CHEK2 gene mutation, associated with heightened cancer susceptibility, extends its implications to gastric cancer predisposition, requiring vigilant genetic counseling and monitoring in affected families to preemptively address emergent malignancies. Intratumor heterogeneity in gastric cancer, manifested by distinct subclonal populations, influences treatment responsiveness and therapeutic resistance, necessitating comprehensive sampling and advanced sequencing approaches to effectively tailor multimodal interventions. The implementation of enhanced recovery after surgery, ERAS, protocols in gastric cancer resection aims to minimize hospital stays, expedite functional recovery, and curb postoperative complications via multidisciplinary tactical measures harmonizing patient perioperative care. P53 mutation status in gastric cancer represents a crucial determinant in prognostication, potentially guiding therapeutic selections, as its loss of function often signals aggressive behavior and poor clinical outcomes, pointing to the importance of integrating genetic profiling in routine diagnosis. The identification and manipulation of long non-coding RNAs, LNCRNAs, in gastric cancer research have uncovered a wealth of novel biomarkers and therapeutic targets, spotlighting their role in oncogenic signaling cascades, metastasis, and chemoresistance, thereby enriching innovative therapy development. Ethnopharmacological investigations into natural compounds, notably curcumin and resveratrol, demonstrate tentative anticancerous effects against gastric cancer cell lines, proposing an expansive trajectory for phytochemicals in complementary therapy refining and integrative cancer management. Gastric cancer treatment paradigms continue to evolve, embracing hyperthermic intraperitoneal chemotherapy, HIPEC, as an adjunct to cytoreductive surgery in peritoneal metastasis, showing promise in prolonging survival and restricting local recurrence in meticulously selected patient cohorts. The HER2 positivity in gastric adenocarcinomas, markedly present among a subset of patients, is capitalized upon in precision oncology through the administration of trastuzumab-based regimens, vindicating the stratification of patients by HER2 status to enhance targeted treatment efficacy. CD44, a prominent stem cell marker, defines a self-renewing subpopulation in gastric cancer that drives tumorigenicity and therapeutic resistance, substantiating urgent research into CSC-targeted strategies intended to thwart gastric cancer relapse and metastasis.